colleagues have brought up today. So, Chair Powell, could you just talk a little bit about this? And I'm especially interested in using your bridge analogy. What are the risks of not building this bridge? What happens if we don't take this action right now? And the long-term impacts of this growing inequality on our economy post-pandemic?
Thank you, Senator Smith. So these disparate economic outcomes across racial and other lines are a long-standing feature of our economy. They've been with us for a very long time. And there is a great risk that the pandemic is making them worse because the people who are most affected by the job losses.
And we continue to roll on right here on News Now from Fox. A live look at the White House on this Tuesday. We have some major breaking news to get to in just a moment. We also want to let you know that in just about a half an hour time, we will be hearing from Joe Biden about some new cabinet picks, and we'll be bringing that to you live as it happens in about 30 minutes or so. But we do want to go to some breaking news regarding President Trump's legal team, what they just filed. The Trump campaign filed a lawsuit to the Wisconsin Supreme Court today, alleging abuse around the process of absentee voting in the state, which they say affected approximately 220,000 ballots. The lawsuit was filed today and comes after Wisconsin completed its partial recount, which maintained that Joe Biden won the presidential race in the state, and after Wisconsin Governor Tony Evers formally certified Biden's victory just last night. The Trump campaign's Wisconsin legal team, led by former Wisconsin Circuit Court Judge Tim Trupas, told Fox News that while the recount in the state did not flip in President Trump's favor, it gave the campaign the, quote, unique ability to examine ballots. Exposing exactly how the election process were abused in Wisconsin holds enormous value for the election beyond a victory for President Trump. But the fact is, our state's electoral votes likely won't change the overall outcome, Trupas told Fox News. Regardless, we're demonstrating that the results of the election unequivocally ought to be questioned. The legal team also said the suit highlights a, quote, lack of transparency and credibility on part of local election officials and their willful disregard of the law on multiple occasions, and added that the state's laws and processes gave it the, quote, unique ability to illustrate this abuse with precision. The campaign claims officials on the Wisconsin Election Commission and the city clerks of Milwaukee and Madison, quote, willfully disregarded the current statute and made conscious efforts to circumvent Wisconsin election law, resulting in tens of thousands of votes cast well outside the bounds of Wisconsin law. It also asserts that the law was violated on several occasions through what it described as altered certification absentee ballot envelopes, a lack of required absentee ballot applications, unlawful claims, confinement, and voting events called democracy in the park, end quote there. Wisconsin law requires that written absentee ballot request forms must be submitted ahead of the voter casting their absentee ballot, but the Trump campaign claimed that election officials instead, quote, accepted ballots without the required absentee applications on file. The Wisconsin state legislature has explicitly required an application, a Trump campaign official told Fox News, saying it is, quote, mandatory, and any ballots without an application or with an incomplete application are not to be counted. The campaign said ballots cast without the initial absentee ballot applications on file must be called into question. Next, the campaign pointed to Wisconsin law, which requires any ballots that are incorrectly filed out, missing information, or damaged to be returned to the voter to correct and resubmit. But the lawsuit alleges municipal clerks were, quote, illegally altering ballot envelopes themselves. In many instances, witness addresses were left off of the envelopes, and clerks, using their own knowledge or searching in unknown databases, filed in the information themselves. A campaign official told Fox News, according to the statute, this is illegal. If the certificate or envelope is missing a witness address, the ballot can be counted until the voter corrects the error. Plain and simple, the official added. Instead, election officials decided to take the law into their own hands, end quote there. The official also added these ballots were fraudulently completed and counted, and the illegal ballots should not count towards the certified vote totals. The lawsuit also alleges voters were, quote, fraudulently allowed by election officials to circumvent voter ID laws by claiming absentee voting status that under state law was only to be used for voters who are indefinitely confined. The status of indefinite confinement in Wisconsin is intended for voters who are physically ill, infirm, elderly, or disabled, and for those who are unable to vote in person under those terms. The campaign claimed that due to the confusion and misinformation from Democratic election officials amid the coronavirus pandemic, many voters requested that status even though they definitely were not confined. And this allowed voters abusing the status to vote without providing identification as required by law, another Trump legal team official explained. The campaign said that back in March, Democrat election officials falsely told voters they could claim the status because of the pandemic, but said that quote was later struck down by the Wisconsin Supreme Court. The Trump campaign said that from 2016 to 2020, the number of indefinitely confined voters increased dramatically, nearly 600% in Dane County and about 500% in Milwaukee County. The lawsuit also will claim that clerks, quote, did not do their due diligence to remove voters fraudulently claiming the status and made no good faith effort to check publicly available information and remove indefinite confinement permissions from illegitimate voters. The lawsuit alleges that anyone who cast a ballot under the terms of indefinite confinement without meeting that criteria did so fraudulently, and therefore their illegal ballots must not be counted. Meanwhile, the campaign also alleged that the city of Madison created unlawful polling locations at over 200 locations throughout the city's Democracy in the Park voting events, and said that the ballots accepted at the events were, quote, illegally cast. The campaign claimed the polling locations were held outside of the county's approved polling locations and did not follow the state's strict absentee voting requirements there. A Trump campaign official told Fox News its lawsuit is to ensure that legal voters are not being disenfranchised by ensuring only legal votes are counted. Added that Democrat election officials, quote, motive is clear. They want Joe Biden to win at all costs, regardless of whether the votes for him are legal or illegal, the official said, adding that the court must do the right thing and remove the illegal ballots from the certified vote total. The Wisconsin Election Commission told Fox News that they do not comment on lawsuits. Neither Evers nor the Biden campaign immediately responded to Fox News request for comment. The Trump campaign's Wisconsin legal team told Fox News it had more than 4,000 volunteers working throughout the recount in the state. The lawsuit comes after Evers certified Wisconsin's results for Biden just yesterday. So we will keep an eye on this moving legal fight there in Wisconsin, as once again President Trump's legal team doubling and tripling down there in the state. So we will definitely keep an eye on that for you as always right now. President Trump has also appeared to acknowledge that his legal bid to overturn the election results, quote, probably wouldn't reach the U.S. Supreme Court, which has been the goal of his legal team. So we'll definitely be keeping an eye on all of that right here for you on News Now from Fox, everyone. Hi, everybody. I'm your host, Mike Page. Thanks so much for joining us here worldwide. As always today, it's going to be a busy day here, and we're going to try to get as many live feeds for you as we can, and we'll be able to really mix that in with politics, the COVID-19 updates, and all the way around. Just another update. We're about 22 minutes away from a scheduled Joe Biden event where he will be talking more about his transition process, and we will bring that to you in its entirety once that gets going, everybody. A live look right now at the Senate floor as we continue to roll on right here on News Now from Fox. I do want to take you out to a Senate hearing that continues right now. This has to do about COVID-19 and the federal response from agencies, including the Treasury. Let's listen right here on News Now from Fox, live, raw, and unfiltered, bringing you these live feeds right to your TV, phone, or tablet we bring the news to you.
Government funding. And I will tell you, in Las Vegas and Reno, employment in our hospitality and leisure sector is down nearly 25% and 14% respectively. So let me start there with both of you. Secretary Mnuchin, what is the administration or what are you advocating moving forward that we should do to address the impact that we are seeing on our leisure and hospitality industry?
Well, specifically, and I agree with you, that this industry has been devastated. I believe that the PPP could immediately help people. I think that the airlines have also been devastated, so we support additional relief for the airlines, but hotels, small businesses, entertainment, all of these companies could access the PPP.
Well, let me jump back there, because when I talk about hospitality and leisure, I'm talking about restaurants, I'm talking about live events. And if they're accessing the PPP, they're not looking for loans. And I think you've said it earlier, it's not the loans that help, it's the grants. Isn't that correct? Shouldn't we be looking at providing them more opportunities for grants than loans that they have to pay back?
Well, the PPP, if it's used correctly, is a grant. So it's a loan that should get forgiven without the bureaucracy. But yes, the PPP is effectively a grant, and that's what they need, not more loans.
Yeah, effectively it is. But as we've heard, there's challenges with it and ensuring, and I think the confusion even for these businesses is whether that will turn from a loan into a grant is still questionable for many of them. And that's why we're seeing the concerns that we see for so many not even applying. Let me ask Chairman Powell, I know you and I have had this conversation. Again, do you believe that the hospitality and leisure industry needs another stimulus package, like a comprehensive package for relief to sustain this industry?
I would agree that the industry has really been devastated. And the two things it needs is for the pandemic to be over, which we really can't do. And it needs grants, which we also can't do. Our loan programs are really not, you can't overgeneralize, but for most people in that, most businesses in that industry, really what they need is more fiscal support.
That's right. And so let me jump back then to another conversation that I've heard is state and local governments. Let me just reassure, gentlemen, you that the states and local governments need an additional relief. My state does, in the state of Nevada, for the very reasons that I'm talking about. We have a budget hole of over $1 billion, but that's just not Nevada. That's all of the states. There's bipartisan support that I have seen, as most recently as September of this year from the National Governors Association, bipartisan support for additional relief for state and local governments for the very reasons that we're talking about. So this idea that there are red states and blue states, or states don't need it, they're going to misuse it, I think is a misnomer. It's getting in the way of really the needs that we have across this country in a bipartisan way. So let me just reassure you, governors from Republican and Democratic states, or Republican and Democratic governors, are both asking for additional relief for state and local governments, and we need it for the very reasons I've just talked about. But let me ask you this, Secretary Mnuchin, jumping back to the $454 billion that was appropriated to the Federal Reserve's Exchange Stabilization Fund, is it your position that by the end of this year, if Congress doesn't make changes or change the legislation, that not only your authority stops, but that you will actually transfer those additional funds back to the state treasury?
Well, I've commented on this several times already, and I'll repeat it again. My actions are not economic. It's purely my interpretation of the law. I think the section was pretty clear. I cited it earlier. I'd be happy to follow up with you or anybody else on this. And as regards to when the money comes back, it's fully prescribed within the law what happens to the money. So there's no discretion on my part.
Okay, and that's what I want to get back to, because I absolutely agree with you. It's very specific in the law, the termination of the authority, of your authority, but it's also specific on where that money is supposed to stay, and that you do not have the authority to transfer it under this law. And I just wanted clarification with that. If your legal authorities are telling you something differently, or your attorneys, I would like to know that, because the way I read it, you don't have the authority to transfer this money back to the Fed under at least the CARES Act authority. So please share that with me. And let me just, I know my time is running out, and I'll submit the rest of my questions for the record. Let me just say, Secretary Mnuchin, thank you for your service. It is not an easy thing to do, particularly in
We continue to listen to the Senate hearing. You're watching News Now from Fox. We're going to be taking a quick 2-minute break for some of you. Stay right here with us. We're just getting warmed up.
them and their contributions to this committee have at least helped me understand as well numerous issues that impact this country in our financial sector. So thank you all again for your service.
Thank you.
Thank you. And our final senator who will be by telephone is Senator Sinema.
Thank you, Chairman Crapo, and thank you to our witnesses for being here today. You know, Arizonans are struggling to make ends meet during the pandemic, and I regularly hear from families and small businesses back home that are concerned they won't make it through the winter, especially since coronavirus cases are spiking across the country. By passing the CARES Act and authorizing the Treasury Department's backing of the Federal Reserve's emergency lending facilities, we lowered borrowing costs for households and businesses alike, protecting jobs and stabilizing our economy as we continue to fight the coronavirus. With cases on the rise, now is not the time to pull back critical support for families and businesses in Arizona. And that's why I'm disappointed by Treasury's decision to withdraw financial support for the lending facilities, particularly the Main Street lending facility. It moves us in the wrong direction and puts relief further out of reach for people that desperately need it. So, Secretary Mnuchin, recognizing that many U.S. businesses need direct relief as well as access to credit, do you believe that businesses, particularly local restaurants, retail businesses, and those in the hospitality industry, have what they need right now to survive the winter?
No, I don't. I think that's why I encourage Congress to authorize us to spend the $140 billion of unspent PPP money so we can give them second loans that, if used properly, will turn into grants and save lots of jobs.
Well, this is an area where we agree, Secretary Mnuchin. I also think that those dollars should be released and used by businesses around the country. I do hear from business leaders across the state, though, that we need to expand and improve, not retreat, the lending facilities. And so I'm hearing from folks at home that many small and mid-sized businesses in Arizona won't make it without additional relief. And if they can't get direct relief, they should at least get access to credit. I think they should have both. And of course, this isn't just about the businesses. This is about the small business owners and the workers and their households. There's a lot of stake here, and families, jobs, and their homes hang in the balance. You know, back home in Arizona, most people don't think that Washington cares very much about what happens to them. And my concern is that decisions to end the Main Street lending facility, where things are getting caught up in partisanship and procedure, and people are losing sight of the end result, it makes me think that folks in Arizona might be right to have given up on Washington. Now, Secretary Mnuchin, if you could just briefly respond to my question about the Main Street lending facility. We agree on funding for PPP, but I'd like to hear your thoughts about the Main Street lending facility and why you think that this should be eliminated or ended for mid-sized businesses in Arizona and throughout the country.
Well, again, my reason of why it should be ended is because there's a December 31st termination date in the law. I think it's very clear. I've already cited the section. I have it with me. I won't go through it again. I'd be happy to send it to you. Congress can extend it. I personally think that idle loans out of the SBA are more effective. One of the problems with the Main Street facility was that a lot of those small companies that are doing well had access to banks, and the companies that didn't fit the program. But again, it was not a judgment on my part. It was merely following what the law prescribes.
Now, Secretary, I know that Senator Cortez Masto asked to see the legal reasoning for your decision to end. I'd like to see that as well. You know, we have known about some concerns around the Main Street lending facility for months. And in our last time together, I lamented the fact that I believe that Treasury and Fed jointly set these terms too stringently, and that many businesses in Arizona were unable to take advantage of them. So I'd like to reiterate that I believe that the program should be continued and that eligibility should be expanded for the facility, and the term sheet should be changed so we can help more businesses in need. Now, Chairman Powell, I've seen your take on this, and I know that you and Secretary Mnuchin don't agree on the extension of the Main Street lending facility. Do you think that households and businesses will risk having lower or higher borrowing costs because of the end of the Main Street lending facility?
Actually, it's a little more complicated than that. The Congress gave the Secretary sole authority over the CARES Act funding. We play no role in that, and that's in distinction to the 13th Year facilities, which we designed together because we both have to approve. And the Secretary made that, reads the law as he said, and really his voice is the authoritative one on that, and we accept that. We accept that reading of the law. So our point really was that other central banks and any central banker would tell you that it's premature to be pulling back support for the economy. And the Secretary did indicate in his letter, and it's true, that we can either reestablish facilities or institute new facilities, and we can even have exchange stabilization fund backing for that, provided the legal requirements are met. I hope that's responsive to your question.
It is, thank you. I see that my time has expired, Mr. Chairman. I do have a couple further questions, but I'll submit those for the record. Thank you.
Thank you, Senator Sinema. That concludes the questions. Senator Brown has asked for a little bit of time for closing remarks, and Senator Brown.
Thank you, Mr. Chair, and thanks again for your service on this committee. Mr. Chairman, Republicans told us today the only thing we set out to do is to stabilize the markets, and we've achieved those goals so we can end support to the facilities. Look around us. That's not the reality we're facing in our states. People are dying in larger numbers than ever before from this virus. Businesses are still closing. Restaurants, 60 restaurant owners collectively told me yesterday that it's worse than it was in February, March, and April. People are increasingly worried about the virus. People are still losing jobs. They're working at unsafe jobs in an unsafe environment. Secretary Mnuchin ended programs that are still helping small and medium-sized businesses and helping state and local governments. He just simply didn't need to do that. Thank you, Mr. Chairman.
Thank you. And that concludes the questioning from today's hearing. For senators who wish to submit questions for the record, those questions are due to the committee by Tuesday, December 8th. To each of our witnesses, we ask that you respond to those questions as promptly as you can. I want to thank you each for joining the committee today and for your service. And this hearing is adjourned.
And that's the end there of that Senate hearing, and we will take a quick 2-minute break here for you as well, right here on News Now from Fox Live. Look at the White House here on this first day of December. You're watching News Now from Fox. All right, folks, in the meantime, we're going to show you this COVID-19 update from New York City right here. Bringing that to you right here on News Now from Fox.
Thank you, Mr. Mayor. We're greatly appreciative of the mayor's leadership in working with his office towards this new campaign of Give Blood NYC. As he said, we need about 2,000 donations a day and 25,000 additional donations this coming month. This next wave of COVID and the weather and the holiday season makes it very much more difficult to collect blood. Typically, we do so in office buildings, churches, synagogues, schools, university, all basically closed. We need you to come out to our fixed site centers at nybc.org and on our website, make a donation plan and a time and appointment. During COVID, all people still go to the hospital with trauma, mothers delivering babies who are premature, surgeries, cancer patients. All these patients need blood. So we very much appreciate the mayor's leadership in this. We look forward to working towards these 50 prizes that the mayor talked about, and that those will be chosen 10 every Monday morning and handed out to people who sign up. Sign up at NYBC, NewYorkBloodCenter.org, NYBC.org/GiveBloodNewYork, New York City, Give Blood NYC, and then go on our website, NYBC.org, to make an appointment. We need very much everyone to come out at this critical juncture so that we don't move from critical shortage to dangerous shortage. Thank you.
Thank you, Dr. Hilliard. Again, thank you to you and all your colleagues, and really want to make sure people understand there's a lot of folks looking out for us every day who we don't get to know so well, but we really need to thank the folks who work at the Blood Center, do so much for us. We're going to hear from another special guest, and she is an educator who serves our kids. And if she was just here to tell you about her life of helping others and helping uplift our children, that would be powerful enough. But she's here to tell you about what it means to be someone who got one of those blood transfusions, what it means to be someone who really needs that help. And so you can feel the impact of what you're going to do, what it means humanly to be there for your fellow New Yorker. So my pleasure to introduce a great educator, someone we're so happy to have with us, Shatira Weaver. Welcome, Shatira.
Thank you, Mayor de Blasio, for inviting me here today to help support this very important effort in collaboration with the New York Blood Center. I am Shatira Weaver. I'm an educator at the Metropolitan Expeditionary Learning School in Queens. So a real quick shout out to all my students, all the love to you. Hey, y'all. In addition to being a public school educator, I am a sickle cell warrior, and I'm one of the many New Yorkers who regularly rely on the voluntary donations of blood. In fact, just 3 weeks ago, I faced a sickle cell crisis, which is both unpredictable and very painful when it occurs. One of the main treatments for sickle cell is a blood transfusion. I'm almost immediately invigorated and emboldened after a blood transfusion, given the influx of healthy red blood cells that my body normally doesn't produce on its own. I swear it's like spinach for Popeye. Every single time I feel immediately better, and without it, I would have had to stay in the hospital and remain there for an indefinite amount of time. Thankfully, I was able to receive 2 blinds of life-saving blood transfusion because of the generous donations of New Yorkers who have already donated. But unfortunately, COVID-19 has put a real strain on the blood supply, and that scares me and other sickle cell warriors. But not just us. Blood is needed for cancer patients, accident victims, mothers experiencing complicated births, just to name a few. We all need you. That's why I am so excited about the Give Blood NYC campaign that the city is launching. This campaign can help me, essential workers, and countless other New Yorkers get through the holidays and get to see a new year. I became an educator to make a difference in the world and to help people. And you can also make a difference. You can help New York City remain strong and stay strong. If you are healthy and able to give blood, I am asking you, please, please do so. You can also make the world of difference in not only blood receivers, but their families and friends alike. We need healthy New Yorkers to donate blood. So thank you again, Mayor de Blasio and the New York Blood Center for helping to ensure that despite this pandemic, New Yorkers like me continue to receive the life-saving blood that we really need to survive.
Thank you so much, Shatira, and thank you for telling your story, because it really is powerful and reminds people this is such a beautiful and important thing you can do for your fellow New Yorker. So I want to thank Shatira, thank Dr. Hilliard, everyone who's doing this good work. Thank you to all the folks who are donating the prizes, the companies and the folks who are really stepping up to make it something so appealing for New Yorkers to get involved. But really, we need you. So we're going to start today saying we need 25,000 people for the month of December. We're going to keep giving you updates to remind you how we're doing and how much we need. But everyone, you're going to feel so good after you give blood. Maybe not as much as spinach to Popeye, to use that great analogy, but you're going to feel good because you're going to feel in your heart that you did something so good for your fellow New Yorker. And imagine just that few minutes of your life could save someone else's life. So please, everyone, we need you now. All right, let me go to our daily indicators. And again, this is another day where we have some results that are lower than recent days, meaning the number of tests that we are relying on is lower because we saw a reduction around the Thanksgiving weekend in the number of people being tested. So we're going to give you the numbers, but with a bit of an asterisk that they're based on a lower sample size than usual. Okay, number one, daily number of people admitted to New York City hospitals for suspected COVID-19, threshold 200 patients. Today's report, 132. Confirmed positivity rate, that continues to go up. We're watching that very carefully, 58% now. Number two, new reported cases on a 7-day average, 550 cases is the threshold. Of course, far beyond that now, 1,685 cases. And number three, percentage of people testing citywide positive for COVID-19, threshold 5%. Today's report, 5.72%. So that's a daily report, and again, based on a lower sample size, but obviously something we're very concerned about. The more important number, even though also affected by lower test numbers recently, lower amount of tests recently, but still a number that we are really concerned about, 4.14%. Let me say a few words in Spanish. Este año, nuestra ciudad.
And right now we are taking a listen and an update in New York City there. Mayor Bill de Blasio giving his daily updates. I do want to let you know that pretty soon we will be hearing from Joe Biden announcing his cabinet picks. This is from inside his rolling pool camera shot there with journalists waiting and going to travel there with Joe Biden to his event there. So kind of a cool shot here that you don't get to see too often there. And you see the ambulance there that is always accompanying anytime there is a motorcade. So this is a shot that you don't normally get to see there too often there. But pretty soon we will be having Joe Biden speaking on his latest cabinet picks, and we will feature that for you on News Now from Fox, everybody, as that gets going. Let's go back out now to the New York City update right now.
You know, being involved with family activities or whatever else it may be. So we expect those numbers, they are starting to go back up again, but we had several days where the numbers were noticeably lower. The number of people being tested were noticeably, meaningfully lower than previously we had seen. Go ahead, Katie.
Great. And my second one is just about with the hospitalizations increasing. I know the city has been prepared, I guess, for what could be a second wave at some point. But if I don't know if someone, Dr. Katz or Dr. Trotsky, wants to speak a little bit about the city's preparation, especially now with there's larger advisories to the elderly and those with pre-existing conditions, just some of the preps being done.
Yeah, that's a very, very important question. We're putting a lot of focus on that. Obviously, we've been working closely with the state, and the plan the governor put out yesterday is something we were involved in over the last week, working on with the state. But the city, the public hospitals, H&H, have been preparing now for many weeks for this possibility. I know the hospitals in Greater New York Hospital Association have as well. So, Dr. Katz, why don't you talk about some of the ways that you have been preparing for these additional cases and what you are doing, obviously, based on the lessons we learned from the spring.
Thank you very much, Mr. Mayor. So, as you say, we've been working on this for the last several weeks so that if there is a major increase in cases, we are prepared to handle that. Right now, people should know that Health and Hospitals, our ICU is only about 2/3 full, so we have a third capacity. Same on the regular medical surgical wards, and we're not overwhelmed at any of our 11 hospitals. I've talked with my colleagues at Health through the Greater New York Association, and all of the hospitals are right now prepared to take more patients if we need to. In terms of preparation, what we've done is first, thank you, Mr. Mayor. You made sure months ago that we had 3 months of supplies for all of our personal protective equipment, what people call PPE. We have more than enough ventilators. We purchased a group over the summer. So equipment is a non-issue for us at this moment. We are well prepared. We have prepared a number of spaces to be able to take care of people who have COVID by adding HEPA filters into their rooms, creating negative pressure rooms, which suck the air out and thereby suck the virus out and protect the healthcare workers from infection. We've added cameras and audio monitors to a variety of rooms so that patients can request things from their nurses, their doctors, without anyone having to enter the room. If there are things we can answer questions or provide without putting anyone at risk, we want to do so. We've learned a lot about how to take care of this disease, providing people who are short of breath steroids makes a huge difference and shortens hospitalization, which is undoubtedly one of the reasons why we are not overwhelmed despite the growth of cases that we've seen. We've learned that patients do not all need to be intubated when they become short of breath. Many people can be cared for better by giving them a high flow of oxygen and thereby saving intubation only for those patients who absolutely need it. So it's a combination of preparing our facilities and being able to better care for patients so that we do not become overwhelmed. Thank you, Mr. Mayor.
Thank you, Mitch. Go ahead.
The next is Bob Hennelly from the Chief Leader.
Yes, Mr. Mayor, I just wanted to ask you, why should members of Congress from districts and states poorer than New York vote for $1 billion bailout for New York City, New York State, and the MTA when this state has been refunding back to Wall Street billions of dollars in rebates of a tax it had on its books since 1905, but stopped collecting in the 1990s? I think that some have been stacked estimates. It's worth $19 billion a year, and that in the last decade alone, we've sent back $138 billion to the Goldman Sachs crowd.
Okay, Bob, I want to flip that. I'm going to answer it, but I think I would order it a little bit differently. The first point is New York City and New York State send so much more money to the federal government than we ever get back. And that's been happening for decades and decades. For God's sake, Senator Daniel Patrick Moynihan used to do an annual report on how ridiculous the disparity was going back to the 70s and 80s. It continues to be an unacceptable disparity. We send so much out, we get so little back. So for the federal government, for the Congress to approve a stimulus to help the whole country back on its feet, to help the whole country recover humanly and economically is the right thing to do. New York City is one of the leaders of the national economy. Helping us back on our feet helps the entire country. And I say again, helping us back on our feet helps the entire country. That is why the Congress should pass a stimulus. It's the right thing to do. It will spur on the economy. It will help people to survive these tough times. Also, we deserve our fair share. We've never gotten it for half a century or more. We should get our fair share of resources. It's long overdue. But you also point out something really important, Bob. Are we taxing the wealthy enough? No. The answer is simple, no. The wealthy are doing better and better during this pandemic. It's a shocking truth. You look at the stock market, you look at how the rich have literally gotten richer while everyone else is suffering. It was unacceptable, the status quo before the pandemic. It's worse now. There need to be higher taxes on the wealthy. The stock transfer tax totally should be reconsidered and handled differently going forward, because clearly Wall Street can afford to contribute more to New York City and New York State. So your question is very, very fair. I just think the ramifications are much broader than that one tax. I think Washington needs to help us because it's the right thing to do on many other levels as well. Go ahead, Bob.
So since the earliest days of the state's public health crisis, Governor Cuomo has urged that public hospital systems like H&H and private hospitals operate as an integrated unit. Why shouldn't that be the model going forward, since we know that the pre-existing fractured system resulted in so many poor people falling through the cracks in terms of the care they were getting?
Well, Bob, again, you ask a good and big question. I'm going to turn to Mitch because he's obviously on the front line of this. Look, I think that the core of your point is right, that we need to see as much of a team effort among our hospitals, and that those hospitals that happen to have more resources should be in the work of helping patients with the greatest needs. We did see, to be fair, some amazing teamwork during this crisis. When H&H needed help, Hospital for Special Surgery stepped up, Memorial Sloan Kettering stepped up. I want to thank them for really being there and working in that team effort. And it wasn't because of an order. It was something that they wanted to do to help each other out. But I think you're right. Going forward, there's more ways to think of the whole hospital system as a team effort. So, Dr. Katz, you want to speak to that?
Yes, thank you, Mr. Mayor. I think it's a wonderful point that we are stronger when we work together, when we level set across all of the hospital systems And that's very much the plan going forward. We're also going to be working actively with the fire department to allow patients to be transferred across borough lines if necessary, when part of the challenge we had in the first wave was that Central Queens was so disproportionately hit that it was difficult to transfer patients beyond any hospital in Queens because all of the hospitals in Queens were full. So we're looking at much more as the city as a whole resource, as all of the systems as a whole resource, and I think that will make us stronger. Thank you.
Thank you. Go ahead.
The next is Shant from the Daily News.
Yeah, good morning, everyone. Wanted to ask about the commissioner's notice. First of all, when it said that it applies to older New Yorkers, can you put like a more specific number on the age you might be talking about? And also, could you put the notice in context? Is this, what happens after this? Should this be interpreted maybe as leading up to broader stay-at-home orders like we saw in the spring?
I'll have the commissioner reiterate who he is focused on, who is in greatest need right now and most vulnerable. I think, Sean, to the bigger question, we all have to work really hard right now in every way, the smallest ways like wearing a mask and practice social distancing. And
just want to show you again, moments ago, Joe Biden, look at it, he's showing off his foot there that he fractured over the weekend, has the boot on and is now walking in. And now in just moments, we will be hearing from him talking about his cabinet picks, but he was showing off that boot right there. And we go back now.
The bigger ways in terms of
shot.
people not hosting bigger events and really making sure to keep people safe and protecting our elders, protecting people with pre-existing conditions. We have to do all those things. We have to do them intensely. If we are not successful in driving down these numbers soon, of course, there's the real possibility of much greater restrictions. So we have to do this work individually if we want to avoid those restrictions. Dr. Choksi, you want to go over again who you're focused on?
Yes, sir. Thank you. And thanks for the question, Shant. Specifically in terms of age, what we know from the science is that for adults, the older one is, the greater your risk is. So people in their 60s are at higher risk than people in their 50s. Same for folks in their 70s, 80s, et cetera. The commissioner's notice specifically refers to people above the age of 65 because we do see a significant increment in risk for seniors who are older than 65. But remember, it also includes people who have other conditions that put them at risk to have the severe outcomes that we're really trying to prevent that lead to hospitalizations and more catastrophic outcomes as well.
Go ahead, Sean.
Yeah, thanks for that. I also wanted to ask about testing for students. I understand that pre-K and kindergarten students don't have to submit COVID testing consent forms. Could you and maybe Dr. Choksi explain the rationale for that and say if there are any other measures being taken to assure the safety of pre-K and kindergarten kids specifically?
Yeah, Dr. Choksi can talk about the reality we've seen with kids that young because it obviously is different. Go ahead.
Sure, Mr. Mayor. So the rationale for thinking about testing differently among younger kids is that we know the risk of transmission is lower among younger kids. This isn't to say that, there aren't situations where they may need to get tested. It's still possible for a younger child to get infected with COVID-19. And if they develop symptoms, they should certainly get tested as well. But in terms of what we're doing with the more routine testing in schools, that's the rationale for the difference.
Go ahead.
Pardon. Next is Marcia from WCBS.
Good morning, Mr. Mayor and Dr. Choksi. I have more questions about your directive for seniors to stay inside. I wonder Are you going to provide any special services helping seniors get food, helping seniors get to their medical appointments, anything that they might need so that they can find staying inside the safer alternative?
I'll start and turn to Dr. Choksi. Marsha, look, food right now, absolutely. We've had that from the very beginning. Any senior who cannot get food themselves or have someone bring it to them and needs it delivered, we will do that for them for free. All they have to do is call 311. That has been from the very beginning of this crisis. I've said we will not let any New Yorker go hungry. We will not let any senior go hungry. Even if it means delivery right to their door, we'll make it happen. In terms of medical appointments, I've spent enough time around Dr. Choksi to know he's going to say one of the only exceptions to what he's saying is to make sure that people get the health care they need, and that is something sacred, to make sure folks stay in touch with their medical professionals. And we will do anything we can, of course, to support seniors and folks with pre-existing conditions who need that help connecting with healthcare. Go ahead, doctor.
That's exactly right, Mr. Mayor. Let me just take a step back to emphasize that the commissioner's notice is specifically about avoiding non-essential activities. That means that essential activities, whether it's someone going to the grocery store occasionally, or as the mayor said, someone going to their medical appointments, which are very important, those can and should continue. But it's non-essential activities that we really want to see curbed and curtailed as we see cases and now hospitalizations, starting to increase. With all of that said, yes, we need to do everything that we can as a city, but also as neighbors, as family members, to support people who are more at risk. So that includes, the food delivery programs that the city has set up earlier and that continue throughout the pandemic. There are ways to ensure that you have support, whether it's for transportation or getting medications delivered to you or prescribed in a more convenient way. You can call 311 for assistance with those services as well. And then the final thing that I'll just say is that another essential activity is getting care for COVID-19. So if you are feeling symptoms, you should get tested as quickly as possible. And certainly if you're feeling even worse, you should seek care with your doctor or at an emergency room.
And one other obvious point, which has really changed a lot, Marsha, in the course of this crisis, is the use of telehealth. And Dr. Katz, I'd love you to jump in here. I know that it's something obviously health and hospitals used before, but we've seen in the crisis many new ways of using telemedicine, much more willingness of your patients to engage it. This is also a crucial way you can help seniors and folks with pre-existing conditions without them having to leave their homes. So Dr. Katz, you want to speak about that?
You're absolutely right, Mr. Mayor. I see many of my primary care patients these days through televisits, especially if they're older or have comorbidities. And we've learned a lot about sending people blood pressure cuffs, sending them oxygen saturation meters, sending them home with glucose testing kits so that people can actually do many parts of the exam. And I know that it's not just health and hospitals that's seen this explosion. The providers all over New York City and all of the hospital systems are prepared to see people in televisits with just the telephone. So people, if you're worried that, oh my goodness, I don't know how to use a laptop, I couldn't possibly, that's okay. The phone works quite well in most cases. But for people who have the ability to use a laptop, we can also do televisits. Thank you.
Thank you. Go ahead, Marsha.
So, Mr. Mayor, a few weeks ago, you predicted that December 1st would be the day that, or the demarcation of when there might be more orange zones or red zones or yellow zones actually in New York City. I know you've seen the numbers continue to rise. The numbers are rising today. Do you have any prognostication about whether once the Thanksgiving numbers come in the next 7 days or so, whether you'll see more mini cluster zones and restrictions in New York City.
Look, this is something I've been talking to the governor about. Our teams are talking constantly. The state obviously is focused on, a microcluster approach that's had a lot of impact, clearly, and it's been effective in many cases. So I think what we're going to see is the state looking at the different areas in a targeted way. You look at the zip code data for the city that we put out, we see very different realities in very different parts of the city. But I certainly think there will be some more restrictions coming if we continue to see these numbers. I don't have any doubt about that. I can't tell you exactly how and when, but I expect more to come. And again, if I know, I don't even have to say if, I know New Yorkers want to avoid more stringent restrictions. We all have to do everything we can do right now to do the hard work to avoid those restrictions. That includes getting out there, getting tested, wearing a mask, all those things that Dr. Choksi has been telling us to do. People have to be really devoted to that now, or else we are certainly going to see more restrictions going forward.
Here we go. More restrictions could be happening in New York City. Just hearing that from the mayor right now. Stay right here with us, folks. More News Now from Fox coming up in just 2 minutes.
There are, and I know District 75 will be opening soon, but there are special ed classes in these schools, not in District 75. Are these students going to have to wait till the new year, or will the special ed classes be opening earlier?
It's a very important question, Ruben. I appreciate it. I can tell you this much. With District 75, we made the decision to do the opening across all grade levels. So I want that to be really clear because everyone agrees. All of our stakeholders, the state, the city, everyone agrees that kids with special needs, the in-person support is absolutely crucial. So District 75 schools will be open across all grade levels. Your point is a very good one, and we are looking right now at how quickly we can reach special needs kids at the middle school and high school level. I don't have an answer for you on that today, but we'll come back with that soon. I also want to emphasize our goal is to open up middle school first as quickly as we can. But I think realistically, as I've said, that's not in the next few weeks, but I do think that's in January, and then after that to go to high school as well. But we need the testing capacity since we're at a much higher level of testing under our new plan. We need to make sure we can do that first properly for District 75, pre-K, 3K, and K to 5, and then we can build out to middle school next, and then eventually to high school as well. Go ahead, Ruvain.
I have a question for the doctors. I've asked in the past about antibodies, when they might be recognized as people being immune and perhaps giving allowances to these people. Just as if they had a vaccine. Generally, the answers I received were that, we don't have complete information. We're 8 months into this pandemic. I'm wondering, is there some point at which we might have some more information and people with antibodies might be treated like people with the vaccine eventually will be treated?
Dr. Choksi, you want to start?
Sure. Thanks for that question, Ruvain. I would reiterate, what we've said about this in the past. The science has not changed with respect to being able to say that someone who has had a positive antibody test should act any differently than someone who has not had a positive antibody test. The way that we think about antibody tests is they are tests of exposure and not necessarily tests of immunity. So most importantly, continuing to do the things that you would otherwise do, wearing your mask, making sure that you're distancing, washing your hands frequently, et cetera. Those things all continue to apply. I do hope there will come a point where we understand more about immunity to COVID-19, where we can say things with more certainty about who is and is not protected. But with a vaccine on the horizon, I think that is the most likely destination, the most likely point at which we will be able to say that with more certainty.
Dr. Varma, you want to jump in on this?
I guess the only other point I would make is there was a question about timeline, and I just want to make the point, we are all impatient and would love to have valid information right now, but 8 months when it comes to understanding a new disease is actually a relatively short period. So we would love to have definitive information, but it is almost certainly going to take more time.
Yeah, and Dr. Varma, I think you would actually do a service to everyone because we're all still trying to recognize reality. We never heard of this disease a year ago, basically. What is the typical timeline, just to give people some perspective?
Yeah, what we're seeing right now is science moving at an incredibly fast pace. And even though we're all impatient, this would normally take years to answer this type of question. And even then, there would be still some uncertainty. And that's because of a simple fact. When we want to say, how long are you protected, you can't speed up time. And the studies that you do in laboratories really don't give you a sense of how the body is going to maintain its immunity over time. We're still learning things, for example, about measles, which is a virus that we've had a vaccine for since the 1960s.
Very, very important point. Thank you, Doctor. Go ahead.
The next is David Cruz from Gothamist.
Good morning, Mr. Mayor. How you doing?
Good, David. How you been?
Good. Thanks for taking my questions. So my first question is, the Archdiocese of New York filed a lawsuit against the city, claiming that the city is violating state law by not offering Catholic schools the same free COVID-19 testing provided to public schools. So why did the city file the appeal if there's a state law in the books that would grant Catholic schools the same access?
We believe the law is clear that it is not the city's obligation to provide the actual testing service. Our lawyers have looked at this carefully. Law department has handled this from the beginning. Look, I've spoken to Cardinal Dolan about this. It's something I fully understand, the fact that folks in other school systems are urgently trying to protect their kids. I appreciate that. I know they are dealing with all the challenges we are. They have limited resources, but our obligation right now is to continue the process of having New York City public schools be open and healthy and safe. We've got a huge number of kids to serve. We need all the resources that we have right now. What we're describing now, this weekly testing is going to take a huge amount of resources. It's the right thing to do. It's taking our gold standard we started with in terms of health and safety in our schools and adding even more. And it's what's going to sustain us. But it takes an immense amount of resources. So the law is clear that our obligation is to ensure that the facilities we run, we're providing the testing to. For the other types of schools, they have an obligation, but we'll help them. The Department of Health has been there for them the whole way through. We'll help them get the free tests from the state. We'll help them learn the best ways to implement it. We'll give them a helping hand every time we can. Go ahead, David.
And then your office hasn't released a racial demographic data of students who've opted for hybrid learning. So when can we expect to see that data?
If that data is collected in that fashion, I don't know the history, honestly, of Department of Education providing demographic data. But if they have it, we'll make sure it gets released soon. But again, I want to be careful because I'm not sure how that is handled in general. But look, the bottom line here is remembering that our school system is about 80% kids of color. And obviously, in comparison to private schools and religious schools, New York City public schools overwhelmingly provide support for more kids who are working class and lower income, more immigrant kids, obviously a huge number of kids who tragically are in temporary housing. When we put the open opportunity out there for parents from the original surveys in the summer on through to the different opportunities to engage blended learning, it has been an absolutely available choice to all parents. And I want to emphasize this. I care deeply. My whole public life has been focused on the issue of fighting disparities. But I also want to really respect each parent's choice, because I'm a parent too, and I understand our public school parents. We many times have said to parents, this is what you feel is right. Whatever you want to do is what we will support. And we've made that open opportunity available from the beginning, and obviously with the most recent opt-in period. And I think everyone who cares about disparity also has to respect the individual choices of parents who know what's best for themselves and their kids. Go ahead.
We have time for two more for today. The next is Abu from Bangla Patrika.
Abu,
how are you?
Hey, Abu, how you doing?
Good, how are you?
Good.
Okay, Mayor, my question is,
Wait, we need a little more volume. Can we get our volume up there?
Abu, can you speak a little bit closer to the microphone, please?
Abu, can you hear us? I think we're going to have to come back.
We may have lost Abu for now. We'll get back.
Okay, you'll come back in a moment? Okay.
The next we'll do Arthur from Fox 5.
Good morning, everybody. Mr. Mayor, I was wondering, since you've been collaborating with the governor on an approach here, what can you tell New Yorkers about the original plan of 10 days above 3% or 5%, I forget what it was, but needing those 10 days before some more severe restrictions. Is that still currently the plan, or could there be a scenario where the numbers go up so quickly that that plan is set aside and those restrictions have to go into place more urgently?
Yeah, Arthur, I mean, obviously it's important you ask the state directly. We've had a number of conversations with them over the last few days. Everyone's focused on health and safety, and also obviously focused on people's livelihoods. We're really aware of how much pain folks have gone through this year, and how many families are struggling. Working class families, low income families that need employment, and small business owners. So we're trying to balance all these factors. As I said, the state obviously has focused on a micro-targeting approach. I think that's where they're going to be continuing to focus. As to the numbers, again, that 10 consecutive day number is something they've used up to now. I'm not sure that's how they're going to continue to do it, but we're going to continue to talk to them to figure out the best way to balance all these pieces. Go ahead, Arthur.
My other question is on street safety. There was a car after midnight on Monday in the Bedford-Stuyvesant section of Brooklyn that went through a red light and slammed into a car. I don't know if you saw the video. The woman in the back seat of the Uber that he T-boned, the car was hit so hard that she ended up outside the vehicle, being ejected from it. The driver, as is often the case, was not cited for anything and allowed to go home. Police say that they're investigating it. Given the fact that she's in critical condition in the hospital, that he was seen on video camera speeding, going through a light and hitting that car, do you think in a year where we're seeing 15% more traffic-related fatalities, that there's a better message to send to drivers who drive recklessly in our streets and leave other New Yorkers in critical condition, if not worse?
Yeah, Arthur, look, first I want to be clear. I want to make sure I get the exact facts of what happened. But the broader point you're making is something I feel very strongly about. There's not clear enough, strong enough consequences in the law for drivers who hurt their fellow New Yorkers or even killed their fellow New Yorkers. The law is still, I'm talking all law, city, state, federal, everywhere. It's still too deferential to the automobile and the automobile driver. And especially if someone's under the influence and they harm someone, there needs to be real penalties for that. So I don't know the specifics, and I'll find out right away. And if something wasn't handled right here, we'll obviously make sure that that's addressed immediately. But I think the bigger point is, I think we need stronger laws, harsher penalties, honestly. And it's something I've worked on with the NYPD. I want to see the NYPD constantly improve its enforcement and follow through. There's been a lot of good work by NYPD to make Vision Zero come alive. It never would have worked without NYPD, but there's still more that we can do to tighten up enforcement. I'm quite clear about that. Go ahead. Do you have Abu back?
We're going to go back to Abu.
Hi, how are you?
Good, Abu.
Okay, sorry that it was interrupted. So my question is, the South Asian community, their involvement, the COVID is increasing. Every mosque, yes, I'm, hello?
Yeah, Abu, you're skipping in and out, but keep talking. Let's see if we can hear you.
Yeah. Hello, did you hear me?
Yeah, keep talking.
Okay, yeah, so there is every Friday, the mosque has a lot of congregation, the Muslim community, they're coming in the mosque, they are praying. So do you have any kind of guidelines for them? That because of increasing the disease, and when the people are coming to the mosque, and some people they're expressing their concern. Do you have any suggestion for them?
Yeah, it's a very important question. Thank you. I'll turn to Dr. Choksi, but just say everyone needs to be mindful about the precautions we have to take. especially indoors, especially in colder weather where more people are indoors. And it all begins with the use of masks, especially. This is such a crucial piece of the equation. But I want you to reflect on what Dr. Choksi said today, that if someone is older or has those pre-existing conditions, being really, really careful not to do anything they don't have to do. And if they can worship at home or worship separately, there's so many virtues in that. So Dr. Choksi, you want to speak to that?
Thanks, Mr. Mayor. I think you covered the major points. I'll just add a couple. First, I want to acknowledge that COVID-19 has affected.
We want to take a quick 2-minute break here for you on News Now from Fox. Looking like the Joe Biden event is about to begin, so we want to slide another break in there right here on News Now from Fox.
Many people of South Asian descent. Part of this is related to the topic of this morning, which is that COVID-19 has more severe effects on people who have chronic conditions. Diabetes, heart disease, high blood pressure. These are things that we know occur more frequently among South Asians as well. And that's why it is so important to follow the precautions that we've been talking about. I'll just reiterate the ones that are the most important. Wearing your mask at all times, particularly indoors. If you do choose to worship in a mosque or a temple, it's important to keep your mask on when you're doing that. It's also very important to maintain 6 feet of distance and practice good hand hygiene. And then most importantly, for people to stay home if they're not feeling well, because that is how we know this virus spreads among people.
Go ahead, Abu.
And second question is, the president said the vaccine could distribute by December, but as he mentioned that the New York will not get the vaccine because of his kind of reservation. Do you think it's going to be an impact on the New York state and city people, the president, because of the president decision?
Abu, it's a really important.
And News Now from Fox, always bringing you the live feeds as they're happening worldwide here for you on News Now from Fox. We're going to go out now to Wilmington, Delaware. Joe Biden about to announce more cabinet picks for himself.
Family and friends, apart from many we loved, but I hope you had a good Thanksgiving. And I know times are tough, but I want you to know that help is on the way. Last week, I announced the nominations and staff for critical foreign policy and national security positions, a first-rate team that's going to keep us safe and secure. And today, I have the pleasure of announcing key nominations and appointments for the critical economic positions in the administration. A first-rate team that's going to get us through this ongoing economic crisis and help us build the economy back, not just build it back, but build it back better than it was before. A team that's tested and experienced. It includes groundbreaking Americans who come from different backgrounds, but who share my core vision for economic relief here in the United States of America. And given a fair shot and an equal chance, there's nothing, we all believe there's nothing beyond the capacity of the American people. Let's not forget who built this country. Working class and middle class people built this country, and unions built the middle class. And from the most unequal economic and job crisis in modern history, we can build a new American economy that works for all Americans, not just some, all. We need to act now, though, and we need to work together. You know, in the weeks since winning the election, Vice President Harris and I have covered meetings with a number of people. We convened meetings with labor leaders and CEOs at the same time, mayors and governors of both political parties. There's a consensus out there that as we battle the COVID-19 disease, we have to make sure that business and workers have the tools, resources, and guidance, and the health and safety standards to be able to operate safely. The goal is simple: to keep businesses and schools open safely. And for millions of Americans who have lost their jobs or hours and have had to claim unemployment, we have to deliver them immediate relief. That includes affordable health care for millions of people who have lost it, and are in danger of losing it. Child care, sick leave, family leave, so workers don't have to choose between work and family. Relief from rent and student loans. We need to support small businesses and entrepreneurs who form the backbone of the communities that we live in, that are teetering on the edge. You know, there's an urgent need to fund state and cities so the frontline workers on those jobs can stay in the jobs. You know, the founders are pretty smart. I could have gotten this lesson from the future Secretary of the Treasury. You know, there's a reason why all the states and localities have to have a balanced budget, but we're allowed federally to run a deficit in order to deal with crises and emergencies as we have in the past. And we have to keep vital public services running. We have to give aid to local and state governments to make sure they can have law enforcement officers, firefighters, educators, as we did in the Recovery Act of 2009. And right now, the full Congress should come together and pass a robust package for relief to address these urgent needs. But any package passed in a lame duck session is likely to be at best just a start. My transition team is already working on what I'll put forward in the next Congress to address the multiple crises we're facing, especially our economic and COVID crises. And the team I'm announcing today will play a critical role in shaping our plan for action starting on day one and move fast to revive this economy. They're going to help me help the country lay out my Build Back Better plan, a plan that an independent analysis from Moody's, a well-respected Wall Street firm, projected would create 18.6 million jobs. It's based on a simple proposition: reward hard work in America, not wealth. It's time to invest in infrastructure, clean energy, climate change, manufacturing, and so much more that will create millions of good-paying jobs. And it's time we address the structural inequities in our economy that this pandemic has laid bare. Economists call this current economy in recovery K-shaped. Well, like the two lines coming off of a K, some people are seeing their prospects soar upward, while others are watching their economic prospects drop sharply. For those at the top, jobs have come back and their wealth is rising. For example, luxury home sales are up over 40% compared to last year. But for those in the middle and the bottom, it's a downward slide. They're left figuring out how to pay the bills and put food on the table. Almost 1 in every 6 renters was behind in rent payments as of October. Let me be clear. With this team and others, we'll add in the weeks ahead that we're going to create a recovery for everybody, for all. We're going to get this economy moving again. We're going to create jobs, raise incomes, reduce drug prices, advance racial equity across the economy, and restore the backbone of this country, the middle class. Our message to everybody struggling right now is this: help is on the way. My dad, you've heard me say this before, when he lost his job in Scranton when I was a kid, and we eventually moved the family not far from here, Claymont, Delaware, just in the outskirts of Wilmington. He used to say, Joey, a job is about a lot more than a paycheck. It's about your dignity. It's about respect, your place in the community. It's about being able to look your kid in the eye and say, honey, it's going to be okay, and mean it. He also used to say, Joey, I don't expect the government to solve my problems, but I do expect them to understand my problems. This team understands. For Secretary of Treasury, I am really pleased to be able to nominate Janet Yellen. No one is better prepared to deal with these crises. I wish it weren't as much of a crisis, future Secretary. But she'll be the first Treasury Secretary who was also Chair of the Federal Reserve, Vice Chair of the Federal Reserve, and Chair of the President's Council of Economic Advisors. Janet is one of the most important economic thinkers of our time. She has spent her career focused on employment and the dignity of work, which is really important to me and to all of us. She understands what it means to people and their communities when they have good, decent jobs. Respect across being looked at by their neighbors and being respected. It matters a lot to them. And respected across party lines and around the world by Main Street and Wall Street. An educator, a mentor, above all, the daughter of a working class Brooklyn neighborhood who never forgot where she came from. Her husband, George, is pretty good too. He's won a Nobel Prize, but he's the one that married up. Jan will be the first woman to hold this office. We might have to ask Lin-Manuel Miranda, who wrote the musical about the first Secretary of Treasury, Hamilton, to write another musical about the first woman Secretary of the Treasury, Yellen. So that's what I'm working on right now, Janet. For Director of Office of Managing the Budget, I nominate Neera Tanden. You know, I've known Neera a long time, a brilliant policy mind with critical practical experience across government. She was raised by a single mom on food stamps, an immigrant from India who struggled, worked hard, and did everything she could for her daughter to live out the American dream. And Neera did just that. She understands the struggles that millions of Americans are facing, and she'll be the first woman of color from South Asia, and I think that to lead OMB. We also have another one of those women as Vice President of the United States of America. And so look, all being very serious, she'll be in charge of laying out the budget that will help us control the virus and deal with the economic crisis and build back better. But above all, she believes what I believe. A budget should reflect our values. Again, quoting my dad, for real, my dad's people would say, Joe, let me tell you what I value. And he'd look at them as a high school educated guy, very well read. And he'd look at me and say, don't tell me what you value, show me your budget, I'll tell you what you value. That's what you're going to do for us, Mayor. As Deputy Secretary of Treasury, I nominate Wally Adierno. Wally is, you know, Wally, I don't know. I tell you what, Senator Warren really likes you. She highly recommended you, but I wasn't sure she worried I stole you as well. But thank you for being willing to do this, Wally. A skilled leader and thinker on issues ranging from macroeconomics to consumer protection and from national security to international affairs. I've worked with Wally during the Great Recession. That was my excuse to the senators, saying that's why I wanted to steal you. And I saw him tackle one big job after another. Deputy National Security Advisor to President Obama, Deputy Director for the National Economic Council, former Chief of Staff to Elizabeth Warren, where he helped create the Consumer Protection Bureau and Financial Bureau, which has done so much good. It's designed to protect consumers and working people from unfair, deceptive, and abusive financial practices. And now Wally will be the first African-American ever to hold this post and the highest ranking African-American in the Treasury Department's history. An immigrant from Nigeria, the son of a nurse and an elementary school principal. Wally understands everything we do is basically for the people, for families, hard-working people, to understand their struggles and most of all their dreams, and he understands both. And I want to thank you, Wally, for being willing to do this. For chairperson of the Council of Economic Advisors, I nominate, notwithstanding she was a very distinguished professor at Princeton. I joke, my children who went to Penn used to always kid about, you know, but Cecilia C.C. Rouse, one of the most distinguished economists in the country, an expert on labor economics and race, poverty, and education, dean of the Princeton School of Public and International Affairs, a member of the Council of Economic Advisors to President Obama, an advisor to President Clinton at the National Economic Council. More than that, she's a proud daughter whose mom, a school psychologist, encouraged her to pursue economics. And her dad, one of the country's first African-American astrophysicists who dared her to dream. She's done both. If confirmed, Cece will be the fourth woman to lead the Council of National Economic Advisors and the first African-American ever to hold that post. And as CEA chair, she'll serve as a member of my cabinet as well. As a member of the Council of Economic Advisors, we also appoint Jared Bernstein, an old friend who's been with me a long time, a brilliant thinker, a quick wit, with a heart as big as his head, and a heart he got from his mom, an educator who raised him correctly. A social worker turned economist, Jared is one of my closest economic advisors and friend. He served as my chief economist during the vice presidency. He was there in that foxhole during the Great Recession, with the economy on the brink and our country on our back. I couldn't think of anyone else who I'd want to be at my side to face the challenges ahead. Jared will be one of the leading voices of my administration on economic policy. I can always count on him to deliver straight from the shoulder, as his hero FDR used to say, straight from the shoulder. The one thing I can assure you is working people will always have a voice with Jared in this council. As a member of the Council of Economic Advisors, I appoint Heather Bousset. Heather, thank you for all the help you had in the transition team and getting me here. She's one of the foremost economists working to make sure we build an economy that works for all Americans. The daughter of a union family, it's no wonder she believes so deeply in the idea that leave no one out, leave no one behind in this economy. During the campaign, I relied on our counsel on addressing structural inequities within the economy. And I'll do so again as president because that's one of the central issues of our time. To this team, thank you for accepting the call to serve again. To your families and thank them for their sacrifices because it's real sacrifice. We could not do this without you. And to the American people, this team will always be there for you and your families. This is family-oriented team. We got to make sure ordinary people get a chance to do well because when given a chance, they've never, ever, ever, ever let the country down. 11 years ago, President Obama and I entered office during the Great Recession and implemented the Recovery Act that saved us from a Great Depression. I didn't see the map of America at the time, nor did he, in terms of blue states and red states. We only saw the United States of America. We worked with everyone, for everyone, and we recovered and rebuilt together as one nation. Vice President Harris and I will do that all over again with an outstanding team. They're ready on day one. And to the United States Senate, I hope these outstanding nominees will receive a prompt hearing and that we will be able to work across the aisle in good faith and move forward as one country. So let's begin the work to heal, to unite, to rebuild an economy for all Americans. They deserve and expect nothing less. Thank you. May God bless you, and may God protect our troops. I now turn this over to the new team, starting with our next Secretary of Treasury, Janet Yellen. Again, Janet, thanks for accepting. Appreciate it. I think they're going to clean this off for us here.
While we have this moment, we will be taking a quick 2-minute break here for you on News Now from Fox.
No, I put it in my book.
Thank you, Mr. President-elect and Madam Vice President-elect. It's my great honor to have this opportunity to serve you and the American people and to join this incredible economic team at this moment of great challenge for our country. Mr. President-elect, when you reflect on what your father taught you about how a job is much more than a paycheck, I hear my own father, who raised our family in working-class Brooklyn. When he graduated from medical school during the Great Depression, he looked for a home and a place to hang his shingle near the Brooklyn docks. Back then, Bush Terminal on the Upper New York Bay was a thriving hub for manufacturing and transportation, and for the union workers whose livelihoods depended on them. Knowing they didn't have cars, my father found a home near a bus line. He started his family practice in the basement while we lived on the floors above. At the end of the day, he would talk to me, my brother, and my mom about what work meant to his patients, our friends and neighbors, especially if they lost a job, the financial problems, the family problems, the health problems, the loss of dignity and self-worth. The value of work always stuck with me, so much so that I became an economist because I was concerned about the toll of unemployment on people, families, and communities. And I've spent my career trying to make sure people can work and achieve the dignity and self-worth that comes with it. Mr. President-elect, I know you've done the same. I saw that understanding during the last Great Recession and the Recovery Act that followed. And now we're facing historic crises again. The pandemic and economic fallout that together have caused so much damage for so many and have had a disproportionate impact on the most vulnerable among us. Lost lives, lost jobs, small businesses struggling to stay alive or closed for good. So many people struggling to put food on the table and pay bills and rent. It's an American tragedy, and it's essential that we move with urgency. Inaction will produce a self-reinforcing downturn, causing yet more devastation. And we risk missing the obligation to address deeper structural problems, inequality, stagnant wages, especially for workers who lack a college education, communities that have seen industry disappear with no good jobs replacing lost ones, racial disparities in pay, job opportunities, housing, food security, and small business lending that deny wealth building to communities of color, gender disparities that keep women out of the workforce and keep our economy from running at full force. It's a convergence of tragedies that is not only economically unsustainable, but one that betrays our commitment to giving every American an equal chance to get ahead. But I know this team will never give up that commitment. As you've said before, Mr. President-elect, out of our collective pain as a nation, we will find collective purpose to control the pandemic and build our economy back better than before, to rebuild our infrastructure and create better jobs, to invest in our workforce, to advance racial equity and make sure the economic recovery includes everyone, to address the climate crisis with American ingenuity and American jobs, working together with the outstanding national security and foreign policy team you announced last week to help restore America's global leadership. And above all, we share your belief in the American dream of a society where each person with effort can rise to their potential and dream even bigger for their children. I pledge, as Treasury Secretary, to work every day towards rebuilding that dream for all Americans. And to the great public servants of the Treasury Department, I look forward to working with you and Wally to rebuild the public trust. To the American people, we will be an institution that wakes up every morning thinking about you, your jobs, your paychecks, your struggles, your hopes, your dignity, and your limitless potential. Thank you.
We will be taking a quick 2-minute break right here for you on News Now from Fox.
Mr. President-elect, Madam Vice President-elect, I'm humbled and honored by the trust you've placed in me to work with this talented team on behalf of the American people. I'm especially proud to work alongside leaders who understand that budgets are not abstractions. They are a reflection of our values. They touch our lives in profound ways, and sometimes they make all the difference. Like the Vice President-elect's mother, Shyamala, my mother, Maya, was born in India. Like so many millions across every generation, she came to America to pursue a better life. I was raised in a suburb of Boston, a middle-class kid. But when I was 5, my parents got divorced, and my mom was left on her own with 2 young children and without a job. She faced a choice: return to India, where at a time divorce was stigmatized and the opportunities for her and her children would be limited, or keep fighting for her American dream. She stayed, and America came through for her when times were tough. We relied on food stamps to eat. We relied on Section 8 housing vouchers to pay the rent. We relied on the social safety net to get back on our feet. This country gave her a fair shot to reach the middle class, and she made it work. She got a job as a travel agent, and before long, she was able to buy us our own home in Bedford, Massachusetts, and eventually see her children off to college and beyond. I'm here today thanks to my mother's grit, but also thanks to a country that had faith in us, that invested in her humanity and in our dreams. I'm here today because of social programs, because of budgetary choices, because of a government that saw my mother's dignity and gave her a chance. Now it is my profound honor to help shape those budgets and programs to keep lifting Americans up, to pull families back from the brink, to give everybody the fair chance my mom got, and that every single person deserves. That's the America Maya and Shyamala were drawn to. The America the President-elect and Vice President-elect are ready to grow. I believe so strongly that our government is meant to serve all the American people, Republicans, Democrats, and independents alike, all of whom deserve to know their government has their back. I look forward to working together alongside the dedicated career professionals of the OMB to expand possibilities for every American family. And I want to thank my own wonderful family, my husband, Ben, without whose love and support I would simply not be here, and our children, Alina and Jaden. Thank you all for this profound opportunity to serve.
Mr. President-elect, Madam Vice President-elect, thank you for this profound opportunity to return to the Treasury Department and serve the American people. I know firsthand the President-elect's capacity to lift our country out of hard times because I had the privilege of working with him to help Americans recover from the Great Recession. In California's Inland Empire, where I'd grown up in a working-class neighborhood, the Great Recession hit us hard. We were one of the foreclosure capitals in the United States. The pain of this was real for me. It wasn't just numbers in a report or stories on the nightly news, but neighbors and friends who lost everything. I was proud of the work I got to do at the Consumer Financial Protection Bureau, protecting American consumers, and at the Treasury Department, helping to grow the U.S. economy. I was proud also of getting a chance to serve with leaders like the President-elect, who oversaw the Recovery Act's implementation, investing in American workers, betting on their resilience and drive, and giving families a chance to get up off the mat. I believe that's what public service is all about at its best. Giving people a fair shot when they need it most, offering hope through the dark times, and making sure that our economy works not just for the wealthy, but for the hardworking people who make it run. Those are the lessons I learned from my parents, an elementary school principal and a nurse who came to America to build a better life for me and my siblings. They taught us that we have a responsibility to serve our community and the country that gave us so many opportunities. But I also learned early on how much more needs to be done to ensure that everyone has a fair chance they deserve. I look forward to working with Janet Yellen to reduce inequality in this country and expand the middle class and make sure that we build an economy that works for everyone. And as we build back better, we must also remain laser focused on the Treasury Department's critical role protecting our national security. This includes using our sanctions regime to hold bad actors accountable, dismantling the financial networks of terrorist organizations and others who seek to do us harm, and ensuring our foreign investment policy protects America's national security interest. The challenges before us today are unlike anything we have ever faced. But I know that what the President-elect so often reminds us of is true. The American people can do anything when given a chance. And I'm honored to be a part of this talented team and to work with them and all the American people to build an economy that gives everyone that chance and turns our nation once again from crisis to hope. Thank you.
Good afternoon, Mr. President-elect, Madam Vice President-elect. Thank you for this extraordinary opportunity to join this team. I'm humbled and honored and ready to get to work for the American people. To be perfectly honest, until recently, I did not anticipate I would return to public service. As every academic knows, when you've laid down roots at a school you love, with incredible students and colleagues you've grown with, it isn't easy to take a leave. It requires a rare combination of urgency and opportunity to pull you away. But that rare combination is precisely what our nation is facing right now. My path as an economist began in my first year of college. My mother, the school psychologist, encouraged me to take a course in economics. And it happened to coincide with what at the time was one of the worst spikes in unemployment since the Great Depression. It was impossible for me to separate what we were learning in the classroom from what I know was going on in towns across the country. And so I found myself drawn to the study of the labor market in all of its dimensions. The reasons that jobs disappear, the impact of education on people's job prospects, and the ways we can tear down barriers to job growth and make it easier for people to find long-lasting economic security. Today, nearly 40 years later, we are once again living through one of the worst job crises since the Great Depression. Millions of families have had their lives turned upside down. The safety net has frayed, leaving vulnerable Americans to slip through into hardship and hopelessness. And importantly, structural inequities that have always existed in our economy are being exacerbated like never before. This is a moment of urgency and opportunity, unlike any we faced in modern times. The urgency of ending a devastating crisis and the opportunity to build a better economy in its wake. An economy that works for everyone, brings fulfilling job opportunities, and leaves no one to fall through the cracks. I look forward to working with the President-elect and Vice President-elect and this amazing entire economic team to address that urgency and seize that opportunity and make our economic system work better for every American. Thank you.
Good afternoon. I'm hard-pressed to find the words to express my gratitude to the President-elect and Vice President-elect for the chance to be here today. In thinking about the path that brought me here, a good place to start is 12 years ago, almost to the day, when I met with then Vice President-elect Biden at his home not far from here. It was supposed to be a job interview to be his chief economist, but it quickly turned into a conversation about economic justice and fairness, which, as many here know, is a common destination in conversations with the President-elect. Over the years, we've continued that discussion. Often it takes the form of some policy minutiae. Sometimes it's me hitting him with far more graphics than are necessary, or him telling me to stop speaking economese and start speaking English. Guilty as charged, Mr. President-elect. I suspect the reason we had such a meeting of the minds back then dates back to a common saying in my household when I was growing up. If you're not part of the solution, you're part of the problem. I grew up with a single mother, a lifelong educator. There was a picture of FDR on the wall. Her proudest moment wasn't when I got a PhD, it was when I got a union card. Local 802, the New York City's musicians union, but that's a whole other story. Of course, if you intend to be part of the solution, you need to accurately diagnose the problem. In that regard, I think the President and Vice President-elect's agenda is timely, resonant, and visionary. Yes, they've stressed the urgent need to control the virus and provide the relief needed to help families and businesses get to the other side of this crisis. But they've been just as adamant that simply getting back to where we were sets the bar too low. We must build back an economy that's far more resilient, far more fair, and far more inclusive. It is precisely the vision this nation needs, and I suspect I'm not the only person on this stage chomping at the bit to get to work on making their vision a reality. Thank you. Oh, yeah.
Mr. President-elect and Madam Vice President-elect, I am honored and very grateful for the chance to be a part of this absolutely exceptional team and excited to get to work helping build an economy rooted in the values that we share: equality, opportunity, and the dignity of work. It's no accident that I've focused my career on instilling those values in our economy, developing policies that help our nation grow stronger by growing more equitably. Like the President-elect and the Vice President-elect, those values were instilled in me at a young age. In the late 1970s, my dad got a job at Boeing. And if you grew up in Seattle like I did, you know what that means. A lot more than a paycheck, as Janet referenced, and as the President so often reminds us. And for our family, my dad's job at Boeing meant security. It meant union benefits, a place in the neighborhood, a place in the middle class. But when the recession hit in the early 1980s, one by one, the pink slips arrived for every family in our cul-de-sac. Every kid at my bus stop had a parent who was laid off. Our entire community saw its future dimmed, and one by one, it was my turn. So the first time I truly experienced this thing called the economy, it was my parents sitting down and explaining that things were going to be tougher for a while because my dad was on layoff. Too many kids in America experience the economy through those kinds of difficult conversations, or far worse. I was struck by the profound power this mysterious force held over my life, my friends, and my community. And I wondered if that power couldn't also be wielded to create happier conversations and fuller lives. I've dedicated my career to figuring out how we can grow and sustain the middle class and uproot the gender barriers and racial barriers that leave too many Americans outside the dream looking in. Through the organization I co-founded, I've pursued solutions to reverse the dangerous march of inequality and bring us back to the core value of broadly shared success. That's the same value I see at the heart of the Build Back Better plan, and why I'm so excited and honored to help this team bring not just good jobs, but the good lives and peace of mind that comes with them to every American community. Thank you.
Mr. President-elect, congratulations on choosing this outstanding team of brilliant minds, this economic team. This is the right team for this moment. And to our nominees and appointees, thank you for your continued service to our nation. This is the team we need to deliver immediate economic relief to the American people, to get our economy back on track, and to make sure it works for working people. And as President-elect Biden noted earlier, completing that task could not be more urgent. Cases of COVID-19 are spiking, and beyond the tragic loss of life, the toll of this recession continues to mount. Across America, 1 in 6 adults with children say their families are hungry. Janet Yellen talked about food insecurity. This is real. We are looking at a hunger crisis in America right now. 1 in 3 adults are having trouble paying their bills, essential bills, the bills that need to be paid at the end of every month to get to the next month. And the number of open small businesses has fallen by nearly 30% due to this pandemic, while many others are hoping they can stay afloat until a vaccine is available. These are the struggles, the worries that keep people up in the middle of the night, that have them sitting at their kitchen table past midnight, trying to figure out how they're going to make it work. But Americans are not united by their worries alone. They are also united by their aspirations, the aspirations they have for themselves, for their children, for their families, and for their community. Because no matter where you live or what language your grandmother speaks, everyone wants to be able to get a job and keep a job. No matter what your gender or who you love, everyone wants to be able to buy a home and keep a home. And no matter how you worship or who you voted for in this election, everyone wants to be able to give their children a decent education and allow those children to pursue their dreams, even during a pandemic. And Joe and I understand that. We were raised to respect the dignity of work. We were raised by hardworking parents who always understood the dignity of work and the potential not only for their children, but of our country. And that's why I've always fought for working people, standing up for middle-class families who'd lost their homes in the Great Recession. Wally, you talked about that. Families in California were devastated, but they were able to rely on their government and the leaders, as Joe always talks about, who needed to see their condition and speak to that condition. And that's the work that needs to happen now. And I look forward to collaborating with this extraordinary team to put working people front and center in our administration. These public servants are some of America's most brilliant minds. They are proven leaders whose talents, achievements, and life stories, their life stories reflect the stories of the American people, and their stories reflect the very best of our country. And they not only have the experience, the expertise, and what is necessary to help end this economic crisis, but also what is necessary to put people back to work. And they also share in our commitment to building an economy and America where everyone has access to a higher minimum wage and affordable health care, paid family leave and paid sick leave, home ownership, and capital to start a small business. An America where opportunity is within reach for everyone, for all the people. So we've got a lot of work to do to build that America. And as Joe always says, to build back better. And President-elect Biden and I, together with this economic team, will be ready to hit the ground running on day one, because that is what this crisis demands, and that is what the American people deserve. Thank you.
See if Joe Biden takes any questions here on this transition process where he has announced, well, the big one, obviously, the U.S. Treasury Secretary Janet Yellen as the nominee there, and doesn't look like any questions will be happening here. So you are watching News Now from Fox, always bringing you the live events as they are happening and in their entirety. We showed that event from the very beginning all the way until the end. Live look right now. Talking about the economy, let's look right now at how the Dow is doing. Just under 30,000 right there, getting close to about 300 points up for the day in the green. We'll continue to monitor that here for you on News Now from Fox. We're going to take a short commercial break right here on News Now from Fox. Stay with us right here. Before we go, I got to take you out to D.C. area. Look at that. Oh, yes. Winter is definitely here. It's a white Christmas already shaping up for the D.C. area. Take a look at that there as we are just now 24 days away from Christmas. Hard to believe that we're already in December, but if you're thinking about it, I know a lot of you want this 2020 to be over and on to the next year. You're watching News Now from Fox here. Let's continue our coverage here after this 2-minute break. And right now, we will be going out to Dr. Mike with the very latest with the COVID-19 pandemic.
Good morning, Dr. Mike Sirigliano joining us from Penn Medicine today. How are you, Doc?
Very well, Paul.
The FDA leader has been summoned to the White House for a meeting today. The reporting is that he's being asked why the Pfizer vaccine hasn't won emergency use authorization yet. But this is a bit of a balancing act, right? They want to make sure that the vaccine has been fully vetted. But you also want to assure people that it's safe, right?
There's no question, Paul, that we need to make sure that all of the proper procedures are being followed so that, one, we have a safe and effective vaccine, and two, that the public is aware that everything has been done according to protocol. So we don't want to rush anything and then have problems later. So I am all in favor of being cautious, careful, and following every detail. In other words, we want to dot the I's and cross the T's. That's the bottom line.
What are you hearing from your patients about their willingness to take a vaccine?
There's a lot of angst about the vaccine, but I can tell you for a fact that I'm also getting 1 million calls a day about when they can get the vaccine. So I think that you're going to see over time people really buying into the fact that this is the only way we're going to get out from under the rock of COVID-19. Vaccination has been proven to be the most effective public health maneuver that there is. There are some people that will just never buy into it, but you want to go it alone? I always say America is the land of the free and home of the brave. I personally am going to get the vaccine.
What do we know about potential side effects of the vaccine candidates that are out there right now?
Just about every vaccine, Paul, that I give to people, whether it be a flu shot or a shingles shot, has the potential for muscle aches, low-grade temperature. You might feel like you have the flu. There are some that cause more side effects than others. One is the shingles shot that I give to people, and it can really kick your butt for 12 hours or so. It can make you feel like you have a low-grade temp, have the flu, muscle aches, but it goes away. And the bottom line is that is kind of the response that most people are going to get when they get this COVID-19 vaccine. I really believe that being a little bit punky, if you will, for a day is well worth the risk of getting COVID-19 and all of the risks associated with that. So I'll take a day where I'm not at my top of my game.
And it's good that health professionals would be open about this, because people are going to have to come back in most cases, like you've been saying for a long time, and most likely get a second shot, right?
Well, I teach medical students here at the University of Pennsylvania. It's all about transparency, how you discuss and present information. No one wants to hide anything. You need to be, you really need to disclose everything. You may not feel well. And if you do that, people accept it, they understand. And then when they do feel that way, there's no surprises. I don't like surprises, especially in what I do for a living.
In my own personal health portal yesterday, I got a message from my doctor's office about COVID-19 testing and where you should get it done if necessary. And a couple points stuck with me. The first was they were mentioning that you should not go to the ER unless you're seriously ill. Is that what you're seeing at your practice and at your hospital? Are people showing up at the ER or calling you who want to get tested but aren't seriously ill?
Paul, basically the way it has been working out with my office, if someone calls, they don't just walk in. We don't encourage that at all. If someone calls and says, hey, I'm concerned, I'm not feeling well, I feel sick, I have a sore throat, I can't taste or smell, then we will advocate that they get a test done. Now, we are very fortunate where I work that there is a location where you can drive through and get a PCR test, which is a very accurate test. Now, if that test comes back positive, then what happens is the patients are quarantined at home for 14 days. Now, that may change down the road, but for now, it's still 14 days. What I tell people to do, and I've been telling people to do this since the very beginning, go buy a little device called a pulse oximeter. It goes on your finger and it measures your oxygen levels. If you do that and you stay home and you take Tylenol, rest, chicken soup, you generally will be okay. But if you get worse, especially about a week into your illness or your oxygen levels go down, then you need to call me back, and that is when you go to an emergency room. You don't go to an emergency room just to get tested. That's not the appropriate use of resources. So if you do those things, you protect everyone around you, you self-quarantine in your house, in a room, have people bring food to you, and that way you reduce the risk of spreading the virus.
Another thing I mentioned in my portal was to, if you've been exposed but are asymptomatic, that aren't experiencing any symptoms, to wait 5 to 7 days to, as this can help, and really you're getting tested at that point to help guide additional contacts that you may have had as to whether you were carrying the disease and were positive.
Many people, Paul, forget the fact that once you are exposed to COVID-19, there is a lag time, anywhere from 4 to 7 days, where the test may come back negative. So you need to give it a little bit of time. There's a little bit of a lag time after exposure for the test to become positive. And that's why we usually advocate people getting a test anywhere from 5 to 7 days after their contact or exposure. If you do that, you're more likely to get an accurate result. And then once you have those results, you can either be reassured that that contact did not result in you getting it, or if you're positive, you need to self-quarantine.
And in bold letters in my note, it mentioned that you cannot test your way out of the 14-day quarantine even if your COVID test is negative during this interval. Is that the way you've approached it as well?
If someone has had an exposure or they have symptoms, the bottom line is you need to be isolated from everyone else for up to 14 days. Now, there are some ways around that, and there's talk with the Centers for Disease Control that maybe after 7 days, after testing positive, perhaps if you test again, or if you weren't positive but had a contact, you can be tested in 7 days. And if you're negative, that may change things. But right now, the guidelines say 14 days.
I think this is a good conversation because I think coming off the holidays, a lot of people are, considering or are quarantining because they did travel or saw family or loved ones. Thank you very much again for coming on today, Doc. Can we have your daily tips for staying safe during the pandemic?
Well, Paul, we are very concerned about the next 7 to 14 days, given the fact that millions of people traveled either by air or by car and visited friends and family. We need to socially distance. We need to wear masks. And if you have any symptoms or concerns, whether you had a contact, reach out to your healthcare provider, get the appropriate treatment and testing so that we don't cause the spread to continue. That's the bottom line.
Thank you, Doc. We appreciate you and all the healthcare professionals guiding us through this. Have a great day.
You too. You as well, Paul.
And we continue to roll on here on News Now from Fox. Looks like we're going to have a busy next hour here, and we want you all to continue to watch here with us on News Now from Fox, always taking these live events. So let's show you right now. This is Live Look in Chicago. About to get an update there from health officials as they are going to be announcing possibly new COVID-19 travel quarantine orders and also release new details on how the vaccine will be rolled out locally there in Chicago once that gets going. So we'll be keeping an eye on that for you. And then also expected a Pennsylvania update pretty soon right here on News Now from Fox. You can always check us out at newsnowfox.com. And we continue to roll on here. Also going to be looking for a Senate Majority Leader Mitch McConnell news conference. So we got you all lined up here, ready to go on News Now from Fox. And it looks like we could be getting this one just popped up. And like I've been telling you, we take the feeds as they come into us. And I just saw this one pop up. Looks like we'll be getting some sort of update from the CDC in just a little bit on the committee there on immunization practices. So we got a full lineup here in the next hour. Everybody, don't go anywhere. News Now from Fox, always taking these live events as they're happening worldwide. And if I had to guess, well, there we go. Pennsylvania is starting up. I was going to say, we're going to take the first one that goes live. So let's go to Pennsylvania right now, getting that update.
More concerning than that alone, we continue to see the number of Pennsylvanians hospitalized increase every day, and we see the number of Pennsylvanians in intensive care increase. Both of those things are cause for real concern in Pennsylvania. Every day COVID continues to spread, and every day our numbers continue to rise, and that puts our healthcare system at risk, and it puts our healthcare workers at risk. To help stop the spread, we today are going to be announcing a new testing strategy in the Commonwealth of Pennsylvania, and one that we hope is going to help improve access to testing for Pennsylvanians in every part of the state. The Department of Health has expanded its contract with AMI, Expeditionary Healthcare, to deploy 5 regional testing strike teams throughout Pennsylvania over the next 12 weeks. The strike teams will provide testing services to residents of 61 of the 67 counties who do not have their own health service, their own county health department. And Pennsylvania is pleased to be able to partner with AMI to provide additional testing resources for regions of the state experiencing COVID outbreaks. So starting tomorrow, that's Wednesday, December 2nd, free testing will begin in 4 counties with recent rapid increases in COVID case numbers. And those counties are Bedford County, Mifflin County, Tioga County, and Northampton County. The 5th location will open in Butler County on Friday, December 4th, 3 days from now, December 4th, and the strike teams And all of these areas will move to new locations each week, and the most up-to-date information can be found as to where they're going to be in the Department of Health website. Again, I want to thank AMI and all of our testing partners for everything they are doing and that they do to keep Pennsylvanians safe and informed about our health. Our testing capabilities have come a long way, as you all know, over the past several months. And that's in large part in thanks to our testing partners like the Latino Connection, Quest Diagnostics, Walmart, Pennsylvania's county health departments, and all of our hospitals and health systems and community health centers, including our federally qualified health centers, the FQHCs, as well as the faith-based organizations involved with the faith-based testing initiative under the Department of Health's Office of Health Equity. All of these organizations have stepped up to help serve the people of Pennsylvania in a time of great need. When COVID first began to spread in the Commonwealth, you recall, last spring, we had an awful lot to learn about this virus. Until early March, there wasn't a COVID test widely available for use by health officials. And once an accurate test became available, there were all kinds of shortages of necessary testing supplies that further complicated efforts to swiftly ramp up our testing, our case investigations, our contact tracing. But we knew from the beginning that testing, case investigations, and contact tracing would be critical to protecting Pennsylvania, so we kept working at it. And that's why we dedicated so many resources to expanding our testing capacity throughout the summer and the fall. Our goal is to ensure that everyone who needs a test in Pennsylvania can get one. And while we will continue to explore ways to improve the process, I think it's probably important that we look back to see how far we've come. If you take the 3-month period between March and May of this year, we administered in that 3-month time period 67,000 tests, COVID tests. Right now, as of 1st of December, we're capable of doing nearly that many tests in one day. Since March, the Pennsylvania Department of Health has received nearly 6 million test results. And the average number of test results received per day over the last 30 days is more than 50,000. I think our biggest single day was around 70,000 tests. So testing is a critical tool in the fight against COVID, but we need to pair it with effective case investigations, contact tracing, and mitigation measures to prevent the spread of this virus. We need every Pennsylvanian who contracts COVID to cooperate with our public health professionals and contact tracers. It's one of the best ways for you to protect your friends, your neighbors, your family members, and to stop the spread in the community. And there are things every single one of us Pennsylvanians can do to stop this spread. It's essential that every Pennsylvanian take the threat of this virus seriously, and that we all, each and every one of us, follows mitigation measures. Those measures include simple things like wearing a mask, stay home when you don't have to go out, follow the travel restrictions, and we have restrictions on restaurants and businesses. All these are in place to stop this virus from hurting more Pennsylvanians and getting through this as quickly as we possibly can. Right now, what we can do is all unite to stop the spread of this virus. If we work together, if we follow mitigation measures, if we stay home whenever we can, if we wear masks whenever we have to leave our homes, we actually can stop the spread of this virus in our communities, and we can save lives. This holiday season, what a wonderful thing to do. Thank you very much, and now I'm going to turn this over to our testing director, Michael Huff, for more details on the expanding testing. Michael.
Thank you, Governor Wolf. Good afternoon, everyone. Every Tuesday, I brief you on the testing and contact tracing activities of the Commonwealth. We stress the importance of being tested when you have symptoms, have been identified as a contact, or are involved in a COVID-19 outbreak. As the governor has already indicated, today I would like to discuss Pennsylvania's expansion of testing for COVID-19. This was done through an extension of a contract with AMI Expeditionary Healthcare to provide COVID-19 testing in 5 health regions across Pennsylvania to help contain local spread of COVID-19. This expanded contract allows for 5 teams to provide regional testing in 60 counties over the next 12 weeks, with one of the 60 sites providing testing for 2 counties. The 6 counties not receiving testing from AMI have county health departments who are currently providing testing at their sites. This is all part of Pennsylvania's public health infrastructure testing that we talked about several times. It's utilizing the resources and leveraging the strengths of the federally qualified health centers, the county municipal health departments that account for 40% of Pennsylvania's population, as well as Pennsylvania Health's Department of Health's infrastructure of state health centers. When you think of AMI being a surrogate for the health centers to provide significant testing in those counties that are of greatest need. We've seen a rapid increase of positive case counts reaching record high levels, which gives us significant cause for concern. AMI has been a significant partner to the Department of Health by providing pop-up testing in counties with a high positivity rate and other factors contributing to outbreaks of COVID-19 across the Commonwealth. These testing sites are open to anyone who feels they need a test. The Department of Health will continue to deploy testing based on the number of total confirmed cases per 100,000 people in a county, as well as where outbreaks are currently happening. Increased testing will assist in determining the prevalence of the virus and assist the counties in moving forward. Counties of concern, identified as those with percent positives above 5%, can be found on the early warning monitoring dashboard. Each county is being monitored as the state continues to examine all available data. As the governor indicated, beginning tomorrow, Wednesday the 2nd, drive-through and indoor walk-in testing clinics will be held in the following counties: Bedford, Mifflin, Tioga, and Northampton, with Butler starting on Friday. Testing will be available daily from 9 to 6 p.m., 9 a.m. to 6 p.m., starting tomorrow, and go through Sunday, December 6th. And the testing site addresses can be found on the Department of Health's website. Anyone is welcome. No appointment is necessary. Patients are encouraged to bring a photo ID or insurance card for ID. Registration will also be completed on-site, and the turnaround time for testing results will be 2 to 7 days after testing. Up to 450 patients can be tested per day at each location on a first-come, first-served basis, and again, is completely free to all patients. The type of test we're using is the gold standard PCR test. It's done with a swab placed in the center of your nose, twirled a couple times, very simple. Patients must be aged 3 and older, and again, are not required to show symptoms of COVID-19 to be tested. However, it's important for everyone to know that even though you have no symptoms, you test positive, you must isolate to stop the spread of COVID-19. Remember, case investigation and contact tracing remain essential components of COVID-19 response and are a key strategy to interrupt disease transmission and reduce spread of the virus in a community. So after you're tested and you receive a call from the Department of Health, answer it. Participate in the conversation and help decrease the burden of COVID-19 in your area. As a reminder, COVID Alert PA, the exposure notification and resource app, is an important tool that you can use to join the fight against COVID-19. I encourage you to download that app and use it daily. To date, there have been over 340,000 downloads. Testing, contact tracing, isolation, quarantine, and other critical mitigation efforts, such as wear your mask, Wash your hands, social distance, avoid large groups, download the COVID-19 Alert app, and answer the call and participate in case investigations and contact tracing. And holiday gatherings with only your immediate family household members. These are all a bridge to get us over the next 6 to 8 weeks until a vaccine may be available. We can do this. As Governor Wolf says, COVID-19 is tough, but working together, Pennsylvanians are tougher. Governor Wolf and I will now take on topic-related questions. Thank you.
Thank you, Director Huff. Our first question is from Chris Mamula. Chris, go ahead and unmute yourself.
Hi, Director Huff. Thanks for being available today. Two easy questions. The first is there any reason why Juniata County was not included in the original rollout? And second is, will the new testing program replace the pop-up testing in the counties?
Thank you for those questions. Second question first. No, this AMI contract will not replace the pop-up. In the event we have a serious outbreak in an area where we need special attention, those pop-up testing sites will continue. In addition, I want to remind you that it's not just AMI testing sites that are available throughout Pennsylvania. As we've talked before, we have over 550 contracted sites currently, and with the new AMI contract, as well as the county municipal health departments and FQHCs, an additional 400. So there are other sites where Pennsylvania citizens may go get tested in the event they need to. Juniata County was not passed over. In terms of utilization, Juniata County and Mifflin County site will serve both of those areas.
Thank you.
Next up will be Seth Kaplan from ABC 27. Seth, go ahead and unmute yourself.
Hey, thanks so much. To Director Huff first, and then I've got one for the governor, if I may. I'm wondering whether the fall surge has exceeded even the expectations for the fall surge. I'm just asking because I saw 180 new deaths, and if you kind of go back and look at everybody's forecast, CDC, it seems like what we're seeing is just beyond anything that anybody expected. Could you provide a little perspective?
Yes, some of your question broke up, but I think I have the gist of it. We look at modeling from all over the country, and the modeling tells us what we might be able to anticipate or expect. Factored into this fall surge, obviously, has been the holiday travel, spending time in small groups, large groups, which again increases cases, and we won't see those cases probably for another week, maybe 10 days, and we'll see even greater spikes at that particular point in time. This is a very dangerous time not to use the mitigation efforts that we tell you. But are we surprised that it is worse than it is? This continues to demonstrate that we're not surprised at anything we see. And our job is to reinforce these strong mitigation efforts that we hope you will share with your constituents so that we can control this disease.
Next up is Jamie Martinez from Spotlight PA. And Jamie, go ahead and unmute yourself.
Hi, thank you. My question's for Governor Wolf. Thank you. Governor Wolf, back on November 23rd, the administration issued an order that set metrics for when hospitals have to scale back elective procedures. But back in March, at least one major health system decided to ignore a similar order for a time and do procedures anyway. So how will you be enforcing this order, and will there be any penalties if systems don't comply?
Yeah, we are working more closely with hospitals and health systems than we were back in March. And if you recall, back in March, we had a statewide ban on elective surgeries. Right now, what we have is a regional approach, and we are working with healthcare officials. And when it comes down to it, it's really something that they're going to enforce themselves first, because they have no incentive, either from a staffing point of view or from a facilities point of view, to let their healthcare system be overwhelmed. They've seen what's happened in other states, and in conversations with them, I am convinced that there is nobody with a greater incentive to make this work than the healthcare systems themselves. So we're working with them to make sure that we do this the right way. There is no one, most of all the healthcare systems, who want their facilities to be overwhelmed.
And if I may follow up, related to hospital staffing, if facilities find themselves struggling, as some already say they are based on people that I've spoken to in systems across the state, what state resources will be deployed to assist with staffing issues if they don't have doctors and nurses?
Well, I'll let maybe Michael can help with some of this, but it's not just state, but also federal resources, and hospitals will also help each other. So that we're working in terms of things like machinery, equipment. We can share that. In terms of personal protective equipment, we at the state have stockpiled between the beginning of the pandemic and now. We have a lot of things that we can share, so that we'll be helping out. The National Guard stands ready to help, and the federal government has programs that they brought up and that we made use of back in the spring phase of this pandemic that I'm pretty sure we'll be able to take advantage of moving forward if we have that need. Right now, the focus is on making sure the healthcare systems we have in place right now here in Pennsylvania don't get to the point of being overwhelmed. And we Pennsylvanians can do everything, a lot of things, to make sure that we prevent that from happening, simply by wearing a mask, simply by staying home when we don't have to go out. This is where what we do, each of us individually, makes a big difference in the overall outcome and the safety of our fellow Pennsylvanians.
Next up is Harry Lee from Fox 43. Harry, go ahead and unmute yourself.
Hi, can you hear me?
Yes.
I believe this is for Mr. Huff, actually. So I have two questions. One, how much is this contract for, and where's the money coming from? And also, when the vaccine arrives, would you consider transitioning these centers to administer vaccines?
Well, let me talk about the contract first. The Pennsylvania Department of Health receives federal dollars from the Epidemiology Laboratory Capacity Grant, and specific dollars have been allocated that are targeting testing. So that's where the money is from, and that's exactly what we will be doing to enhance our testing program. As far as vaccine, I can tell you that the Department of Health continues to plan, and as the landscape changes in terms of where the vaccine is going, what the vaccine is going to be targeted to, whom it's going to be targeted to, those plans will be, they're very nimble, and they will be completed and addressed to handle any of those. At this particular point in time, because ACEP is meeting even as we speak to determine priorities, we're not sure exactly who will be administering those doses.
Next up is Mike Rubinkamp from the Associated Press. Mike, go ahead and unmute yourself.
Director Huff, a question about contact tracing. You obviously have a huge number of cases to contend with, as well as testing delays, and you're only reaching a small fraction of the people who test positive. I believe it was 13% in the last reporting period. So I'm just wondering, at what point, does contact tracing become essentially useless, and is Pennsylvania at that point? Why or why not?
Thank you, Michael. Contact tracing is not useless. Our percent is currently is about 21%. And I would say to you, that's 21% of disease. that we're handling, and that we're providing education and isolation quarantine when necessary. The shortfall of case investigations and contact tracing has actually, the communication that we've provided and the assistance we've received from the media has actually demonstrated that many groups around Pennsylvania have actually reached out to us and said, we want to help. How can we help? So we continue to talk to those stakeholders, continue to talk to people who really want to be part of the solution. I can tell you, as I have before, the important thing is to have folks answer the phone and engage in a conversation with the Department of Health, and be able to kind of control this disease in their particular area, because this is their area, this is their home, this is their family and their neighbors that we're talking about. But we will not be giving up on contact tracing. We have done a good job of prioritizing to get the most bang out of it that we can, and it's working for us. And we will continue to refine the system. We will continue to modify anything we need to do so that we can control this disease. Thank you.
Mike, any follow-up?
Yeah, I mean, the 13% comes from your own numbers. That I think that was the percentage of people that you actually successfully reached of the positive cases. It was only 13%.
Michael, there's two numbers. There's a number. The first number is the ones that we reached within 24 hours, and then there's the one that we've reached within 48 hours. And my reference to 31 is adding those two together. But thank you.
Next up is Aaron McCarthy from the Philadelphia Inquirer. Aaron, go ahead and unmute yourself. Aaron, go ahead.
Can you hear me?
We've got you.
Okay, sorry. Thanks for taking the time, Michael. I have two questions. One is for you and the other is perhaps for you and Governor Wolf. My first question is, do the 61 counties to which strike teams will be deployed include Delaware County, which doesn't have its own health department, but is currently being run by the Chester County Health Department?
Yes, Aaron, it will. We're doing all, there is a state health center, Department of Health State Health Center in the city of Chester. So we'll obviously setting that up as well.
Okay, and my other question for you and Governor Wolf is, does the omission of counties with their own health departments indicate that the Commonwealth is satisfied with the number of testing sites and the accessibility of testing in places like Montgomery, Bucks, Chester, and Philadelphia counties? And can you kind of expound on how testing is going in those places, particularly in the southeastern portion of the state?
Certainly, Aaron. Let me start, and then I'll turn it over to Governor Wolf for any other comments. As you know, each of the county municipal health departments in the southeastern district of Pennsylvania have received funding from the Department of Health for the purposes of testing, the same type of funding that the Department of Health gets. Philadelphia, on the other hand, receives directly from CDC HHS. They receive their own ELC grant dollars per se. So we look at them somewhat separately, but I can tell you that they are doing the testing. The other county health departments that I'm talking about are key partners of the Department of Health in assuring that testing is made available. We work seamlessly with them to assure that this is done, and again, provide the funding so that they're able to accomplish the same success that we are. Thank you. Governor?
I think Michael answered your question, but just again, for the counties without their own health department, the State Department of Health is automatically the health department for those counties. So the reason it makes sense for us to be looking at those 61 counties first is because we are their health department.
And our last question this afternoon is from Crispin Haver from WGAC. Go ahead, Crispin.
Thank you, Governor Wolf. Governor, you and Dr. Levine have said for months the virus is doing the talking and it's what's driving your decisions. Well, the virus is doing a lot of talking the past few weeks with case numbers in the stratospheres, hospitalizations at a record pace, and deaths not far behind. Yet the state is only advocating right now for plugging holes, it seems. Well, I know no one wants to go back to what we saw with restrictions in the spring. Is the virus still doing the talking here, or is the political and public pressures driving the ship here? Because to me, just looking at the numbers, seeing the modeling that says we might run out of ICU beds in the state, it looks like if we keep trying to plug the holes, the ship is going to sink.
Yeah, no, good question. I think we have to keep in mind we're in a different place now than we were back in March. And so we're addressing this in a different way. We're no less anxious to do everything we can to defeat this virus, but we are in a different place. The vaccines actually, according to the vice president yesterday, should start being available sometime this month. We might have as many as millions of vaccines available in this country starting this month, December. And that's just going to increase exponentially as we move into the early months of 2021. So we're in a different place. We have more personal protective equipment. What we're doing right now is something we couldn't do as well back in April, back in March. And that is focus on the healthcare systems to make sure that in each area, each region of the state, they're doing everything they can. They have the capacity to respond. So as you recall, I came out last week with 3 criteria for getting hospitals, healthcare systems to reduce dramatically their elective surgery and elective healthcare. We didn't do anything with the kind. We did a broad-based, one-size-fits-all statewide ban on elective health procedures back in March and April. We're not doing that now. We are doing, I think, a much better job focusing on the elective care issue and the capacity issue. It's more focused, it's more laser-like, it's not as broad-based, not as draconian. Maybe that's what you're talking about, but it's every bit, we hope, is going to be every bit as successful. So the virus is still in charge. We're still fighting the virus. That's the enemy, and we're going to do everything, continue to do everything we can to fight that virus.
No follow-ups from me. Thank you.
Okay, thank you.
Thank you. That concludes today's press conference. A recording of this will be available through pacast.com.
We continue to roll on here for you on News Now from Fox. Stay right here with us. Some of you going to a 2-minute break. Now let's go out to the CDC doing this news conference on vaccines.
Of cases and 40% of deaths in the U.S., despite the fact that long-term care facility residents account for less than 1% of the U.S. population. The skilled nursing facility population is approximately 1.3 million, and as of November 15th, had experienced almost 500,000 confirmed and probable cases and more than 69,000 COVID-associated deaths. Assisted living facilities are home to approximately 800,000 residents across the nation. And although surveillance is less systematic for these types of facilities, 28,000 confirmed and suspected cases were reported over 28 states, and more than 5,000 deaths were reported over 20 states. This figure shows the proportion of COVID-19 associated hospitalized patients in the COVIDNet surveillance system who were admitted from a long-term care facility. As you can see, more than 30% of hospitalized patients aged 65 to 74 were admitted from a long-term care facility, and more than half of hospitalized patients, COVID patients, 75 and older, were admitted from a long-term care facility. Now let's review the implementation considerations. A Harris poll was completed in August, and survey respondents were asked which of the following groups should receive priority when a COVID-19 vaccine is available. Survey respondents most strongly supported early allocation of vaccine to healthcare workers and seniors. While not expected to exactly predict COVID-19 uptake, influenza vaccine among healthcare personnel may give us some indication of COVID-19 vaccine acceptance. Overall, influenza vaccine coverage is high among healthcare personnel, with the highest rates of uptake among hospital workers and lower rates among workers in the long-term care setting. Another early indication of long-term care facility acceptance of COVID-19 vaccination is the overwhelming response to the Pharmacy Partnership for Long-Term Care program. CDC is partnering with 2 national pharmacy chains to offer on-site COVID-19 vaccination services for residents and staff of skilled nursing facilities and assisted living facilities. To date, 99% of skilled nursing facilities nationwide have enrolled in this program. The program provides end-to-end management of COVID-19 vaccination process, including cold chain management, on-site vaccination, and fulfillment of reporting requirements. But even with the Pharmacy Partnership for Long-Term Care program, COVID-19 vaccination implementation and achieving high levels of coverage in the long-term setting will still be challenging. This slide is an example of a simulation of 1 and 2 dose coverage among skilled nursing facility residents over time. Even if acceptance is high and 3 vaccination visits are made, because of the high turnover, the proportion of current residents who are vaccinated decreases over time. The situation will improve, of course, when vaccine is readily available in the community and adults can be vaccinated prior to admission. Now on to ethics. Vaccinating healthcare personnel supports the principle of maximizing benefits and minimizing harms through what we are calling the multiplier effect. In other words, protection of healthcare personnel leads to preservation of healthcare capacity and better health outcomes for all. Vaccinating healthcare workers promotes justice because healthcare personnel put themselves at risk and will be essential to carry out the vaccination program. Vaccinating healthcare personnel also has the potential to mitigate health inequities because the group includes a broad range of occupations, inclusive of low-wage earners and racial and ethnic minority groups. Vaccinating long-term care residents maximizes benefits by directly preventing disease in a high-risk group and minimizes harms by potentially reducing the burden on hospitals. The Federal Pharmacy Partnership Program can promote justice by facilitating equal access to vaccine across most long-term care facilities. The program has the potential to mitigate health inequities by reaching long-term care facilities across the socioeconomic spectrum. In summary, the work group felt that early vaccination of both healthcare personnel and long-term care facility residents was strongly supported by science, implementation, and ethical considerations. Here are some additional important considerations the work group wanted to share for Phase 1A. What's presented here are interim guidance for Phase 1A. Allocation policy will need to be dynamic and adapt as new information, such as vaccine performance and supply and demand, become clear. To that end, we will need gating criteria to move expeditiously from one phase to the next as demand saturates. And it's important to keep in mind that following vaccination, measures to stop the spread of SARS-CoV-2, such as masks and social distancing, will still be needed. And ultimately, this interim allocation is a short-term measure. The U.S. government has stated its commitment to making COVID-19 vaccines available to all residents who want them as soon as possible. During the last ACIP meeting, there were a number of important issues raised, and we wanted to take this opportunity before the vote to provide some additional information on those issues. And to summarize, for healthcare personnel, ACIP members and liaisons expressed a need for guidance on sub-prioritization of healthcare personnel when vaccine supply is very limited in the beginning. To address vaccination in pregnant or lactating healthcare personnel, as well as how to approach expected reactogenicity following vaccination. For long-term care facility residents, ACIP members requested more information on consent and assent within the facilities and plans on interpretation of reactogenicity and safety monitoring in this specific population. So that concludes my comments for the moment, and I return the microphone back to Dr. Romero.
Thank you very much, Dr. Dooling, for that excellent presentation. We will now open it up to the voting members for questions regarding the presentation only, please. I see Dr. Atmar has his hand up.
I do. Thank you, Dr. Romero. Thank you, Dr. Dooling, for a very clear presentation. I have a question about the pharmacy partnership. One of the arguments for performing vaccination in long-term care facilities at the prior meeting was that both the healthcare personnel working in the unit or the facility and the residents could be vaccinated at the same time. Does the pharmacy partnership vaccinate healthcare personnel, or is it only for the residents? And if it's the latter, can you further address that question about a potential advantage? Thank you.
Thanks for that question. The Pharmacy Partnership for Long-Term Care will, in fact, vaccinate residents as well as staff in the facilities.
Before I take the next question, does anyone else have a comment or question to dovetail onto Dr. Atmar's? Okay. Dr. Fry, please.
Thank you. I don't know if this is a fair question to ask at this time. If not, just please tell me. But there was a slide earlier that looked at, I believe, 1 and 2 doses of vaccine. And I was wondering if we have any evidence for any kind of efficacy after administration of a single dose of vaccine at this time. Thank you.
We don't have any evidence right now, but that is one of the questions that we'll be asking of the phase 3 data once it becomes available.
Again, any comments or questions that tail with Dr. Fry's question?
This is Dr. Atmar. I have a brief follow-up on the same issue, but it doesn't relate to efficacy, but it relates to the challenge with the declining population and what the implementation plans would be to basically keep and complete vaccination in long-term care facilities. So it seems to be quite an implementation challenge. Over.
Thank you for that. I agree that it will be a challenge. The pharmacies that have signed up for this program have agreed to make 3 separate visits to the facility in order to vaccinate all persons who wish to be vaccinated. And again, once vaccine is more available in the community, this will be less of an issue.
Any other comments in that vein? Okay, Dr. Fry, your hand is still up. Is there anything else?
No, I'll put it
Thank you. I'm just making sure that everybody has a chance to speak. Dr. Goldman, please go ahead.
Thank you. First, thank you to the committee and the staff for all their hard work and consideration on this difficult issue. I did want to stress a few points in concerning the phase 1 prioritization, especially of healthcare workers and guidance on sub-prioritization. The outpatient community physician and small private practice truly being the backbone of the healthcare system, I'm pleased to see it's considered in healthcare first phase, but we need to really look at the outpatient offices being most at risk. There was a recent study out of the University of Pennsylvania that showed small community and outpatient physicians may be at a higher risk of death than the inpatient. And when you look at potential mitigation strategies, for example, an ICU physician, while seeing sicker patients, may have greater access to PPEs compared to small offices. I'm greatly concerned about the ability for the small and private practice to be able to get appropriate vaccination, especially from large healthcare systems. Additionally, the office staff is critical to running the small practices almost as much as the necessity of the physician being there, and they truly are the frontline workers. So I would hope that the committee would greatly look at the guidance and sub-prioritization, especially with vaccine distribution for those offices who are not employed by hospitals and not associated with large healthcare systems to make sure we are truly getting the vaccines to the people on the front lines who need it the most, more specifically the small, private, independent, community primary care physicians. Thank you.
Thank you, Dr. Goldman. Does anyone have a comment or a question to tail on to Dr. Goldman's topic? I see none or hear none.
Dr. Romero.
Please go ahead and speak up. Don't hold your hand up. Just add to that. Go ahead, please.
Yeah, this is Sean O'Leary with the Pediatric Infectious Diseases Society. I want to second Dr. Goldman's point there about outpatient providers and just add that also consideration should be given to other people that work outside of hospitals, like home health aides and EMS, et cetera, that plans should be made for those providers as well.
Thank you very much. Anybody else to add a comment to what has already been said?
Sorry.
Dr. Sanchez, I hear you. Go ahead.
No, I just want to echo that, because I do think that with sub-prioritization, and a lot of that I think will be left to jurisdictions, presumably, I do think that that the availability of PPE will be critical in terms of what subspecialty and what practices should be allocated to first. So I do want to agree with that.
Thank you very much, Dr. Sanchez. Anybody else adding to Dr. Goldman, Dr. O'Leary, or Dr. Sanchez's comments?
Sandra Freihofer, American Medical Association. Also wanted to emphasize the importance on making sure that small community practices have access to COVID-19 vaccines.
Thank you very much. There is some data in Dr. Oliver's next presentation that deals with this. So if you have other comments, we're fine to take them, but there will be some information coming. Anyone else wish to make a comment?
Dr. Romero, this is Jeff Duchin from IDSA. Can I make a comment?
No, of course. Please do, sir.
Thank you. I would just like to add that on the science front, that the transmission dynamics of COVID-19 also suggest that those providers that care for patients earlier in their course of illness may be at higher risk. This is supported by information CDC has recently published as well, and that would include outpatient healthcare providers. Thank you.
Thank you. Anyone else before I take Dr. Bernstein's question? I hear none. Dr. Bernstein, please go forward.
Thank you. First, I wanted to thank Dr. Dooling again for an excellent presentation, as she always gives. My question relates to the long-term care facilities and the potential for sub-prioritization. Is it envisioned that the healthcare personnel will first get vaccine in a long-term care facility if supply is constrained before giving it to the residents? Or is there another sub-prioritization scheme?
Dr. Bernstein, this is Amanda. I would assume that most planning around long-term care facilities would have a long-term care facility vaccinate both residents and health care personnel working in that facility at the same time. But there will be some jurisdictions that will likely start with healthcare personnel and then vaccinate residents. It's very dependent on supply and local context.
Thank you.
Thank you, Dr. Cohn. Anybody wish to add additional questions or comments to the topic brought up by Dr. Bernstein?
Yes, Dr. Ramirez, I have similar concerns about making sure that the staff in long-term care facilities are getting vaccinated. They too, as mentioned by others, are often less equipped in terms of personal protective equipment and have certainly had a huge burden of disease among them out.
Very good, thank you. That was Ms. Bata, a voting member of the ACIP. I'm just stating your name for whoever is transcribing. Are there any other comments on this topic?
Hi, this is Marie-Michelle Leger from AAPA. This is in relationship to the long-term care residents. I know in previous discussion we made mention that there's a high turnover of the residents, and usually within a 30-day time period. So the question is more from an implementation and follow-up of those residents for their second dose, and the challenge that may entertain because of that.
This is Dr. Cohn. I can respond to that. You are highlighting one of the many challenges with ensuring high coverage among long-term care facilities, both of residents and staff. The turnover in long-term care residents, it tends to be a portion of residents turnover frequently, and then the additional residents are more long-term. So there will need to be additional visits to the long-term care facility, and we have data systems in place to support those individuals who leave the facility and getting a second dose. But that will be a challenge, particularly in the first couple of months of vaccination, where the places where you can get vaccinated will be more limited than when we have more supply.
Thank you, Dr. Cohn.
Yeah, this is Bob Gluckman from AHIP. I do feel that the opportunity to immunize residents at the time as the healthcare workers in long-term care facilities is important, because logistically it'll be much easier to get people administered at the same time. Really, the question that is asking is, what's the recall system? It would seem to me like the skilled nursing facilities could schedule people for one of the subsequent second or third days that the pharmacy is coming on site again, and then it's just a transportation issue. I think there are ways to do this logistically, and I really do endorse the efficiency that can be gained by co-administering residents and healthcare workers at the same site at the same time. Given the relatively small numbers, it doesn't have a meaningful impact on delaying vaccination for other populations, such as essential health workers or others that would be phased in at a later place. So I think the logistics can be overcome with thoughtful planning.
Thank you, Dr. Goldrin. Anybody else wishes to add to this train of questioning and comment?
Yeah, this is Peter Szilagyi. I was thinking exactly the same as Dr. Gluckman, that it just seems efficient to vaccinate both the residents and the healthcare personnel around them. And I did have a question about the type of personnel, the type of residents who are in the long-term care facilities. And I do know that there are those who kind of cycle through very quickly, and then the proportions stay very long. Do we know about the COVID deaths, and which of those groups? My guess is that the vast majority of the COVID deaths are not the ones who are in long-term care facilities for rehab for a very short amount of time, but because sort of the other more truly long-term patients.
This is Dr. Cohn. We don't have that data at our fingertips, but that is a good question, and we will look into that. Thank you.
Yeah, this is Bob Gluckman. I would just comment, I don't know that we know that. I mean, some of the patients that are in long-term care facility are for acute medical illnesses where they need some short-term health. I can tell you that from our diagnoses from a health plan point of view, there are lots of patients who need short-term help with conditions like sepsis, post-pneumonia care, congestive heart failure. It's not just joint replacement. Those are not in long-term care facilities as much as they used to be. So I'd be cautious about prejudging who's at most risk and thinking that the short-term residents are not.
Thank you.
Thank you very much. We're going to move on to the next question. There'll be plenty of time during the discussion section to add more to this if you wish. So let me turn to the next hand that's raised. Excuse me. Dr. Fry, do you wish to ask another question?
Yes, please. So I just want to mention that if people in long-term care facilities, particularly the elderly, are going to be batch vaccinated, if you will, that this is another situation where there's going to be we'll need to have a lot of guidance post-vaccination to evaluate symptoms
All right, everybody. So we've been listening to this CDC meeting on the vaccine supplies and just how they will all be distributed. We're going to take a quick 2-minute break here on News Now from Fox. Coming up, we'll take you to another live event that is already happening, getting the COVID-19 update in Wisconsin. That's coming up next here on News Now from Fox, everyone.
There's been, the consensus that healthcare workers should be first to receive it. I'm wondering whether the governor or the health experts can kind of give an accurate picture of when, that first set of healthcare workers are expected to receive those vaccines, and if there are any other additional details about, who may be next and what that timeline may look like. Thank you.
Yeah, thanks, Victor. I think while we are all very anxiously awaiting a vaccine, I think we do need to remember that first and foremost, the FDA has to find the 2 applications that they now have in their possession, one from Pfizer, one from Moderna, that those applications provide enough data for them to feel comfortable to approve either under emergency use authorization or full approval, the use of those vaccines. Anticipating that does happen, we do expect to have a small amount of vaccine in the state of Wisconsin by the end of the year. And as you suggest, it seems like while we're waiting on final recommendations from the Advisory Committee on Immunization Practices, which is a federal advisory committee, and the CDC for how we think about prioritization, we certainly do anticipate, as you suggest, that healthcare workers will be at the top of that list. And so we continue our planning. We actually are in very close contact, as are all states, with the CDC and with our federal partners, so that as they have additional information or things shift and change, that they're able to provide that to us as quickly as possible, and we in turn will be able to shift and change here on the ground in our planning and our efforts moving forward. So we anticipate we did right before Thanksgiving a briefing specifically on vaccinations and the status of things with you all. We anticipate doing more of those, and so as we get enough information to make it something that is a worthwhile way to spend 45 minutes of your time, we will certainly schedule more of those.
Thank you, Victor. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline.
Hi, my question is, yesterday we learned that a high school student from Madison had died of COVID-19 complications over the Thanksgiving weekend, and I saw that this person's death is not reflected on the DHS website. So first of all, I'm just wondering, what are your thoughts on a young person, a teenager, dying from COVID potentially, and it could be the youngest person in the state if confirmed, and then what is DHS role in determining if, in fact, this death is a confirmed result of COVID?
Mm-hmm. Well, as you suggest, it would be a first for us, and obviously, the death of a young person from COVID or anything else is a significant tragedy, and I know that his family, the high school, that whole community is grappling with what happened over the holiday weekend. As it relates to the reporting of that death, I'll let Dr. Westergaard dig into the details of it, but to your point, we have not yet at DHS received a report of an adolescent death due to COVID-19. That it may be with the medical examiner, maybe with the healthcare provider, but as that information, if that is what it is deemed to have been the cause, that will come up through the process, up through the local public health agency to DHS, and will be reflected on the website. But Dr. Westergaard, you may want to dig in.
It's a good response. The reason that there's sometimes a lag of a couple of days with the death reported data is that our role at DHS is not to determine the cause of death. That happens either by the medical team that's caring for a patient if they're in the hospital, or a medical examiner or coroner if someone passes away outside the hospital. So that death certificate is.
All
right, it looks like Chuck Schumer just took the stage, so we'll listen in to his remarks here on News Now from Fox.
Avril Haines. We had a wide-ranging discussion that covered the globe and priorities for the U.S., foreign policy, national security. In particular, I urged the incoming Biden administration to be tough on China, but in a smarter, more multilateral way than the Trump administration was. What was immediately clear in our discussion is that President-elect Biden's foreign policy and national security team are exceptionally qualified, accomplished individuals with the expertise to protect our nation and advance American interests abroad. In addition to Tony Blinken and Avril Haines, she corrected my pronunciation, it's Avril, President-elect Biden continues to roll out an impressive slate of nominees to his cabinet and other key administrative positions. Now, after all we went through over the past 4 years, I would expect that almost all of President-elect Biden's nominees would be widely acceptable to the Senate. After all, Republican senators looked the other way and confirmed several of Donald Trump's unqualified, ethically compromised, and scandal-plagued appointees. Republicans argued that a president deserves broad deference when it comes to the cabinet and official appointments. Well, Republicans ought to give President-elect Biden the same deference. But we're already seeing more pearl clutching about overblown complaints from Republican senators who conveniently ignored scandal after scandal in the Trump administration. Honestly, the hypocrisy is astounding. After spending 4 years pretending they didn't see the latest insane tweet from President Trump, Republican senators have just found the passwords to their Twitter accounts, since they're now suddenly concerned about what's being said about them on Twitter. But after the caliber of nominees that this Republican majority confirmed over the past 4 years, it would be impossible to take them seriously. The Senate committees should prepare to hold hearings on President-elect Biden's nominees in January, immediately after the Georgia elections. That's what the Senate did for President Trump and for President Obama. That's what the Senate must do for President-elect Biden as well. Our nation's facing unprecedented crises. We need the next administration to hit the ground running to tackle these multiple challenges. That means ensuring that on January 20th, 2021, President Joe Biden and Vice President Kamala Harris have much of their team in place. I hope my Republican colleagues will look at Joe Biden's nominees based on their merits and their impressive credentials and not let petty political animus get in the way. Senator Menendez.
Well, thank you, Mr. Leader. Look, I want to echo, particularly in the national security front, the leader's comments. This is about our nation's security and prosperity. It shouldn't be about politics. There's no question that the slate of nominees, particularly in the State Department, UN ambassador, and elsewhere, put forward by the president-elect are capable and qualified. Now, does the Senate have to do its due diligence and vet them? Of course. Do we have to understand their thinking and ask them about their views? Of course. That's part of advice and consent. But there's a difference between that and some who are already suggesting that they seek to weaponize the confirmation process and seek to turn it into a political wrecking ball. Those who ultimately, for their own purposes, as they may aspire for future election to the presidency of the United States, wants to use the vetting process in a way that undermines the very essence of what we need our nation to be able to do on day one, is that the American people deserve to have a government that not only looks like America, but that is up and running from day one to deal with the pandemic and the economic wreckage that has come from the pandemic, and to pursue our interests and extend our values around the globe. Today, I was on a panel with European parliamentarians, and the cry from all, and these are all people from the European Union, elected, different countries, different political beliefs and whatnot, but the one thing they want to see is America be back and engaged in the world. That takes a Secretary of State. Tony Blinken is an incredibly qualified individual to help us once again be back on the global stage, engaged, creating more allies, less enemies, creating more prosperity, less challenges, and that also takes a UN ambassador. And Ambassador Greenfield is an extraordinary, I know her, I helped her become the Assistant Secretary of State for Africa. When I was the chair of the committee, she's an exceptional example of an exceptional career diplomat. That's who we need helping lead the national security of the United States. That's what we need to get on day one, which means we need early hearings in January and a vote in order to guarantee it.
Senator Klobuchar.
Thank you very much, and thank you for your leadership, Senator Schumer, at this critical time, and thank you, Senator Menendez. I think that really President-elect Biden has set the tone here when he said this should not be a partisan moment, this should be an American moment, and we just don't have time to mess around. We have, as Bob has pointed out, security threats across the country, we've got across the world, we've got incredibly qualified nominees, which really are in keeping with the tone that the president-elect set from the minute the president would not concede this election. President-elect Biden took the stage and said, you know what? Give me a chance, people that voted for Donald Trump, and I'll give you a chance. He set that tone, and now you see that tone in these nominees, in people like Tony Blinken, in people like someone who won't come before us for confirmation, but I must mention, because he's from Minnesota and used to work for me, Jake Sullivan. You see people that are well respected, including Treasury Secretary to be Yellen. And so he has really lived his words in who he has nominated, and it's our job to get it done. And the last thing I would add is that we are in the middle of a pandemic right now. I don't have to tell you that. And one of the things that we need right now is stability for the rest of the world and for our own country. And I am been pleased that my colleagues are moving ahead with some bipartisan negotiations. Obviously, that's not done. We know we haven't heard good words from Leader McConnell on this, but that doesn't mean that we cannot keep moving ahead, because we cannot have no leadership for America in place when we want to lead the world when it comes to this vaccine. That's going to mean funding to get this vaccine out. If I said at home, you just can't drop a bunch of vaccines in the middle of Laverne, Minnesota, and think they're just going to magically show up there. It takes coordination on infrastructure, on storage, and the like. And to do that, we need Joe Biden to be able to put a leadership team both internationally and domestically. So I'm excited to work on this. I think we have had great nominees come forward, and it is on our Republican leaders and us to work together to get them confirmed immediately.
Thank you, Senator Klobuchar. Yes, yes, ma'am.
I have two questions. You sent a proposal to Leader McConnell on COVID relief last night. What was in it, and are you let going of the $2 trillion demand that you previously had? And also, I'd like you to respond to Attorney General Bill Barr saying there was no widespread fraud, please.
Well, in response to Attorney General Bill Barr, I guess he's the next one to be fired, since he now, too, says there's no fraud. Trump seems to fire anyone in that regard. In the first, Speaker Pelosi and I sent yesterday a proposal to Leader McConnell in an effort to get things moving. I'm not going to get into the details. It was a private proposal to help us move the ball forward. But let's make no mistake about it. I just heard Leader McConnell say he's going to put another partisan proposal on the floor. He's going to talk to McCarthy and Trump and put something on the floor. The obvious fact of the matter is the biggest impediment to getting an agreement is the Republican leader refusing to negotiate in a bipartisan way. He knows darn well the House is Democratic majority. He knows darn well he needs Democratic votes in the Senate to get anything done, since a number of his people won't vote for any proposal. And yet he continues to negotiate in a partisan way. Speaker Pelosi and I sent him the proposal in a good faith effort to start to get him to negotiate in a bipartisan way. I always welcome and encourage my Democratic members to talk to Republican members, and there's another proposal that way. All are in efforts to get Leader McConnell to stop being so partisan, because the needs of people are desperate desperate during this Christmas season and later.
He indicated that he wants to add it to the must-pass government funding bill. Are you worried about getting jammed and that you've lost your negotiating power and you're going to have to accept whatever he comes up with the president?
Let me just say, I hope McConnell will start doing things in a bipartisan way. Every time he's tried to do it in a partisan way, it has failed.
Leader Schumer, it seems like there's a debate within the caucus about holding committee chairmanships and leadership positions. How do you plan to proceed as leader on this issue?
Look, I think the bottom line is every 2 years, we have a robust discussion in our caucus about the caucus rules and what should be changed and what shouldn't be changed. And we're going to have another good discussion in the next few weeks.
This morning, there was a $900 billion bipartisan proposal proposed. What do you think of that proposal specifically? Has your letter more than that or around the same?
Again, our letter was done in a private way to get McConnell and maybe the White House to move. So I'm not going to get into its details. The bottom line is that it's an effort to get things moving forward. As for the proposal that the bipartisan group of senators announced, as I said, I've always encouraged our Democratic senators to sit down with Republican senators and negotiate. And this is a good effort. I haven't seen all the details. They haven't come out with the details yet. But when Democrats and Republicans can get together, that's a good thing. And I hope Leader McConnell will heed that call. Yes.
So, I'm assuming by this that Leader McConnell hasn't responded to your letter
Not
in
yet.
any sort
We
of
hope
way.
he will. It was just sent yesterday.
What about Secretary Mnuchin? Did he respond when he spoke?
We
on
just, not yet. We hope they will give us a real response so we can get something done.
Does this that he's putting out
Next question. Yep, go ahead.
He's not engaged on this?
Let's hope he'll negotiate in a bipartisan way. Thus far, every time he's done it in a partisan way, it hasn't worked. There's a Democratic House. They need Democratic votes in the Senate.
I know that you said you encourage your members to meet with Republicans, but this proposal they've put forward is a full $1 trillion less than what you all are proposing. So is it something that you all think as a
Look, and we have to see the details. Bipartisan proposals, again, are what is needed to get things done.
Can I just say one more thing?
Yeah, go ahead, Amy. Yeah.
I just, one thing I note about the earlier question about McConnell and whether he'll jam us and those things, do remember there were Republicans in that group, right? And while it is not nearly what we had asked for, there were Republicans that stood up and said they wanted this amount of money. So I wouldn't assume that everyone's just going to go down the path with Mitch McConnell this time when you have states like in Maine that have had so many small businesses close. There was a Yelp study out recently that showed 800 small businesses are closing a day. We have restaurants that have tried to hang in and can't do it anymore. We've got a vaccine around the corner, light at the end of the tunnel, but if we don't put the funding into it to get the distribution going and the storage going, we're not going to be able to recover like we want to. We've got the head of the Federal Reserve under Donald Trump, his appointment, Jerome Powell, saying it would be a tragedy if we didn't get something done. So I wouldn't just assume that everyone's going to go down his path this time. And I think that this bipartisan negotiation, while of course just a start and is significant to show that some people are willing to cross over to get something done, which Senator Schumer has been calling for from the beginning.
Okay, last one.
Joe Biden said that on his first day of office, he will give transgender students access to sports, bathrooms, and locker rooms in accordance with their gender identity in all federally funded schools. Do you think he has the ability to do this, and do you agree with this decision?
I agree with the decision, and I know he'll check things out thoroughly legally. Thank you, everybody.
You're watching News Now from Fox. That was Democratic senators speaking about a number of issues. Just to break down a couple of those here on News Now from Fox. We're talking about this bipartisan COVID-19 relief bill. If you've been watching the news at all, you understand that it's been months in the making to get a COVID-19 stimulus bill, a second one, so that people can get some stimulus checks during this COVID-19 pandemic. It's what they're calling a lame duck session. A lot of Republicans and Democratic senators kind of clashing and not able to come to any sort of compromise. So hopefully it's sounding like that line of communication is opening up a little bit. You heard from Schumer right there, Senate Minority Leader, talking about that, but then also talking about Biden's picks, which will ultimately have to be elected by Congress as well. So we'll continue to follow that here on News Now from Fox. And really quickly, some new news from Attorney General William Barr talking about massive fraud and kind of saying that these allegations are incorrect and that they haven't found any evidence of fraud. We'll, I'm sure, be hearing a lot more about that here on News Now from Fox. No press conferences quite yet, but we will continue to follow that as well. There's a couple different stories going on today. We're looking towards a couple more press conferences about election 2020. We heard from Georgia election officials already this morning, just on the latest of vote counting out there. We'll hear from them again in a couple of hours or so from the Secretary of State's office. We're also following other COVID-19 press conferences across the country. And as of right now, I think we have Wisconsin officials talking as we speak. So we'll play that out for you here on News Now from Fox. We're going to send some of you off to a 2-minute commercial break, but when you come back, that update out of Wisconsin.
Readily available to the general public. We also certainly are thinking about, like we have established mobile testing sites or drive-through testing sites, that is a tool that we have developed and over time made more efficient, and we certainly are looking at that model again when we are in a place where vaccine is really readily available, and you would want to have those kind of community access points for large numbers of the population. So we're thinking about this in a variety of ways, wanting to be creative, wanting to make sure, because this is a challenge when you're thinking about the number of vaccines that you're going to want to put in arms in as short a period of time as you can, as safely as you can. So we're anxious to have new partners if that's necessary, but do want to make sure we build on what we have learned already in this pandemic to build and drive public health infrastructure in ways that help us deliver vaccine as quickly as possible.
Thank you, Kent. Now to Sophie Carson from USA Today Network, Wisconsin. Sophie? Sophie Carson?
Hello.
Go ahead.
Hi, I'm sorry about that. I clicked *6, but thank you for taking my call. What, if anything, can we draw from the declining 7-day average since mid-November, and what can we see in the coming weeks? What do you see in the coming weeks?
So I'll say a couple things, Sophie, and then Dr. Westergaard can weigh in as well. I think, we have, as you suggest, seen a decline in our 7-day.
All right, so we did mention a little bit earlier, again, you're watching News Now from Fox. I'm Daytona Everett. We mentioned really briefly that there was going to be a Georgia Secretary of State update talking about election 2020 and the latest on the vote counting out there. In that right box, you can see they are setting up for the speakers, which we're hearing that Brad Raffensperger, the Secretary of State, and Gabriel Sterling, who is from the Secretary of State's office, will be speaking for this update. So when they do eventually take the stage, we will bring that to you full here on News Now from Fox. But for now, we'll just listen in to this Wisconsin COVID-19 briefing as well.
That there is something real there in that decline, and that we as Wisconsinites continue to double down, continue to do the work that is necessary to reduce the spread of the disease. We've got, even at a reduced 7-day average, what is like 4,200, 4,300 new daily cases is the 7-day average. That is still way too high. I mean, I remember the days when we started breaching 1,000 and we were alarmed by that, and now we're glad when we're at 4,200. We sort of have gotten used to a cadence that way too high. And while I hope we are going in the right direction, it is in no way a sign that we need to take our foot off the gas, because we have a long way to go to get back to a place where our daily cases are manageable, right? From a testing perspective, from a contact tracing perspective, from a hospitalization perspective. There are so many deaths that we can and should prevent by doing everything that we can to stop the spread. So I want to be hopeful, but I think we need to be realistic. We need to wait and see how the numbers shake out here over the next couple of weeks. And we need to double down and do more to reduce our numbers even further.
I agree. I'd say the one piece that I think still is a sign that it's a really dangerous situation is it's a really high % positive test. And we really, our standard of wanting to see that less than 5% or ideally less than 1% as a marker of we're testing enough people and we have a good handle on transmission. We're far above that. So I think it's measured good news. If there were two possibilities backing up 2 weeks where it would continue to climb or level off as it has, clearly it's better than what we're experiencing here, but we can't really call it good news in the sense that we can work any less hard. In fact, we still need to work harder because there's still a lot of undiagnosed infection out there. Transmission is still occurring at a high level, and we really need to do more, not less, to try to prevent the spread further.
Thank you, Sophie. Now to Jonathan Nizer from NBC 26 in Green Bay. Jonathan?
Yes, thank you for taking the question. My question was that I was going in with just got answered, so I'll throw a new one out there that we've been kind of tossing around amongst our newsroom. We're curious, at the beginning of the pandemic, there were locations in some communities like hotels and such where people could go and quarantine away from their family units and such. Are such facilities still available for people who need them now, or has that kind of gone away?
Yeah, safe isolation and quarantine is absolutely still a thing, right? Household transmission, positive case in a household that can't safely isolate from the rest of the family leads to transmission among those family members. And right, that's part of the chain we want to break. And so people being able to safely isolate and quarantine is a really important part of what we are doing and need to do. And some of those facilities I assume you're talking about were ones that we invested in at the state level, which have been decommissioned, but our local public health and county partners are still accommodating safe isolation and quarantine. They are using some of their CARES Act dollars to make sure that people have access when they need it to safe isolation and quarantine. But it is fundamentally a piece of this that continues to need to happen. It's why we talked about it in our opening remarks, that people need the space to isolate and quarantine in a way to break transmission, not to transmit to family members and other people that they live with. I don't know, Dr. Westergaard, if you want to say more about that.
It's a resource that would be put to good use wherever possible. There's so many cases, there's so many households where cases are. It may not be sufficient, but any means we can do to support people isolating and quarantining safely out of their household would be better, because household transmission is one of the greatest risks. It's probably higher than 50% risk of one person having an infection in their household that, within a week, 50% risk that another person in the household will be infected. So it's a very high risk, and it's a great point that it needs to be part of our strategy.
Thank you, Jonathan. And our final question this afternoon belongs to Angelina Mosher Salazar from Milwaukee Public Radio. Angelina?
Hi, good afternoon. So we know that nursing homes have been fatally hit by the coronavirus. So as the vaccine becomes available, what is the plan for residents of long-term care facilities? And I'm thinking specifically residents or staff who don't want to take the vaccine. Will private facilities mandate their staff, or will the state roll out any information campaigns to target this population? Thank you.
Yeah, I mean, you're absolutely right that throughout this pandemic, our nursing home and skilled nursing facility residents have been an absolute priority for us. And we continue, whether it's on the testing front, whether it's on infection control, whether it's on staffing shortages, to be close partners with skilled nursing to try to reduce the spread and infection, illness, and death as much as possible. As it relates to the vaccine, as I mentioned, we as a state have opted into a program whereby pharmacies have agreed to partner with skilled nursing facilities to go on site at those facilities and provide vaccine when it is available. Obviously, we are awaiting approval of a vaccine. We are awaiting, subsequent to that, recommendations from the Advisory Committee on Immunization Practices and understanding what the cadence and frequency of delivery of vaccine and in what numbers we will see here in the state of Wisconsin. So we are grateful for this partnership with pharmacies. Almost all of our pharmacies, almost all of our skilled nursing facilities have indicated that they want to participate in the program with us and with our pharmacy partners. So we anticipate good uptick of the vaccine among this population, but they will continue to be a focus for us. And as we understand more of the details about when and how much and at what cadence we'll be receiving vaccine, we'll be able to dig in on the specifics more easily with you.
Thank you, Angelina. And that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good afternoon.
You're watching News Now from Fox. Obviously dipping out of that Wisconsin COVID-19 briefing. We are awaiting the Georgia Secretary of State, who will be speaking about the latest election news out there. There's still a Senate runoff going on right now, so it's a busy time for the state of Georgia. They will likely be taking the stage in the next 5 minutes or so. So we're going to take this time to send some of you off to a 2-minute commercial break. When you come back, we'll have the very latest on election 2020. So again, you're watching News Now from Fox. I'm Daytona Everett. We are awaiting not only Brad Raffensperger, the Georgia Secretary of State, but also another worker in his office, another employee in his office, Gabriel Sterling. We've seen him several times giving the latest on these counties and what they are working towards in the state of Georgia. We're hearing the recount is supposed to be finished by Wednesday at midnight. This is yet another recount in the state of Georgia after the Trump legal team pursued that and paid for that. There was a hand recount that was already done in the state of Georgia. So this new one is being done by machines. Another big headline today as we await this press conference coming from Attorney General William Barr. He said today that the Justice Department has not uncovered evidence of widespread voter fraud that could change the outcome of the 2020 presidential election. That's despite claims by President Trump and his campaign's legal team. Barr, during an interview with the Associated Press today, said that U.S. attorneys and FBI officials have been working to follow up on specific complaints and information that they've received, but have not uncovered enough evidence. that would change the outcome of the election. Last month, Barr issued a directive to U.S. attorneys across the country, allowing them to pursue any substantial allegations of voting irregularities if they existed before the results of the 2020 presidential race were certified. And if you remember, just yesterday, Wisconsin and Arizona both certifying their results. We brought that all to you live here on News Now from Fox. Barr's move, though, gave prosecutors the ability to go around Justice Department policy that typically would have prohibited investigations of the time before the election was certified. Soon after Barr's memo was issued, though, the Justice Department's top elections crime official announced that he would step aside from that position. Barr's interview comes just 2 days after President Trump told Fox that the DOJ had been missing in action on possible election fraud. Trump told Sunday Morning Futures that he has not seen anything from the DOJ or FBI on investigating the 2020 election. So this is the first time that we're really hearing from Attorney General Barr about this situation, election fraud. We've been hearing quite a bit from Rudy Giuliani. The Trump campaign has filed lawsuits in a number of key battleground states where President-elect Joe Biden led by a razor-thin margin. The Trump campaign has been alleging a widespread conspiracy to dump millions of illegal votes into the system, but has not provided substantial evidence to support those claims. The campaign's legal effort, led by Rudy Giuliani, has in part, though, been focused on Republican poll watchers being blocked from viewing vote counting at polling sites in some locations. Those claims have been dismissed by even Republican-appointed judges who have said that the cases lack evidence. Election officials in many of those states have certified Biden's victory, like I said, in Arizona and in Wisconsin. Again, this is a developing story every single day, new information coming out. President Trump's and his legal team still not backing down from these lawsuits. President Trump has not yet conceded to Biden, despite allowing the formal transition process to begin. We saw that with the GSA. The president continues to blast election officials in multiple states while also claiming the 2020 presidential election was rigged. In the state of Georgia, though, all eyes are on this Senate runoff. As this race will determine who gets the majority in the Senate. This is a big race that America is watching day in and day out, and they'll likely update on that as well, how they'll move forward with that Senate runoff. If you're watching News Now from Fox, just in the past 30 minutes or so, we heard from Senate Minority Leader Chuck Schumer. He briefly touched on Barr's comments, saying that, quote, he might be the next one to be fired by President Trump. This, as the president has fired several people in high positions of the White House, also pardoning Michael Flynn. We all remember that story coming just last week. As we await this press conference, we were following really quickly Governor Whitmer taking the stage. So we'll put both of these shots in a double box here on News Now from Fox. So when they do take the podium, we'll bring that to you. If you're new to our platform, to our newscast, it's live, raw, unfiltered. We're bringing you these feeds from across the country as soon as we get them, whether it's politics, breaking news. Yesterday we covered a little bit of sports. As the sports world gets shaken up by the COVID-19 pandemic, everything is kind of intertwined in this pandemic right now. We bring that to you. We got you covered across the board when anything comes out. So we appreciate you being with us. If you'd like to, follow us on Twitter at NewsNowFox. We post all of our segments on there, all of our live interviews, all of those big headlines that continue to break every single day. As we await this press conference, we will bring you out to Michigan for a little update from Governor Whitmer.
Good afternoon. Today is Tuesday, December 1st. I am joined today by Dr. Janae Caldoun, our Chief Medical Executive. We are now nearly 2 weeks into the MDHHS 3-week Pause to Save Lives epidemic order. This epidemic order is geared toward stopping the spread by limiting indoor gatherings where COVID-19 can easily spread from person to person. This is the right thing to do to protect our families, to protect our medical workers, and to protect small businesses from the virus. These steps are what public health experts say we need to take to avoid overwhelmed hospitals and death counts like we saw in the spring. Earlier this year, Michigan emerged as a national leader in fighting COVID-19 and saving lives. We beat COVID-19 last time by listening to public health experts, and we can beat it again. But it's going to take every one of us doing our part and working together. And it will take leaders from both sides of the aisle working together in a bipartisan way to get it done. Last week, I sent a letter to the Michigan legislature wishing them a nice Thanksgiving with their families and asking them to join me in our work to defeat our common enemy. This is the most urgent public health emergency our state has faced in any of our lifetimes, and it demands our full, immediate, and unified attention. In my letter to the legislature, I requested that they work with me on 3 key priorities during the few remaining session days of 2020. The first is passing a $100 million Michigan COVID relief plan. Week after week, we have been urging, the nation's governors on both sides of the aisle have been urging Congress and the White House to pass a bipartisan and sign a bipartisan relief bill so that we can provide for our families, protect our frontline workers, help our restaurants, support our educators.
Good afternoon. My name is Gabriel Sterling. I'm the Voting System Implementation Manager for the state of Georgia. And just to give you all a heads up, this is going to be sort of a 2-part press conference today. And at the beginning of this, I'm going to do my best to keep it together because it has all gone too far. All of it. Joe DeGeneva today asked for Chris Krebs, a patriot who ran CISA, to be shot. A 20-something tech in Gwinnett County today has death threats and a noose put out saying he should be hung for treason because he was transferring a report on batches from an EMS to a county computer so he could read it. It has to stop. Mr. President, you have not condemned these actions or this language. Senators, you have not condemned this language or these actions. This has to stop. We need you to step up, and if you're going to take a position of leadership, show some. My boss, Secretary Raffensperger, his address is out there. They have people doing caravans in front of their house. They've had people come onto their property. Tricia, his wife of 40 years, is getting sexualized threats through her cell phone. It has to stop. This is elections. This is the backbone of democracy, and all of you who have not said a damn word are complicit in this. It's too much. Yes, fight for every legal vote. Go through your due process. We encourage you, use your First Amendment, that's fine. Death threats, physical threats, intimidation. It's too much. It's not right. They've lost the moral high ground to claim that it is. I don't have all the best words to do this because I'm angry. And the straw that broke the camel's back today is, again, this 20-year-old contractor for a voting system company just trying to do his job. Just there. In fact, I talked to Dominion today and I said he's one of the better ones they got. His family's getting harassed now. There's a noose out there with his name on it. It's not right. I've got police protection outside my house. Fine. You know, I took a higher profile job. I get it. Secretary ran for office. His wife knew that too. This kid took a job. He just took a job. And it's just wrong. I can't begin to explain the level of anger I have right now over this. And every American, every Georgian, Republican and Democrat alike should have that same level of anger. Mr. President, it looks like you likely lost the state of Georgia. We're investigating. There's always a possibility. I get it. And you have the rights to go through the courts. What you don't have the ability to do, and you need to step up and say this, is stop inspiring people to commit potential acts of violence. Someone's going to get hurt. Someone's going to get shot. Someone's going to get killed. And it's not right. It's not right. And y'all, I don't have anything scripted. This is, like I said, I'm gonna do my best to keep it together. All of this is wrong. DeGeneva, who said for Chris Krebs to get shot, is a former U.S. attorney. He knows better. The people around the president know better. Mr. President, as the secretary said yesterday, people aren't giving you the best advice about what's actually going on the ground. It's time to look forward. If you want to run for re-election in 4 years, fine, do it. But everything we're seeing right now, there's not a path. Be the bigger man here and step in, tell your supporters, don't be violent, don't intimidate. All that's wrong, it's un-American. I don't know what else to say on that front. I mean, these are elections. One of our goals was to make elections boring again. Well, guess what? That didn't happen. This is all wrong. It's all too much. And I'll leave that for there. Okay, now, as I said, this will be a bifurcated press conference. Here's the stuff that we want to talk about where it's kind of hard to come back out of that. I apologize. There are 91 counties that have finished. This is going to seem really bipolar at this point, I guess, but 91 counties have finished their recount so far, and so far we see no real anomalies. Everything is going along the lines we would have expected. So I'm going to read off the list now. Appling, Atkinson, Bacon, Baldwin, Banks, Barrow, Ben Hill, Berrien, Bibb, Bleckley, Brooks, Bryan, Bullock, Burke, Butts, Calhoun, Carroll, Charlton, Chattooga, Clark, Clay, Crisp, Dade, Dodge, Eccles, Effingham, Emanuel, Gordon, Green, Habersham, Hancock, Harrelson, Hart, Hurd, Irwin, Jackson, Jasper, Jeff Davis, Jefferson, Jenkins, Johnson, Lamar, Lanier, Lee, Long, Lumpkin, Macon, Madison, Marion, McDuffie, McIntosh, Merriweather, Miller, Mitchell, Monroe, Murray, Newton, Oconee, Oglethorpe, Pierce, Pike, Polk, Pulaski, Putnam, Quitman, Randolph, Schley, I'm 99% sure it's pronounced Schley, Screven, Seminole, Stewart, Tatnall, Taylor, Telfair, Terrell, Thomas, Tift, Toombs, Troutland, Troop, Turner, Twiggs, Union, Walker, Ware, Warren, Wayne, Wheeler, White, Wilkes, Wilkinson, and Worth. So those counties, and it's 91 of them, have everything ready for their upload. The upload for the December 1st election today, those ENR sites will go live at 4 o'clock. The big counties. I understand Rob Pitts had a press conference trying to refute what I said earlier. I didn't watch it. I don't know what he said, and we know what happened, so we'll just go with that. They have 315,000 advance in person that they have to do, and they're taking the absentee by mail ones that have to be adjudicated to the English Street warehouse away from the World Congress Center today. Gwinnett is still going apace and still scanning and adjudicating. Cobb, which we had been told had been done, they were only done with the election day votes yesterday. They're scanning absentee by mail now, and the early vote will be done by 7 p.m. tomorrow is their plan. DeKalb has under 1,000 ballots left to adjudicate, and they have already scanned everything. Chatham is going well. We've seen no anomalies there. And then for the specific absentee ballot numbers that were requested this morning, accepted absentees so far is 7,017, and we have 924,891 requests in, and another 52,602 that are on the absentee ballot portal dashboard for the counties to accept. That's a total of 977,493 ballots, so we're approaching 1 million. We expect to be there by the end of the week, obviously. And we'll begin to see more of these get accepted because, as I told you all yesterday, all of the all of the rollover voting ballots were mailed as of yesterday. So with that, I'll take any questions. About the threat. Young man, contractor, basically somebody took a video of him manipulating election data off of the recount. It was wrong. And then people started accusing him of treason. They started hanging things like a noose up saying, you know, this is treason, you're gonna pay for this. He's just a contractor. And now he's got a name, I'm not gonna say it to spread the name more, but it's a unique name, so apparently they've tracked down family members and harassing them as well. I do know that Gwinnett PD has been contacted, I believe the sheriff's office as well. I don't know if we talked to the GBI yet, but I'm sure at some point in the near future they already have been, or they will be soon informed about the details of this. Justin. Well, this goes back to a couple of things that we've talked about as part of our elections package, that if the Secretary's office is going to be continually blamed for counties making mistakes and failing their voters, at some level we need to have the power to fire people who are in the way of this, similar to what they have in other states. And this is one of those where they've continually failed their voters. We saw the issues in Spalding County on election day. They didn't follow procedures properly. They didn't do it earlier. They basically, then they made false claims that they got a phone call of people saying that the stuff had been uploaded, that they later recanted. I mean, the trust in that particular office has been undermined. I believe all the local elected officials and local state officials agree that this person needs to move on to find a different kind of career. But this goes back to the fact that this office needs to have the power to deal with these things instead of having to call for other people to do it just to be able to do the jobs ourselves. Yes, sir. I'm talking about Senator David Perdue and Senator Kelly Loeffler, two people whom I still support in the election booth, but they need to step up on this particular thing. And that's me speaking as a Republican, not in this office, because I probably stepped out of line, but I'm kind of pissed. Yes, ma'am. We have said it repeatedly. I mean, it's been pretty clear. They called for us to resign, and frankly, when they called for us to resign, and then the president called the Brad Raffensperger, who was a fine, upstanding, lifelong Republican, an enemy of the people, that helped open the floodgates to this kind of crap. It takes people who are already spun up, and you know, there are people who can have some righteous indignation to be angry, but there's also people out there at this point in the social media world. We see what happens. There are some nutballs out there who are going to take this and say, the president told me to do this. Essentially, you have to be responsible. You have to be responsible in your rhetoric. You have to be responsible in your statements. You have to be responsible in your deeds. That shouldn't be too much to ask for people who ask for us to give them responsibility. What else? All right, sorry. It's going to look like a regular ENR. You know, we have a banner on the Secretary of State site. It'll say recount results in the top banner, and then you'll click on that, and it'll look like a regular election night reporting. But we probably aren't going to do that until tomorrow, probably around lunchtime, I think, because we want to get some separation because we have two ENRs going up tonight, because the Congressional District 5 is a separate election project from the other state elections. So there'll be two different ones going up. We figured a third one might be confusing. They'll be posted. Counties will upload full results more than likely, because what they're doing is everything's coming off a single ICC, and they'll probably put them all up at one time. They could put them up in parts, but I don't think so. All right, thank y'all.
All right, you're watching News Now from Fox. That was Gabriel Sterling really coming out hot in the very beginning of this update for Georgia. Very different than ones that we've seen in the past. Let's just kind of break down what happened for those of you who may have missed the beginning of that update. If you don't know, Gabriel Sterling is one of the election officials out there in Georgia. Sometimes he speaks in place of Brad Raffensperger, who is the Georgia Secretary of State. And obviously Raffensperger wasn't there today. You know, a lot of these election officials right now are receiving death threats. And he came out in the very beginning saying this has to stop, saying that leadership is not condemning this, and kind of pointing towards President Trump for this, and saying if you're going to be in a position of leadership, show some, and just really fired up, honestly, about these death threats coming to the election official's office in Georgia. He briefly touched on the recount that's going on out there. Again, we're thinking tomorrow at midnight is the deadline for counting. He was very forward about Georgia and some of the mistakes that they've made through the election process, but he said it's tough for the election office to take full responsibility for all of, you know, the problems that they're enduring out there in every single county. So this is the second update that we've had from the state of Georgia talking about elections out there. We'll of course play that again here on News Now from Fox, because that was a side of Gabriel Sterling that we have not seen yet. He was very frustrated about what not only Brad Raffensperger, the Secretary of State, and his family are enduring, but even just contractors who are working in the state of Georgia for the election. He said that death threats are getting pretty intense out there. And this is something that we've seen in the state of Arizona as well. Other election officials in Arizona seeing some similar situations. So it's a safety issue at this point. Again, we're bringing you all of these feeds live, unfiltered, and raw. That was our update in the state of Georgia. We're going to go out to Michigan now, because I wasn't able to bring that to you in full before they stepped up to the podium. So we'll play out Governor Whitmer. She's talking about COVID-19 in the state of Michigan and their response that they're taking. We're going to send some of you off to a 2-minute commercial break. When you come back, you'll see that COVID update in Michigan.
Good afternoon. Today is Tuesday, December 1st. I am joined today by Dr. Janae Caldoun, our Chief Medical Executive. We are now nearly 2 weeks into the MDHHS 3-week Pause to Save Lives epidemic order. This epidemic order is geared toward stopping the spread by limiting indoor gatherings where COVID-19 can easily spread from person to person. This is the right thing to do to protect our families, to protect our medical workers, and to protect small businesses from the virus. These steps are what public health experts say we need to take to avoid overwhelmed hospitals and death counts like we saw in the spring. Earlier this year, Michigan emerged as a national leader in fighting COVID-19 and saving lives. We beat COVID-19 last time by listening to public health experts, and we can beat it again. But it's going to take every one of us doing our part and working together. And it will take leaders from both sides of the aisle working together in a bipartisan way to get it done. Last week, I sent a letter to the Michigan legislature wishing them a nice Thanksgiving with their families and asking them to join me in our work to defeat our common enemy. This is the most urgent public health emergency our state has faced in any of our lifetimes, and it demands our full, immediate, and unified attention. In my letter to the legislature, I requested that they work with me on 3 key priorities during the few remaining session days of 2020. The first is passing a $100 million Michigan COVID relief plan. Week after week, we have been urging, the nation's governors on both sides of the aisle have been urging Congress and the White House to pass a bipartisan and sign a bipartisan relief bill so that we can provide for our families, protect our frontline workers, help our restaurants, support our educators, and give small business a hand during this tough time. But leaders at the federal level still have not been able to agree on a plan. And that's why we need to take action at the state level. It's crucial for us to come together now to pass a targeted, state-based economic stimulus plan of up to $100 million that will provide direct financial support to the families and small businesses that have been hit hardest by this pandemic. Michigan is facing a budget shortfall of up to $1 billion next year. So we've got to make some hard choices. But right now, prioritizing our families, our frontline, and small businesses while avoiding spending too much on non-critical projects. I also urged the legislature to pass a permanent extension of unemployment benefits. On the heels of the last recession, the legislature cut workers' economic lifeline from 26 weeks to 20 weeks and let inflation whittle away the $362 maximum weekly benefit. Michigan's benefits are in the bottom third in the nation and the lowest in the Great Lakes region. Earlier this fall, I worked with legislators from both sides of the aisle to pass legislation that codified my executive orders to provide temporary extension of unemployment benefits to 26 weeks. But this legislation, unfortunately, expires at the end of this year. House Democrats have already drafted some bills to get this done, and just yesterday they invited their Republican colleagues to join forces with them to protect unemployed Michiganders. If we don't take this bipartisan action now, thousands of Michiganders who are unemployed could lose benefits right after the holiday. Let's work together and get this done. Last, I urged lawmakers to pass legislation to protect public health. Since COVID-19 first showed up in Michigan, I've taken swift action to save lives and protect people. This virus has infected more than 350,000 Michiganders, and sadly, it has taken the lives of over 9,000 people in our state. This virus, as I've said many times, doesn't care if you are rich or you are poor. if you are young or if you're old, if you're a Trump Republican or a Biden Democrat. And that's why it's so important that we focus on the fact that we are all Michiganders and our common enemy is this virus, and we need to work together to save lives. That means passing legislation to require masks in public places. It's received bipartisan support. This policy would greatly improve compliance, it would help our law enforcement, and it would slow the spread of COVID and support our businesses. I want to acknowledge Representative Tommy Brand for standing up in favor of this policy. As a small business owner, I know he has a unique perspective here. And as federal coronavirus relief funds expire at the end of the year, I've urged the legislature to work with me to focus spending on direct public health costs like hospital overflow, staffing needs, testing, PPE, and mitigating the spread of COVID in our prisons and congregate care settings, in our veterans' homes, adult foster care, and nursing homes. In the absence of federal funding, we also need funding to begin preparations for vaccine distribution and administration. So we as the state need to step up and make this a priority now so we're ready when the vaccines are available. We must also work to support our schools. Our public schools have played a critical role within our communities since the onset of this pandemic. They not only have continued to provide learning opportunities for our students in whatever manner is available, but they have stepped up to provide food, emotional support, and other critically needed services that help countless students and their families across Michigan. The work of our school administrators, our teachers, and support staff over the past year has been critical in helping students find as much normalcy as possible, enabling parents to return to work and our economy to begin to recover. But our school officials are scrambling to make ends meet. Providing some support for them is going to make and take a commitment at every level of government. That means a bipartisan recovery package at the federal level to help our schools. The nature of this virus demands that we all work together to protect the people that we serve. We cannot wait to get it done. Yesterday, my administration announced the Pure Michigan Small Business Relief Initiative. This program will put $10 million of CARES Act dollars to use to award grants of $15,000 to Michigan small businesses that have been hit particularly hard by COVID-19. Businesses will be able to apply for grants starting December 15th. It's first come, first serve, so small business owners, mark your calendars for December 15th. And to determine whether your business is eligible, please visit the MEDC website. As we head into the holiday season, I want to remind all Michiganders, if you are shopping for loved ones or friends or neighbors, strongly consider supporting businesses in your community. Last week, the MEDC launched the Support Local campaign, reminding Michiganders to shop small during the holidays and throughout the winter months. There are a number of ways that we can support local businesses this season and stay safe. Buy your holiday gifts from small businesses that you love or find online in your area. I, for one, have sent Detroit Basket Company gift baskets to my sister and her family in New York. They're going to have burners and Faygo and Better Made chips and a lot of other good stuff. I also ordered a bunch of candles from Kalamazoo Candle Company that I'll be giving to people. I went shopping at October Moon in Old Town, Lansing. And you can help a small business restaurant by ordering and buying gift cards for loved ones. My brother is getting a Crunchies gift card. I encourage you all to seek out small businesses here in Michigan and give them your business and treat your loved ones to a cool Michigan gift. Our small businesses are truly the lifeblood of our communities, and we must do everything we can to help them and to support them. I've spoken to people all across Michigan about the impact of COVID-19's about the immensity of the impact of COVID-19 on them, their families, and their businesses. My job is to work on behalf of all 10 million people in this state, and I'm committed to making sure that your voice is heard here in Lansing. Yesterday, I had a call with nurses who have been taking care of people throughout this pandemic. Last week, I spoke with postal workers as they geared up for the busy holiday season, just finishing the election season. I've spoken with business owners from Detroit to Marquette who are desperate for some support from the federal government. And I know every one of us is tired of this pandemic. Me too. We've been fighting this for a long time, but we have to be resilient enough to see this through. We've got to continue working together to eradicate this virus. I'm not going to sugarcoat this. The next couple of months are going to be hard. Last Sunday, I spent my time with our leadership at DHHS, including Dr. Khaldun and a number of others here who are working so tirelessly to keep people safe, on calls with national experts. Did a number of calls back to back and spent a lot of our Sunday trying to make sure that we're asking the smartest people to give us counsel as we are forging our path here in Michigan. We all know the next 2 months are going to be hard. Too many people traveled for Thanksgiving, and we will see our numbers increase very likely because of it. And that'll coincide with the next big holiday, Christmas. And too many people are considering traveling, and I'm reiterating, please don't. And about 4 weeks after that, we will see the impact of that. So the next 2 months are going to be hard. Our case numbers, our hospitalizations, and deaths are dangerously high already. And even with our targeted and temporary actions to slow the spread, we expect to see numbers increase over the coming weeks and months as more people travel for the holidays. To our families, to our medical frontline and our small business owners and our essential workers everywhere, I will continue working around the clock to try to make your job a little less hard. I'll continue to follow the data closely, and I'll listen to public health experts like Dr. Khaldun as I continue to make decisions to protect people and public health. And the good news is there is hope on the horizon. There truly is significant progress being made in the realm of vaccine development from Moderna, from Pfizer, and from a few other companies that are in that process as well. We will continue to work 24/7 to ensure an effective and safe vaccine is distributed safely and in a way that follows the CDC guidance. There is light at the end of this tunnel. We're gonna get through this. It's gonna be hard, but you know what? We're Michiganders and we have grit. We've come this far. A few more months and we will see the light at the end of this tunnel. We're tough enough to beat any crisis that comes our way. We've done it in the past. We can do this. So let's mask up. Let's take care of one another. And with that, I'll hand it over to Dr. Janae Khaldun.
Thank you, Governor. Good afternoon. So as of yesterday, we had 360,449 cases and 9,134 deaths due to COVID-19 in Michigan. Overall, our case rate is now at 608 cases per million people and has been declining for the past week. All regions of the state have seen a decline in cases over the past 7 to 15 days. However, case rates remain above 500 cases per million people for all areas of the state except for the Traverse City region. Test positivity is also showing slight improvements, with the positivity rate declining as well over the past week. Test positivity is now at 13%, and this is down from 14% on November 16th, but it is still obviously much higher than we would like it to be. We are cautiously optimistic. Based on what we are seeing, more people started doing the right thing towards the beginning of November. That means wearing masks, not gathering, and maintaining 6 feet of distance from others. And we think that is contributing to the decrease in our rate of rise in cases. We will continue to watch these trends as we have throughout the pandemic in case rates and test positivity, and especially looking for those increases from the Thanksgiving holiday. That is one thing that I am very concerned about, is that people may have gathered or traveled over the Thanksgiving break. Any increases in cases from the Thanksgiving holiday, we would not expect to see for 2 to 3 weeks in our data. If you did gather or travel during Thanksgiving, you should really make sure you're trying to stay away from others as much as possible for 14 days after you traveled. You should also wear a mask whenever you will be around someone outside of your own household. And please keep in touch with anyone who you may have interacted with over the holiday break. If you or anyone you were in contact with becomes ill, you should immediately get tested and isolate from others. The state still offers hundreds of testing sites across the entire state, and many of them are free. You can go to our website, www.michigan.gov/coronavirus test, or you can call 211 for assistance in finding a site near you. The actions that you take now could have a real impact in decreasing how much the virus spreads. We also continue to watch the impact of COVID-19 on our healthcare systems. Michigan still has about 20% of inpatient beds filled with patients that have COVID. Overall, there are about 4,200 patients hospitalized for COVID-19 across the entire state. We are in regular contact with our healthcare system leadership to support them in managing their bed capacity. Since October, the state has actually identified 9 additional community recovery centers. That means 200 additional beds that can support hospitals in discharging patients from the hospital who need long-term care services. And again, we continue to be in regular communication with our healthcare system leadership so that they can maintain sufficient capacity and implement their surge plans effectively. I also want to give a brief update on contact tracing. So statewide, our ability to investigate cases of COVID-19 is the highest that it's been throughout the pandemic. We are able to attempt outreach to over 4,000 positive cases on a daily basis. However, with several straight weeks of over 5,000 newly identified cases per day, this surge is surpassing our ability to perform timely outreach to all people who test positive. State and local public health staff simply cannot reach out to everyone in a timely way. MDHHS continues to hire additional staff, and we are providing guidance to our local health departments so we can reach as many positive cases as we can. We are still encouraging everyone to download the My COVID Alert app. It protects your privacy and it is free. And it can alert you if someone who you've been around in close proximity to test positive. As the governor mentioned, we are still working hard on planning for when a COVID vaccine becomes available. As many of you know, there are several vaccines that are currently undergoing clinical trials. 2 vaccine manufacturers, Pfizer and Moderna, have submitted requests to the FDA to be authorized to use in the fight against COVID-19. Right now, the FDA and the CDC are going through their process of reviewing the data that was submitted and will be making a final determination on whether or not the vaccine will be authorized to use and in what groups. We expect to have that decision by the middle of December. We are actively working on plans for distribution when these vaccines become available. The vaccines will require very specific storage requirements. The Pfizer vaccine in particular must be stored at very cold temperatures, actually negative 70 degrees Celsius, and it will require special cold freezers to store it. As of today, there are 48 hospitals and 12 local health departments across the state with these ultra-cold freezer capabilities who are able to receive and administer the Pfizer vaccine if it became available today. There are also over 100 hospitals and local health department sites across the state that have the ability to store and distribute the Moderna vaccine, which does not have to be stored at such a cold temperature. We are working with all of these sites to make sure they have what they need to start administering the vaccine the moment it becomes available. It's important to note that when Michigan first gets the vaccine, it will be available in very limited quantities. And we are still awaiting word from the CDC on exact numbers of doses that Michigan will receive in that first allocation. Because there will be such a limited amount in the beginning, our first priority will be to keep our healthcare systems operating and to protect those who are the most vulnerable. Right now, this means that we are prioritizing vaccinating frontline healthcare workers, such as EMS, those working on hospital medical floors, in ICUs, or in emergency departments. And as the vaccine becomes more available, hopefully by January, we hope to quickly get vaccine out to people working in congregate care facilities and residents of skilled nursing facilities. But all of this is dependent on how quickly additional vaccine becomes available from the manufacturer. Per CDC recommendations, and again, depending on the supply of vaccine, we will continue to expand to other types of critical healthcare workers. That includes essential workers, which includes educators, also those who are at highest risk of severe illness due to COVID-19, and then eventually to the general public. We hope to be able to have vaccine available to the general public by late spring. It's important to note that each of these 2 vaccines will likely be first available and will require 2 doses actually to provide immunity, and those will be separated by several weeks. Initial data shows that both of these vaccines are about 95% effective, and it will be important that we can vaccinate as many people as possible. So overall, as the governor mentioned, I'm hopeful. We have some very early indicators that in November, people started doing the right thing, and we are starting to see a slow in our cases. We now know that vaccines will soon be available, potentially in the next 2 weeks. So this is not the time to ease up. Now more than ever, we must collectively strengthen our resolve to do what's right and to take care of each other and our frontline workers. Let's all continue to wear our masks, to avoid gatherings, to wash our hands, and please, there's still time to get your flu shot. A vaccine, fewer deaths, and brighter days are right around the corner in 2021. So thank you, and with that, I'll turn it back over to the governor.
Thank you, Dr. J. With that, happy to open it up for some questions for either me or Dr. Khaldun.
All right, great, Governor. The first question will come from Emily Lawler with MLI.
Governor, thanks for taking my question. I know that you mentioned the data is still early on the effects of the 3-week pause. Wondering if there's any chance or consideration that you might extend that at this point.
Well, I appreciate the question, Emily, and I'm sure that that's what's on lots of people's minds. Certainly, you know, Dr. Khaldun and I are working with our medical experts, including Dr. Lyon Callow and University of Michigan School of Public Health and the department, and our local experts as well. Our county leadership has been really, the local departments of health have been doing incredible work. And as I mentioned on Sunday, we spent a lot of time with national experts to determine how we best protect people. You know, at this point in time, it's really too early to say precisely where we will be in a few days, much less next week. But I think it's important for people to know we've not predetermined anything. It's going to be driven by where we see the numbers. We have modeling calls, and we are getting up-to-date information. And so as we continue to monitor the numbers, we're going to also continue to center our work around keeping people safe. You know, the epidemic order was geared toward stopping the spread of COVID by limiting interactions that are indoors, where people are maskless, where there are many households present. And that's why it's been a very targeted way of trying to bring our numbers down and to keep people safe. We also, you know, as we are consulting our public health experts and getting this data, we know what it takes to be successful here. And if more people embrace masking up and avoid any gatherings that have multiple households that are indoors, that are maskless, especially anywhere really, if you're together and maskless, it's inherently dangerous. And so if everyone does their part, we'll see these numbers drop, and we'll be in a stronger position both for our health systems that are really seeing numbers fill up, and also seeing medical employees, nurses and doctors and respiratory therapists succumb to COVID themselves because of the high prevalence in communities. And And that is our most urgent priority right now, and that's what we're focusing on to get our numbers back down. So I would anticipate early next week we'll have a much better idea of what this pause has meant, if people have taken it seriously and done their part, and if we're and that will inform any decision going forward.
The next question will come from Mara McDonald with TV4 Detroit.
Hi, Governor. Thanks for taking the question. I'm not trying to beat a dead horse on the restaurant issue, but when you and your team are looking at the numbers that will determine your course of action next week, is it strictly the volume of cases? Is it test positivity? Can you, I mean, I can't tell you how many DMs I get on social media from people who work in restaurants who, I mean, they're facing an existential crisis and they're scared. Can you give them an idea of what the numbers need to look like and what specific numbers you're looking at in order to make this decision, especially to reopen dine-in?
Well, I know that they're scared. They're scared of what it means not to have a paycheck. They're scared of what it means to go back to work and possibly get the virus and bring it home to their loved ones. I think we're all feeling that anxiety, but no one as acutely as restaurant workers. And that's why we are really being thoughtful and targeted and listening to our public health experts as we design a path forward here in Michigan. You know, I was talking to a restaurant owner yesterday who acknowledged, you know, the kind of different way that they've been providing food to their customers, takeout. They've changed their model. I know not every restaurant has done that or has been able to do that. But he said, you know, consumer confidence ultimately is going to be the most important thing, and that's why following the science is really important for the long-term economic health of restaurants and obviously for our people. So that's why we focused on places where people are indoors, where they are from multiple households. I challenge you to think about even a 10% full restaurant and what that means in terms of how many households are represented there. And inherently unmasked because people are eating. That's just unfortunately all the different ingredients for a higher risk situation, and that's why we've tried to do this strategically. All of that being said, you know, we continue to look at positivity rates, all right? So that's the percentage of tests done that are positive. We're continuing to stay very close to the heads of our hospital systems so that we've got data in terms of how many beds are filled, what we are seeing in that trajectory. These are two important metrics that we're looking at. I need to reiterate this often. Context matters too, and that's the public health part of this. The contact tracing. We are getting so overwhelmed because there's so much community spread that we are challenged to get contact tracing as quickly and as connected as we were doing this summer, simply because there's so much COVID across the state of Michigan. And that hurts us when we're really trying to divine what the context is. And why that matters is if all cases can be attributed to one place, well, that's a different solution than if there is community spread everywhere. And unfortunately, we're in a position where it is the latter, and that's why it's so much more concerning and serious. So there are a lot of different factors that go into this, and each of those is important and tells a much bigger picture about what's happening at the local level.
Okay, at this point, Governor, next question will come from Rick Alvin with TV8.
Governor, thank you for doing this afternoon. I know that you have advocated over the months for the Democratic plan in the U.S. House for another stimulus and COVID relief plan. But this morning, bipartisan group of Republicans, Democrats, independents from the Senate and the House, including some Michigan legislators in the Problem Solvers Caucus, introduced a $900 billion stopgap plan, no stimulus, money for state government, money for unemployment, money for PPE, money for distribution of those vaccines. I know it's not what you have talked about, but if they could get traction, would that be of some help?
Absolutely, Rick. And I am encouraged to see that there are people on both sides of the aisle that are engaging in dialogue to see how we can help get through this moment. It maybe is not the long-term solution that we all want and need to see, but to help us in this moment would be a great thing, and provide much needed support for families who are struggling, for businesses that are struggling, to Mara's question. So a bipartisan relief plan that requires leaders from both sides of the aisle to come together would be welcome news. I've not studied all of the intricacies of the proposal. I can just say that the spirit of it is something that gives me great hope, and I'm encouraged.
All right, we've got time for just a couple more. So the next question will come from Eric Lloyd with TV 9 and 10.
Hello, Governor. I was just wondering, when you make your decision to either extend or end the 3-week pause, is it going to be an all or nothing plan, or is it going to be kind of in phases where maybe schools are put back or theaters, but restaurants are still closed for indoor dining?
Eric, I appreciate your tenacity. I can't shed more light on it at this juncture, and I know, maybe. I know that people understand too that these are epidemic orders that come from the Director of Health and Human Services. We are having constant conversation and updates and discussion about what next steps might look like, but it is too early to tell you what the director is thinking and what our experts like Dr. Khaldun, Dr. Lyon-Kello, and our public health experts are recommending. So we're not at that point in time. I wish I could tell you more, but it's just premature.
Okay, Governor, last question will come from Jim Kirchner with TV 7 in Detroit.
Good afternoon, Governor. I'm going to go to the restaurants one more time. We had a story break here yesterday in Macomb County in Metro Detroit that some restaurant owners, some bar owners are talking amongst themselves behind the scenes about defying your state orders, especially if they are extended next week after the current ones expire. On Tuesday, they're awaiting the federal judge's ruling. It could come out now at any minute. The federal judge over in Kalamazoo with their legal challenge on that. You talked about getting compliance with masks. You want the legislature to bake that into the state law. If you see this growing group of owners taking a stand and defying you and the state orders, what's your reaction to that? They tell me that restaurants just to the south of us in Ohio are remaining open and doing so safely. They're frustrated. How do you respond to them?
Well, let me just say this. I understand the frustration. I understand the fear. None of these decisions that have had to be made over the last 10 months has been easy. Every single one of them has weighed heavily on me, on all of us. And yet we know that this virus has taken the lives of over 9,000 people in Michigan. When September 11th happened, the whole world stopped. We helped one another. We saw the humanity in one another, and we stepped in to do our part. We forever changed the way that we live and how we travel, because that's how we keep one another safe. We've had over 3 9/11s here in Michigan in the last 10 months. It's devastated families. So many of us know someone who's died or is struggling with COVID, or is struggling with COVID months after they've had it. This is still a very real threat to all of us. I want these restaurants to succeed. I want to do everything in my power to help them through these tough times. That's why I've asked our legislature to get this $100 million plan passed. That's why I've been asking our federal government to take some action. But since they haven't, I'm hoping that our legislature will work with me on this to give some relief to these restaurants. I don't want them to have to make tough, awful decisions that could jeopardize their workforce and their customers, because I want them to be successful, and I know they need help, and I'm trying to give that help. I would discourage people from willfully breaking the law, always, no matter what the law is, on any subject. I would strongly discourage that. But I think in this moment, we need to give one another a little empathy and a little bit of grace and recognize the gravity of this situation.
All right. Thank you, Governor. Thank you, everybody.
Thank you.
All right, watching News Now from Fox. I'm Daytona Everett. That was Governor Whitmer speaking about COVID-19 response in the state of Michigan. But as you heard right there, she's still not committing to extending or ending this 3-week pause in Michigan. Just to dive a little bit deeper into that, Michigan is 2/3 of the way through the epidemic order, referred to as a 3-week pause. It was implemented in mid-November, and while data is showing a little bit of improvement in the state of Michigan, Governor Whitmer said she wouldn't commit to plans on extending or ending that pause, despite a lot of those reporters kind of pressing her on that issue. Several restaurant workers frustrated with the situation, saying bordering states are open, why can't our restaurants be open? So this is an ever-changing situation for all of these states, and that includes the state of Oregon as well. We have Governor Kate Brown, who is speaking live right now. We're going to send some of you off to a 2-minute commercial break, but when you come back, the latest from Oregon. Just want to remind you, though, you're watching News Now from Fox. I'm Daytona Everett. You can follow not only my Twitter account, but also our News Now Twitter account at News Now Fox. We have a lot of great content on there, and here on News Now from Fox, we have live, raw, unfiltered feeds all throughout the day, all across the country. So no matter what or where you're located, even across the world, it pertains to you. So we're happy to have you here on this beautiful Tuesday. We were seeing a little bit of snow earlier in Pennsylvania. We might check in on some of our live feeds out there. Pretty soon they're getting hit by a winter weather advisory as well as a tornado last night. So interesting weather across the country, but here in Phoenix, Arizona, it's sunny and beautiful and in the 70s. So I apologize for everyone across the country right now. So again, we'll take that 2-minute commercial break and then update from Governor Kate Brown.
For our vulnerable children in foster care, or making sure that families have the ability to put food on the table through the SNAP program, were held in place. In terms of where did we see the pain, I will tell you we saw it in places in the budget, from our court system to our public safety system. Together, our public safety system, we cut roughly $100 million. I had a very tough conversation with the hospitals today because the Oregon Health Plan is still short roughly $400 million. So that we need to work collaboratively to preserve our healthcare infrastructure. We need to make sure that our hospitals and medical providers have the tools they need to provide healthcare for Oregonians around the state.
Thanks, Hillary. We'll go next to Gary Warner with EO Media. Go ahead, Gary. Gary, I think you might still be on mute. Okay, we'll come back to Gary. We'll go next to Wright Gazaway with K2. Go ahead, Wright.
Real quick follow on what you just said. The Hospital Association just sent out a statement after you started saying that the cuts to the hospitals could force them to reduce services to Oregonians during a pandemic. Can you just respond to that direct criticism?
Absolutely. I'm absolutely committed to making sure that every Oregonian, regardless of who they are or where they live, has access to health care. if the pandemic has shown us nothing else, it's that healthcare is so critically important for every Oregonian. As I met with the hospitals this morning, I said this is the starting point, and I look forward to working with them to make sure that we have the resources to provide healthcare to every Oregonian, and that we can sustain the Oregon Health Plan into the future. In addition, frankly, to providing very critical health care to Oregonians, our hospitals and our medical providers also provide really good paying jobs. And I want to make sure that we don't lose that healthcare infrastructure in communities around the state. And I'm absolutely committed to working with them to make sure that we can create a sustainable future.
Thank you. Just one quick follow-up. You mentioned in your budget that you needed some federal help on the testing stuff. The White House reports have consistently said that we need to increase testing for asymptomatic and other exposed people. What would an ideal testing project look like in Oregon, and why is that something the state cannot fund?
So our needs for the next year for the pandemic response run roughly $750 million. I think I said in my remarks, $685 million. This includes testing, it includes contact tracing, and it includes vaccinations. Ideally, every Oregonian who wants a COVID test should be able to get one. Obviously, we are a ways off from ensuring that that system exists. But in order to deliver, we need financial help from the federal government. And this is an area where Republicans and Democrats and everyone in between can help us with that. Everyone has the ability to call their congressperson, their congressman, or their congresswoman. We can all write letters. We can all send emails. Together, if we work collectively, I'm confident that our federal government will step up and provide assistance to help us.
Thanks, Wright. It looks like we have Gary Warner back with EO Media. Go ahead, Gary.
Thanks. Governor, before the pandemic, higher education funding was already hurting. What's your budget going to do to higher education funding, both on community colleges and on four-year universities? And if you could help me find a little grain of sand in there, is there going to be money for OSU Cascades and their capital budget?
In the capital budget, yes, there is money for OSU Cascades. What I have heard from the community is that the student center is really important. In my visits to the university, I heard from students who said, honestly, I wouldn't be able to attend higher education without the presence of this campus in Central Oregon. So I know it's a life changer for many Oregon students. So I look forward to working with the legislature to fund this particular project. In terms of higher education, I will tell you that I struggled making really difficult choices and tough decisions. I didn't have enough resources to build the budget I wanted, particularly for higher education. Both the universities and the community colleges were left at the legislatively approved budget from the last biennium. So I am hoping that we can work with the legislature to find some more resources for our universities and our community colleges. Our community colleges are our workhorses. They are the ones providing career and technical education. They are working hard to make sure that students in communities very small and even very large have access to the skills they need to provide for their families. And our universities literally open up the world for our students. We need to make sure these are both adequately funded.
Thank you, Governor.
Thanks, Gary. We'll go next to Dirk Vanderhart with OPB. Oh, go ahead, Dirk.
Okay, thanks. A couple quick questions, Governor. You mentioned potential new resources for higher ed. Are you planning to push another revenue stream in the upcoming session? Do you have one in mind? I didn't see it in your proposal. Or alternatively, are you committed to not pushing for a new tax or something along those lines? And second of all, sorry, I also didn't see a lot of mention of your executive order around capping greenhouse gas emissions and doing that via your administration. Is that effort fully funded in this budget, or are you leaving some components of that behind?
In answer to your last question first, I am committed to fully funding the work we are doing through my executive order to cap greenhouse gas emissions in Oregon. You might recall either the first or the second special session, we worked to make sure that we had adequate funding for the agency to continue this critically important work to tackle global climate change. As we saw with the wildfires this year, climate change is impacting Oregon now, and we need to take action now, and I'm absolutely committed to following through. In terms of revenue, given the challenge with the budget, this budget plans a couple of things. As I mentioned earlier, cuts in systems, whether it was public safety, healthcare, and others. We also, frankly, closed some tax loopholes that primarily benefit wealthy Oregonians. So that's how we approach the budget, and frankly, asking for a lifeline from the federal government.
So no new taxes then, but you are closing some tax loopholes, which a lot of people might consider a tax raise.
That's correct.
Thank you.
Thanks, Dirk. We'll go next to Sarah Hurwitz with KPTV. Go ahead, Sarah.
Thank you, Governor. Last month there's been a push from some Oregon lawmakers for a legislative special session to help some struggling Oregonians right now. What's the likelihood that you would declare a catastrophic disaster so that the legislature can actually conduct a remote session?
I think that the likelihood of a catastrophic session is great. I am absolutely committed to making sure that we meet the needs of vulnerable Oregonians, particularly those who may be evicted from their rental homes at the end of the year. I am working with legislative leadership on that package. In terms of how we do it, honestly, given the level of community virus spread, I think we have to do it in such a way that it is safe for legislators, for the staff, and ensure a way for Oregonians to participate via technology and public hearings.
Thank you.
Thanks, Sarah. We'll go next to Peter Wong with the Portland Tribune. Go ahead, Peter.
Governor, okay.
There you go.
Okay. On the Oregon Health Plan and FMAP, would a continued increase in the federal share of Medicaid eliminate that shortfall, or do you have to negotiate something like a new provider tax agreement or some other way to raise the revenue, given that you would not want to cut services?
Thanks, Peter. And I would love to ask you a question when I'm done answering yours. As I mentioned earlier, I think it's so critically important during a global pandemic that every Oregonian have access to healthcare. We've done really good work. Right now, we have roughly 94% of Oregonians covered, adult Oregonians covered through the Oregon Health Plan, and 100% of our children are eligible for the Oregon Health Plan. I think Oregon can do better, and we should be at 100% for adults. I think we've seen the impacts of this pandemic, particularly on our historically underserved communities of color and tribal communities. So as I mentioned, we have a shortfall in meeting the needs, the funding needs of the Oregon Health Plan, roughly $400 million. I'm really open to that conversation and how we do that. I do think one of the challenges in putting together this budget is that I didn't know what level of federal aid, including FMAP match, that we would be receiving. And our revenue forecast will be updated in February. The legislature will have the benefit of both of these, I hope, and it will enable them to build the budget on more concrete revenue. In the meantime, I've already tasked my team, led by Tina Edlin, to sit down with hospitals, providers, and labor advocates to have conversations about how we can close this gap. I think the challenge for our healthcare system is that everybody is just spread really, really thin. Folks have been working so hard for the last 10 months to meet the healthcare needs during this pandemic. As you know, we're in the midst of a surge. A number of our hospitals, particularly in the metro area, have already modified elective or non-emergent surgeries to ensure that they have enough beds and ICU beds for this COVID surge. So it's really a challenging time for our healthcare system. And I'm hoping over the next few months, we can come together and come up with a package that will sustain funding for the Oregon Health Plan and deliver our priorities of making sure that every Oregonian has access. And so, Peter, my question for you is, how long have you been working in the Capitol or reporting in the Capitol?
If you subtract the 5 years from 2015 to the start of the pandemic when I was reassigned back here, 35 years. Actually, my first special session was in August 1980, so 40 years.
Thanks, Peter.
Thanks, Peter. We'll go next to Julia Silverman with Portland Monthly. Go ahead, Julia.
I unmuted? There we go.
Yes,
Governor,
we can hear you.
Sorry about that. Thank you. Governor, as you know, a number of your colleagues in other states, including New York, New Jersey, Rhode Island, and Washington, have taken some very specific steps toward reopening schools, including a statewide program providing testing for educators and students, centralized bulk purchasing for air quality improvements like air purifiers, and school-specific contact tracing. I'm wondering if you could explain a little bit why Oregon hasn't yet adopted any of those measures, particularly given the data emerging from around the country and the world that schools, and in particular elementary schools, don't seem to be centers of transmission, as we most recently heard yesterday on OPB from Dr. Dawn Nolt, the medical director for infection prevention at OHSU Dornbecker. Thank you.
Thank you, Julia. And I was just on a call with superintendents this morning and on a call with teachers and advocates yesterday. I am absolutely committed to getting our kids back into schools. We know that our kids are literally suffering from COVID in so many ways, a COVID crisis, so to speak. They are, frankly, struggling with a lack of social and emotional support that they get in our schools. They are struggling with online learning, and they are struggling, frankly, with some basic services. The school districts have worked really hard. The teachers have worked incredibly hard to do the best they can with comprehensive distance learning. We know that some school districts in Oregon have been successful in reopening, particularly in our rural school districts. Other school districts, frankly, have challenged when the community spread is high. And that's what we're seeing, frankly, all across Oregon. So there are a number of strategies that we are working on, including addressing vaccination needs for teachers and professionals that are in the school system, addressing other tools that our schools need to reopen, and working with our teachers, with our superintendents to figure out how we can do this safely for professional staff, for teachers, and for our kids.
Sorry, so if I could just quickly follow up, are you saying that there is a plan then for school-specific contact tracing and testing, or something in the work?
We are working on a plan specific for vaccinations for teachers and schools.
Thanks, Julia. We have time for just a few more questions, so we'll go next to Ben Botkin with the Lunch Report. Go ahead, Ben.
Yes, Governor. I was hoping you could clarify one thing. I heard you mention a $400 million shortfall in the context of healthcare, I believe, and the press materials I've read mention a $718 million shortfall. So I was just hoping you could clarify that.
Ben, I will have my public health advisor get back to you for the details on that.
Thanks.
Thanks, Ben. We have time for just two more questions, so we'll go next to Noel Crombie with the Oregonian. Go ahead, Noel.
Thank you. Can you hear me?
Yes, we can hear you, Noel.
Okay, thank you. Sorry, Governor. Good afternoon. Governor, I was wondering if you could address your proposal to close 3 minimum security prisons, given the pushback we heard from Lakeview and North Bend over the summer, and how that proposal fits into your criminal justice priorities.
Thank you. Oregon has made some incredibly great strides toward criminal justice reform. Under the prior administration, Governor Kitzhaber, we took the steps to create the criminal justice reinvestment plan that has been extremely successful. In the last legislative session, we passed Senate Bill 1008, really incredible reforms. And there is so much more work that we need to do. And I am working closely with my Racial Justice Council to ensure that we are centering the voices of Black, Brown, and tribal Oregonians in that work. My plan for the future of our prison system is that the state will no longer invest in extensive and expensive buildings, but invest in the people. Rehabilitation, and of course, ensuring that our communities can be safe upon their release. The schedule is over a period of time. So I am proposing that Mill Creek close the first of next year, January 2021. I'm sorry, I got that wrong, July of 2021. My staff is all panicking. Shutter Creek in Coos Bay closed 6 months later, and then Warner Creek in Lakeview closed a year and a half later, essentially. So it's 6 months, 6 months, and 6 months starting July 1st of 2021. Got those dates right. And the reason for this is that obviously Mill Creek is in Salem. There are other correctional facilities that can absorb the corrections officers here and take on these really great employees that have been on the front lines of the COVID pandemic. In Coos Bay, that is roughly a year out. We will be working with those corrections officers to work on reemployment either in state system or elsewhere, and obviously Lakeview as well. These are really tough decisions. And I have to say to our corrections officers around the state, I know it's been an extremely challenging year. We are grateful to you for your hard work. We appreciate everything that you are doing to protect our adults in custody, and look forward to working with you as we make this transition to a more just Oregon.
Thanks, Noel. We have time for just one more question, so we're going to go to Dick Hughes. Go ahead, Dick.
Thank you very much. Governor, to follow up on that
question, as I often like to do. I want to ask about rural Oregon. Prisons are centers of employment in rural towns. I mean, like, that's why Sheridan wanted a federal prison. And when you're talking about equity, people in rural Oregon would say, where's the equity for us? And we're losing these sources of jobs and vendors and things like that. So how does your budget treat rural Oregon, and how will it help Coos Bay and Lakeview and places like that survive this loss of jobs?
So, Dick, I will end the conversation today with where I began it, and that is around racial justice. What the pandemic taught us is that we have communities of color in every single corner of the state, and that it's critically important that we invest in all of these communities, provide them with the tools and the resources, not only to survive, but to thrive. And I think it's fair to say that our communities of color, our tribal communities, also primarily in rural Oregon, and our rural communities have been historically underserved. We make significant investments in these budgets to address these needs. I also made significant investments in our communities that were impacted by the wildfires. Not only did we provide specific relief for repair and rebuild, but we added additional resources, including $170 million for community development, and then an additional $70 million for wildfire preparedness. This looks like job creation. It looks like harvest and thinning and prescriptive burning, so that we can build healthier, more fire-resistant landscapes. I invested over $100 million in broadband. Every single school across the entire state must and deserves to be connected to the internet. That benefits both rural and urban Oregon, of course. And then we have the ability to create, to invest in communities through capital construction. For example, in each one of the fire impacted communities that was on the list for a courthouse, I funded those projects. We funded other projects. And I think, Dick, you know, I've been trying to rebuild the dam in Wallowa County for a couple of years now. And all of the projects, almost all of the projects that were on the 1921 lottery list were refunded again this year, including the Wallowa Lake Dam.
Thank you.
Thanks, Dick. That's all the time we have for questions today, everyone. Thank you.
Thank you, everyone. Thank you, Charles.
Thanks, Governor. You're watching News Now from Fox. I'm Daytona Everett. That was Governor Kate Brown introducing what they are kind of striving for in this next 2021 year. Looks like we have a little more audio up. Yeah, so again, that was Kate Brown. She was talking about what that 2021 budget will look like, but she was really kind of talking about the needed stimulus bill that still is in talks with Congress right now. We're going to get to that in a moment, but first I want to show you the big board. If you take a look at this, U.S. equity markets climbed into record territory today after a bipartisan coalition floated a plan for a $908 billion COVID-19 aid package. We'll get to that in just a moment. The Dow Jones, though, climbed 184 points, 185 from this right now, just 0.63%, while the S&P 500 and the NASDAQ were higher by 1.13% and 1.28%, respectively. The major averages finished off their best levels of the day when the Dow was up more than 400 points. So economically, we're looking good, but that stimulus bill is still kind of in talks right now. We've heard from Chuck Schumer today. We are about to hear from McConnell right now, Senate Majority Leader Mitch McConnell, because there was that bipartisan package that was floated, but, you know, McConnell was saying today we just don't have time to waste. He's saying that he was speaking directly with Treasury Secretary Steve Mnuchin and said that he knows exactly what Trump would sign into law and what he wouldn't sign into law. And people like Kate Brown, Governor Kate Brown in Oregon, are saying we need this now. We can't wait until January for this money in order to make these budgets. It's really kind of a ticking bomb right now. So we're going to play out Mitch McConnell from earlier today because we didn't have time to get to it. We've had a lot of live events here on News Now from Fox. They're live, raw, unfiltered feeds that are coming into us constantly from across the country. So this one right here with Mitch McConnell and other Republican senators talking about that COVID-19 stimulus bill. So this is big stuff right now. We're going to send some of you off to a 2-minute commercial break. When we come back, you'll have that update from McConnell and others. And we got a lot more to get to today, not just COVID-19, but some other breaking news that's coming across the country as well. Stay with us here on News Now from Fox.
Well, good afternoon, everyone. We just had a lunch meeting by conference call this time, aware of the growing concern about the rise of coronavirus, and we adjusted our meeting to reflect our concern about it being extra safe in conducting what we believe is essential work for the American people. The subject of additional coronavirus relief is on the minds of lots of our members. You've already spoken to probably Senator Collins, Senator Romney, and others who've been meeting with Democrats about a possible way forward. We received a proposal through a letter from Speaker Pelosi and Senator Schumer last night. Let me tell you where I think we are. Leader McCarthy and I have been in discussions with the Secretary of the Treasury and the President's Chief of Staff to try to ascertain what the President would actually sign into law. And I think we have a sense of what that is. I laid that out in the call that we had just a little while ago. We're going to send that out to all the offices and get some feedback to see how our members react to a proposal that we can say for sure would be signed into law. I think the one thing we all agree on is that we don't have time for messaging games. We don't have time for lengthy negotiations. The issue is, do we want to get a result? And I like to remind everybody that the way you get a result is you have to have a presidential signature. So I felt the first thing we needed to do is to find out what the President would in fact sign. We believe we've got the answer to that. We're vetting that on our side, and then we'll let you know later whether we think there's any way forward. But certainly we know we can say, I hope, that this is something that would be signed into law by the President, be done quickly, deal with the things that we can agree on now. And I think we all know that after the first of the year, there's likely to be a discussion about some additional package of some size next year, depending upon what the new administration wants to pursue.
Between now and the end of the year, we have to wrap up a lot of the unfinished business of this Congress, and so we've got a number of nominees to important agencies and judgeships that we will need to be acting on and filling. We've got to fund the government, obviously, and of course we have to pass a defense authorization bill as well, all of which we will have to try and get done hopefully the next week or two, depending on how much cooperation we have. As the leader pointed out, the issue of coronavirus relief is also subject of discussion, and I think in terms of the any of these year-end negotiations could be, if there's an agreement, wrapped up and considered as part of a spending bill or perhaps separately. But in any case, it would have to get a presidential signature. It'd have to get 60 votes in the Senate and obviously a majority in the House of Representatives. And so the question is, what does that look like, and will there be enough movement among Democrats to enable us to get an agreement? And I think what we've seen, of course, so far, we have now, not once but twice, passed, or I shouldn't say passed, but gotten 52 Republican votes in the Senate, a majority. If you could pass it at a majority in the Senate for a bill that provides funding for vaccines, that provides funding for schools, provides additional assistance for unemployment insurance, and also replenishes the PPP program, which helps a lot of our small businesses who are struggling and the workers who work there. Those are all things that the Democrats say that they agree upon, but they have insisted, at least up until now, on a bloated messaging bill on the order of a couple, $2.5 trillion or thereabouts, which is something that obviously would not pass in the Senate and get signed into law by the president. So the question is, what can we get through the House, 60 votes in the Senate, and a presidential signature on? And I would hope that in the course of the next couple of weeks, as we are debating the year-end issues, that we can get some agreement on something that fits those basic parameters. Like I said, we had all but one Republican who have now voted not once but twice for a bill that addresses those critical needs and things that I think both sides agree need to be addressed. But it will require a level of cooperation and compromise from the Democrats that we have not seen or witnessed yet in order to get that done. But I'm hopeful. I think the American people need help. They need relief. Our small businesses need help. Our frontline workers need help. Our schools need help. And obviously, we want to make sure that we're investing everything we can in the vaccines and the therapies that will help us defeat this virus. So those are areas of agreement, bipartisan agreement. The question now is whether or not Democrats are going to come to the table in a meaningful way and help us get something across the finish line.
Nancy Pelosi has been stubbornly dug in since she passed her bloated messaging bill about 6.5 months ago, stubbornly dug in against doing a coronavirus relief bill in a cooperative way. As a matter of fact, right before the elections, she said that she would not budge. She's been dead set for using the pandemic as a way to push a far left agenda, because she was going to use this and pick up 15 to 20 seats for Democrats in the House. Well, what happened? As a result of her actions, Republicans picked up over 10 Republican seats in the House of Representatives. Why? Because the Democrats refused to deal and address the number one issue, which is on the minds of the American voters, which was relief for coronavirus and dealing with the disease. So now here we are at a point where we have an increased number of cases around the country and around the world. And you say, so what is the House of Representatives doing this week? So I looked into it. Well, they have a bill that is going to be taken up in the Rules Committee tomorrow. It's called the MORE Act. I didn't know what exactly that stood for. So I looked into it, researched it. This is Pelosi's priority. Marijuana Opportunity Reinvestment Act. Now, I don't know exactly what's in that bill, but that is the priority of the House right now. I don't know if it has to do with decriminalization, legalization of marijuana, making it easier for our kids to get marijuana in our neighborhoods. Whatever it is, that is today's priority of the incredibly shrinking Nancy Pelosi-run House of Representatives. That's not what the American people are talking about. That's not what I heard about in Wyoming this weekend. What I heard about is all the good news about the vaccine. People looking forward to having that available to them. Well, the Republican relief bill has money for distribution of the vaccine. The Pelosi-Schumer approach, well, they really do shortcut the vaccine. The Republican bill has money for paycheck protection, the Senate bill that we're working on. That's what small businesses are asking for and the workers are asking for. It has money to help kids get back to school safely so they don't fall further behind. This is the path forward for our country. The Republican bill is sizable, it is significant, and it is the path that the American people want to follow.
I think also safe to say that today Senator Shelby said we were making real progress on the omnibus spending bill. I know on the part of the labor education bill, I think we're down to only discussing report language with the full committee help. We're going to close that out. The four members, House and Senate, have worked through that bill over the last couple of weeks now, and I think we're getting to a good place there. I hope we are with the rest of the bill. The other topic I wanted to talk about today was the arms sale, the F-35 sale to the UAE. It appears that sometime this month there'll be a congressional vote on that issue. My personal view is it would be a big mistake not to move forward with that arms sale. Israel is supportive. I think it may be the only thing that Netanyahu and Gantz had agreed on since they formed their coalition government, that this sale should go forward. They say that understanding that there would be a qualitative difference between the UAE F-35 and the Israel F-35, and then another difference between what we have. But for 20 years now, 3 different administrations, we have increasingly worked closely with the UAE on defense issues, on the ground together, in the air together, in at least 6 different extended deployments. The UAE has been there. Clearly, the Abraham Accords, what's happened with Bahrain following, and I think others to follow that, will be impacted by whether we continue to have the kind of cooperation on defense issues that we've had with the UAE, again, for 3 different administrations. That will come up. It will not successfully be stopped by the Congress, I don't believe, but it's a debate that we ought to be thinking about. I certainly think we should continue with that arms sale.
First, I want to welcome back my senior senator, Chuck Grassley, to the United States Senate and our work schedule. Whether Chuck is working from his Iowa farm, whether he's working from his office here in the United States Senate, or whether he's teleworking because of the virus, Chuck Grassley works. He is always working. Many of you have probably heard the Chuck Norris jokes out there. You know, the dark is afraid of Chuck Norris. Well, we have our own Chuck Grassley jokes too. And right now the COVID is afraid of Chuck Grassley. So we are just very thankful to have him back and in good health and continually working for Iowans. He is just such a tremendous asset to our great state of Iowa, and we wish him continued health. As we are approaching the end of our congressional session, we do have a number of things that need to be done, and I just want to address 2 of those that some of my colleagues have already mentioned. One is making sure that we have a coronavirus bill that is done. Just earlier today, our governor of the great state of Iowa, Kim Reynolds, did state that Congress needs to come together and get a bill done. We have people across the state of Iowa and across this nation that are hurting. We want to keep a strong economy. We want to keep our citizens safe and healthy. And then finally, we do have the National Defense Authorization Act that is hanging in the balance. We need to work together to ensure that we get this completed. We have done this for many decades now in a bipartisan fashion. We need to do it again. It includes a lot of provisions that are very good for our servicemen and women. Things as simple as body armor for females, body armor that conforms to the size and shape of a female. So simple. Well, that's included in this National Defense Authorization Act. So it is vitally important that we are putting our service members, their safety first, and getting that over the finish line. So I'm just encouraging our Democrats, come back to the table. Let's work through these issues. Let's get the NDAA done, and let's get this coronavirus bill done. Thank you.
Well, I welcome everyone back. I hope you had a blessed Thanksgiving. It's, of course, December 1st, and we still don't have a coronavirus relief package that has been passed, signed into law by the president, and is providing relief to the American people. Look, people are hurting. They're beyond frustrated with this whole exercise. Republicans have put forward a package that, as the leader has emphasized, can actually be signed into law. one that provides assistance to schools and students, one that provides assistance to our hard-hit small businesses, one that provides additional resources for testing. So why don't we go ahead and pass what we can all agree upon, what we know can be signed into law, and then we can debate and negotiate and give further consideration to additional measures. As it relates to small businesses, I'll tell you, Hoosier small businesses have been absolutely hammered, as have so many others around the country. A recent NFIB survey indicated that nationally, 75% of their members would either consider or would go ahead and apply for a second round of PPP assistance, the sort of assistance that is included in the Senate package. So whether it's PPP assistance or inclusion of the Restart Act, the legislation, bicameral, bipartisan, that I put together with Senator Bennett of Colorado. It now has, incidentally, 58 co-sponsors with the addition of Senator Perdue of Georgia here in the U.S. Senate, 180 in the House of Representatives, again, bipartisan. So I'm going to continue to push on this small business front and on the other fronts I mentioned to provide the much needed relief to the American people. Unfortunately, it seems the House is focused on other priorities. We just heard that they're focused on something pertaining to marijuana and giving more consideration to marijuana policy before year's end. That can be debated, but the far left needs to sort of cool their jets right now as we deal with the serious business and the plaintive requests of our constituents around the country.
On COVID relief, you alluded to the bipartisan framework that came out today. Have you had a chance to look at that? And since you're talking about the importance of the president signing something, the House would have to pass something too. So why wouldn't a bipartisan proposal that could potentially also pass in that body be a better way to go?
Yeah, we just don't have time to waste time. We have a couple of weeks left here. Obviously, it does require bipartisan support to get out of the Congress, but it requires a presidential signature. And this government is in place for sure for the next month. And I think the place to start is, are we actually making a law or are we just making a point? And I think the way you make a law for sure is you know you've got a presidential signature. So we'll see how it goes forward. I think the one thing we all agree on, as I said, waiting till next year is not an answer. We need a targeted relief bill, including things that we can agree on.
The House Majority Leader has said that House Democrats are likely bringing back earmarks next year. Some of your Senate Republican colleagues say that with Biden likely being in control of the administration, Republicans should consider bringing back earmarks here in the Senate. Do you have an opinion about that?
Take your mask down and say that again.
Earmarks. House Majority Leader Steny Hoyer says House Democrats are bringing back earmarks next year.
Yeah, I haven't given any real thought to that. I did hear that Hoyer said that. That's a decision, obviously, the majority has decided to make over there. And it'll be interesting to see how the Republicans in the House respond to it.
Yeah. In terms of the timing for a COVID relief bill, does it need to ride on the government funding bill? What should we expect kind of on a horizon when it needs to come out, when it needs to come to fruition?
Well, first, we're working really hard to finish up the omnibus bill, as Senator Blunt pointed out. Obviously, given the challenges of moving things across the Senate floor speedily, that would be a vehicle to add on whatever coronavirus relief bill we know will get a presidential signature. And obviously, as was discussed earlier, it'll have to have Democratic votes to get through the House. But I think it'll all likely come in one package.
Given the concerns you've raised over the years about the electoral process, integrity in the election, why have you not spoken out and why have you been quiet amid the president's claims that the election has been rigged and it's been stolen from him?
As I've said repeatedly, we have this government for the next 3 weeks for sure. And what I'm focusing on is trying to accomplish as much as we can during this 3-week period, which requires dealing with the government that we have right now The future will take care of itself. As I've said repeatedly, we're going to go through these processes. The Electoral College is going to meet December the 14th. There'll be an inauguration January 20th.
You keep saying that the president, you want a bill that would pass COVID relief that would have the president's signature. But he's been far apart from Senate Republicans. He's been willing to go as high as $1.8 trillion. Are you coming up on your number? And is there anything from the compromise package that you saw today, which included state and local aid?
Yeah, well, what I'm doing, maybe I wasn't very clear about, what I'm doing is talking to Secretary Mnuchin, who's been deputized by the president to indicate what he's willing to sign. And Leader McCarthy and I went over with Meadows and Mnuchin this morning. For sure, what we know will get a presidential signature. That's where we began the discussion at lunch today. I'm sending that proposal to all offices. It's probably been done by now. We're going to get feedback about how our members feel about it, and then to determine the way forward. Yeah.
Is the judicial that nomination dead, or do you think we'll be able to try to reconsider that before March?
Well, as you may recall, I changed my vote and made a motion to reconsider, so we can reconsider it in the future. Thanks a lot, everybody.
Those are the updates there. Stimulus talks still ongoing in Washington. And live look right now at the Capitol. Great shot of that always in the evening there in D.C. I want to take you to this tweet that was just tweeted a little bit ago from the incoming U.S. Senator Mark Kelly of Arizona, saying, "This morning my family paid our respects to Senator John McCain as I prepare to be sworn in tomorrow. Senator McCain has been a hero of mine since I was a young pilot. He left a legacy of service to Arizona and country that can't be matched, but that we should all strive towards there." And then he also includes that picture as well. You're watching News Now from Fox here as we continue to roll on. Some of you will be taking a quick 2-minute break. When we come back, we're going to take you out to Chicago. Only 3 states not included in Chicago's COVID travel order. We'll tell you about that coming up next.
Who conveniently is also a fluent Spanish speaker and is going to help translate some of the remarks into Spanish. So let's start with our travel order update. As a reminder, we are updating the travel order every other week at this point. And as you can see, most of the country at this point is either red or orange, meaning we are recommending avoiding travel. There are only 3 states still that are under the 15 daily cases per 100,000 mark that makes it so that you should really avoid travel unless it's essential. That's Maine, Vermont, and Hawaii. All of the other states are either in the red category or the orange category. And you can see that for both red and orange, the advisory is to avoid travel. If it is a red state, you are required upon arrival in Chicago to quarantine for the 14 days. If it is a state in orange, you can either complete the 14-day quarantine or have a pre-arrival negative test. And then when you're here, avoid in-person gatherings with strict masking and social distancing. Here's what our numbers look like. Here in Chicago, we have almost 160,000 diagnosed cases of COVID. You'll see that our active cases are at almost 20,000. And as a reminder, an active case means someone who has been diagnosed with COVID-19 in the last 14 days, or if they're hospitalized in the last 30 days. That's about 13% of our cases throughout all of the time that COVID has been going on here in Chicago, which is an improvement over the last couple of weeks, but it still is a lot of active cases. We've had 136,000 people recover from COVID, and unfortunately, we've had almost 3,500 deaths. If we take our approximately 20,000 cases that are active right now, we know that between 5 and 7 times the number of people that are diagnosed with COVID actually have COVID. And so using that estimate, we estimate that there's between 99,000 and 140,000 Chicagoans with active infectious COVID right now. And that means as many as 1 in 19 Chicagoans still has active COVID right now. If you've been following along, that's a little better than last week where it was 1 in 17 Chicagoans, or the prior week when it was 1 in 15 Chicagoans. But still, the risk for COVID here is high. and gathering remains, unfortunately, a high-risk activity. Here is what our data looks like over time. The light blue is the 7-day rolling average. And you can see that we peaked at over 2,400 new cases per day as a 7-day average. As a reminder, we want this number less than 400 and ideally less than 200 cases per day based on our population. But we've seen over the last week and a half the numbers coming down. Our current average is now at just over 1,700 cases a day. Still 4 to 5 times where we like it to be, but definitely some improvement. This, of course, is prior to any potential post-Thanksgiving surge. It's still too early to see what that may look like, either locally or nationally, but obviously we're watching closely to see what impact that may have. Here's what our test positivity is looking like. The citywide test positivity is currently at 11.6%. Again, much higher than it should be. We want this down below 5%, but better than it was if we look back over the last week and a half to 2 weeks where we peaked at a 16% positivity across the city. If you look, though, across all of Chicago, we continue to see parts of the city that are hit harder than others. In darkest blue here are the zip codes where the positivity is between 18 and basically 25%. So there are zip codes still where almost 1 in 4 people are testing positive for COVID. And we've been pushing additional testing and outreach efforts through Protect Chicago, especially into Northwest and Southwest Chicago. Our ICU and non-ICU numbers have continued to rise. You can see our non-ICU numbers are more than 4 times what they were in early October. We still have, the red number is how many today. We had 1,056 people reported to be not in the ICU here in Chicago hospitals, another approximately 300 in the ICU. We're maybe starting to see just a little bit of flattening there. We would expect to see that, lagging about 2 weeks behind the improvement in cases, so we're keeping a close eye on that. This is a lot of people to have in the hospital with COVID. Our hospitals are under a lot of strain, and the goal is to, again, hope to start to see some coming down in those numbers. We're a little worried about around us, too, particularly in south suburban areas where there are a lot of cases and a lot of hospitals that are relatively full. Sometimes Chicago's hospitals end up accepting a lot of sicker patients in from outside Chicago, and that may also play a role. So watching this closely, but certainly feeling pleased to see some flattening at this point and want to see that continue. Deaths have not peaked yet. They are up 5 times what they were 5 weeks ago, just since the middle of October. And where we were averaging 2 to 3 deaths a day throughout all summer, we're now averaging 15 to 16 deaths per day. And as expected, those lag even further behind cases. So we expect those, unfortunately, likely to keep rising for at least a couple of weeks. Again, not knowing what a possible additional surge related to Thanksgiving could look like. And I wanted to put this in some actual numbers because I think we get very used to hearing statistics, but I pulled out just the number of Chicago residents who have died from COVID-19 in the last month alone. So between November 1st and December 1st, there have been at least 356 Chicago residents who have died of COVID. Undoubtedly, there will be a few more who get reported probably from late November, but that is 5 times what we were seeing over the summer. And I provided the age breakdown here. We had just in the last month, 1 person die of COVID between the ages of 18 and 29, 9 people die of COVID in their 30s, 15 die of COVID in their 40s, 36 die of COVID in their 50s, 87 die of COVID in their 60s, 95 die of COVID in their 70s, and 113 die of COVID in their 80s. So this again reflects the increased risk that we see for the severe outcomes, hospitalizations, and unfortunately even death as people get older. I still hear people say folks in their 20s, folks in their 30s can't die of COVID. This obviously proves that that is unfortunately not true, but it does reiterate that people who have underlying conditions, people in their 60s, 70s, and 80s are at highest risk. And so if you did travel for Thanksgiving, if you did gather, if you've let down your guard a little bit around COVID, now is the time to not be getting together with people in their 60s, 70s, 80s, or with underlying conditions. Now is the time especially to not be gathering, to not be having more potential spread of COVID. And finally, we wanted to talk about some vaccine updates. So we are waiting to certainly hear some details from the federal government. As you're likely aware, there have now been 2 pharmaceutical companies, Pfizer and Moderna, that have submitted applications for what's called an emergency use authorization, or an EUA, by the FDA. The FDA will be meeting on December 10th to consider that emergency use authorization from Pfizer, and they will be meeting 1 week later on the 17th to consider the emergency use authorization from Moderna. Based on the preliminary information that's been shared, we expect that they will be granted emergency use authorization because both companies have at least preliminarily showed excellent safety data and excellent efficacy data with a vaccine that looks to be more than 90 to even 95% protective. But the first step is that the FDA has to grant that emergency use authorization. Then the CDC meets through a group called the Advisory Committee on Immunization Practices, which is a non-governmental group that advises, and that will have an actual recommendation for vaccination. So the ACIP through the CDC will meet in the days right after the 10th of December, and then again right after the days after the 17th of December. And we expect that the CDC will make that recommendation to vaccinate and will likely make it to start vaccinating in our highest risk healthcare workers, and likely also followed by long-term care facilities. So I will pass this to Dr. Robinson to talk in a little bit more detail about our plans, but at the very highest level, I want you to know that we are ready to accept whatever amount of vaccine we receive. We have plans that will start with all 37 Chicago hospitals receiving vaccine for healthcare workers, not yet for patients, and we have plans for all 128 long-term care facilities in Chicago. That would include both skilled nursing facilities and assisted living facilities. That work has already been done. We're in the final stages of completing the paperwork, but that's where we'll start. And then we've got a lot of plans to go from there as more vaccine is available and rolled out. We can't be sure about any of this, though, until the federal government makes that emergency use authorization and then the recommendation for vaccine. So I think it is likely that we will be vaccinating here in Chicago probably the 3rd week of December, possibly the 4th week of December, again, depending how the federal timeline plays out, which means, literally 2 weeks from today, we could be talking about vaccination. A lot of details to come, but we are ready when this vaccine is available. And I will pass it to Dr. Robinson, who is really leading on the medical and scientific side for all things planning on immunization at Chicago Department of Public Health.
Good afternoon. As Dr. Arwady mentioned, I'm Candace Robinson, one of the medical directors here at the Chicago Department of Public Health. I wanted to kind of start by reiterating some of what Dr. Arwady said. So if the Federal Food and Drug Administration approves the emergency use authorization for the Pfizer vaccine and the Moderna vaccine, that means we could see vaccine here in Chicago beginning the 3rd or 4th week of December. Now, initial supplies of the vaccine will be limited, so there will not be enough for everyone. And specifically, based on some numbers recently released by the federal government, our initial planning is based on us receiving, Chicago specifically, receiving somewhere between 20 and 25,000 doses of vaccine. Now, as Dr. Arwady mentioned, if we are to get more doses, we have plans to be able to scale up rapidly for vaccination distribution, and if we are to get now, due to this limited supply, certain groups will be prioritized to receive the first doses of vaccine, and that includes our healthcare personnel. Additionally, we anticipate that there will not be enough vaccine to vaccinate all of our healthcare personnel at once, so there will be prioritization amongst our healthcare personnel, and those who are seeing COVID-19 patients, as well as those who are performing procedures that put them at highest risk, will be first. Our prioritization plans are based on national level guidance. Our current plans are based on the framework outlined by the National Academies of Science, Medicine, and Engineering. And our plans will be updated to account for the recommendations of the Advisory Committee on Immunization Practices, or ACIP, as mentioned by Dr. Arwady. The ACIP is meeting to discuss prioritization plans today, and so we expect to have some of their recommendations later this week. Now, as Dr. Arwady mentioned, we are planning for initial allocation of vaccine to hospitals, and we are working with all of the hospitals here in Chicago. And we will be providing vaccine to the hospitals directly so that they may vaccinate their employees. We are also making plans for Chicago and the Department of Public Health to vaccinate first responders, first starting with first responders that are at highest risk for exposure. And then we're also making plans for vaccination of healthcare workers who are not affiliated with a hospital or health system. Now, vaccination efforts, I should say, will continue to expand as we receive more vaccine in the city. And as we receive additional supply of vaccine and as we vaccinate our healthcare workers, we will expand to additional groups based on those prioritization recommendations from the ACIP. So that could include our long-term care facility residents, our persons who have certain underlying conditions, persons over 65, and essential workers. Now, I will note that the Chicago Department of Public Health has launched a new COVID-19 vaccine website. It is www.chicago.gov/COVIDVax. And this will be the site where you can find the most updated information on vaccine here in Chicago. And as vaccine is expanded and distribution is expanded for additional groups of people, we will keep this site updated so that everybody will have a place to go and find information about this. And now I will turn it over to Dr. Luna.
Thank you, Candice. Gracias, Candice. Mi nombre es...
All right, we'll be taking a quick 2-minute break here for you on News Now from Fox.
Has said is likely to be available at the beginning. We are anticipating literally every single week getting additional allotments. So our expectation is that that first week may be 20 to 25,000. If, for example, that's the Pfizer vaccine, if the Moderna vaccine is coming along just 1 week behind that, we would hope to not only be able to receive additional Pfizer vaccine, but be able to receive that first dose of the Moderna vaccine. And there's a federal system that's set up that basically allocates vaccine based on population, but then we have to be able to show that we are using that vaccine appropriately here. We have very good plans that will allow us to continue to scale vaccine at whatever rate it is made available, but we are quite dependent on the timing of when vaccines are available and then the production of these vaccines.
And then how is it done equitably so that all of the city receives it and not just perhaps those with means to know and listen and hear all the information and know where to go?
Yeah, absolutely. So as you heard, the first prioritization is very much based around healthcare workers. And so we've been in close communication with our hospitals, but also our outpatient healthcare providers, our long-term care facilities, to ensure that they have the information for this work at the very beginning. We know there's not going to be enough vaccine to vaccinate even all of the healthcare workers who work in hospitals, for example. And so lots of conversation about what that looks like. Once we get past this very first and we start being able to think about who comes next, again, we are dependent on those federal guidelines that will come through ACIP and through CDC. But we anticipate, for example, essential workers being part of that next tranche of who this is made available to. And we'll be working very hard, as you've seen us do for testing and everything else, to make sure that we are pushing messaging, that we are encouraging a lot of extra sort of outreach in areas that have been hardest hit by the vaccine. And so this Protect Chicago initiative that we launched a number of weeks ago has both a broad component where we're thinking about getting messaging out sort of digitally and broadly across the city, as well as very focused, even door-to-door work in a lot of our census tracts that have been hardest hit. The vaccine will fold right into our Protect Chicago campaign. And so as there is messaging available, we've thought a lot about how we are able to kind of get that messaging out there so that people know when it's available to them. And then finally, I would say we're doing a lot of thinking and planning about how to create the space for conversations at a community level, thinking about pairing healthcare workers who work in certain zip codes and are feeling supportive of the vaccine and willing to spend some time, pairing those people up with community leaders, church leaders, groups who are interested in having conversations, especially in communities of color here in Chicago, where we're anticipating perhaps less initial uptake, partly based on some of that history. Is that good? You want? Okay.
Are the hospitals already, or perhaps they already have this, but are they getting new refrigerators? Are they getting equipment? What's going on behind the scenes that we don't see?
Yeah, certainly. So that Pfizer vaccine in particular is the ultra cold vaccine, the one that requires the minus 80 Celsius. Even the Moderna vaccine, it's not the ultra cold, but it is much colder than vaccines typically need to be. And some of our hospitals in Chicago do have some of that ultra cold capacity. And where a hospital has that ultra cold capacity, they can receive that shipment more directly, but most of our hospitals don't have ultra cold capacity, and we have absolutely committed at CDPH to ensuring that all hospitals are able to get that vaccine really approximately at the same time. So we've built up at CDPH the capacity to handle more than 130,000 doses at a time, even of the ultra cold, and have plans to be distributing to the many hospitals that don't have that ultra cold capacity. There's a lot of logistics in that. But we felt very strongly that we wanted to make sure all hospitals, including smaller safety net hospitals, would be getting access to this vaccine. And even the distribution there, we've done equitably based on their numbers of employees and their numbers of especially these higher risk employees directly caring for COVID patients.
Is this, and maybe I should know this already, once you get the vaccine, do you have to do this every year? Or is it one and done?
Yeah, we don't know yet. We know that there will be certainly 2 doses of vaccine initially. So both of these first 2 vaccines that we're talking about, you get a first dose and then you get a second dose, either 21 or 28 days later. We haven't even had COVID on this planet for a year at this point. So there's not been the opportunity to really do some of those longer term immune studies that we'll need to do to fully answer that question. I think a lot of vaccine experts are feeling optimistic that this won't be an annual vaccine. Partly that's based on the fact we've not seen a lot of mutation in the COVID virus itself. That's very different from the flu vaccine, which we see a lot of mutation. There's a lot of different strains. And so every year you have to create a new vaccine. Partly, we haven't seen a lot of that mutation because we haven't developed a lot of medications to treat it. There hasn't been a lot of pressure for mutation, so you could see some changes there. We know that some other coronaviruses, natural immunization doesn't last that long. And certainly a question I get a lot is if I've had COVID before, do I need to get the vaccine? And the recommendation is yes, because we are not sort of trusting whatever. There's a lot of variability in terms of levels of protection and how sick somebody was. So these are some of the questions that will be answered. Even if this turned out to be an annual vaccine, it might be something that we gave annually like the flu. That would still be very effective. But I think it's looking promising that it would have some more longevity, but it's just too soon to know for sure.
Are there discussions underway that once you're vaccinated that you would have some kind of, I don't know, whether it's on your phone or you walk around with a certificate that allows you to go to restaurants, bars, sporting events, concerts, and all of those events where more people gather?
Yeah, so that is a big conversation, as I'm sure you know. And a couple things I can say. First is that there's been a lot of work to make sure that as people are being vaccinated, their information is being stored privately, but also in a way that will keep track of who has been vaccinated with which vaccine. Have they gotten both doses? The CDC is setting up a post-vaccine monitoring system where people who are vaccinated will have the ability to receive text messages, to be able to report if they have any side effects or any concerns, to have some follow-on. And certainly, I think down the line, we may see some employers or businesses, requiring vaccine. We are not anticipating at this point a sort of a city requirement around vaccine or a national requirement around vaccine. And in this early stage where it's still under emergency use authorization and where it's just not widely available, we would not anticipate vaccine mandates in any setting. I think time will tell as more vaccine becomes available, decisions that are made in that regard. But this is absolutely people electing to take the vaccine at this point. We certainly are. I'm very optimistic. I'm thrilled with at least how this preliminary data looks. I am certainly planning to be vaccinated myself very early. And I'm very hopeful that we'll see healthcare workers and others who are early available and then essential workers really taking advantage of the opportunity to protect themselves and their community. But this will be a choice that people will have, particularly early on.
Also, can you clarify, there are all the questions about probable cases versus real cases. Do you update your system so that do you go through how often do you do that? Because aren't the probable listed as yes? And perhaps maybe they're not.
So the definitions for probable and sort of confirmed cases are based on the kind of test that someone has had to diagnose them with COVID. And so the confirmed cases are based on people who have had a PCR test, which is the gold standard test that we've been using for months. More recently, we have seen these antigen tests emerge. They are tests that instead of looking for the genetic material, the RNA of the virus, they look for a protein that the virus produces. So they're more like a pregnancy test or something in terms of not looking for genetic material. They're able to be made more cheaply. They're able to be done faster. You lose just a little bit of the accuracy when you do them. When you have as much COVID as you have here in Chicago and here in Illinois right now, even a probable case is almost certainly a case. It becomes more of a problem when we're in a lower risk setting and you could have more potential false positives. So the Illinois Department of Public Health is including both probable and confirmed cases within its case reporting. And for all intents and purposes, with the amount of COVID we have right now, we absolutely recommend that people who have a positive antigen test treat that as an actual positive. There's not really a difference with the amount of COVID we have right now.
From the Chicago Tribune, will Chicago follow the state guidelines for distributing the vaccine for the general population, or will it get some of its own additional guidelines?
So the whole country, whether it's the state, whether it's cities, has to follow the federal guidelines, just to be clear. The ACIP, or the CDC, through the CDC, makes the recommendations for vaccinating, and we are receiving all of this vaccine free of charge. And we are required, and anybody who is vaccinating, any provider eventually who is vaccinating, has to certify that they will provide vaccine following these guidelines. So all of the prioritizations at the high level are set federally and then they are implemented locally. Chicago actually does receive vaccine separately from the state of Illinois. And that is because we're one of the large cities in the U.S. that for years and years does receive direct CDC funding and direct vaccine for immunization. So all of our childhood vaccines, our flu vaccine, all of that comes directly to the Chicago Department of Public Health, and we have the responsibility for vaccinating within the city of Chicago. The Illinois Department of Public Health would have the responsibility for vaccinating basically everywhere outside of the city of Chicago. We're in very close alignment there. There's a lot of conversation about the details, and I don't anticipate significant differences at all in things like prioritization prioritization because those are set federally. We will be receiving vaccine based on our population, just as the state will, and we will be allocating that and really working to push that out as quickly as we're able to.
I think you addressed this, but the Trib is also asking, will it be equal by neighborhood, or should areas hardest hit be prioritized?
So again, we have to follow the federal guidance there, and that has not been formally released. We are anticipating that the way this will be prioritized will not be by neighborhood per se, it will be by risk. And so starting with healthcare workers, probably next coming with essential workers, next, and people who are over 65, people with these underlying conditions. What we are anticipating at CDPH through Protect Chicago is that we will do additional outreach efforts, for example, in neighborhoods that have been hardest hit to ensure that there is good knowledge about how to get vaccine as it is available to the population. We also, when there is more vaccine available, will absolutely be looking to our clinical partners. We will be distributing Chicago's vaccine allotment to outpatient clinics, to private practices, to federally qualified health centers, to pharmacies, and encouraging people to be able to get vaccinated through their trusted healthcare provider. That's really our goal in the long term. So we do not anticipate at this point an allocation per neighborhood. We want to make vaccine widely available, certainly throughout Chicago. It will be prioritized based on risk, but we've seen that essential workers, for example, are more likely to live in some of the neighborhoods that have been hardest hit. And so in that way, those neighborhoods would be prioritized.
And so how, and this is from Craig Wall, how will essential workers be prioritized?
So again, and I have to just keep putting the caveat on this, that this will be based on when federal guidance, when this is released. We are anticipating that this would follow the same essential worker categories that were defined, early on at the federal level and that were used here in the state and city around stay at home, et cetera. And what we are anticipating, again, there's going to be a lot of planning on this, so it's premature to be able to talk specifically. But what we'll be thinking about is, are there employers, for example, who we can help support or connect? So a grocery store chain may work to be vaccinating its workers. A school system may work to be vaccinating its employees, a transportation system, et cetera. Certainly the Chicago Department of Public Health is anticipating standing up some larger mass vaccination sites. Those will be available certainly initially by appointment. And so this would be work, again, outreach to essential workers, working to get them an appointment, either with their healthcare provider, if the healthcare providers have vaccine at that point, or through some of the city's mass vaccination efforts. And we'll be working to reach people who are essential workers, and especially reach people who are in the neighborhoods that have been hardest hit.
All right, from Block Club, what is the ICU bed availability in Chicago proper?
So it is, if you go to the website, chicago.gov/coronavirus, right up at the top under latest data, if you pull down to hospital capacity, you'll see those numbers every single day. When I looked at it this morning, we were at approximately 25% availability. It's somewhere in the 25 to 26% range.
That's not good.
It's, we're pretty full. We want to see that number stay over 20%, certainly. That's across the whole system. So, you can imagine we've got some hospitals that are very full and some that have a little more capability. But we've got more than 1,000. We've got more than 1,000 patients in the non-ICU, close to 300 just with COVID in the ICU, and we haven't even seen flu season hit yet. And so we are appropriately concerned about how this second COVID surge has already been hitting our hospitals, and that it has the potential to sort of hit them even further. We had dipped down to as low as just around that 20% availability mark, and we start to get really worried if we see that drop below that. So we watch every single day. We get numbers on both non-ICU and ICU and ventilators, and the reason we're up here every day asking people to wear their masks, not have people over into their homes, not travel, really stay home, except for going to work, school, or unless it's necessary, is because we are seeing a lot of bad outcomes from COVID, and we are seeing hospitals that are quite full already, and the potential to get even worse.
And also from Block Club, could you give more details with those cold storage limitations? How much vaccine will Chicago actually be able to store and distribute at once? And will that slow down the vaccine campaign?
No. So we have built actually a very unusual amount of cold storage capacity for a city. What's that?
I mean, where is it?
Oh, we don't share the details of it for security reasons, but we have a warehouse that is set up and has has a lot of layers of security, but has this appropriate cold storage capacity.
And is that new?
It's new.
I'm sorry to interrupt.
Yes, this is new. So cold storage was not something, this is an example, our emergency preparedness program starting way back in the spring. We bought a lot of needles and syringes and sort of all the other things you need to launch a mass vaccination campaign. And then as we were learning more about these vaccine candidates, we have been purchasing these additional freezer capacity. We have plenty of capacity here for what we would expect to receive related to the ultra cold, because remember, we're pushing it out every week as we get it. And I am really confident in the plans that we have related to distribution.
Thank you. And Ben Bradley from WGN, what's your guidance for people who have had COVID in the last few months and fully recovered? Presumably, could they travel, not wear masks, gather in groups, since there is believed to be a significant level of immunity?
So the problem is significant level of immunity can mean very different things for different people. There are still a lot of questions about how long some level of protection may last. We worry about people who didn't get very seriously ill, didn't mount a very significant immune response, perhaps not having as much protection that comes later. The CDC has broadly said that in the 3 months or so after recovery, there is some level of protection, but there's major questions about how long that lasts and what those levels are like. And there have absolutely been hundreds of cases of people who have been reinfected with COVID. And so it doesn't seem to be the norm, but it can happen. The larger point is that we really need everybody continuing to do the things that we know work. Wearing the masks, doing the social distancing, not gathering. We don't consider natural infection to be protective in a way that we recommend against doing those things. Once we're talking about people who are vaccinated, I will tell you, even in that first time period after people are vaccinated, they too will continue to need to wear their mask, continue to have some limitations. There's still even questions. We know that the vaccine looks like it is protective for the individual. We're still learning, for example, does it actually protect you from spreading? We don't know that for sure. We hope so, but we don't know. And so it's going to be complicated, I think, as we're sort of rolling this out over this coming year, where increasingly we're going to have more people vaccinated and still asking really at a population level to continue to restrict and do some of these personal level activities. As we have a higher percentage of the population vaccinated, we'll be able to start dialing back on some of those restrictions. And I'm confident this is the way that we will get past this and that it will happen in 2021. But it's going to be a combination of rolling vaccine out quickly and effectively, which I'm confident we have good plans to do, seeing good uptake of the vaccine, which I think is a bigger question and will take some real conversation, and we'll be learning about side effects and, this whole conversation going on. And then combined with people continuing to do the things that we know work against COVID as the vaccine campaign is rolling out. I'm very hopeful that by the time we're halfway or in the third quarter of this year, we'll be in a really different place. But it's dependent on all of those things, and very few of those are directly, in the Chicago Department of Public Health's control.
So your goal pardon me? Okay, good. Your goal is 70% of Chicagoans vaccinated by when?
As soon as possible.
I know, but realistically, what are you thinking? June, July, later?
Yeah, I think we don't know that exact percentage for sure. It depends how good the vaccine turns out to be, sort of when it's in use outside of a trial. If you have a vaccine that's very effective, like this one seems to be, you can vaccinate somewhat less of the population, as opposed to if you have more to start to get to that herd immunity place. I almost feel like it is foolish to make predictions at this point, because there are so many unknowns and we are just at the beginning of getting started. Certainly, I am anticipating this campaign to really last for a year, give or take. I think we're thinking the first 6 months or so will probably be a period where the health department is playing a fairly significant role and we're needing to talk about prioritization. And then probably once we're into sort sort of the second half of the year, we're hopeful that there will be wide availability of vaccine in many settings, and it will be more of, following on the people who have had vaccine and encouraging everybody to get vaccinated. But we really just don't know yet. And if I've learned anything from COVID, is that things continue to change month by month. So we're planning for all eventualities here. We really are. And I'm very confident in these plans that we will be able to grow them or shrink them as vaccine is available and as we learn more, with a lot of input from local scientific experts and others who will be helping guide us as we roll this out, and then talking to a lot of community groups and experts about how to continue to shape messaging. And, we're at the beginning of what's going to be a long campaign here, but we will continue to make these recommendations absolutely based on the data, as we've been doing all along, and trying to be absolutely as transparent as we can be. That website is going to get busy. We're going to be putting a lot of information up there, creating a lot of materials, and working to really educate Chicagoans as we all learn about this vaccine.
And then just last question, the big party that was broken up over the weekend, as well as various restaurants that are ignoring, what's your reaction to all of that?
Yeah, I'm really disappointed when I see this. I'm thankful to the Business Affairs and Consumer Protection Division, certainly, and to our partners who have continued to work hard to enforce COVID regulations. At the Health Department, our sanitarians who do restaurant inspection to ensure food safety have also been doing a lot of COVID guidance enforcement. But, certainly I'm disappointed with the people hosting that party, but I'm also disappointed with the 300 people who thought it was a good idea to go to a party. And, I saw those pictures, as I know others did. And when I see numbers like we have in Chicago right now, right, 1 in 19 Chicagoans have COVID, you got 300 people? Like, do the math. There's a lot of people at that party, statistically, who have COVID and are spreading it, and they weren't wearing masks. And it's when we're working as hard as we are as a city, and so many people have made so many sacrifices in their own personal lives, our only goal is to get Chicago through this as quickly as we can. And things like large parties and things like people thinking they don't need to follow public health guidance is what sets us back. So I'm personally just disappointed. And it just means that the people who are doing the right thing have to do the right thing even longer when we have people doing the wrong thing.
Thank you.
Thank you.
So we were just listening there to Chicago officials talk about how they plan on distributing the vaccine there in the Windy City. So kind of interesting, they were going into the fact that they do have their own warehouse. They wouldn't disclose the location of that to reporters in the room there who were asking, but they said they are prepared. They couldn't give an exact timetable, but said it should be soon as far as distribution goes to Chicagoans in the city there. So we're going to get out of that for just a little bit. It's over. My name is Andrew Kraft, and this is News Now from Fox. We're almost to the 4 o'clock hour here in Phoenix, Arizona. We have a live report now, though, from Wilmington, Delaware. And, with just 50 days until the Biden administration is set to begin, the president-elect's transition team's work is in full swing. Today, naming those who will help his administration form economic policy during the pandemic. And we have a live report. Fox's Ali Rafa is here and joining us from Wilmington, Delaware with the latest. Ali?
Hey, Andrew. Good to be with you.
Ali, I wanted to ask, can you tell us about this economic team from today? Some familiar faces, is that right?
That's right. So Biden made his first public appearance since fracturing his foot on Saturday. Today, he showed off his boot to reporters before unveiling the 6-member economic team today. Some of the names, like you said, were familiar, like Janet Yellen, who's the former Fed chair, who Biden nominated as his Treasury Secretary nominee. Biden making a point to highlight today that if confirmed, she would be the first female confirmed to the role. Moderate Democrats are fairly happy with with the choices, but progressives are less so. But also, I want to make the point that just because Biden is nominating and making nominations, it doesn't mean that we are going to have, a vast number of Senate confirmations. With a little over a month until Georgia's runoff elections, we still don't have any idea of what party will control the Senate. And if Democrats win both of those races, the Senate will be split 50-50, and the Vice President-elect Kamala Harris will be that tie-breaking vote in the Senate, Andrew.
And Allie, I was kind of curious as well, congressional lawmakers, they met today introducing this $900 billion for COVID-19 relief. What was the president-elect's reaction to that? And does he have his kind of own plan for when he gets in office? And do those match?
Yeah, so Biden was asked if he supports this proposal as he left his event today. He said he's not familiar with it. He had just heard about it and he has to read a little bit more into it. He was also asked if he's spoken with Senate Majority Leader Mitch McConnell. He said not yet, but he's calling on Congress to pass one of these COVID relief bills right away. But he says even if it is passed, it's just going to be a start. He said his transition team is already well underway working on one right now. And he also said that would be his priority on day one, is getting economic relief to Americans dealing with multiple crises. Andrew?
And Allie, still no discussion yet with Mitch McConnell. President-elect Biden said he still has not talked to the Senate Majority Leader yet. What do you make of that, and what does the campaign make of that? Are they kind of concerned? Is this in the works? Can we expect this soon?
That's right. So I think these talks are imminent. I think that just because this came out today, Biden and his team were kind of focused on this economic unveiling. And so I think we should expect some communication between the two very soon, Andrew.
And I did want to ask as well just about Biden's hurt foot. Do you have any idea of how long he'll be in that brace on his foot? I know one of the pool reporters, our own Tara Prindiville, asked him today how he was feeling. He said good, but can you offer a little more details on that injury?
Yeah, so Biden's personal doctor on Sunday night issued a statement saying he expects Biden to be in this boot for several weeks. But the big question now is, will those weeks extend up to Inauguration Day? Will we see Biden with a boot on Inauguration Day? So we're just going to have to take a look and hope that he heals quickly.
And Allie, just lastly, I know it's really cold there in Wilmington, but can we kind of expect the Biden transition team to issue any kind of public pronouncements on all of these legal fights happening on the other side with the Trump campaign and their legal team, kind of this declarative statement from them? They've been really reluctant to do that, but are you hearing anything about maybe something like that coming forth in the next few days just to kind of put an end to all this? What do you think?
Yeah, so the feeling among the campaign is that all of this, Trump, re-upping, Trump and his lawyers re-upping their lawsuits against Wisconsin. And after we saw the certifications of both Wisconsin and Arizona yesterday, they see it as all background noise. And so there's no real indication that they're going to start taking this more seriously, making any statements about it. But still, this doesn't prevent the president from pursuing these lawsuits. But the big question now is, if the president and his lawyers pursue these lawsuits, how far will it actually go?
All right, Fox's Allie Rafa there for us in Wilmington, Delaware. Allie, anything the president-elect is doing tomorrow? Can you give us any insight on his schedule tomorrow?
Yeah, so we just got word about an hour ago that the president and vice president-elect Kamala Harris will continue receiving their presidential daily briefings tomorrow, so we should expect that. But as of right now, no public events planned.
All right, Fox's Allie Rafa, thanks so much there from Wilmington, Delaware. We'll talk to you soon.
Thanks, Andrew.
All right, and that's the latest from the Biden-Harris transition team announcing their economic team there as well today. Remember, Allie said that Janet Yellen is announced for the Treasury Secretary pick. And Neera Tanden is announced for the head of the Office of Management and Budget. So it'll be interesting to see, like Ali was alluding to, how these picks fare up in a Senate confirmation battle. So we'll be following that here all on News Now from Fox. We want to thank everyone for watching. Remember, we are all live, raw, and unfiltered here on News Now from Fox. We bring them events to you in their entirety, with limited commentary, just the facts, no opinion or bias. So we thank you for watching. If you want to watch us or tell your friends where they can find us, go to newsnowfox.com and give us a follow on Twitter @NewsFox as well. So we'd love a follow. We have a great lineup of reporters out in the field going into the late afternoon and the early evening hours, and even another update from the Biden-Harris transition and what's happening with all those lawsuits that the president has been filing and his team later today. So we want to take it out now to one of these great shots that we have for you all the time around the country. That's the White House right there. And like we were referring to yesterday, that's that large ribbon there commemorates World AIDS Day, which has happened ever since 1988 on December 1st. All right, we're going to take a quick commercial break and be back for some great content going in the early afternoon and late evening hours here. So stick with us here on News Now from Fox. It'll be about 2 minutes, and then we'll be back. Probably stick with some coronavirus news and some news out of the CDC and how they plan to administer the vaccine once it's ready in the next couple of weeks. So stick with us. Okay, got it. I have to. All right, we just wanted to break in here as well after that commercial break, because we do have some news out of the CDC, and a panel has just voted on who should receive the vaccine first. And so we're getting some news that an estimated 20 million healthcare workers should get top priority for a vaccine to keep the nation's hospitals and clinics functioning. So that's according to an advisory panel at the CDC who recommended that just minutes ago. The biotech company Moderna has requested emergency authorization of its experimental vaccine, which means the U.S. government potentially could start distributing 2 vaccines in the next few weeks. So that's, we just wanted to hit that news for you here on News Now, that the vaccine will be going to healthcare workers and long-term care facilities first once it gets rolled out. That's according to that CDC panel who is recommending that, and that just came through. So we're going to have all the latest updates on vaccine progress, vaccine distribution, like we just said, who is getting the vaccine first. And remember, just a couple days ago, the CDC did revise their guidance on how long you should quarantine if you've been exposed or contracted the virus, from 14 days down to 7 to 10 days. So even that has been changed amidst this news that the vaccine is on the horizon in the matter of just a few weeks. So we want to take you out now to the Capitol. We've been showing you a lot of news there out of Washington today. But in the meantime, we do have some more coronavirus news headed into this late afternoon here in Phoenix. Also, amid rising cases, we also wanted to show you this press conference from earlier out of the state of Kentucky. Governor Andy Beshear.
Hi, everybody.
Addressing the press.
It is 4 o'clock on Tuesday, that time we come together for Virginia Moore to remind us that we're going to get through this, and we're going to get through this together. I want to thank Bryan Station High School, Fayette County Public Schools, for their mask today. To all of our educators that are working as hard as ever virtually right now, thank you so much for the experience that you are providing. And while I know there are many of us, myself included, that would prefer that our kids be in-person learning right now, we know that you are working as hard as you can to provide the very best experience. And we do believe right now that the steps that we have taken are absolutely necessary. And maybe today's report will convince those out there who disagree. No way to sugarcoat it. Today is the very worst day that we have had for reporting on the spread of the coronavirus, and it is the deadliest day that we have had. Today, we're reporting 4,151 new cases of the coronavirus. This is exponential growth. Remember how we talked about it taking 7 odd months to have our first day of 1,000 cases, about a month and a half to have our first day of 2,000 cases, about a week or so to have our first day of 3,000 cases. And guess what? Here we are at 4,151 cases. That's the highest number we have ever had. And today, it includes 461 kids. It's 461 of our Kentucky kids, most of them school age, who are infectious with this virus right now. We are thinking about them. We hope that most of them are asymptomatic. We are fortunate that we've identified who is positive on all 4,151, so that hopefully they are taking the steps not to spread this virus any further. We're now up to 183,168 cases since March the 6th. So today is a record number of cases, 4,151. Record number of kids under 18 testing positive, 461. Record number of people currently hospitalized for COVID-19 in Kentucky, 1,777, up 36 from yesterday. Today, we have a record number of people in the ICU because of COVID-19 at 441, up 20 from yesterday. And today, we have a record number of people on a ventilator fighting for their lives because of COVID-19 at 241. That is up 12 from yesterday. And today, we have a record, at least from May 5th, when we were able to start ramping up testing, of our positivity rate now at 9.59%. 9%. Put simply, today is a terrible day that shows us how quickly this thing is spreading and shows why it is so important to take steps to stop it before it gets any worse. New cases by county. Jefferson County with 700 cases. Our heart goes out to the residents of Jefferson County. Until recently, I was a resident of Jefferson County. We are thinking about you, and we're going to be there for you. Fayette County, 238. McCracken County, 172 cases in McCracken County. Warren County, 148 cases. Kenton, 126 cases. Hardin, 120 cases. Davis, 119 cases. Boone, 102 cases. Madison, 97. Laurel, 89. Oldham, 80. Campbell, 73. Christian, 72. Hopkins, 67. Marion, 62. Bullitt, 61. Lincoln, 56. Nelson, 55. Hart, 54. Pike, 51. Montgomery, 50. Carter County, 49. Clay County, 49. 48 in Barron and Graves. 44 in Pulaski. 41 in Greenup. 39 in Magoffin. 38 in Marshall. And the list goes on and on and on, with numbers that I haven't read yet. You go down 8 counties, Franklin County with 28, Harlan County with 25. It's all on kycovid19.ky.gov. But it means that there is a huge amount of virus spreading rapidly in every county across the Commonwealth, which means it takes all of us doing our part in a concerted effort if we are going to slow this spread and save lives. If we don't work in a concerted effort, if we don't all do our part, if we try to be the exception, then slowing down this thing won't work, and we will lose a lot more Kentuckians who we love and care about. If you need more convincing, today, the deadliest day with 35 new deaths. For people in their 50s, 60s, 70s, 80s, and 90s. And it's a long list. 70-year-old man from Boyd County. 75-year-old man from Callaway County. 82-year-old man from Christian County. 96-year-old woman from Davis County. 95-year-old woman from Graves County. 66-year-old man from Grayson County. 79-year-old woman from Grayson County. 57-year-old man from Grayson County. 86-year-old woman from Grayson County. 93-year-old woman from Henderson. 87-year-old man from Hopkins. And a whole lot from Jefferson, including a 77-year-old woman, 76-year-old woman, 72-year-old man, 61-year-old woman, 80-year-old woman, 64-year-old woman, and a 64-year-old man, 73-year-old man, 94-year-old man, 64-year-old man, 77-year-old woman, 66-year-old man, 62-year-old man, all of those just from Jefferson County. 62-year-old woman from Jessamine, 76-year-old man from Kenton, 79-year-old woman from Marshall, 66-year-old woman from Mason, 64-year-old man from McCracken, and a 59-year-old man from McCracken. 88-year-old woman from Monroe, 64-year-old man from Monroe, 65-year-old man from Montgomery, 93-year-old woman from Robertson, and an 82-year-old man from Union County. So these individuals are real people that are loved by the people around them. Today's memorial came to me from someone I know who had reached out in his grief. So yesterday, a friend of mine lost his father to COVID-19. At 1:46 a.m. on November 30th, Bruce Gdansky, 76, passed away after a long-fought battle with the virus. Bruce and his wife, Mickey, became infected with COVID-19 at the end of October. While they were able to handle treatment at home for the first few days, Bruce was transferred to Baptist Hospital on November 6th, and his wife was admitted only a few days later. Although she was able to fully recover, Bruce continued to get sicker and sicker. On the 14th of November, Bruce left his son Chris a voicemail, the last voicemail Chris would ever receive from his father. 4 days later, Bruce was intubated. On the 27th of November, the team at Baptist medically paralyzed him to help his body rest from the struggle. And then yesterday, as Bruce passed on, his wife and son were left to say their goodbyes, urge him on to a better tomorrow through a phone held to his ear by a nurse. That is what COVID does to our loved ones. That is how it impacts our ability and the way we say goodbye. Bruce was a friend to everyone and a stranger to no one. He was a man of service. He was a U.S. Navy veteran serving in Vietnam, and also as deputy sheriff in Oldham County for 10 years. Bruce championed causes for the elderly during his time as vice president of operations for the Louisville Better Business Bureau, working with the FBI against consumer fraud. And he also spent time volunteering for the St. Matthews Baseball League, where he made friends young and old, something his son Chris would miss seeing the most. Above everything else, Bruce was a loving husband to Mickey, a father to 2 sons, and a grandfather to 5 children. He was a passionate fan of baseball, bourbon, cigars, and a good joke. What we must stress here is that Bruce and Mickey tried to do it all right. They barely left the house in 9 months, and they always wore a mask. But that's the thing about masks. It takes all of us wearing them correctly to protect one another. If we do, we can prevent the loss of individuals like Bruce and the heartbreak his family is now mourning. So to Chris, to Mickey, to your whole family, we are so sorry for your loss. We thank you for letting us share a little bit of Bruce with the rest of the world. And this shouldn't have happened. Shouldn't have happened even amidst this pandemic. It's not fair that it happened to y'all. We're going to do our very best for you moving forward. I'm wearing my mask for Bruce and for all of you. We will do everything we can to make sure that this doesn't happen to any other family. So to everybody out there, Bruce should still be with us. He should still be with Mickey. He should still be with Chris. He should still be with his other son and his grandchildren. We all have a duty to protect one another, to protect individuals like Bruce. And we at least failed him. So can we do better? Let's please try. We continue to see our long-term care facilities, again, overwhelmed by the community spread of this virus. And when we talk about where we are right now, the virus is spreading so much, it overwhelms any communal setting, any one. It's overwhelmed our long-term care facilities. It's overwhelmed our prisons when it gets in. Any place where people gather, if we have our current community spread, it will spread and it will ultimately harm people. 173 new residents, 109 new staff testing positive, 18 new deaths attributable to long-term care residents. So get this, right now we have 57 long-term care facilities with 15 or more active cases. These are facilities that test their workers, many of them 3 times a week, that wear PPE religiously. They're not letting down their residents. Our community response isn't where it needs to be. We need to know whether or not people in long-term care facilities get COVID. It's about what we do in our daily lives, the decisions we make, and whether or not we do what it takes to prevent it from spreading to those around us. And because of that community spread, we've lost another veteran at the Thompson Hood Veterans Center in Wilmore. We previously thought that he was recovered and was going to recover, but has since died. That's 31 veterans who served our country, who we were able to protect until the middle of October with no cases there. Because of community spread, 31 individuals who fought for us that we have lost. We still have 2 active cases of COVID in the Thompson Hood Veterans Center. It's been 18 days since the last COVID positive result in a Veterans Center there. We hope that we are stemming the tide. But as long as there is this active of community spread, there is still significant possibility of losing more veterans, losing more people in long-term care facilities, losing more of everyone. So the veteran who first became active, the first active case of COVID at Western Kentucky Veterans Center in Hanson, has also now died. We've also had a COVID-19 related inmate death. He was incarcerated at the Lee Adjustment Center. It's a 37-year-old man, initially taken to the local hospital and then transferred to Norton's in downtown Louisville. Passed away yesterday, November 30th. He did have underlying health conditions. So that's where we are. COVID is spreading like wildfire, taking record numbers of people from us, infecting record numbers of people out there. That's why we're fighting back. That's why we're trying to be aggressive and not wait for it to overwhelm us, but to try to stem this third wave just like we stopped the first two, to not surrender and accept unacceptable fatalities, but to fight back for those we care about. Part of that is testing. With it spreading the way it is right now, we need to continue to get people tested regularly. I want to walk through some of those options. Right now, we have more testing locations than ever before, so there's no excuse not to get out there and to regularly get tested. Over 358 locations across this Commonwealth. Let's go through a few. With Louisville having the number of cases they did today, let's start there. First, we have the surge testing that the federal government has been helping us with. That's what we would call the fairgrounds. That surge testing is also being done in Lexington. You sign up for an appointment, it's free, it's actually moving really fast, and we have increased the number of tests that we are doing. It's a partnership again with the federal government who's paying for all those tests, paying for most of the testing. We're providing some of the logistics, so we are grateful for that extra help. Next is the Norton's location. We continue to provide testing to Norton, and they, again, accept reservations the way that is listed on the screen. So you can sign up to get a test there. Finally, U of L. We have multiple testing locations in a contract with the University of Louisville. You can sign up there as well. So many different locations in that area. In the Lexington area, the second most number of positive cases today. In addition to that surge site, UK has a partnership with the state where there are multiple locations, again, where you can get a test in Lexington. We'll wait for that to come up so people can see it. That's with UK, and I believe they're using a company called Wild Health that is doing the testing. Regardless, that's on kycovid19.ky.gov. Then Northern Kentucky, where we are seeing significant number of cases, especially in Kenton, Campbell, and Boone County. St. Elizabeth's is our partner there. Again, these tests are free. You can sign up, and you should sign up. Make sure you get tested. And then we have 4 different locations that we are working with throughout the state. Those cover just about every other area of the state. But I've only listed, about 10, 11 different locations out of the 300 plus. So we need you to continue to get tested. And that's not for the numbers we read, but it's for your safety, to make sure if you are positive, you get the help that you may need. And it's also to prevent the spread to other people. Think about it. If we don't find out that the 4,000 people today plus are positive with COVID, and each of them doesn't know, and as we've said, can spread this virus to hundreds of other people, how quickly that can grow. It also underscores the importance of continued federal support, in the very least, for testing, for contact tracing, and the other necessary steps, public health steps, to defeat this virus. We're going to have a couple of other updates, and then we're going to get an update on contact tracing. I want to start with CARES Act funding to local governments. Our local governments have been lifelines in our communities during this pandemic. That's why we set aside $300 million in CARES Act funding to reimburse city and county governments for expenses related to COVID-19. We did that back in May. $250 million of the allotment was divided based on population from recent census data for immediate release. The other $50 million was reserved for future hotspots and other needs. After discussions with the Kentucky Association of Counties and the League of Cities, we're now releasing that last $50 million. Approximately 200 cities and counties are eligible because they've already exhausted their original allotment and have remaining eligible reimbursements. To apply, eligible local governments will follow the Department for Local Government's original application process, which is outlined on their website. Thank you to all our local governments and leaders that are fighting this thing every single day, that are part of Team Kentucky, that are trying to do it right. You have been an important piece of how we fought back against this virus. And again, once this allotment has gotten out there, federal government will need to step up to provide additional help moving into the future. Everything stops at the end of December unless we get a new act from Congress. Okay, other ways that we're working to help people, the Healthy at Home Utility Relief Fund. So we created several funds to assist Kentuckians through this difficult time, including the Food and Beverage Relief Fund, which we're going to talk about in a minute, the Eviction Relief Fund, where we've already provided $15 million of help, and $15 million for the Healthy at Home Utility Relief Fund. The CARES money we've directed to these funds must be spent by the end of the year, and we want to make sure they help as many people as possible. So there is around $11 million remaining in the Healthy at Home Utility Relief Fund, and I want to encourage those who are eligible to apply. That will help you so you're not behind on your bills. That will also help your utility, which many right now need this extra assistance. Eligible households can receive a one-time $500 benefit towards their water and or wastewater and $400 towards their natural gas or electricity bills. Crisis assistance is still available for households with past due natural gas, electric, water, or wastewater bills. This is to help resolve an arrearage and prevent a pending disconnect. Funding for electric and natural gas benefits has been increased to assist more households across the state. The Healthy at Home Utility Relief Fund now has a subsidy program available to assist more Kentuckians and is intended to prevent a future crisis and possible disconnection. This is for households with incomes up to 200% of the federal poverty level who have been economically impacted due to COVID-19. Apply at your local community action agency. To locate that office, call 1-800-456-3452 or visit www.capky.org. All right, last update on one of our funds that's out there. This one is to assist restaurants and bars that are being significantly impacted by this pandemic. As of 3 o'clock today, we received 2,650 applications with a total requested amount to $25.6 million. We are working through these applications. We've already approved 1.7 million to go out. And that's just because that's how far we've gotten in the last day or so. We will be fast on approving these dollars. So a couple questions that we've gotten. Do we have any numbers on how much the restaurant fund is being used, numbers of requests, anything like that? So again, in the first 26 or so hours of the fund, 2,650 applications filed. And we're going to continue to take applications until we have fully exhausted the $40 million that we have set aside. What can business owners who receive the funds use them for? Are there specifications, for example, to allocate money to employees? Eligible expenses are expenses incurred by the business entity from March 6th to December 31st this year for the following items: mortgage rent, salaries and wages for employees or contractors, employer contribution for both employee health insurance costs, business supplies or equipment, inventory, utility payments for the business location, PPE, or measures implemented to protect employees or customers from COVID-19, and to comply with the Commonwealth's Healthy at Work requirements. Finally, the Public Protection Cabinet has begun reviewing applications as of yesterday. What does the review entail? So it's a multi-step system that starts with the online portal. Restaurant and bar owners should visit teamkyfbrf.ky.gov and carefully review the eligibility criteria before applying. After completing the process, a team of reviewers will ensure all documents are included and the claim meets eligibility requirements. An applicant will be notified of their status through email. If there's something missing or in question on the application, the team member is going to follow up with them and attempt to correct any errors. So please get those applications in. I know that 10,000 isn't anywhere close to making you whole, but let's at least get these dollars out to help in the way that they can. Final update is on vaccines. Kentuckians can visit kycovid19.ky.gov to view the latest information we have on the vaccine. That includes the draft of our vaccine plan, outline on planning phases, critical populations, and vaccine provider enrollment and administration. There's also CDC COVID-19 vaccine resources and frequently asked questions. We're going to update this regularly. So we're getting a lot of questions, which is good, on vaccines. A lot of them can be answered with the resources on kycovid19.ky.gov. I will warn you that the information we get on the vaccine changes frequently. Now we're ready to roll with that, and to make sure that whatever allocations we get, we are getting out there as quick as possible to those most in need. But do understand that if the information we get from the federal government changes, the information that we give to you changes. We're going to be transparent about that information each and every day. All right, we have an update from Mark Carter now on contact tracing. Mark?
Well, thank you, Governor. Let me just start out with a brief overview of contact tracing and what it is and what it isn't. I know that I've described this before, and I think with the attention to contact tracing in the popular press, most people think they know what it is. But let me just spend a minute on that topic. And probably the best way to do that is just walk through a case. So essentially what happens is someone tests positive for COVID. A lab notifies a local health department. It goes through a process to get there, but that's what happens. Once that occurs, a disease investigator, which is typically an RN or a clinician, will call the person who tested positive and interview them. And that call is focused primarily on that individual, his or her health, what they need to do to protect themselves. It's important. It's an important part of the process in terms of trying to determine where the person became infected, to learn more about the infection that can inform of future clinical interventions as well as public health interventions. A component of that disease investigation is compiling a list of potential close contacts. That becomes the second part of this process, where those are handed off to a contact tracer, who will then call those individuals and essentially walk them through what they need to do to protect themselves, their family, loved ones, fellow citizens. So it's important. It's a two-part process that consists of a disease investigation and the actual contact tracing. And the focus and the goal from the start has been on containing the spread of the infection. And containment is an important word here. When we started out on this back in March and April, our focus was on containment. And as I'll show you in the slides, we've really moved away from containment now with the spread of the infection and more into what I would call a mitigation phase. So the last comment I'd make on the overall contact tracing effort is that we, at the start, it was just a component of a systematic approach to the infection on the part of the public health departments in our Commonwealth. And by systematic, I mean that it had to work together with masking, testing, social distancing, all the things that have been talked about in this hour for the last number of months. And all of that depended upon our citizens in the Commonwealth, the significant portion of our citizens participating in the process, doing the right things, as the governor mentioned earlier. So if we could put the first slide up, just a couple of comments here overall on where we are at the moment with our program. And while that's coming up, I'll just comment that we have about 1,600 people doing disease investigation and contact tracing today. We started out with about 430 before this all started, so approaching 1,200 new staff have been hired over the course of this program. The other thing that we did is that, and I certainly can't take credit for this decision was made before I came on board, but the decision was made to invest in a system that could be used for disease investigation and contact tracing across the Commonwealth. And this was really an important investment, in my opinion, because what that allows is for application in the current situation with COVID-19, but most infectious diseases experts and epidemiologists think that we will have a future pandemic. And so if that does happen, the Commonwealth will be far better prepared to deal with something like that down the road. So that system now is deployed across the Commonwealth. Everyone is using it. There are a few health departments that require some assistance from Frankfurt, but for the most part, everyone's using the system on their own, and it is effective. If we could go to the next slide. This just shows a few things that we're doing with the system. We're constantly improving it. Every 2 weeks, there are enhancements that are deployed in the system that help improve productivity and effectiveness of the tracing and disease investigation efforts. If any information that we have on as we develop it going through this process is available on the kycovid19.ky.gov website. You can, and then lastly, as I would just comment, I get daily reports on the statistics of contacts reached and cases that we've reached that come through each day. We're now over 215,000 daily check-ins with contacts, checking in to make sure that they're staying healthy and doing the things they need to do to protect their families and so on. And that's with about over 47,000 contacts. So the system and the staffing until just the last few months had been effective in terms of playing its role in the public health response to COVID-19. If we could go to the next slide. And I think the governor already stole my thunder on this, but unfortunately, we just haven't contained the spread of the disease and the exponential growth that we see. I didn't know the numbers today until the governor read them off just a few minutes ago. But you know, we've really reached a point where we're being overwhelmed in terms of our disease investigation and contact tracing efforts. And I think that is in part because we haven't had the level of compliance that we need to have with the public health recommendations around masking and social distancing and so forth. But we can turn that around. We can make a difference with that by taking our individual personal responsibility to heart, knowing that we're protecting our loved ones and friends and family, and we're just being good citizens, and we can turn that around. But the issue that we're facing in the public health arena is that we really are in a mitigation phase now of trying to limit the spread. It hasn't been contained, but we can limit it, and we can do an effective job of doing that over the coming weeks and months until we get a vaccine deployed to our citizens that can get us past the pandemic. So one of the things that we've done, and one thing that folks need to be aware of, is that we've had to prioritize the contacts that we actually reach out and touch on the telephone. And for example, what we've done is if the contact has some underlying health problem, autoimmune deficiency or some respiratory disease or something that makes them particularly vulnerable to COVID, those are the folks that we're going to call that are contacts. Now, we're going to call every case, and we're going to do a disease investigation on every case, but we are going to prioritize the contacts. So there is a chance, if you were a contact and you were not deemed one of these high-risk exposures, that you will not get a call from the health department. Instead, what we're doing is we're asking our fellow citizens to do a little bit more to help mitigate the spread of the disease. We've developed 2 documents, and they're illustrated on this slide. On the left side is a summary of a document that we're providing to the person who has tested positive. And it essentially summarizes a lot of the telephone call that they receive. And it also asks them to take the document that's on the right side of this slide and provide that to any contacts that they have. So to other family members or friends, folks that they know that they may have come in contact with while they were infectious. And then that person can use that card to sort of self-manage their own quarantine or self-isolation such that they do their part to help prevent the spread. So that all of that information is on the kycovid19.ky.gov website, and I would encourage the folks listening to the show today to review that information. Last slide, please. The last thing that is causing my hair to start to fall out, it turned gray a while ago, but I think I'm starting to lose it now, is we're facing a funding cliff. Essentially, all of our disease investigation and contact tracing effort across the Commonwealth has been funded by the Federal CARES Act. And that funding, we're required to have spent that funding by December 30th. We desperately need either an extension of that date or additional funding or both in order to take this program into 2021 and get us through the months that we need to get through till we reach the point where we have a widely available vaccine. And so that, if there's one Christmas wish that I have for my family, is that we'll get an extension of that CARES funding, and that our representatives in Congress will work diligently to get that done. And so with that, I'll wind it up. I think I would just like to thank the citizens of the Commonwealth that have fully participated in the program. And it is the majority of citizens. And many of them changed their Thanksgiving plans, and they didn't get to have the celebration with their family of thankfulness that we're all used to having, and something that we enjoy in our family. And then I'd also like to thank the public health leadership across the Commonwealth. The last time I was on, I called them out. Our physicians and nurses, other clinicians in hospitals and nursing homes and other healthcare provider settings are clearly our heroes, but so are our public health leaders. And so with that, I'll just conclude by saying thank you to them, and thank you, Governor, for having me on today.
Thank you to Mark Carter. We are going to move into questions. I've got some written questions, some on the line. I'm going to start with a couple of the written questions. So Chelsea Jones at WKYT, will COVID remain after widespread vaccination? We're still awaiting the answer to that question. So what we know right now is that the 2 vaccines that are out there help people to either not get sick or to significantly lessen how sick they could be. If Moderna's numbers, for instance, at 100% effective at preventing severe cases hold up, then I heard one national expert say we could turn COVID into something like a cold or a minor flu. But what we don't know yet is whether when you get the vaccine, you can still potentially spread this to someone else. We don't know whether it prevents you from getting it at all or prevents you from getting sick from it. It is a blessing, even if it's just keeping you from getting sick from it. And then the risk of, if you still can spread it, and again, we're waiting to see and the evidence on that. But if a significant number of people get the virus, then they can't get sick from it or significantly sick, even if you can spread it. So that is to be determined, and we are waiting to see. Sierra Henry, how has the governor worked with surrounding states when responding to the COVID-19 pandemic? We work in a number of different ways. I have regular calls with the governors of Ohio and Indiana. We then work with the Midwest governor group. I have a call on that coming up. The NGA, the National Governors Association, also has regular calls. Some of us have personal calls with those that we know a little bit better or where our experiences are similar. What I've found is, for the most part, all our governors want to stop this virus. We may have differences of opinion or differences on willingness on steps that we take, but we all recognize how concerning and how deadly it can be, and we all want people out there to be wearing masks and doing the right thing. So with that, we'll go to the phone lines, and we have Karen Czar from WUKY.
Good afternoon, Governor. Welcome back, Virginia. We're glad to see you. Obviously, the numbers are going in the wrong direction. How challenging is it for you and Dr. Stack and health officials to get a complete buy-in from the public on restrictions, especially from people who are on the fence about it, when other state lawmakers are tweeting or vocalizing support for businesses who won't follow the mandates? And have you spoken directly with any of those legislators to try and get them on board recently?
So getting full buy-in from the public is a challenge, and it's one of the reasons that we are where we are. But I don't want that to, and it always seems to be the central focus in what we're talking about, because we need more help. And what we don't talk about enough is how the vast majority of people are doing it right, are working really hard, are wearing masks, are doing uncomfortable things, are giving up Thanksgiving, all to protect themselves and those around you. There's a huge amount of sacrifice out there. Unfortunately, we have some that still don't recognize that sacrifice, or who are still playing politics. I mentioned earlier, I'm beyond politics. The decisions I make are between bad and bad, typically. The choices that I have for those decisions are between bad options and bad options. Most of those who state lawmakers who criticize push for inaction. Well, inaction is deadly. Action's unpopular, but I'm willing to do what's unpopular if it saves the lives of those around us. And when you look at those who are criticizing the current orders, well, they criticize the mask mandate too.
All right, we just want to break in here for some breaking news that we're getting out of the District of Columbia, out of the nation's capital here, from the Justice Department, and we just want to put that up on your screen. The Justice Department, we're just learning, is investigating this cash for pardon scheme in which a scheme for a substantial amount of money was uncovered in exchange for either a pardon or a reprieve of sentence. So just to bring this up for you here, we have the filing out of the U.S. District Court for the District of Columbia here, and we just want to read some of this for you. A lot of it is redacted, but the communications at issue were seized by the government pursuant to search warrants It goes on to say that over 50 digital media devices, including iPhones, iPads, laptops, thumb drives, and computer and external hard drives, were seized. And it goes on to say that these names obviously are redacted, but they acted as lobbyists to senior White House officials without complying with the registration requirement of the Lobbying Disclosure Act to secure, quote, a pardon or reprieve of sentence, a related bribery conspiracy scheme in which, redacted, would offer a substantial political contribution in exchange for presidential pardon or reprieve of sentence for redacted. So we're following this story here on NewsNOW from Fox, and this is breaking out of the Department of Justice today, but this was unsealed. This was broken by another news outlet. Fox has since confirmed, and that's how we got this filing that we're reading to you right now. But just to go over that, the Department of Justice is investigating this cash for pardon scheme. We don't know the people involved on either side. We don't know who's asking for the pardon. We don't know who's paying to receive, or who's soliciting money to either grant that pardon or clemency. So we'll be following this here on NewsNOW from Fox, but quite a stunning story coming out of the nation's capital in the D.C. Circuit from Chief Judge Beryl Howell, who unsealed this today. And like I said, a lot of it has been redacted. So we'll be following up on that to see if any more updates come through this evening. But we just wanted to update you on this pretty stunning story. Remember, a lot of pardons are always issued in the last few weeks remaining of these lame duck presidencies. We're not insisting or insinuating any of that that is taking place, but remember, we just last week had the pardon of the former National Security Advisor Michael Flynn. There was a New York Times report just a few days ago that said possibly or alleged that Rudy Giuliani might be seeking a pardon for himself in case he's under any criminal liability if the president leaves office. So a lot of news happening around pardons, and this coming in tonight, out of the District of Columbia, the district court there. So we'll follow it here on NewsNOW from Fox. We want to take a quick commercial break. This will be 2 minutes long. We'll see you back here after that break. And remember, this is NewsNOW from Fox, where everything is live, raw, and unfiltered. I'm going to be stepping away here. Daytona Everett's going to take over the chair from the 5 to 7 p.m. hours here in Phoenix, Arizona. And we'll see you back for the later hours here on NewsNOW from Fox. We're going to go back to that Kentucky briefing. Governor Andy Beshear is taking questions from reporters in the room, talking about all things coronavirus.
People that believe the world is flat, the ones that outright tell it to you, and some of them are tweeting that, and we know we can never convince them. The others are embarrassed because they believe the world's flat, but they don't want to tell you. And so they keep asking you for data to show them the world is round. And you can even send them the pictures from space. You could give them all the scientific data, and they still ask for more. We are in a worldwide health pandemic. We know the places that it spreads the most. We can either acknowledge the challenge we face and do what it takes all together over these period of weeks, all do our part, not try to be the exception, but try to be a part of Team Kentucky, and we can stop this escalation. Or we can play politics or think that everybody else should follow them, but we shouldn't, and then it just continues to grow. Tom Latek from Kentucky Today.
Good afternoon, Governor. Attorney General Cameron, of course, is appealing to the Supreme Court. And I was wondering, first of all, your thoughts on that appeal, and also his maintaining that this is merely a free exercise of religion with the private religious schools.
Today, we had over 4,000 cases. We are in exponential growth. And we are having, for the deadliest month last month, the deadliest day on the first day of December. And we are treating everybody the same, every school the same. And we're asking all of them and others to do their part to stop this virus. In other words, all we're asking everybody is to make the same sacrifice to stop it. The Attorney General, I think, is the one that wants to create exceptions to that. Exceptions will just spread the virus further. The state already regulates multiple aspects of religious schools. Your cafeteria, has to apply with the different codes and requirements that are out there. In other words, you can't say that's an expression and therefore we don't have to follow those. Your curriculum, you have to teach math. There are already a number of regulations that apply to all schools equally that are out there, and those are legal. Listen, my faith is critically important to me, and right now it tells me that all of us have a duty to love our neighbor and to do our part to stop a worldwide health pandemic. If we are trying to be the exception and think we should be able to do what nobody else does, I don't know that's a true expression of our faith and trying to care about the people around us. And this is going to overwhelm schools that are open. It's as simple as the highest positivity rate, the most number of cases, and exponential growth. Again, if this were a 3% positivity rate, we'd all be in-person instruction. But when it's overwhelming, long-term care places where we do 3 tests a week of staff, where we have PPE on every day, it's going to overwhelm any school at this point too. We simply can't keep it out. And that means it reaches those teachers, it reaches our custodians, it reaches our bus drivers. We've already lost at least 2 teachers, 2 bus drivers, and a student. And we want to make sure, especially after Thanksgiving holiday, when they think that this thing is going to surge, that we are protecting people at the time when it's critical to slow this thing down. My hope and my expectation is January 4th, we'll be back to some form of in-person learning, and it'll look different. But I want to get there too. My kids are missing out too. And it hurts me. And it hurts our family. And we go through what a lot of other families are going on out there.
All right, you're watching News Now from Fox. We're going to hop out of that really quickly, but stay on this COVID-19 beat that we've been following. Specifically, we're turning to Florida now. We have Fox's Robert Sherman in Orlando, Florida. Robert, I think we're hitting some big milestones in the state of Florida. Can you kind of explain what the situation is out there with addressing the current situation following the Thanksgiving holiday?
Yes, that has been a big concern that we've heard here from local officials about the amount of travel happening in Florida. And we now know that the state of Florida in that vicinity, right around 1 million total cases. Some big news is coming out on the COVID-19 front today. The CDC's committee, this is the Advisory Committee on Immunization Practices, just met this evening, and they've been discussing who would be getting some of these vaccines first. Well, a vote was just handed down this evening in which they determined that when a vaccine has been FDA approved and has been recommended, that vaccine will first be offered up to healthcare professionals and residents of long-term care facilities. And what we've been hearing from officials with Operation Warp Speed, for example, is that acknowledging that there has been a lot of good news on the front of vaccines, and they're hoping to distribute that as much as possible. But that said, the nation is by no means out of the woods yet, and what they're juxtaposing right now is that while they do have a couple of vaccines that they're hoping to start to see distributed by the end of this month, and 3 or 4 more vaccines that are in the works in clinical trials right now, they're hoping to start to see come out a little bit later after that. They say that there's that right now they're looking at a limited number of doses that they'll be able to distribute in the month of December. So the goal is to try and get some of these other vaccines going and up to the forefront in order to get those out to as many people as possible. So there is some good news. There is some reason to be optimistic with what we're starting to see with some of these vaccines, approaching that point of distribution, but still a ways to go around the country.
Robert, specifically on the Florida front, what are you hearing from officials out there about distribution? Every state's going to look a little bit different.
Yeah, every state is going to look a little bit different. And one thing that Governor DeSantis has mentioned from the beginning is, an emphasis on protecting seniors here in the state of Florida. So that is, of course, going to continue to be a point of emphasis down here, with Florida definitely being known for its large senior citizen population, as are some other states such as Arizona, which is where you all are right now. So that continues to be a key concern, protecting senior citizens, protecting those who are living in those long-term assisted living facilities. So that continues to be the main mantra here.
And Robert, also, let's talk a little bit more about Governor DeSantis. He is saying he will not do a shutdown for the state of Florida. Do you think that could change anytime soon? But with this good news, it's sounding like that's probably going to end up being the situation, right?
This has been a firm stance from Governor DeSantis since the beginning. Ever since we saw large portions of the state shut down in the month of March, it has been a pretty stern and firm message that the state is not going to shut down again. They're not going to take some of these measures here in the state of Florida. And the governor has not really wavered from that message to this point. We will be waiting to see, over December is going to be very telling with what's going to happen with the distribution of all of these vaccines, but that continues to be his stance. He just had a news conference where he expressed that point again yesterday, so that has not changed.
And one last question for you, Robert. What is hospital capacity and testing looking like in the state of Florida? Because all of these governors have been speaking about, they're a little worried after the holidays, people traveling around, cases are surging in a lot of places. How are hospitals looking in Orlando, where you're at?
That has been a concern, not just in Florida, but around the country. And we do continue to hear reports of those concerns continuing to come to the forefront, especially with the Thanksgiving travel just in the rearview mirror. We keep hearing that, you may not see the total surge today. You may not see the full strength of some of these spikes today or tomorrow, but perhaps later in the week, perhaps next week as well, as some of these cases come to the forefront. So it's another thing that we know that officials and medical professionals alike are watching very carefully at this point, with so many people either leaving the state of Florida or spending the holidays here in Florida, what things are going to look like over the next couple of days. There's definitely a lot of interest being paid to that.
All right. Thank you so much. Fox's Robert Sherman in Orlando, Florida. We appreciate you. Stay safe.
Thank you.
Again, you're watching News Now from Fox. We're bringing you everything, the latest about COVID-19. We heard that vote from the CDC, big, coming down just in the past hour or so, talking about what vaccine distribution is going to look like. We're going to play that out for you really quickly. A story from our sister station about COVID vaccines. They dove a little bit deeper and talked to some health officials out there. So we'll play that out for you right now on News Now from Fox. We're going to send some of you off to a 2-minute commercial break. When you come back, you'll get a little bit of vaccine news, but then also we'll have a live report about the latest on these lawsuits from President Trump and his legal team. Again, I'm Daytona Everett. Thanks for watching.
Get the coronavirus vaccine first, and with 2 companies already applying for FDA emergency approval, it's expected that the first doses will be going out this month in just a matter of weeks. Operation Warp Speed saying every American will have had the chance to get vaccinated by the month of June. So let's bring in Dr. James McDevitt with Baylor College of Medicine to talk more about this. Doctor, thanks for your time this morning. What do you think about this timeline? Is it pretty accurate that you could see the first priority group getting vaccinated on or about December 21st?
I think it's a pretty good timeline, and a couple of key dates to keep in mind. One is this afternoon. This afternoon, the Advisory Committee on Immunization Practices meets. It's an independent body that advises the CDC. And as you say, they are going to talk about how to prioritize the initial doses of vaccine, which will likely go to frontline healthcare providers who are actually taking care of COVID patients. The next 2 dates to keep in mind are December 10th and December 17th, when a separate advisory body will meet to make recommendations about the approval of the Moderna and Pfizer vaccines, or make that recommendation for approval of the FDA. So by mid-December, we potentially could have approved vaccine for those two different vaccines, and it should ship within days then of that approval.
And doctor, as far as the priority list goes, we've heard healthcare workers, those dealing immediately with coronavirus patients, along with the elderly and those with underlying health conditions, would be in the first priority group. Do you anticipate the vote changing much or veering much from that today, or any group possibly being added to that first priority group?
I don't think it'll change much, and there was a lot of advanced work done by the Academy of Medicine that convened a body that looked at a broad range of issues, including where's the vaccine going to be best used, how do we address issues of equity across all our different populations. So there are pretty good guidelines in place that have been generally accepted, and I expect the ACID today will more or less follow those Academy of Medicine guidelines.
And doctor, what do you say to skeptics who don't believe a safe, effective vaccine can be developed in less than a year and may be reluctant to take one?
Well, I'd encourage everybody to look at the data. We will not give the vaccine to any of our employees until we are convinced that it is safe and effective. All the preliminary data that I've seen shows it has a very high rate of efficacy, but also minimal side effects. The most common side effects are soreness at the injection site, body aches, and mild headache, which are very short-lived. So again, this is great news. We should be celebrating. As you said in your previous piece, we need to keep our focus on masking and distancing because we're a long way from herd immunity. But we potentially will, I think we will, have 45 million doses available by the end of December. Which again, that's 5, 6, 7% of the U.S. population. We probably need to be closer to 50 to 70% to reach herd immunity, but it is a great start.
Well, you certainly have a lot of hope to share with us, and we appreciate you coming on, answering some of our questions. We wish we had more time, but we invite you back again soon, Dr. James McDevitt with Baylor College of Medicine. Thank you so much. Have a great day.
Thank you.
Are you watching News Now from Fox? I'm Daytona Everett. Just a little more information out there about these vaccines, and some big information coming down from the CDC saying that it is going to be distributed first to those medical professionals out there and then to nursing homes as well. So that is something that we will continue to follow here on News Now from Fox, but we are going to switch gears a little bit. We have Fox 6 Milwaukee's Bill Miston, who is going to break down some of these lawsuits from the president and his legal team. This is ever-changing. Bill, what do we need to know right now in this moment? Because hour by hour, we are trying to keep up with this.
Good evening, Everett. What I can tell you right now is that in the next several hours, we're expecting Governor Tony Evers' administration to respond to this lawsuit filed by the Trump campaign in the Wisconsin State Supreme Court earlier today. Now, that lawsuit is seeking to toss out roughly around 220,000 absentee ballots that were cast in Democratic strongholds in Dane and Milwaukee counties. Now, this is the president's latest attempt to litigate the results of the November 3rd election here in battleground states. Now, President-elect Joe Biden won Wisconsin by around 20,000 votes. That's roughly the same margin that President Trump won Wisconsin back in 2016. And those results this year were confirmed by the state and the governor on Monday. And then today, the Trump campaign filing that lawsuit in state Supreme Court. Now, it's worth noting that there was a recount that was done here in Wisconsin, a partial recount in those Democratic stronghold counties of Milwaukee and Dane counties. And at the end of it, the Trump campaign paying $3 million to conduct that recount, and it netted Joe Biden 132 votes, padding his lead here in the state. So now this campaign this lawsuit filed by the campaign at issue with these 220,000 ballots, it's claiming that clerks filled in missing address information on absentee ballot envelopes, the certification envelopes, but that practice has been in place for roughly the last dozen elections or so, and that has been guidance from the Wisconsin Elections Commission to municipal clerks. So there's going to be likely going to be some filings here coming in the next several hours, and this is an indication of how quickly that the Supreme Court is likely to decide in this case. Everett?
And what are we hearing right now from President Trump and his team? Have you heard anything from Twitter, probably?
I've been eyes deep in a bunch of different court filings, so I haven't been completely up to speed. But what I can tell you is I know that shortly after that this afternoon, when this lawsuit was filed, there have been a number of claims made by the Trump campaign's legal team that there was widespread voter fraud in a number of these battleground states. Today, though, U.S. Attorney General Bill Barr announcing that the DOJ hasn't found any evidence of widespread voter fraud that would change the outcome of this election. Shortly after that, the response came from the Trump campaign and attorney Rudy Giuliani attacking Bill Barr's position on this. And so from that standpoint, what I do know is I'm paying close attention to what these filings are saying in court and before the state Supreme Court. So we're going to be keeping an eye on that here in the coming hours, and then no doubt here in the coming days.
And I'm not sure if you touched on this or not, Bill, because you broke down a lot, but there's specifically alleged illegal voting events that were held. Is that going to be held up in court too? Are they taking a look at that?
I'm sorry, I'm not exactly sure what you're referencing specifically. I know that absentee ballots have been requested for some time by voters here in the state as allowed, and those voters could turn those ballots in by mail or turn them into their local municipal clerk or to secured drop boxes here in the state in their local municipalities. So I'm not exactly sure what you're referencing.
Alrighty, Bill, is there anything else that we should be looking forward to? I know that in the next few hours things are going to drop down, but anything in the next few days for Wisconsin as well?
Well, I think what we're expecting, though, is like I said earlier, is that we're expecting the state Supreme Court to probably have some sort of decision on this case soon, considering how quickly it's asking for Governor Tony Evers and his administration to respond to this complaint filed by the Trump campaign here in the state Supreme Court today.
Okay. All right, Fox 6's Bill Miston out there in Milwaukee. We appreciate you. Thank you for the details with these ever-changing lawsuits from the Trump campaign. Again, you're watching News Now from Fox. We've got a lot more to bring to you in the next hour or so. We're talking Houston, we're talking California, and we're talking Wilmington, Delaware from President-elect Biden as well. We'll have live reports coming up for you here on News Now from Fox. We're bringing you live, raw, unfiltered news all throughout the day, all across the country. For now, we are going to take you back out to an update this morning from Governor Pritzker about COVID-19. We're switching back into COVID-19 for you here. We're going to send some of you off to a 2-minute commercial break. When you come back, we're talking what the latest is for the COVID-19 response for the state of Illinois.
Well, good afternoon, everyone, and welcome to the COVID-19 update for Tuesday, December the 1st. To start, I want to affirm that my administration is monitoring the situation at the 11 Illinois long-term care facilities owned by Infinity Healthcare to ensure that services for our most vulnerable residents continues uninterrupted. There are hundreds of SEIU nursing home workers on strike who are asking for the same type of reasonable working conditions that a large number of long-term care facilities around Illinois have already agreed to in their own contracts. And given the significant federal and state financial support for nursing homes during this pandemic, it's important that workers see that funding reflected in their that they see that funding reflected in their workplace, in their safety and their pay. It's very important to me that the owner and the unions are able to sit down and negotiate quickly and in good faith so that they can get back to work and to the work that matters the most, which is getting our residents safely through this pandemic. So on to our regular COVID update. Just as has been the case throughout this pandemic, the new COVID-19 diagnoses of today were a result of actions people took days, even a week or more ago. The new COVID hospitalizations of today were people who were first exposed 1 or 2 or sometimes even 3 weeks ago. And those who passed away due to COVID-19 today may have been fighting in the hospital for days or weeks or possibly even longer. All that is to say that we know that we aren't going to see the bulk of the impact from Thanksgiving in our data quite yet. Just as it took time to see the impact of the 4th of July and Labor Day celebrations in the data. Additionally, past experience has taught us that decisions about whether to get tested are much different around the holidays. As expected, we saw peak demand here in Illinois running up to Thanksgiving, followed up by a significant drop-off. As you could imagine, that leads to more uncertainty in the trends that we're seeing in this in-between period. Today's uptick in our positivity rate could be from exposures beginning perhaps 2 weeks ago and including exposures that may have occurred at Thanksgiving, or it could be attributable to these fluctuations in testing. Yet another reason that we need to give ourselves time to monitor changes as behaviors begin to normalize. Again, people returned now from Thanksgiving. What I am certain of is that this virus is circulating widely in every county across the state of Illinois. And if you are exposed to the virus and become infected, you will be infectious before you're aware that you have this disease. That means if you didn't socially distance at Thanksgiving and you spent time with people who are not in your own family bubble, you may feel fine right now, but you could nevertheless be passing COVID-19 on to others without knowing it. So for anyone who traveled or gathered with family and friends for the Thanksgiving holiday, monitor yourself for symptoms. And if you have any of those symptoms, stay home. Even if you think you are having allergies or experiencing what feels like a mild cold, IDPH recommends that you stay home as much as possible and avoid close contact with other people, and that includes those in your own household. If you didn't travel for the holiday, now is not the time to go have an in-person visit with your friend who did. For those who traveled for Thanksgiving, IDPH recommends that you get tested between 5 and 7 days after your return. So that's tomorrow, Thursday, or Friday. That's only if you're asymptomatic and you want to go get a test. If you have symptoms, you should get tested right away. This is the time to be extra careful. With a surge of the virus expected, limit your mobility outside your home and stay home if you don't feel well. Even if you feel well, other than leaving for work or for school or for essential trips like going to the grocery store, these next few weeks are a time to stay home as much as possible. Assume you were exposed, and assume more of your coworkers or friends were exposed than ever before, and act like it with social distancing, wearing your mask whenever you're in public, whenever you're with other people. It's the safest thing that you can do for the people that you love and for the healthcare workers who risk their lives to help you when you need them. When Dr. Ezike stands up and provides these updates each day. You'll often hear her add, these are more than numbers. She's right. She says these are people, mothers, fathers, siblings, children, friends. COVID-19 has stolen so many lives that weren't ready to be taken. That's the curse of this disease. And it's a curse made incredibly more painful when it rains down upon so many families all at once. Our next speaker knows that pain all too well. Mrs. Shauna Seegers of Stager, Illinois, her husband Otis, and their son were 3 of the thousands of Illinoisans to become infected with COVID-19 last spring. Shauna and her son recovered, but tragically, Otis did not, and he succumbed to the virus in April. I asked Shauna to join us today and to share her story with all of you. She graciously agreed to speak to you in hopes of preventing someone else's tragedy. So with that, I'd like to turn it over to Shauna.
Hi. Thank you, Governor Pritzker. Can you hear me?
We can.
Awesome. Thank you for inviting me to join today's share my family story with you guys. My name is Shauna Seegers, and I am a lifelong Illinoisan. In March of this year, my family and my husband, we were affected by the COVID-19 virus. It started with my son and my husband, both truck drivers. I don't know exactly how we contracted it. I just know that we did get it. One of the things that back in the early part of the COVID illness, we began to ill, and a couple of days later, I began to feel ill as well. Okay, at the same time, we think that my son was sick as well. We went to the U of I and we got tested. And they confirmed that both my husband and myself had the illness. We actually began quarantining ourselves prior to being diagnosed. However, after the diagnosis, we began being vigilant about changing the sheets, making sure no one entered our house, making sure that we did not go any place. My brother and my sister, they began to go shopping for us. They began to drop things off at the door, food outside the door, and they would do the ding-dong ditch and run and go back to the car. One of the things that we were able to do is that we were able to quarantine ourselves so no one else got it, but both Otis and I was having a hard time. Otis a little bit more difficult than I did, and we went back to the hospital. That particular day, which was March 28th, they told me I could go home, but my husband had to stay. That was the last time I saw him alive. They began to give him oxygen, but it wasn't enough. On March 30th, they told us that they had to intubate him, and his oxygen level was dropping lower and lower. Otis never recovered, and on April 25th, Otis passed away. Since that time, every day has been a challenge, focusing on new memories and how to live without our loved ones in this ongoing difficult time, especially during the holidays as it gets closer to this time of year. It's going to be difficult for my family. It's going to be difficult for my children. I do want to say that I don't want any other family to experience losing the pain that my family experienced. So please, please, please follow the guidance of Governor Pritzker and the IDPH. Stay at home as much as possible. Wear your mask. Wash your hands. And please try not to hang with people that you don't know. As a matter of fact, don't hang with people that you don't know. This COVID-19 virus is impacting people's lives. I'm partnering with friends and family so that we can make sure that it doesn't affect people like it affected us. And around this time of year, people are struggling from the virus. Anyone that's struggling financially and they experience a loss from the virus, we want to actually help them out. On December 11th, we're going to be at the Creek Park District accepting donations because we want to be an assistance to families, accepting non-perishable food, toys, and accepting donations via check. If you're able to drop that donation off, we'll be there from 5 p.m. to 9 p.m. And since today is Giving Tuesday, I would like to encourage everyone to think of a way to give back to your community if you are able. And everyone can support their community. Remember to do this: mask up, wash up, and back up. Thank you, Governor Pritzker, and it's back to you.
Thank you very much, Shauna, and thank you very much for sharing your story and of course your great loss of your great love, Otis. And you and I spoke about the fact that your son, thank God, recovered, and I know you have other children too, and they so far have been free of the virus. But I think your messaging, your standing up and telling people your story is very, very important, so that people know that they really need to follow the mitigations, that this can be tragic when it gets into a home, when it gets spread among a family, and there's so much that people can do to prevent it, and hearing your story helps teach that to them. So thank you for your willingness to share. And now I'd like to turn it over to Dr. Ezike for today's medical update.
You're watching News Now from Fox. That was just a little bit of Governor Pritzker speaking about COVID-19 in the state of Illinois. But we do want to bring you a story coming out of Houston, Texas today, a really tragic, unfortunate story. Alexis Sharkey, she's a 26-year-old Instagram influencer with over 30,000 followers. She was found dead off a Houston interstate last week, and we do have a live report coming in from Ivory Hecker. She's from Fox 26 Houston. Ivory, can you explain kind of the timeline of this situation and who Alexis was? It's just so unfortunate to hear things like this.
Yeah, it all began actually on Friday. Alexis's friends told me today that they noticed something was wrong when she stopped posting on her Insta story. She's an influencer who promotes products, and it was Black Friday, so she should have been posting a lot, but it all ceased sometime on Friday. Then Friday night, Alexis's husband reaches out to one of Alexis's good friend's boyfriend, and he said to him, "Hey, you know what? I can't find my wife. We got in a fight. She took off, and I don't know where she is." That was about 9:30 Friday night, and so the word was passed on to the friends. The friends start reaching out to her, no response. Then Saturday morning, a city of Houston employee was driving down this sparsely populated road near the interstate in West Houston, and he noticed feet protruding from the bushes in the ditch of the road. That is when a naked body was found, turned out later on to be confirmed to be Alexis Sharkey, the missing influencer. So her body was found just pretty much hours after she was reported missing by her husband, and there were no visible injuries on her body. She was just naked in the bushes. No word on how she ended up there. So today, police tell me they have seized surveillance video from the one business that was on that road, which was a beauty salon. So that beauty salon, I went out there today, it does have a camera facing the roadway. Police won't say yet what they found on that video footage. So her friends are very hopeful right now that that will lead to some answers. And what happened to this young woman? They tell me that she was married to her husband about a year ago, but just in the past month, they filed for divorce. I tried reaching out to him for comment today. He has not gotten back to me, but he has been posting a lot about her on his Facebook, a lot of photos, and expressing that he is heartbroken on his Facebook. Daytona.
Ivory, I do have a question for you. As far as friends and family go, it's kind of interesting that they are being so open to speaking with all of you reporters. I saw that her mom is also speaking out. What are they saying about the situation and about her husband in particular?
Well, the two friends of hers that I spoke with, they told me that they just felt that the more open and expressive they could be about this case, that hopefully it would just bring on more answers, the more exposure this case could have. They were just so shocked that this would happen to such a sweet person. And one friend actually told me that apparently there were some pretty bad issues that Alexis had been dealing with, and she had just kept it low key and not told anyone what was going on because she was such a positive spirit. She didn't want to just cast negativity on her friends by talking about her issues, but apparently there were some things going on that those friends tell me they are not ready to just tell the whole world yet because they haven't even spoken with detectives yet. So they said they have evidence they're waiting to share with the detectives. They don't want to compromise the case by sharing it with the media first, but they said this girl was just the sweetest soul that you would ever meet, and they're absolutely devastated.
And I'm not sure, Ivory, if you said anything about this, but specifically when her body was found, was there any visible marks on her, or what's the investigation on that specifically?
There were no visible signs of injury, according to detectives on the scene that we spoke with on Saturday when her body was found. So that really adds to the complexity of questions about what on earth happened. Why was she left on the roadside with her feet just protruding from the bushes for anyone to see? So police today told me they're still not calling this a murder, but her friends told me they are confident this girl was murdered. Why on earth else would she be naked on the side of the road in the bushes? Police said they are just waiting for evidence for the autopsy results from the medical examiner's office at this point, and of course trying to collect more evidence overall in this case, find out what exactly happened.
Yeah, and obviously, Ivory, I mean, I've got her photos pulled up here and her Instagram account. I mean, you live in Houston. Like, is she pretty well known? She's got 30,000 followers out there. This is a new world that we live in right now where everyone is online and these people are accessible. What do you have to say about that, just being from Houston?
Well, I think that she seemed to be quite well known in kind of the beauty community, people who are into skincare and hair care. That's kind of what she promoted on her social media, as well as her travels. She traveled a lot with her friends, or with her husband, her friends told me. So, I do know people who knew her, and everyone is just really shaken by this happening. Some people wondering, was this a creepy follower who came after her? Or, of course, other people say, the husband is always the first suspect. But right now, police are not saying anything about suspects or even whether this was foul play, but they're not ruling out foul play.
And do we know when that could possibly come out from the police department?
They have not given us a timeline today, and I checked with the medical examiner directly. They did not give us a timeline on the release of autopsy results either. Toxicology results can take a matter of weeks to come back, so I think a lot of people are hoping they won't be waiting that long for answers.
Right. Alrighty, well, unfortunate story out there in Houston, Texas, but we'll be following along. That's Ivory Hecker with Fox 26 Houston. We appreciate you.
Thank you.
Again, you're watching News Now from Fox. We're bringing you all of the latest news from across the country. This situation specifically with Alexis Sharkey, a very well-known influencer in Houston, Texas, found dead off a Houston interstate last week. So we'll be following what investigators have to say about that. Let's just take a little live look around a couple different places across the country. We have the Capitol right there. It's a little darker on the East Coast. It's about 5:40 out here in Phoenix, Arizona. We'll give you another look around at the White House as well, with the notable ribbon on the front steps. Again, if you're new to News Now from Fox, we follow all of these live, raw, unfiltered feeds from across the country. Bring it to you as we see it. If you miss anything here and you step away, but you want to go back and rewatch it, head to our Twitter page at News Now Fox. We post everything on there, our interviews and any breaking news. Join us a little bit later in the night as me and Andrew Kraft break down today's top headlines, which a lot has happened today. It's been a very busy day across the country, both when it comes to COVID-19, updates from the CDC, stimulus bills, breaking news events, and it's not ending quite yet. We've still got a full night ahead of us. We're going to be having a live report from Los Angeles, where Los Angeles County Supervisor has stepped into a very dicey situation as far as going out to eat goes. We have Bill Melugin, who's going to bring us that story. But until then, before we took that live report, we were with Governor Pritzker in Chicago. So we will listen in to him again as he takes reporter questions and talks about the state of Illinois and their response to the COVID-19 pandemic. But first, we'll send some of you off to a 2-minute commercial break. When you come back, the state of Illinois.
That the work that we've done, keeping people in tier 3, having tier 2 and tier 1 just before it, that might mitigate the damage, let's say, that the Thanksgiving travel may have done to the numbers.
Dave Dahl at WTAX, LaSalle, Quincy, compare and contrast.
Well, first of all, we followed the law with regard to reporting to families. 24 hours is the time period now for reporting to families if their loved one in a veterans home has been infected or has a disease. We've issued 2 reports already. Think back to that incident at the Quincy Veterans Home. It took an awful long time to get information out. We have 2 reports that have been issued, one that came from IDPH, one that came from the Department of Veterans Affairs together with the federal VA. And then, we've also instigated and initiated the DHS Inspector General to do an independent investigation so that we can learn all the details and make any corrections and hold people accountable if that's what is necessary here. So I think there's an awful lot of difference. Sorry, I just want to say one other thing, which is the diseases are also quite different. Legionnaire's disease does not transmit from one person to another directly the way that COVID-19 does. The Legionnaire's disease gets transmitted in the mist of steam, for example, in a steam shower, from the pipes, from the water that comes into a facility. And COVID-19, as you know, is insidious. You can carry it asymptomatically. You can convey it to other people asymptomatically for days, really, until you feel symptoms yourself. And so there's a lot of difference.
Brett Rowland at the Center Square. You directed agency leaders to identify cuts, but you have not announced the implementation of any cuts since the outset of the pandemic. Why is the state still spending as if COVID-19 hasn't affected revenue?
Well, I think I want to remind people that there are two different things affecting the budget. And I'll remind this to Brett as well. One is the highly unusual emergency that has occurred in the year 2020, and that's COVID-19. That's one aspect of the budget challenges, and every state is experiencing those. There is the other aspect, which I have been working on since I took office, and that is the long-term structural deficit that's been in place for decades now. And I came into office and identified it, I've held it up, and we've been addressing it really since day one. So we're continuing to look at the ways that we can cut government, the way we deliver services. I don't want to cut services. I want to cut the cost of government for people. So we brought efficiencies to state government. We're continuing to do that. We have proposals that we've talked about with some of the budgeteers and members of the legislature that are, changes in operations, not in programs, but in operations. And that's what we've gotten from all of our agencies. And we've begun to implement those changes. But those are not the bulk of what will need to happen in the budget. It's not, the changes that we make to operations are only a portion of what we need to, see as cuts to state budget in order to balance it. We also need to see stimulus from the federal government, which will help us to pay back the $2 billion of borrowing. That was really the purpose of the $2 billion of borrowing. So you may think that hasn't already occurred, that we haven't already begun to make cuts, but actually we are doing it within the agencies even now. But there's more that needs to be done, and the legislature needs to weigh in as well.
Mike Militich at Quincy TV. Governor Holcomb just extended Indiana's public health emergency through the end of the year. Do you plan on extending our statewide emergency beyond December 12th with another surge expected? If the emergency continues, and I don't believe that the vaccines will have been distributed and that we will no longer have COVID-19 prevalent in the state of Illinois at the end of the current emergency. So I guess if I had to imagine whether we would have to declare another disaster for the state, I would say highly likely. Amy Jacobson. Governor, if you are encouraging Illinoisans to work from home, then why aren't you leading by example, which you did last week?
Thank you. Yes, I am encouraging people who work in offices to do everything they can to work from home. Not everybody who works in an office can work from home. In the job of governor, I do have things that I need to accomplish that require me to either be in the office or use the facilities of the government that I can't access at home. So I am trying to lead by example, and I did stay home last week when I could. There are days when I can't, and I'm trying very hard to make sure that the people who work for me are kept safe. So we've sent many people who work in the governor's office home. They're working from home, and if they can do that and still get their jobs done, that's what we've asked them to do. In my case, I must admit that some of it I can do from home, some of it I can't.
Shruti Bloomberg, the restrictions placed last month are intended to curb the surge and avoid a stay-at-home order. What's your sense of compliance or lack thereof? Has the state reached its limit for how much it can do with mitigations to curb the spread of COVID-19?
Well, as I have said before, we have not gone to a stay-at-home order, and that would be the kind of the next step that we could take for mitigations. In terms of compliance, I think the vast majority of people in Illinois are complying. The problem is the people who don't comply have an outsized effect on people who are complying. So, someone who comes into a room with you, if you're wearing a mask, when they're not wearing a mask, well, that cuts in half the protection that you would otherwise get if you're wearing a mask. So those folks who aren't wearing masks are really putting others in danger.
They're also, by the way, not protecting themselves. And masks are not 100% effective. They're about 80% effective, or something in that nature. And so, there are ways that you can catch the virus, not just person to person. If you're not wearing a mask, and if you're around other people who aren't wearing masks, boy, that is really a recipe for potential disaster. We need people to comply. We'd like to have 100% of people comply. There obviously are people who can't wear masks for a medical reason, but those are really a very small portion of the population. And so I'm hopeful that people will hear stories like the story that Shauna told, that they'll understand the tragedies that are happening around the state. And often they are happening in situations where people are not following the mitigations.
Chris Ty at CBS 2 is asking if the 109,000 doses we're expected to get include the 20 to 25,000 that Dr. already explained the city are getting today.
Those are separate. Is that included? Okay, I'm sorry. I know that they get a separate shipment, so forgive me for having that wrong. They get, the city of Chicago and major cities across the nation get a shipment directly to the city. And so the 109, as Dr. Ezike is reminding me, does include the 25,000 that would go to the city of Chicago. And again, if it's 25,000, it's really 12,500 people that would be getting it. And that's roughly proportionate. The city of Chicago has about 21% of the population of the state of Illinois.
Kate Chappell at NBC5 will be our last question. I know the governor has addressed this before, but we're hearing of even more suburban restaurants defying the indoor dining ban, including in Kane County. They say they must be open or be forced to close permanently due to the lost income. Should stricter penalties be in place to discourage owners from opening anyway? And if local health departments or police choose not to enforce the rules, do you think the state should get involved?
I just want to remind everybody that the laws of the state of Illinois get enforced by the local police departments, by local authorities, by, in this case, local health departments can also be engaged in this, local states' attorneys. That when laws get passed, executive orders get issued, especially in an emergency, we rely upon local law enforcement and local authorities, whether we're talking about speeding tickets or we're talking about health laws, or we're talking about laws that are designed to protect people from crime. If local law enforcement is not enforcing it, they're endangering the people who live in their jurisdictions. And so I would just remind people, we do rely upon local law enforcement for virtually all of the enforcement that occurs for all the laws that exist in the state of Illinois. Ignoring them is putting the people who live in your area in peril. And so I would urge law enforcement to listen to their public health departments, states' attorneys, to follow the law. We need everybody's help to make sure that we're keeping people safe. Bars and restaurants, I have pointed out to all of you, I even talked about it today. Bars and restaurants, unfortunately, have suffered greatly because they happen to be places where there's an amplification of the spread of COVID-19. And it's not their fault. It is not their fault, but it is a fact. And so we've got to ask those people to follow the rules because they're spreading the virus when they open up and people come in and, you're mostly not wearing a mask when you're inside a restaurant or a bar eating or drinking. And that can be dangerous for everybody that's inside.
All right. Thanks, everyone.
Thank you.
Hey, Jordan, I have a question for you. Look at your hand,
Are you watching news now from Fox? I'm Daytona Everett. That was Governor Pritzker talking about COVID-19 response and the latest on the cases out there. We're going to move to Maryland now, where an unfortunate story is coming out of there. Actually, a 1-year-old boy has died of COVID-19, and that is the youngest victim for the state as far as COVID-19 deaths go. We're going to play out this press conference really quickly here on News Now from Fox, just to give you a little bit of something to look forward to over the next couple hours. We'll have a live report coming out of California with our very own Bill Melugin out there from Fox 11 talking about the LA County supervisor who was caught eating at a restaurant after she had decided to ban outdoor dining in the state of California. That'll be interesting. And then me and Andrew Kraft, we're going to break down some of the top stories of the day here on News Now from Fox, just to go over all the headlines. Maybe you weren't able to sit here and watch our entire broadcast, but if you did miss anything and want to go back and see it, you can follow us on Twitter at NewsNowFox. Lots of great stuff on there as well. We're going to send some of you off to a 2-minute commercial break. When we come back, the latest out of Maryland.
And thank you all for being here on Tuesday afternoon. Hope everyone had
and Acting Deputy Secretary for Public Health Services, Dr. Jinlene Chan, as well as Dr. David Marcosi from the University of Maryland Medical System. Yesterday, I contacted President-elect Biden and his transition team to lay out our most urgent priorities, most importantly, the desperate need for a stimulus relief package for small businesses and struggling families. Every day I hear from small business owners who say that without this help, they may not be able to keep their doors open through the end of the year. PPP funding already ran out many months ago, and CARES Act funding will run out at the end of this month. And my message to everyone in Congress on both sides of the aisle is absolutely clear. If you do nothing else, if you pass no other legislation, and you can only accomplish one thing during this lame duck session, it must be to pass the Phase 4 relief package. We simply cannot wait until January 20th for this urgently needed relief. The time for partisan politics is over. We've been pushing for this for 8 long months, and the time has come to stop the partisan bickering, to reach a common sense compromise, and to get this done once and for all for the American people. Yesterday I had a meeting with Vice President Pence, the White House Coronavirus Task Force, General Perna of Operation Warp Speed, regarding vaccine production and distribution. Yesterday, we also held a meeting of the Maryland Coronavirus Task Force, along with many of the CEOs of our hospital systems across the state. And we had a discussion with the leadership of the Maryland Association of Counties and the Maryland Municipal League as we continue our outreach and communication efforts with local leaders across the state. This morning we convened our Unified Command Task Force as we constantly monitor all of the public health metrics in Maryland, as well as the spiking numbers in states across the country. As of this morning, Maryland has surpassed 201,135 confirmed cases of COVID-19, including an additional 2,765 cases in the past 24 hours. We have now had 27 straight days with more than 1,000 new cases. There were over 157,000 new cases yesterday in the U.S., the 28th straight day that new cases topped the 100,000 mark. Maryland's 7-day positivity rate is 7.33%. Our cases per 100,000 is now at 34.4. We continue to be in better shape than most of the nation. Our statewide positivity rate is better than 41 other states. Our cases per 100,000 is better than 39 other states. According to travelers, we're the 14th best state for residents voluntarily choosing not to travel out of state. And a Carnegie Mellon study just showed mask wearing compliance in the state of Maryland at 96%. We are concerned, however, that our COVID hospitalizations have increased by 51% over the past 2 weeks. According to our modeling, we can expect to reach a new record high for hospitalizations in the coming days. 130 surge beds are currently in use at the Baltimore Convention Center, the reopened Laurel Hospital, and the Washington at Venice expansion, all of which that we added this spring. 1,583 COVID patients are currently hospitalized in Maryland today, which is the highest level since May 10th. And 350 Marylanders are currently in intensive care units. 21 hospitals in Maryland have reached more than 90% of their capacity. COVID-19 hospitalizations in the U.S. have surged to their highest level ever, with over 96,000 Americans hospitalized today. As more and more hospitals across the nation are reaching their capacity limits. The virus has taken the lives of over 268,000 Americans, including 4,516 Marylanders. Sadly, we have lost our youngest victim, a 1-year-old boy, to this deadly virus. We are laser focused on taking actions in an effort to prevent the overburdening of our healthcare system. When we were dealing with the initial surge of COVID-19 in the spring, we added 6,000 additional hospital bed surge capacity. And we took a number of steps to increase staffing capabilities. I issued an executive order to fast-track the licensing process for out-of-state healthcare practitioners and those with an expired medical license, and an order to provide broader authority to credential emergency medical technicians and paramedics so that they could work in clinics and field hospitals. We activated the Maryland Medical Reserve Corps, a force of thousands of dedicated and trained medical and healthcare professionals ready to assist in a public health emergency. The Maryland Institute for Emergency Medical Services also instituted a program to allow medical students, nursing students, and medical technician students from our universities and colleges and community colleges to become part of this staffing surge capacity. Last month, we increased the capacity of alternate care sites and provided additional clinical care and staffing support to nursing homes dealing with outbreaks. We issued an order which limited hospital visitation and gave guidance to hospitals and other medical facilities on elective procedure admissions that are not urgent or life-saving, as well as an emergency order allowing hospitals that are either at or nearing capacity limits to transfer patients to hospitals which are more able to provide them with the care that they need. The current surge is not only increasing the burden on our healthcare system and filling available hospital beds, but it is also affecting our healthcare workers who are already spread thin and operating under immense strain and stress. Today, in partnership with the Maryland Hospital Association and hospitals across the state, we are taking a series of additional actions to further mobilize additional medical staffing to battle this COVID-19 surge. We're currently in need of people with clinical backgrounds to work at our hospitals, nursing homes, testing sites, and vaccination clinics across the state. Anyone interested in serving can go to www.marylandmednow.com. We are also contacting those individuals who have signed up for the Maryland Medical Reserve Corps. We're also requesting that all Maryland universities and colleges immediately develop emergency policies and procedures which will award academic credit to students who are willing to serve in healthcare during this pandemic. And we are encouraging our colleges and universities to allow healthcare students who are in their final semester and have satisfied all graduation requirements to be eligible for early exit and expedited testing and licensing requirements in order to more expeditiously enter the workforce. We're also urging our counties to tap all non-deployed school nurses, health services staff, and other county employees to help staff our testing and vaccination sites. And we are urging hospitals and nursing homes to begin utilizing unlicensed individuals to perform certain less critical tasks in order to free up nursing staff. In consultation with the doctors on our coronavirus task force and the CEOs of Maryland hospitals, we're taking these steps to ensure that every single Marylander in need of a hospital bed is able to get a hospital bed. Effective immediately, hospitals are also required to submit a surge plan, which includes detailed strategies for the expansion of hospital bed and staffing capacity adjustments. These plans must be submitted to the Maryland Department of Health no later than December 8th. Hospitals should begin making adjustments on an emergency basis, including adding or redeploying staff, reducing non-critical elective procedures that require, particularly those that require a bed or a ventilator, and transferring patients to other appropriate treatment facilities. We currently have 6,816 Marylanders in our state hospitals. When we reach the 8,000 total hospitalizations statewide, all hospitals will be required to expand their staffed bed capacity by at least 10% within 7 days of that trigger. The Health Services Cost Review Commission is reinstating emergency policies to provide more financial stability to hospitals as they navigate this pandemic. Now, after 40 years of incredible service to the state of Maryland in many capacities, in the House of Delegates and the State Senate as Anne Arundel County Executive, and serving for the past 6 years in our administration, Secretary Bobby Neal's retirement is effective today. He has been a longtime friend, a trusted advisor and confidant, and a dedicated public servant throughout his nearly 4 decades in public service. Most importantly, as we went to war against this unprecedented, deadly pandemic, we're incredibly grateful to him for his service, and we wish him the very best in his retirement. So if you'll indulge me, I'd like to present a governor's citation on behalf of a grateful state and the people of Maryland, just to thank him for his many years of service. Thank you. Thank you. Stepping into his shoes immediately as the acting secretary of the Maryland Department of Health will be the department's chief operating officer, Dennis Schrader. Dennis has also been a longtime friend and a dedicated public servant who's also been a part of our administration for 6 years, most recently running point on our testing and hospital surge efforts during the COVID-19 pandemic. Our acting Deputy Secretary for Public Health Services, Dr. Jinlene Chan, will be leading our COVID-19 vaccine acquisition and distribution efforts. And Dr. David Marcosi, who has served on our coronavirus task force and has been the COVID-19 incident commander for University of Maryland Medical System, will, effective immediately, serve as our senior medical advisor on COVID-19. We're very fortunate to have him playing a more prominent role on our team as we face the challenging weeks and months ahead. I'm really proud of this incredibly capable and talented team and all the people that work under them. They will be playing a key role in guiding us through this critical and hopefully final phase of this pandemic response. So at this time, I'm going to turn it over to Dr. Marcosi to provide some further details on medical staffing surge.
Thank you, Governor. Good afternoon. It's a great honor to speak to you again today. At the start of November, it was obvious that we were entering a period of high risk, with the potential for peaks and mountains of new cases and illnesses. Unfortunately, the data confirms this and shows that more of us are being infected by this virus, more of us are transmitting it, and more of us are becoming ill because of it. Due to the rising numbers of cases and the recent holidays, I am very concerned that these next few weeks and months will be challenging as a result of continued and likely accelerated spread of this virus due to Thanksgiving. I do understand. We all just want to take one day off from COVID-19, especially during the holidays. Unfortunately, the virus doesn't take a day off. We know that millions of Marylanders did the right thing over Thanksgiving. They stayed home. They gathered with only their household contacts and avoided risky activities. To them, thank you. You have helped make a difference. Please keep it up. It's easy to just think about the impact of this virus as something abstract or inconvenient that will run its course, like a few bad weeks of winter weather. But let me be clear. There is no ceiling to this, or at least one we do not want to test. In other words, cases, hospitalizations, and deaths will continue to rise unless we take it on. Our actions, what we do as individuals, will stop the rising case counts and slow the spread. We did it before, and we can do it again. In fact, earlier today, I had the privilege of speaking with leaders and parishioners at the Calvary Baptist Church in Baltimore, who are thinking through the impact of this virus and how best to protect themselves and others during this high-risk time. They are figuring out how to fight back, and so should all of us. I have spoken before on this and want to continue to emphasize the importance of seeing your doctor or nurse practitioner if needed. You don't want to survive this pandemic only to have your other medical conditions worsen. Many providers have the ability to see you either by phone, through a telemedicine application, or in their office safely. We all need to stay physically and mentally healthy, particularly during this holiday season. Call your doctor's office and make sure you maintain your health and have the prescriptions and treatments you need. Let me briefly tell you what it's like to work with the people I work with at the University of Maryland Medical System or at every other hospital across our state. Beds are filling up with significant numbers of patients. Testing, hospital surge plans, and our healthcare heroes, the nurses, doctors, and other healthcare professionals who deliver that care in the most stressful environments. They persevere and are working extra shifts to carry the burden. That means potentially missing time at home during this holiday season. They do it for their patients. They do it to save lives. That said, those heroes are stretched thin, and we need to think innovatively on how to address potential staffing constraints. As the governor mentioned, I believe there are opportunities for students to get involved in the response, and colleges or other higher level educational programs could and should investigate providing credits for their organizational participation in this response. For those dedicated healthcare providers, teachers, and other essential workers who are selflessly working to support patients in our communities, thank you. I'm an Army Reserve officer and reflect on one of the 7 Army Reserve values relevant to all of us in this response so that we can keep those essential workers protected. It is the concept of respect. The Army value for respect states, treat people as they should be treated. And in the soldier's creed, treat others with dignity and respect while expecting others to do the same. It is simple. Wearing a mask is a sign of respect. Let's make it our normal. This simple thing that we wear over our nose and mouth limits the spread of our common silent enemy, and it helps protect each other. To get through this, no question about it, it will require courage. Courage to work together, courage to keep going, courage to address healthcare disparities, courage to ensure that data and science drive our decisions. Marylanders, we need to get our second wind. We need to double our efforts right now to get more of us through this healthy. If we do that, we will not only maintain our health, but also maintain our economy. I was reminded today that this holiday season's theme is hope. We should have hope. We know how to fight back against this virus, and there are safe vaccines on the way. Very effective vaccines. When it is available to you, go and get one. When it's my turn, I will, without hesitation or doubt. I have every confidence in the process, and I believe that its safety and efficacy will be proven and well documented. Vaccines are the very best tool we have for getting back to normal. Our unity is our strength. We were successful in fighting back against this pandemic once before, and we can do it again. Yes, we're tired, but we're also battle-tested. We know what to expect, and we're ready for it. Let's find our second wind. Let's be smart, show respect, stay healthy, and to partially quote our governor, just wear the mask. Thank you.
Doesn't quite have the same impact, but thank you, Doctor. Any questions? Tom?
Governor, obviously these are very troubling details you've just discussed. Why not announce more restrictions today, and could you walk us through the process of what could be next if this trend continues?
Well, we're taking decisions as we think they're necessary. So today we're focused on what we do about the fact that our hospitals have too many people in them. We've taken an awful lot of actions on trying to restrict the virus, and we're going to continue to look at things as they become necessary. But the current focus today is on our healthcare providers and our hospitals and those people that are in the hospital, and we're trying to keep alive.
Question for Dr. Marco. Dr. you mentioned a plea asking for colleges to see students can help out. Do you have maybe a couple of ideas on what the students could do to help out?
Yeah, this is certainly not just a question for me, but also for the governor. So I'll at least start. I think there's a great opportunity to involve students in the response. Students who are particularly health science students, who are partially trained and understand some antiseptic techniques, how to put a shot in someone's arm, vaccinate, how to test for, how to collect samples for testing. There's great opportunity there for colleges and universities to think through collectively how to make sure students are brought into the response.
Yeah, good answer. It's just an extender for our, more highly skilled medical professionals, because if you have somebody at the lowest level that is able to, as he said, give a shot, do a swab, work at the testing facilities, or do other things that you need to keep patients comfortable, then the nurses who are more highly skilled can focus on the patients that need their help the most, and the doctors can spend more time with the patients.
Governor, I know that in 10 minutes the CDC will be voting on their allocation plan for the first batch of vaccine, but I'm curious, in Maryland's draft plan, phase 1 or phase 1A and B, how many doses of the vaccine do you believe Maryland needs to carry out the plan as is, and how many have the feds indicated you'll get? I mean, this week, Mayor Bowser said she only expects to get 10% of what the district needs. Can you give us an idea for our state?
But the whole country is only going to get a small percentage of what we need because there aren't enough in production yet. So I believe, and Dr. Chan can correct me if I'm wrong, we just got this information, I think, this afternoon before the announcement. So our first batch is going to total about 155,000, I think, which is 50,000 some change from Pfizer, and the remaining number from Moderna. And that's a tiny fraction of what we need. It doesn't even it covers half of our frontline healthcare workers. It doesn't get to anywhere near what we need in phase 1. That's the bad. The good news is they have great vaccines and they're years ahead of schedule. And we're going to get some relatively fast. The bad news is it's not enough. And so we have very difficult decisions, which we'll be getting more into in probably our next press conference, about the implementation and rollout of that plan as things ramp up. The good news in our discussion yesterday with General Perna and Vice President Pence and Dr. Birx and Dr. Fauci and the whole team was it's sort of like our testing when we started at 50 tests a day and we got up to 50,000 tests a day now in some cases. That this is going to be a little bit of a slow takeoff as they get producing, and then hopefully we're really going to start to get some volume out. That's what we're looking at.
A quick follow-up because it is important. The 155, is that 155 of the 2 doses, or is that 155 divided by 2?
That was exactly the same question we had. So we're gonna hopefully give you more info on that in our next press conference.
Governor, you're clearly looking for additional help and medical personnel. What's the expected deficit, and how many people do you need to sort of fill that to get an adequate staffing level?
Well, that's, maybe one of the others could give you a more accurate, we don't know exactly how many we're going to need. We know we don't have enough. And just think about it. If we're expecting to potentially get, a couple thousand more people in the hospital in short order, I don't know how many staff you need to take care of a couple thousand extra people, but for 3 shifts a day with multiple people, it's thousands of people that we need to help.
Yeah, thanks, Governor. We're expecting initially, as the cases rise by 1,000 or 2,000, that we will need upwards of 2,000 to 3,000 people. So that's where we're making such a broad call, because people are under stress already, and so we're looking for probably 2,000 to 3,000 people to step into roles over the next several weeks.
I know you've talked a lot about the metrics that you're looking at, tracking hospitalizations and other things very, very closely. But then every time we ask about what is this the moment when we bring in new restrictions, you sort of say, well, we're working on it day by day. We're looking at all these things, and we're going to do what we need to do. When would we need more restrictions?
Well, we just announced new restrictions last week, so it's not like we've been waiting. We've taken some pretty aggressive, probably the most aggressive actions of any state in the country. And we'll take them as we see fit, as we have been for the past 9 months.
So, Geraldine, going back to the COVID relief, I know you're pushing for that. I wanted to get your thoughts on the plan coming out today from some lawmakers, $908 billion. Do you think?
Say that again. I'm sorry, I didn't hear what you were talking about. The mask and my hearing, and you're far away.
$908 billion for the COVID relief plan coming out from some lawmakers in Washington today. It doesn't have any money for families, but I wanted to get your thoughts on that. Do you think that's enough?
Yeah, no, it's not enough. I was pushing for this since going back to March, which is the last time the thing got through. We're pushing for a lot more. Right now, my main focus, because the CARES Act money is about to expire, and that businesses and individuals are really suffering, and there's not enough money out there, and in addition to state and local governments running out of money. That we need to help. And while, yes, we need more, it's like we need more vaccines and we need more relief money, but we'll take what we can get now. So having nothing done for 9 months is really frustrating. Getting some compromise for some amount of money right now rather than waiting until next year is probably a step in the right direction. So I've been in discussions with, I reached out to Vice President Biden, talked to Vice President Pence. I've been trading phone calls with a couple of the senators today that are part of that compromise to try to, weigh in and provide some input. It's discouraging. Secretary Mnuchin said they're not going to have a deal by the year end. Some senators are coming up with a much smaller package. So it's not enough, and I don't want to say, yeah, that'd be great, but it would be better than nothing. And my push is not for a specific amount or a specific bill or what the Democrats in the House want or what the Republicans in the Senate want. I just want people to get together and figure out some kind of a compromise.
Governor, has your office been in touch with Baltimore County in regards to the ransomware attack? And how concerned are you that this could happen to other school systems around the state?
Well, it's obviously a big concern. Yes, our administration has been.
You're watching News Now from Fox. I'm Daytona Everett. We are going to step away from that COVID-19 press conference in Maryland. As you heard from Governor Hogan right there, they are addressing a surge and making sure that hospitals are ready and they are not at full capacity and can't handle the amount of COVID-19 patients that are coming in. You also heard a 1-year-old boy died in Maryland. This is the youngest victim to die of COVID-19 in the state. We're going to stay with COVID-19 for a moment, but switch over to California. Good Day LA, Fox 11 Los Angeles, did a report with LA County's health director. We're going to play that out for you here on News Now from Fox. That'll lead up to our live report coming out of LA County, but this time about the LA County supervisor who was caught dining outdoors just hours after she voted against dining outdoors for LA County. So definitely an interesting story right there. But again, we will watch this from our sister station, Fox 11 Los Angeles. We're going to send some of you off to a 2-minute commercial break. When you come back, we'll have that story with the health director.
The head of the county public health department, Dr. Barbara Frere, joins us now. And I know you're very busy. Thank you so much for carving out time for us because I think this is important. Dr. Frere, right now, what is the most concerning critical issue for you as the head of LA County Health?
Good morning, Michaela, and thanks so much for having me today. I think the most important issue for all of us is we have a set of tools at hand. We're in the middle of the worst surge we've ever seen. Every day I feel like this is the worst day we've had, and then the next day comes and that becomes the worst day we've had. With the tools we have at hand, we have an opportunity to actually stop the surge and slow the spread again. But we have to have every single person willing to make the sacrifices that we've asked people to make, not gather with people who aren't in your household, stay home as much as possible, really only going out for essential work, essential errands, essential services, and wear your mask all the time when you're around anybody that's not in your household.
You speak to the challenge of what we need to do, right? And not everybody's on board. You've got 10 million roughly county residents. You've got 10 million roughly county opinions. A lot of people are wondering, what is the science that points to restaurants being a prime spreader of the virus?
It's such a good question, Michaela, and thanks so much for asking. You know, the Centers for Disease Control did undertake the most rigorous study that you can do. It's what we call a case control study to try to establish where were the highest risk places, where people were most likely to become infected. And restaurants, whether indoors or outdoors, were deemed one of the places where it's most likely for people to become infected. And that's because the science has been abundantly clear that in places where people are gathering, often with people not in their households, in fairly close contact over a prolonged period of time without wearing a face covering, there can be high rates of transmission.
Do you think
That's a
I'm
gold
sorry to interrupt, but I think it bears
Sure.
asking, do you think the county does need to do a better job at highlighting that data point? Because I think that when we hear from frustrated business owners, rightly, they're worried about their bottom line. They're worried about their employees who are hanging on by a very thin margin in their homes, paying those bills, meeting rent, meeting the utility bills. Do we need to hear more from your department about that data right there about restaurants?
Yeah, thanks so much. And, you know, again, we always are trying to do our best to get good information out. And I appreciate that it is confusing.
Sure.
And that lots of people are saying lots of different things. And I also really want to acknowledge how difficult and heartbreaking it is for restaurant owners and employees that work at restaurants. These are extraordinarily tough decisions. They really come because primacy for all of us is to make sure that our healthcare system does not become overwhelmed and that we all can get the kind of care that we need. And these sacrifices that we ask people to make are huge. I wish that there was a better safety net. I wish we weren't in the position where we're really saying, you know, choose public health or choose your economic livelihood. In many other places, that's not the choice. Yeah. You know, this is the richest country in the world, and you know, it's heartbreaking to see that we ask people to make these difficult choices when we really need, you know, economic recovery to go hand in hand with recovering from the pandemic. And that means we need a strong safety net when we have to make hard decisions.
We just got through Thanksgiving. We're looking ahead to Christmas. The holidays, we know, has been a concern, and the winter season has been a concern for all health authorities. But let's talk about Thanksgiving. If people traveled, whether it was by plane or in a car to a neighboring city to see family for Thanksgiving, are you recommending that they self-quarantine for 14 days now?
Yes, I mean, we're absolutely recommending that folks do, in fact, go ahead and self-quarantine for the full 14 days. Yesterday, the Centers for Disease Control and Prevention recommended that during that 14-day quarantine period, you can go ahead and get tested twice, once a couple of days after you return, and then 5 to 7 days later. That makes sense as long as people understand that's to find out if you're positive. But because it's a 14-day incubation period for the virus, you do need to self-quarantine for the 14 days. That's the way we're going to keep each other safe. That's the tool we have at hand. If you took risks, and you did take risks if you traveled, and you were people that weren't in your household, now's the time to come back and be responsible and not intermingle with anybody else.
But you're quick to also caution people not to rely too heavily on testing, because it can give you sort of a false sense of security.
Right. The test is good when it tells you that you're positive, because then you absolutely know that now you need to isolate, identify your close contacts. It's not so great when you're negative. It just tells you that you're negative the moment you got tested. It tells you nothing about your status the next day. And unfortunately for people who traveled, you've got to say your last day of exposure was that last day when you traveled, when you came back here or you went somewhere else. And from that day on, you've got to wait the full 14 days because this virus can take 14 days to incubate in your body before you're going to get that positive test result.
We shared a bit of news a moment ago, Tony did, talking about the CDC meeting today to sort of discuss how the rollout of the vaccine will go. And I wonder if you in your position and other people who hold a position like you do around the nation are maybe concerned that with this imminent news of a vaccine being delivered, that is causing people to let their guards down a bit.
You know, I hope it's not. I see it as the light at the end of the tunnel, though.
Agreed.
And I think it's, you know, it's positive because it's easier to say, you know, we have to get through the next 4, 5, 6 months maybe before everyone will have good access to the vaccine. But once everyone does have good access to the vaccine and we can vaccinate all the residents here and really across the world because it's a global pandemic, we'll be in so much better shape. And I think knowing that makes it easier to, in fact, comply with the restrictions, the safety measures, and making the additional sacrifices.
Talking about the restrictions, I neglected to ask you about the restaurants. If they don't comply, LA County restaurants don't comply with the new restrictions, Could they face fines? And what does enforcement look like? I know that's not your purview, but what does that look like? I mean, we've heard from several departments saying that they don't have an intention of enforcing them. How effective would that be?
The issue with restaurants is a little bit different than it is with some of the other sectors. We actually permit all restaurants, and you cannot be open in LA County if you don't have a public health permit. As any food processing plant, food distribution center, and/or restaurants. So yes, our inspectors will be out. Absolutely, the first step we always make is to make sure people understand what compliance looks like, what the rules are. But if there's non-compliance with restaurants, they can both get fined or they can have their permits pulled.
We saw very recently there were protesters outside your home. We know that this issue, as you had alluded to earlier before, it is very emotional. It's very charged for a lot of people. It's become deeply personal to people who feel that their livelihood is being affected. They made it deeply personal for you, taking the protest right to the door of your home.
Everyone has the right to protest. That's one of our guaranteed freedoms. I respect that everyone has the right to protest, and want to make sure people understand that I'm aware of that. For some people, these decisions neither feel like they're appropriate, and for other people, they feel like I may need to better understand the implications. So people have the right to protest. It was a peaceful protest. And I uphold the right for people to protest.
Speak to that issue, because I think we've heard sound bites from frustrated people who say, well, she needs to listen to us. She needs to hear our side, what we're dealing with. You listen. You look at this.
I do listen. I mean, everyone knows, we've been holding telebriefing.
All right, you're watching News Now from Fox. I'm Daytona Everett. That was Good Day LA, speaking with the LA County Health Director out there about some changes that the state of California has made. We're going to stay with LA County, actually, but bring you some breaking news from today, just hours after Los Angeles County Supervisor Sheila Kuehl voted to ban outdoor dining at LA County's 31,000 restaurants over COVID-19 safety concerns. She visited a restaurant in Santa Monica where she dined outdoors. Fox 11's Bill Malugin joins us live from Los Angeles with the very latest. Bill, what's the story? You've been following a lot of these updates from officials in the state of California, just kind of dropping the ball, quite frankly.
Yeah, good evening. And we were tipped off about this by several people in the restaurant industry who are really angry to hear about this. They feel it's yet another case of that glaring hypocrisy that we're seeing from our government officials. As you mentioned, this one has to do with LA County Supervisor Sheila Kuehl, one of the most powerful politicians in the county. Rewind the clock last Tuesday, she voted to ban outdoor dining here in LA County for all 31,000 of our restaurants. And at the time, her reason for voting that way is she said outdoor dining was just too dangerous. She said people take their masks off. She said people don't social distance, and she said it is, quote, a most dangerous situation for the server. So what we confirmed is that just hours after she made those statements last Tuesday and hours after she made that vote, she came right behind us to where we're standing right now and dined outdoors at Il Forno here in Santa Monica. It's an Italian restaurant that's one of her favorites, not too far away from her house, which completely violated and went against every single thing that she said during the board meeting when she described outdoor dining as too dangerous. She was outdoor dining 3 hours after she said that and after she voted to ban it for everybody else in the county. So we reached out to her staff about this. They confirmed she was here, but they wanted to stop by because she feels bad for the restaurant because they've been losing so much money throughout the pandemic, and she wanted to, dine with them one more time before the ban went into effect. But that's completely beside the point, because just hours beforehand she had said it's too dangerous for everybody else to dine outdoors, and they had to ban it throughout the entire county. But evidently she didn't think it was dangerous enough for her to not get one last dinner in. So there's been a lot of blowback to this here in LA. This went viral once we put it out. Restaurant owners are furious. They say it's more hypocrisy, more politicians who aren't listening to their own messaging. And once again, this comes just weeks after the Gavin Newsom story. We keep seeing these stories here in California of our politicians repeatedly flouting their own own rules, and they're losing a lot of credibility in the eyes of the public.
Yeah, and Bill, I don't know if you've seen the story quite yet, but San Francisco Mayor Breed also ended up attending French Laundry as well, just a day after Governor Gavin Newsom. What are you hearing on that end? Because, yeah, you broke that story and obtained those photos of Governor Newsom at French Laundry, which angered a lot of Californians.
Yeah, I did see that story from the San Francisco Chronicle. They're breaking this one on Mayor London Breed, which it's just a jaw dropper because I think they said it was the day after Gavin Newsom was there, and then 3 days after she visited the French Laundry, she then banned indoor dining, if I read their article correctly. So it's just more hypocrisy. I saw another story about, I believe it was the mayor of San Jose went and gathered with a bunch of households and families for Thanksgiving when he told people not to do it. It's just more of the same here in California. It started with Nancy Pelosi in the hair salon. Then we had the legislators flying out to Hawaii the same week they were issuing the travel advisory. Then we had Governor Newsom. We have Sheila Kuehl here in LA. It's just happening all over the state, and it's just really driving people crazy because the messaging is falling apart, and so is the credibility.
So what are you hearing from restaurant owners out there? Are they saying this is ridiculous? I mean, we should be able to be open if people like officials are not even following their own rules? What are they saying?
That's exactly what they're saying is, look, the very people who instituted this ban, the people who voted for this ban, don't even believe in their own rules. So why are we shut down right now? Sheila Kuehl was one of the primary spearheads of getting this ban done because there were other supervisors who were against the ban, and they did a motion to try to overturn it. It was Sheila Kuehl who said, no, we have to have this ban because it's too dangerous and we're in the middle of a COVID surge. Then we come to find out hours after she said that, she dined outdoors and went against everything she stood for. So, yeah, there's a lot of frustration with the business owners out here. They think the order should be overturned and they should be allowed to be open because if the person who is pushing this ban isn't following it, why should they? Why should their families not be able to feed themselves? Why should their employees not have any money before the holidays and not be able to support themselves, their families, their livelihoods? And at the same time, the county did this ban without offering a shred of data or a shred of science to associate outside dining with the surge in our cases. So widespread frustration out here in LA.
Just one more question for you, Bill. You briefly spoke about other supervisors speaking out. Is there any of those supervisors specifically who are saying, yeah, we shouldn't have done this and we shouldn't have put this ban forward?
Well, there's 5 LA County supervisors. 3 of them voted for the ban. 2 of them voted against it. The 2 who were against it were very outspoken, said we should not be doing this. This is going to crush business. This doesn't make any sense. There's no data. There's no science behind it. Sheila Kuehl and 2 others said, nope, we got to do it. And they went through with the ban. Now, since we put the story out about Sheila Kuehl, one of the supervisors who was opposed to the ban, she did react to our story and said, this is a problem because as public officials, we need the public's trust. We have to gain their trust. And if we don't hold ourselves up to that standard, they're not going to listen to us. And she said she's starting to feel like they're losing the battle of that public trust 8 months into this pandemic. She feels the public trust starting to slip away with all these restrictions and with the hypocrisy that they're starting to see. And she thinks that the public is starting to turn on them a little bit, and it's certainly happening.
Yeah, apart from that statement from Supervisor Kuehl, have you heard anything publicly from her? Is that pretty much it? That's all she said.
We reached out to her repeatedly for an interview today, and we were told she was not available, that she was booked up in meetings all day long, but that turned out to be a blatant lie from her staff because she did go and do an interview at another TV outlet here in Los Angeles where she is kind of playing the victim card. She says she's getting death threats and that she had a quote saying that it's difficult to lose your job, but it's even more difficult to not be able to breathe. And then she went on to say that the reason why she came here was she wanted to stop by in person at her favorite restaurant and deliver the news that she was shutting them down, which I think a lot of people are going to have a hard time believing with that line of thinking there.
Yeah, sure. Any light at the end of the tunnel for Californians out there, whether they're business owners or just trying to get through this pandemic?
Right now, it doesn't look like it. It looks like we're heading back towards more restrictions, more lockdowns. We're essentially going back to square one where we were 8 months ago in March. So it's looking pretty bleak out here at the moment. Our cases are surging. Public health officials all over the state are moving their counties back into the most restrictive tier, closing everything down. So right now it doesn't look like there's much light at the end of the tunnel, unfortunately. We got to get these case numbers down before anything like that happens.
Yeah, and nothing from the governor's office today either, from what I could see.
No.
Yeah. All right, Fox 11's Bill Melugin out there. We appreciate your reporting. You are just on the watch out there in California.
Thank you. Appreciate it.
All right, you're watching News Now from Fox. I'm Daytona Everett. That was Bill Melugin helping us out with coverage in California as several of these officials are going against their own orders and still going out and dining and going out to parties and everything along those lines. But we will continue to keep covering this here on News Now from Fox. We're bringing you live, unfiltered, raw content all across the nation. We definitely have our hands full today, and we're going to break all of that down in the next couple minutes or so. Me and Andrew Kraft are going to talk about today's top headlines, and there are a few. But before we do that, I'm going to play out for you this morning. There was a bipartisan bill that was introduced from both Republicans and Democrats. Maybe a little bit of silver lining when it comes to this COVID-19 stimulus, but we will see. I'll play that out for you here. Some of you are going to go to a 2-minute commercial break. When you come back, we've got a lot more for you on News Now from Fox.
Phone's on.
Y'all want to put your phones on silent? Phones on silent? Anybody have their phones on silent? You all ready? Well, let me welcome all of you and thank you for being here this morning. This has been a group that's been a labor of intense effort. I know every one of us want to thank our staffs because they've done yeoman's work. And as you can see, we have with us a bipartisan, bicameral group of people who have been working diligently for the last 30 days or more, trying to get to a conclusion and a template, if you will, or a framework, because this is COVID emergency relief framework, is exactly what it is.
Take your mic off, or your mask off.
You can't hear me? Okay. Back off. Let me just say that this is intense amount of work that the staffs have been doing for quite some time, and every senator, every congressperson here has put in an enormous amount of time on this in person and on the phone. This is a COVID emergency relief framework. We've worked in the best interest of what we believe is great for our country, is good for our states, and we can all go home knowing that we have worked diligently to make sure that the unemployed, the small businesses, the state and local funding, student loan forbearance, everything that's going to come to a halt in December because of the timing, that's not going to happen. So we're battling COVID-19 more fiercely now than we ever have before. We recognize that. It's inexcusable for us to leave town and not have an agreement that we can come together and not show that we can work the way the Senate and the way that Congress was intended to work in a bipartisan way. It's not the time for political brinkmanship. You'll not see any of that here today on this stage. And we're going to intend to move this forward after months of failing to act for one reason or another. We're not blaming anybody for why they haven't come to an agreement. It wasn't enough, it was too much, whatever. We know what's necessary right now in a timely fashion. Our bipartisan, bicameral group, as I said, has worked over the past month. We're pleased to present to you today a template or a framework, if you will, that's put together by senators and representatives from their respective caucuses. Our action to provide emergency relief is needed now more than ever before. The people need to know that we are not going to leave until we get something accomplished, or this group that's worked together so diligently. So I'm committed to seeing this through. I truly am. My state of West Virginia depends on it, as long as all of my colleagues, every one of the representative states in the country depends on it. And this is going to get us through the most difficult times. This will run up to the end of the first quarter, April 1, and we hope that we can give the relief that's needed. So without further ado, I'm going to call now if my dear friend Susan Collins would come forward for a few words. Susan?
Okay, Joe, when the chart comes, why don't you get back up?
I will. We'll have, the charts are being printed, and the charts will be here in just a few minutes. We'll come back and make sure, you all get a handout before you leave too. Susan?
Thank you. Thank you. First, I want to salute everyone who has joined us today. We have worked very hard to put together a $908 billion framework for COVID relief. We've worked night and day throughout the Thanksgiving recess because we recognize that families all across America are struggling, that businesses are closing, that hospitals are overwhelmed. As we deal with this second wave or third wave of this pandemic, it is absolutely essential that we pass emergency relief. I'm particularly pleased that the package includes $228 billion for the Paycheck Protection Program that has helped keep our small businesses afloat and paying their employees. That's the most important part. In Maine, it has helped sustain the jobs of 250,000 workers. This will be particularly helpful to those businesses that have received a first PPP loan that has kept them alive and paying their employees, but now find that they need additional assistance. In particular, that includes our restaurant and hospitality industry. So again, I want to thank all of my colleagues for their very hard work, and it gives me great pleasure to introduce another leader in this effort, Senator Mark Warner.
Well, thank you, Susan, and let me just first echo what has already been said, this $908 billion framework, which will take us from December 1 through March 31st. Not going to make everybody happy, but there's been an enormous amount of work done. I want to thank particularly the Senate colleagues who have spent, I think, literally every day but Thanksgiving, either over pizza or over pasta at people's houses like Lisa's, and there's been a lot of enormously good give and take. I came to this with the notion that I'm hearing from Virginians, somebody used it and I borrowed their term, that it would be stupidity on steroids if Congress left for Christmas without doing an interim package as a bridge. I think we've laid out that interim package, which shortly will appear. I just want to touch on two items very briefly. One, for all of us who live in the metro area, we saw in the Washington Post editorial today that short of some relief, Metro will have to lay off close to 4,000 workers over the next coming months. It will end service after 9 o'clock every day. It will end service on weekends. That will have a dramatic effect on the functions of the federal government, as well as constituents across the tri-state area. So we've made, I think, the right kind of investment in public transit. Secondly, and Susan has been the leader on this, on support for small businesses. We have literally hundreds of thousands of small businesses across Virginia that are struggling. Disproportionately, we've seen those businesses that have been affected have been minority businesses. We've lost 440,000 black-owned businesses across America, literally destroying generation of wealth creation. In this package, we've allocated $11 billion for investments in CDFIs, MDIs, and other institutions that will lend to these underserved communities. And that'll have a good short-term and long-term effect. So while this perhaps will offend some folks on both sides, we think it is a good framework, and we are all committed to doing what it takes to get it done. With that, let me turn it over to somebody who has been a constant effort at bridging the gaps. Maybe that's because he's a doctor, as opposed to the lawyers in the crowd. That's our friend Bill Cassidy.
Thank you, Mark, and thank you all. Today is a victory for the American people, and it is a victory for common sense. It is a bipartisan, bicameral effort which creates a pathway forward to bring relief to the unemployed, to the small businesswoman, the small businessman struggling to hang on to the vaccines widely used, to the doctors and the nurses who are on front line with a third wave of disease, wondering if they're going to get the relief they need to effectively address this third wave. On a Louisiana note, it's the hospitality workers from the casinos of Shreveport down to the hotels of New Orleans, for the recently laid off refinery workers in Convent, Louisiana, for the oil and gas workers in the Bayou and in Lafayette Parish. As a Republican, by the way, let me say, Republicans and Democrats, neither of us got everything we wanted. Both of us got much of what we wanted. And I think that combination reflects what Congress is supposed to do, reconciling different priorities, but ultimately doing something good for the American people. As a Republican, I will say, it builds upon President Trump's commitment to get something done. And for my fellow Republicans, if you care about the effort that President Trump and his administration made, you should support this bill. As a senator, I want to give a shout out to the Problem Solvers Caucus on the House side, part of the larger No Labels effort. My staff and I have been meeting with their staff and them for months on some of the policies that are contained here, on the strategy to get it through. They have been fantastic partners, bicameral, bipartisan. But I'll conclude by saying once more, this is a victory for the American people. This is a victory for common sense. And now it gives me great pleasure to introduce one of those leaders of the Problem Solvers Caucus, Josh Gottheimer.
You want funny? That's really funny.
I'll use it if you don't.
Okay. Today is a win for the American people, for common sense, and for problem solving. I'm so incredibly proud of all the hard work that made this happen across the aisle and across the chambers, and I'm grateful to the senators who are with us and all the members of the House and of the Problem Solvers Caucus. I'd particularly like to thank the co-chair of the caucus, Tom Reed, and our COVID team leaders, Dusty Johnson, Dean Phillips, Anthony Gonzalez, Abigail Spanberger, and Fred Upton. They're all here, and I'm grateful to them. The Problem Solvers Caucus proudly voted to endorse this package, meaning it now has the support of 50 members of Congress, 25 Democrats and 25 Republicans, who combined represent millions of families and businesses who need immediate action. They want to get help, and they're sick and tired, like we all are, of waiting for COVID relief. With cases spiking, winter around the corner, and countless small businesses closing every single day, and far too many families hurting right now, we simply can't leave town and leave anyone in the cold without getting something done immediately. We can't allow some to prioritize politics ahead of the pandemic. This 4-month COVID-19 emergency relief package will help get us through the hardest months of winter and into a new administration. It's an essential down payment and what our families, small businesses, and local communities need. This bicameral package is consistent with the values and priorities of the Problem Solvers Caucus and that we've been fighting for since summer. It will help families across our country with supplemental unemployment, childcare, rental assistance, and resources for all those families who may be visiting food pantries for the very first time. It includes significant investment for our state and local governments of all sizes, with revenue loss, COVID-19 expenditures, food insecurity, mass transit, and K-12 education. We're also getting a second round of PPP to our small businesses and ensuring they won't be taxed on the first round of PPP, and that there's simplified forgiveness for loans of $150,000 or less. And we're getting federal investment out to our hospitals and health systems and our frontline workers so we can continue working to keep our communities safe, including more resources into the deployment of a vaccine and more testing and tracing. As was said, this is a heck of a down payment and what our country needs desperately. And I think we all can agree, America simply can't wait any longer. I know that here in the greatest country in the world, working together as we are today, we can find light through this darkness. Thanks and God bless. And now introducing, very proud to introduce Senator Mitt Romney.
Thank you, Congressman.
COVID has created a crisis
And in a crisis, the people expect Congress to act. And this group has come together to propose action that could respond to this crisis. We've got people unemployed, we've got businesses shutting down, we've got states and localities getting ready for layoffs of large numbers of people. It's simply unacceptable for us not to respond to help in this circumstance. Now, I happen to be a deficit hawk. I don't like borrowing money. I don't like spending money we don't have. But the time to borrow money, maybe the only time to borrow money is when there's a crisis. And this is a crisis. We want to help people at this particular time. And so we've come together and we've been very careful. This is not a $1.8 trillion stimulus bill. This is a relief measure, half that amount, $908 billion. I would note that of that fund, $560 billion is money repurposed from the first CARES Act. So the amount of new money is actually $348 billion. I'd also make this note, and that is liability protection is critical. And you'll see in the chart, if it ever gets here from the printer, that we did negotiate a liability provision that provides a temporary moratorium on a temporary suspension of any liability-related lawsuits, the state or federal level, associated with COVID, giving states enough time to put in place their own protections. And let me note that any state that doesn't put in place protections hasn't been thinking this through very carefully. Because if I were a CEO, I would never think about putting a new business in a state that didn't have liability protection for COVID. Some states already have. My state of Utah has. So we're giving states the time to put in place their own provisions in the way they think best to protect their businesses, their schools, their hospitals, their universities, and to make sure that the people themselves are also protected. So I'm very pleased to be part of this effort. It's been a long and arduous process, but one which I believe has great merit. And with that, I'm happy to introduce my fellow senator, great senator from the state of New Hampshire, Senator Shaheen, Jeanne Shaheen.
Thank you. I'm pleased to join all of my colleagues in the Senate and the problem solvers folks from the House who are here to endorse a framework that we believe makes it possible for us to move forward to provide emergency aid to the people who are hurting in this country. To date, we've lost almost 250,000 Americans to COVID. Over 13 million Americans have been affected in some way. As I traveled around New Hampshire over the last 2 months, what I heard everywhere I went was that people were hurting and they need help. So whether it's the small business people, those who are unemployed, cities and towns who are worried about laying off frontline workers, hospitals who are in financial distress, they need help from the federal government. And we are here to say we think there is a pathway to an agreement that can provide that help.
All right, you're watching News Now from Fox. We got a beautiful shot of the White House right here. It has been a busy day here on News Now from Fox, where we're bringing you everything live, raw, and unfiltered. We've got a lot to get to. We're going to call this the political rundown. I'm here joined with Andrew Kraft. Just want to mention what we're going to be talking about today. An investigation is underway into a cash for pardon scheme. Shocking details tonight from the White House. We have President Trump's Wisconsin lawsuit. Attorney General Barr says, hey, there's no fraud. And will Trump actually show up to Inauguration Day? Let's dive right into it, Andrew. Let's start first with the White House and the investigation that's underway. Take us away.
Yeah, so Daytona, the Justice Department is investigating whether there was this secret scheme to lobby White House officials for a pardon. And so we were learning just today, CNN first reported this, and then the Associated Press confirmed this, that the DOJ is investigating this scheme of a substantial monetary contribution in exchange for either a pardon or a reprieve of sentence. So you might be able to show that filing there that we have on the screen there. You can see that. So this was happening. You'll see that this order happened in August, on August 28th, and prosecutors sought to keep this private because they said it identifies people not charged by a grand jury. So those of you who might be going through this online or finding this link from the court filing will notice that there are a lot of redactions in the filing itself. We don't know who these individuals are. All of that and their names are redacted. So we just want to say that the Judge Howell, unsealed that document today while redacting many of these personally identifiable information. So Daytona, remember, pardons are common at the end of lame duck presidencies. You know, the president, he is an outgoing president. Joe Biden will take office in January. So a lot of presidents issue pardons, late pardons in their term as they leave office. But we don't have any information on if the president is involved in this particularly. But so this was filed under seal. Then it came out of seal today at the request of these reporters following these stories. So we just kind of want to dive a little deeper into this. The document from August that we just showed you, it reveals people are suspected of having acted to secretly lobby White House officials to secure a pardon or sentence commutation, and that in a related scheme, a substantial political contribution was floated in exchange for that pardon. So, like I said before, we have no idea who these individuals might be, who they might have lobbied inside the White House, if they're just seeking a pardon or if they're just currently serving a sentence at the moment as we speak. So a lot of details are still not really known in this story, but it's pretty groundbreaking nonetheless. This is quite a bombshell report, and we just want to mention that it was first reported by CNN. So Daytona, we'll be following this story in case there are any more developments throughout the week, but a lot of pardon talk right now in the White House and around D.C.
All right, so let's switch gears. We'll go back to election 2020. The Trump campaign filed a lawsuit to the Wisconsin Supreme Court today. We had a live report about that, but we just want to dive a little bit deeper. So again, this is coming after the recount was completed in the state of Wisconsin. We saw Wisconsin officially certify. We saw Arizona certify, but President Trump and his legal team still pursuing litigation in the state of Wisconsin, him even touting it on his Twitter saying, hey, check this out. Wisconsin Supreme Court is hearing what we have to say. What do you have to say about that?
Yeah, and Daytona, like you mentioned, just yesterday, Wisconsin certified its election result. Remember, the Trump campaign had requested that recount, that partial recount in two counties, Milwaukee County and Dane County. And just to note, those counties initially went for Joe Biden, and it stayed that way, though the Trump campaign doled out $3 million in their campaign coffers to conduct this recount. And I just want to, this was exclusive to FoxNews.com this morning. The political reporter there, Brooke Singman, broke this story, saying that the Trump campaign filed a lawsuit to the Wisconsin Supreme Court alleging abuse around the process of absentee voting in the state. And they're alleging that more than 220,000 ballots were approximately affected. So in a sense, the Trump campaign is looking to really hone in on those hundreds of thousands of ballots. And if they find any irregularities that they hope, that would possibly invalidate those ballots and turn the state to President Trump. That's what they hope for. Obviously, the 10 electoral votes are going to Joe Biden at this time after the state certified them yesterday. But we kind of just wanted to go in a little more to this lawsuit where they're alleging a number of things. And I just want to read from the statement exposing exactly how the election processes were abused in Wisconsin holds enormous value for this election beyond a victory for President Trump. But the fact is our state's electoral votes likely won't change the overall outcome. Regardless, we're demonstrating that the results of this election unequivocally ought to be questioned. So that was the Trump campaign's Wisconsin legal team, and that's being led by the former Wisconsin Circuit Court Judge, Jim Trupis, who told that to FoxNews.com. Now remember, like I said, the Wisconsin Governor, Tony Evers, just certified the results of the state's election just yesterday. Daytona?
Andrew, real quick, let's talk about standing litigation from President Trump and his team. It's continuously changing day by day. Is Wisconsin the last state as that they are kind of pursuing for these lawsuits, or are there others still standing right now?
So yes, you'll remember Wisconsin right now, as of this morning, there's active legal cases, I believe, in Georgia and Pennsylvania as well. I think here in Arizona, there are active legal cases at the state level with the state party, the state GOP, who want to look at a number of ballots here in Arizona, especially in regard to the ballot signature verification. We talked to the Secretary of State here in Arizona yesterday on that issue. But as far as Georgia and Pennsylvania is concerned, remember, the Trump campaign has faced really a setback of losses there on the legal front, but they're still kind of forging ahead with that. I believe in Georgia, they are still have active lawsuits going. And remember, in Pennsylvania, they want to eventually bring it to the Pennsylvania State Supreme Court, and that remains to be seen if that's going to happen.
And speaking of widespread voter fraud, this is what President Trump and his legal team are alleging. Attorney General Barr coming out today and saying that there's been no evidence. So this was kind of a bombshell that was dropped earlier this morning, and you know, we heard from Senator Chuck Schumer saying, well, he might be the next one on the chopping block to get fired after statements like that.
That's right, Daytona. And remember, kind of in the aftermath of the election, we haven't really heard from the Attorney General very much at all, hardly at all. Bill Barr speaking to the Associated Press today in an interview where he contradicts this concerted effort by the president, his boss, to subvert the results of last month's voting. He told the Associated Press that U.S. attorneys and FBI agents have been working to follow up on specific complaints and information they've received. And I'm going to quote Bill Barr, "To date, we have not seen fraud on a scale that could have affected a different outcome in the election." So after he said that, you're seeing on your screen right there that the Attorney General was summoned possibly, but he met with the president at the White House today. Remember, that was not on the public schedule going into the morning and the afternoon. Reporters learned about this who were in the White House press pool as they saw the Attorney General pull up to the White House fence and get out and meet with the president there. So we don't know what the parameters of that discussion was with the president. Remember, a lot of people were speculating that, you know, Bill Barr, like you said, could be on the chopping block for issuing this direct contradiction to the president's efforts to undermine the electoral process through this AP interview. But that has not been the case. Bill Barr remains the Attorney General as of tonight. But some more news coming out of the Attorney General's office today. We learned that he revealed in October, you know, he had appointed that U.S. Attorney, John Durham, as special counsel. So that's new. Remember, John Durham was investigating the origins of the Russia probe, which cast doubt on the 2016 election. So now we know Bill Barr has appointed John Durham as special counsel. So when a special counsel is appointed, Daytona, it gives that prosecutor special authority, you know, to issue subpoenas, grand jury investigations, and the like. So it remains to be seen, you know, when Biden assumes office in January, whether or not Biden will keep this investigation ongoing. Remember, the president never fired Bob Mueller. So that's what people have been saying. You know, if Biden does not keep this investigation going, it could look pretty untoward if he fires John Durham come January when this investigation is not complete. People reminding those on Twitter that Donald Trump never fired Bob Mueller during the course of his special counsel investigation into the Russian interference in 2016. Daytona?
You mentioned briefly Joe Biden taking office, and we can't help but include this in kind of our political rundown today. We're hearing reports that President Trump might not be attending the inauguration. This is something that we thought maybe could be a possibility, but it's seeming like things are taking a little bit of formation. Do you think it's possible that he just won't show up on that day?
So yeah, Daytona, it remains to be seen. We're going to cite NBC News and their report today. Fox has not confirmed this, but President Trump in their words, in their reporting, is discussing the possibility of announcing some type of campaign-related event for his 2024 prospects, possibly on the same day of the inauguration, January 20th, as kind of this counter-programming message as Joe Biden gets sworn in. Also, there are reports, according to this story, that Donald Trump might skip the ceremony altogether, not showing up for the inauguration in Daytona. That would be somewhat unprecedented, quite shocking if that were the case, and he did not show up for his successor's inauguration. You know, I'm a history buff as much as they come, and I cannot remember if that has ever happened in the past where a predecessor has not shown up to his successor's inauguration. I hope some of you watching might find a case where that may have been the case, but you know, right here and right now, I can't think of one. And so we're also told in this story that he also does not plan to invite Biden to the White House or even call him before the inauguration. You know, that none of these things are written down, Daytona. Remember, it's all customary. It's all, you know, based on norms, based on these traditions that are long held within the White House, especially with these transferals of power. The outgoing president welcomes the incoming president. So it remains to be seen on if any of this will be followed with President Trump and President-elect Joe Biden. Daytona?
You know, it's an interesting situation, and we've talked to political experts about this before. Just because President Trump is not conceding doesn't mean that Joe Biden won't step into that seat. I mean, we saw the GSA come forward, Emily Murphy, saying, okay, we can begin the transition into Joe Biden stepping into the seat. So just because that concession isn't happening doesn't mean that they're not taking steps forward. We've already seen Joe Biden's picks today, and that's constantly in the headlines every single day about this new team that he has put together. And we were talking earlier, Janet Yellen coming in as Treasury Secretary. This is a huge, huge seat to be filling, especially going into 2021 with likely a lot of economic issues. You know, what do you have to say about this team who is stepping into this really gigantic situation, arguably worse than anything America has ever had to face before?
Yeah, and Daytona, I just wanted to kind of backtrack there and do tell our viewers that the levels and the levers of the functioning aspects of the democracy, the states who certify the elections, the meeting of the electors in each state, the voting on that, convening the Senate and the House January 6th, the vice president presiding over that, they have to approve it, and then the inauguration happens. So all of that is happening on a pretty safe and solid continuum, right? Like, none of that right now has been disrupted. A lot of these Trump campaign lawsuits are still going ahead. A lot of them have faced, setbacks in the legal system. But as far as the levers of government and these systems that we have in place at the state and the federal level, those are proceeding unimpeded. So remember, December 14th, Daytona, is the day where these electors in states will meet and confirm whether or not their state went for Joe Biden or Donald Trump. After that, those electors bring it to the joint session of the House and the Senate. The vice president, as the president of the Senate, presides over it, and then they vote on that. And once that vote is cast, that's it. And that would declare Joe Biden officially the president-elect. So, but back to your question on the transition and the president-elect. Yes, he announced his economic team today. We're following a lot of those picks. Janet Yellen would be the first female Treasury Secretary in its 231-year history as an agency. Remember, Neera Tanden was picked for Office of Management and Budget, and she's a pretty controversial figure, especially on Twitter amongst conservatives. She's the former head of the progressive think tank, the Center for American Progress, and she's been known to really take people to task, especially Republicans, on Twitter, on social media. So it'll be interesting to see. And remember, that's a Senate confirmed position, as is the Treasury Secretary. So what I'm looking for right now is how are these picks going to hold up in front of possibly a Republican majority Senate, depending on the runoffs in Georgia.
So let's talk about Georgia really quickly, because we heard Gabriel Sterling get emotional today. If you don't know who Gabriel Sterling is, he is one of the election officials in the state of Georgia, and they're going through a difficult time in the state of Georgia. A lot of election fraud is alleged out there. Like we were talking about earlier, there's been lawsuits put forward in the state of Georgia. There's a runoff. And in the midst of this, Secretary of State Brad Raffensperger is getting death threats. Him and his family are right now, along with other workers, just normal election workers as well. People are getting really emotional about this election. And he was saying today, it needs to stop. Leaders need to step forward and say, this needs to come to an end, because someone's going to get hurt at one point.
Yeah, that's right, Daytona. I mean, this is probably the most vehement that you and I have heard, especially from a Republican elected official at the state level, who has really is just tired of it and expressed that as such today in front of the cameras at the State House in Atlanta, saying that, repeatedly saying that this has to stop. He's calling on the Senate candidates, especially the Republican Senate candidates, Senators Loeffler and Perdue, to join him in calling it out. He took the president to task and called him out and said, you know, you're the leader, you set the example, you have to tone down this rhetoric. He also lamented the fact, Daytona, that just any old employee of that Dominion, the company that is in charge of the voting systems there in Georgia, that's Dominion, what we've all been talking about, is essentially saying that an employee of Dominion has been getting harassed. His address is online. A noose was found in his front yard, and he was saying he wasn't elected at all. This is just a guy trying to do his job. He just, in his words, took a job. You know, he's not an elected official. He's not held accountable to the public, and so he was really just kind of, visibly shaking. He was so upset at some points in that press conference earlier today. I believe Senator Loeffler issued a statement, responding to Gabriel Sterling today. I don't have that in front of me, but she essentially said that she never misses a chance to call out people when acts of violence are being discussed. She always, in her words, has said that she doesn't refuse to call out acts of violence when they're being talked about.
Yeah, I mean, it's just amazing to hear situations like that in the middle of a pandemic that everyone is having to deal with across the board. So I think that's going to do it for our political rundown. Is there anything else you want to add, Andrew, to be looking forward for the rest of the week here?
Yeah, I think we kind of talked about a lot of the stories, the top headlines from today. Something we'll be watching here in Phoenix, Arizona, especially going into tomorrow. Soon to be Senator Mark Kelly will be sworn into the Senate tomorrow. Remember, that's happening early before January because, that was John McCain's seat. And so that was a special election to fill the vacancy left by the passing of John McCain. Martha McSally held it for 2 years, and that's why he's getting sworn in early. So we'll be looking out for that. Also later up on the schedule tonight, we have another live report with a political update from the Biden-Harris transition from Fox's Madeline Rivera in Wilmington, Delaware. So for those of you who are watching, stay tuned for that as well. Daytona.
All right, so again, you're watching News Now from Fox, where we are bringing you, obviously, all of the latest updates from around the country, live, raw, and unedited. If you miss anything, be sure to head to our Twitter page at NewsNOW Fox. Great information on there, and you'll probably see that interview later on Biden and his team as well in Wilmington, Delaware. We appreciate all of our reporters out and about to have you covered. I think we're going to send everyone off to a 2-minute commercial break. When you come back, we got a lot more on News Now from Fox. Thanks for joining us. All right, you're watching News Now from Fox. We are going to switch gears here, head out of politics and head back into COVID-19. We have an update from Mayo Clinic. Really great information here amid some big headlines from the CDC talking about vaccines, talking about how long quarantine periods should be. But this one is just about frontline workers and COVID-19 struggle. So we'll listen in here on News Now from Fox.
I think we're good to go. Thank you, everybody, for joining us. And thank you especially to our panelists for your willingness to share some of your time today. So I am going to call on each one of you. I'll probably go in alphabetical order by name. I'm going to have each of you say and spell your name, give your title or your role, and then just share a little bit about your role at Mayo and your work with COVID patients. And then we'll go to the next person. So let's start with Andrew.
Hi, my name is Andrew Torres. Andrew, traditional spelling A-N-D-R-E-W. Torres is T-O-R-R-E-S. I'm a paramedic with Mayo Clinic Ambulance Service in Rochester. I've been with them for about 5 years plus now. And I work on the front line as a frontline team member and taking care of the patients of Rochester and Mayo Clinic, which of course consists of COVID patients as well.
Thank you, Andrew. Amy.
Yes, hi, I'm Amy Spitzner, A-M-Y-S-P-I-T-Z-N-E-R. I work in the medical intensive care unit, which is the designated COVID ICU. I've been at Mayo for 5 years now and a nurse for 9.5.
Thank you, Amy. Desiree.
My name is Desiree Cogswell, spelled the cool way, D-E-S-I-R-A-E-C-O-G-S-W-E-L-L. I am a respiratory therapist in the medical ICU, which has now been converted to the COVID unit. I've been with Mayo for 6 years. I started as a new grad, and thank you so much for having me.
Thank you. Tracy.
Hi, I'm Tracy Koke, and my name is spelled T-R-A-C-I-K-O-K-K-E, and I am an infectious disease nurse here in La Crosse, Wisconsin at Mayo Clinical Health System. And I've been a nurse for 14 years, 6 of those here at Mayo. And being the infectious disease nurse, I have done the COVID testing tent since March. And recently we've opened our COVID infusion therapy center. So I've started giving infusion therapy for the patients, and also go to the floor and do discharge teaching for our COVID patients and whatever needs to happen as patients are recovering from COVID in the clinic setting also.
All right, sounds good. Thank you. One other thing I was going to indicate for the journalists, if you should need a photo of the panelists, we do have those, so please let me know. You can just send me an email or to newsbureau@mayo.edu, which is in the chat as well. Journalists, as you submit your questions, please do let me know if your question is geared for someone specific. And if not, I'll just probably kind of jump around and have the people take turns. So we do have a question that was submitted via email in advance. This comes from Tyler from WKBT in La Crosse. And this question is for Tracy. Tracy, what would you describe the past 8 months working in the COVID testing tent in La Crosse? How would you describe?
Busy. It's been interesting, busy. The other thing is we get to deal with the weather challenges, but it's been definitely a anxiety ridden place to be. It's been interesting as a nurse to see the amount of people that has come through the tent and the amount of education that can be done there as far as reassurance for people and the understanding that they don't have for COVID yet, and being able to teach them the reasons and all of that going with it for why they need to wear their masks, how the hand washing works, and the whys. it's been a really great experience, actually. And even to see how sick people really are getting.
Wow. Explain a little bit more what you meant about the whys.
The whys of why it's important to wear a mask and why we need to be keeping our distance for people, why we need to be washing our hands and how the hand sanitizer works and why it's so important. People ask you when they're in line and they're getting ready to be swabbed, they are very vulnerable at that point. And so they often will ask a lot of questions. So it's a good time to do a lot of good education. And reassurance.
Yeah, teachable moment for sure. Okay, this question comes from Matthew from the Post Bulletin. Have any of you been told by people that the virus is a hoax? And what do you say in reply? Should we start with Desiree, just to mix it up a little?
I have heard people consider this a hoax. I can tell you from my point of view, which is not a good side of this virus, that it is not. It's real, it's here, and we have a choice to make if we're going to be part of the problem or part of the prevention.
Andrew, what would you say to that question?
I would say that it's tough to hear. It really is. When someone tells you that what you're doing isn't actually happening, and that the people you're taking care of are not sick or in danger. It's tough to hear that. You just do your best to try to re-educate and say, no, these things are really happening. These symptoms are real and these people are really sick. But at the same time, it's tough to hear that. And it's frustrating a little at times, but you do your best to keep your chin up and just tell them your side of the story.
Thank you. And Amy or Tracy, do you guys have anything to add?
They basically said it. It's very frustrating because we see firsthand how sick these patients are getting from this virus, and it's really tough, like Andrew said, having people say that it's not real. What your work that you're doing and you're putting everything out there for is not real. It's hard to hear that.
I agree. It's very hard to hear that and frustrating. My response usually is, I'm sorry you feel that way, but I'm still going to be here to take care of you if you do get the virus.
Wow, that's great. That's great. So let's see. This comes from Tyler from WKBT. He asks, for the patients that you've worked with, how sick have they gotten? And just describe in general, not specific to a patient. Tracy, do you want to start there since he's a lacrosse journalist?
Sure. They've died. Some of them have died. Some have been on ventilators. Some have done really well and gotten to go home. Some have been in the hospital for months. So it's been a wide range of one spectrum to the complete spectrum of death.
And Desiree or Amy in the NICU, what is your perspective on that? How sick are these patients getting?
The sickest you ever seen in your life. They can be fine one day and the next day they're on the ventilator. And when we go to intubate them, we know that as the caretakers for a lot of these patients, we're the last people that they talk to. And we hold that when we go home at night. We can have them on the maximum amount of support and we still see their bodies giving out. It's horrible to see because we do absolutely everything that we possibly can. And even though all of our medicine, our support, everything that we can do, their bodies still give out and they still die in front of us without their families. And we're their only physical touch that they have when they're leaving this world. It's really hard to watch.
Anything to add?
I agree. Everything Amy said there too, I definitely agree with. Working in the ICU, we are used to seeing patients that are unfortunately ill, and before this pandemic, I guess I was a little ignorant, I guess, on how sick someone really can be and the importance of every role within the ICU to prevent that. And with this virus, we're seeing people from admission all the way till discharge and hopefully recovery, but also death. And that is definitely something that we take home with us and that wears on us emotionally.
All right, thank you. So this question actually came from a few different people, just talking a little bit about your own mental health and how you deal with stress caused by the workload and just the emotional toll. Why don't we go alphabetically again? Andrew, what do you think? How do you handle it?
Yeah, so pre-hospital medicine and emergency medicine in general is a very stressful occupation, and unfortunately, that's only exacerbated by COVID and the influx of patients that we've seen, the additional precautions that need to be taken, and just the anxiety of the risk of infection for us. And we take good care of ourselves and we take good precaution, but there's always still that risk looming overhead some days. And it gets tough. With everything shut down, you don't get to do the things that you did to take care of yourself, be with family. The holidays, I didn't go to Thanksgiving. I didn't see anyone outside of my immediate household, which was tough because, those were things that kind of help reset you. And, without those support groups, you have to take extra precautions and you have to adapt to those things, more Zoom calls, reaching out more and, trying to take care of yourself that way. So it's been a challenge, but I'm actually part of the critical incident stress management team, and they give us a lot of helpful techniques as peers to take care of yourself, hydrating, not making big rash decisions when you're under a lot of stress, things like that to kind of help alleviate some things. So it's been tough, but we make it through.
Thank you, Andrew. Amy, how about you?
Yeah, the stress and mental the difficulty that we deal with every day. When we get to work, where it's immediately you're on your toes and you're working in the intensive care unit for all 12, 13 hours, and it's continuous. So I would say that the best way that we deal with our stress is honestly with our coworkers. We know what each other is going through. We support each other. The medical ICU that we work in is an incredible team. We call each other family. We talk outside of work. We do things when it's not a pandemic. We do things together. So we try to support each other through all of this because, when you go home, your family doesn't really understand the incredible amount of responsibility that you have on your shoulders when you're at work, or maybe that you lost a patient. So I would say that mostly we rely on each other to get each other through it. And like Andrew said, with the pandemic, a lot of things are closed. So you can't go to the gym or go see a movie or something just to kind of relax. So we're kind of forced to take it home and try to get through it all by ourselves and with our families. But like I said, we rely a lot on each other.
That's great, Amy. Thank you. Desiree, how about you?
Well, Amy stole my answers, so I don't appreciate that. But she is right. We are a family. We're here to support each other. I think that we rely heavily on each other in this time because, like she said, we all know what each other's going through. And I think sometimes we kind of hide a lot of that from our family and the people close to us that aren't within the walls of the hospital because we want to not only protect them, but we don't want them to worry. We don't want them to worry about us. I rely heavily on my coworkers, both with the respiratory therapists and nurses, doctors, and everyone else within the ICU to not only, bounce ideas off of, but also to vent and to try to understand their stress and let them understand mine as well. So I'm very, very thankful for our MICU family, just as thankful as I am for my other family.
That's awesome. Tracy, how about you?
I do the same. I try to take, I have a commute to work, so I enjoy my drive time and to decompress a little bit. And also being able to have my coworkers be my sounding board, and we take care of each other the same way and make sure everybody is doing well. And, you know, we don't want to bring it home. So it's, we don't want to bring the emotions home or the virus home, but it's really important that we are here for each other and able to maintain our sanity. So.
Great, thank you.
Mm-hmm.
All right, this question comes from Liz Collin from the Twin Cities WCCO. She asks, how bad are things right now? Are you able to compare this time period to what has happened in the past with the pandemic? So like say April, springtime. Any of you want to try to tackle that one?
Yeah, this is definitely the worst that it's been for us. April, May, June, we didn't really have a whole lot of COVID patients, a handful maybe here and there. It was never steady. And now, like there's been, Mayo has said that we are full, or we've got a lot of COVID patients. We've expanded the ICUs that can take the COVID patients. So this right now is a time that I've never experienced before in my life, where you walk out of one room and the next patient is critical. I saw it just 2 weeks ago where we intubated one patient and the team stepped out and intubated the patient next door. I've never seen it like this, and I hope that this surge ends soon and that we don't ever have to deal with this again.
Thank you, Amy. All right, this question comes from Mark from WCCO as well. COVID-19 is challenging on so many levels of health. How concerned are you about your own personal well-being, including your physical and mental health? And do you worry about bringing the virus home with you or into the hospital due to community spread? Does anyone want to handle that one? How about, let's go back to Andrew. Let's take turns.
Yeah. So at the beginning, especially when there was a lot of unknowns, my personal anxiety about the infection was very high. And while I'm not going to say that you know, now that we know more, I feel less anxious. What I am going to say is that I still worry about my own well-being and my family's well-being. You know, my partner actually has asthma, so I'm still very concerned that if I bring it home to her, that she will have a hard time recovering. Asthmatic, you know, it can be exacerbating and more problematic. So as far as, you know, bringing the virus home with us, you know, we actually have precautions here. We have the opportunity to doff or take off our uniform prior to leaving and change. And they allow us to use the washing machine here to clean our uniforms. So we do take those precautions in that regard. And as far as community spread is actually one of my biggest concerns. At work, I have all of the protections, you know, that Mayo Clinic offers. I have gloves, I have gowns, you know, I have an ample number of masks. But sometimes when I go out to the grocery store, I feel more naked than I do at work. It's tough. So you just try to make sure that you keep up with the precautions as best you can, whether, you know, even while you're out and about. But other than that, you know, that's the best you can really do. So.
And while we're on you, Andrew, mental health. So I recall you saying yesterday that you've seen anecdotally an uptick in just the types of 911 calls that are related to mental health crises. Can you speak to that a little bit?
Yeah, I feel in the pre-hospital setting, we get a good handle on mental health problems throughout our community. You know, we kind of become the last line of defense, so to speak, for a lot of these patients that suffer from mental health issues. And over the course of the COVID-19 pandemic, I feel that, anecdotally speaking, from my personal experience, that there has been quite an upswing. Perhaps attributed to the isolation or the fear or what have you, but definitely becoming more prevalent in our call volumes from my perspective. And you just hope that everyone can find support and take care of themselves as best as they can. And call for us when you feel like you're in that place, that dark place, and you need help, because that's what we're here for. You know, even though we're getting this upswing, we want you to call and come to us, because we want to take care of you if it gets there. So that's unfortunate, an unfortunate aspect of this COVID-19 pandemic.
For sure. Thank you so much. So I see that we have quite a few questions kind of stacking up. So I don't want to have each of you answer every question, but does anyone else on the panel want to talk about, you know, your feelings about your own personal well-being or mental health, or worry about bringing the virus home with you? Anything along the lines of that last question?
I don't worry about bringing the virus home. I think that Mayo has done a wonderful job of keeping us safe and making sure that we have enough personal protective equipment to keep us safe, where I know that you hear other hospitals don't or whatever, but I really feel like we have been really well protected and safe. So I actually feel safest here comparatively, just like Andrew said. So I think that and so should our patients feel safe here.
That's great. Thank you. Yeah, and you know, like in the spring, there was a PPE shortage, and you know, when the surge hit New York, I think that was one of the biggest things they dealt with, was they were, you know, MacGyvering PPE out of anything they could find, and we just, luckily in the Midwest, we didn't have a surge when there was a PPE issue. We haven't had to deal with that, so that's great. Okay, moving on. This coming from Matthew Stoley from the Post Bulletin. Let's direct this to Desiree. Are you feeling overwhelmed? I'm hearing some hospitals are on the verge of being overwhelmed. How is your situation?
I think for all of us, no matter what position you're in, I think everyone's overwhelmed at this point. We are trying to take care of ourselves and our coworkers the best we can, but yes, it is overwhelming. There is a lot of things that we see that aren't easy to deal with, and just the surge in COVID cases and the amount of patients that we're getting, it's overwhelming, and we're doing the best we can to keep up.
Thank you. All right, let's direct this question at Amy. This comes from Jennifer from Care 11. Can you describe your emotional, mental state when it comes to getting the vaccine? Nurses and doctors are used to putting others first, but is there a different feeling knowing when it comes to knowing you'll be one of the first to get the vaccine? Amy, do you want to handle that one?
Yeah, honestly, I really haven't had enough time to think about about putting others first and not myself taking this vaccine, because like we've also discussed here that we do feel safe at work. We feel safest at work with our PPE and the amount of care we use to put it on and take it off in a certain way. I don't really know how to feel about this, to be honest, about taking it first, but I guess to make sure that there's enough of us to be able to take care of all of those in need, it's probably a good idea for us to be vaccinated first. So when more people get sick, we're there to be able to take care of them.
All right, thank you. So as I'm reading the questions here, folks, if it seems to me like it's been answered or discussed, I might just skip over that. But if you feel strongly that it has not been addressed, feel free to ping me again. So this question comes from Maureen Perry. Other than masking and social distancing, is there anything you wish the broader community or individuals were doing to ease the burden of the situation on healthcare workers? How about we start with Tracy?
I wish people would stay home. I think that's one of the other things or keeping a closer inner circle. I know that some people have quarantined together and just kept their circle a little closer instead of just going wherever they want and doing whatever they want. I know people are still going to social outings and doing what they want, where they want, when they want. And I know that the masks help greatly, and social distancing helps, and hands, washing our hands is awesome. But really at this point in time, just staying home and being aware of what you are doing and when you're doing it is going to be really important for us to help break this virus.
So Tracy, another related question to that from Zach Bellman. How frustrating is it for you to know, knowing what the virus does, how frustrating is it for you when you see people not complying with masking and social distancing?
It's very frustrating, and actually it's disheartening. I feel like it's disrespectful to medical professionals, and it's hard. But the thing is I think we need to somehow change the culture of what a mask means. It's been taken out of context. That this is just a public health measure that you should take to protect yourself and others around you. This is nothing else, but it's not any other statements involved. This is purely a public health measure. And wearing that mask says nothing else but you protect yourself and those around you. So I really wish that was what we could get out instead of it being in regards to anything else. And I also wish that people would understand that wearing a mask is your right, and it's also your right that you protect yourself and others, and that's your responsibility, and would somehow empower them that way instead, so we could move forward all together instead of such a division.
Excellent. Any of the other panelists, do you want to speak to your feelings when you see people dismissing the safety recommendations? Desiree, you've been quiet for a little bit. How about you?
I think Tracy said it best. It is disheartening. It kind of feels almost like a personal blow, just because we are seeing the ugly side of this virus, and I'm thankful that not a lot of people are seeing the side that we're seeing, but it is real, and we can only, do our best to encourage those behaviors and protect ourselves and the people around us.
All right, thank you. All right, this question comes from Dan Gunderson. Has your experience during the pandemic in any way changed how you think about the work that you do? Let's start with Andrew.
So, as a healthcare worker, and especially as an ambulance service for the 911 areas of Rochester, I've always felt that our work we do is pretty important. It's a part of a working society and a community. But I think that hasn't changed with the pandemic. But to me, what has changed is a great gratitude that I get to be here for people in their what might be one of the worst times of their lives. During a pandemic like this, I think what's changed about how I feel about my work is not just that we are here for you, but we're here for each other as healthcare workers as well. We've had a strong unity between everyone here.
Wait, you went on mute there, Andrew, somehow.
Sorry about that.
Back up with that last sentence again.
I was just saying that I think that what's most changed is just I'm just very grateful to be a part of a team that gets to be here for everyone during this pandemic and being a part of a greater whole, really.
I also agree with Andrew. I'm thankful. I'm proud of the work that I do. I work in a department of over 200 respiratory therapists, and we care for all patients, from the premature babies all the way up into the elderly population before this pandemic. And I think one thing is our work has now been brought to light with this pandemic, and I'm thankful, because I often say when I'm feeling extra sassy and people ask what I do, I say, all those big machines on TV or the ones you hear about in the newspaper. Most time in pictures, they're strategically sandwiched between a doctor and a nurse. Those are my machines. We are the ones running those machines and maintaining those machines to help people breathe.
I'm also very proud of the work that I do, and it's mainly because this has brought to light the team of infectious disease doctors from Mayo Clinic, and it's really been important. They are working so hard through the entire enterprise, and with their research and with all of their care, with the vaccines, with the medications, with everything that they've all been doing, working hard with patient care, to what can we use to clean, to everything, the vaccine coming now. Every one of them has been putting in endless hours and just being fantastic. And that's really made me super proud of our team, and their dedication to their patients and to each other has really been great and makes me want to work harder. So, and they just condemn they just honor the staff so much every day, say something about it. So it's nice.
That's great. Amy, do you have anything you want to add there?
I could definitely jump on the bandwagon of how proud we all are of the work that we're doing. And nothing has changed in my thoughts of being a nurse and a caregiver. If anything, it's gotten stronger because we give these patients absolutely everything that we can, because we know that we're there for them and that it's a pandemic. This is unforeseen territory that no one has been in before. And we are very proud of the work that we're doing, being there every single day and being there for the patients. So it's a good opportunity, a great opportunity for us to continue to strive to be better. And the things that we do and the changes that we're going through, we just take them and move on. So it's been an interesting couple months.
More than a couple. Time has passed more than. All right.
Almost a year.
All right. This question comes from the Associated Press from Amy for Liddy. Are you dealing with staff shortages in your units? And if so, what sorts of things are being done to ease that? Are you working lots of overtime, using different scheduling models, hiring traveling or temporary nurses? Amy, do you want to tackle that one first?
Yeah, definitely have been short with this increase in patients coming in. Mayo has reached out and they've hired some fantastic travel nurses who have become a part of our team. I think we've had them probably since August, and they've fit right in. They also have a great model to have an on-call option. So on your days off, we have the option to be on call, and if the hospital needs you, they will just call you in. So it's a great way to get some extra people in, a great way to come in and help your coworkers on your days off. Yeah.
So are you getting days off?
Yeah, we are. So we typically work the 3 12-hour shifts, and then it's your option to pick up extra time. So definitely need those days off to recuperate and revive yourself and just kind of forget about everything that happened that week and know that the next week is a new week and to continue on. So.
All right, thank you.
And I think also it's a time to recognize, the strength within your department. I know for us, there's, people coming in early and staying late. Our management has stepped up and also picked up shifts and are there to lend a helping hand. And I think that it truly is, we are short and we need caring people to continue to do the good work that we're doing. And I think everybody's stepping up in any way they know how to help out.
Great, thank you. All right, this comes from Matt. Do you understand, though, the vast difference between your experience and those of ordinary people? You have seen things that others haven't. Doesn't that create a great divide in terms of understanding the virus? You've experienced it, others haven't. What would you say to that, Tracy? Let's have Tracy answer that one.
Yeah, I do. And that's the part of being a nurse that is a blessing and a curse, that you do get to see things that other people don't. And so I do understand the division that has put, but the other thing is it is important that people realize we see the things we see because of what can be happening in the community. And so their actions determine what we see. Meaning, if more people are wearing their masks and doing the things that public health recommendations are, it can ease our burden. Just like if, more people are getting the flu shot every year, we see the flu rates drop. I've had the blessing of being able to give the first monoclonic antibodies here in La Crosse, and still got to see how a patient can react to that and not have to be in the hospital setting, away from their family and away, they get to go home after they get their treatment. And it's really just great. And the fact that they're not away from their family and in the hospital, cooped up and, just surrounded by strangers, basically, and they get the same type of treatment, and they get to go home and be in their own bed and heal in their own space, is just amazing. And, the community doesn't get to see that either, the good work, the hard work that's being done in that area. So that's important stuff too.
That's great. Thank you, Tracy. Amy, what about you? Do you find yourself sort of thinking like, if you could see what I see, you would feel different? Do you find yourself thinking that?
Absolutely, I do. It's hard not to feel that way, that if you, sir or ma'am, who aren't wearing a mask out on the street, if you could see the things that I see, I've thought it many times, if I could just wear, a camera on my head and they could see just the chaos that is a part of the unit right now, that you would think you would think twice about not wearing a mask or going and celebrating Thanksgiving with your family, or doing anything with a group of people. It's hard when they don't get to see that, but I understand that also that, it's not made for everyone to see either. I chose this profession to take care of people and to help them ease their pain, and not everyone chose that. So I know that I still have to.
All right, this is Andrew Kraft. We'll get back to that in just a few minutes here, but we wanted to break in now at the top of the hour. It's 8 p.m. here in Phoenix, Arizona, 10 p.m. there on the East Coast, if I get my math right. Well, we're going to talk about some of the more lighthearted stories that happened today on the first day of December. Can't believe it's the last month of the year, 2020, coming to an end shortly in just a matter of weeks already. It's been a pretty tough year for a lot of people because of the pandemic. But we wanted to bring you some of these stories that might not get as much attention as a lot of the stories that we've been following throughout the day. So we're first going to go, speaking of the pandemic, we wanted to go out now and show you some of this. As we approach the end of 2020, 2 dictionary companies are revealing their pick for word of the year. Both Merriam-Webster and Dictionary.com declaring pandemic the official word of 2020. They say search terms involving the word pandemic increased by more than 1,000% throughout the year. And Dictionary.com adds pandemic was in the top 10% of all search words for half of the year. Other popular search words and phrases include aerosols, contact tracing, social distancing, and herd immunity. The word pandemic stems from Latin and Greek origins, with pan meaning for all and demos meaning people. But experts at Oxford Languages have different opinions about their colleagues' announcement. Their research team says 2020 was simply too complex to be summed up into words. And a car has plowed into pedestrian zone in Germany, killing at least 2 people, and the driver is under arrest. The horrific accident happened Tuesday in the southern city of Trier in a shopping area. Emergency crews and police rushed to the scene after the car slammed into a group of pedestrians. At least 15 people suffered serious injuries. Police say one of those killed is a child. The driver, identified as a 51-year-old man from the area, was arrested and his vehicle was impounded. Local officials say he was speeding at the time and the incident appeared to be intentional, but police have not released any more details or a possible motive. And formerly known as Ellen Page, the actress now is going by Elliot after she addressed her followers through social media saying, quote, "Hi friends, I want to share with you that I am trans. My pronouns are he and they, and my name is Elliot. I feel lucky to be writing this, to be here, to have arrived at this place in my life. I feel overwhelming gratitude for the incredible people who have supported me along this journey. I can't begin to express how remarkable it feels to finally love who I am enough to pursue my authentic self." So, the actor Elliot Page, the star of the Oscar-nominated film Juno, has announced that he is transgender. And lastly, Santa Claus comes to town in waves. 150 people donned Santa suits and hopped on jet skis along Australia's Gold Coast for a children's charity. Some of the jet skis were even decorated to look like sleighs. They took to the waters Sunday to raise money for children in residential care and also attempted to break a previous record of 129 jet skis in a Santa parade held in 2014. The event raised nearly $7,000 for charity called Christmas Presents for Kids in Care. So we just wanted to bring you some of those stories throughout the day that, we might not have time to get to because there's so much happening, especially here on NewsNOW from Fox. We're covering all the angles of the coronavirus pandemic, everything politics and election 2020. So remember, everything is live and raw and unfiltered here on NewsNOW from Fox with no bias or opinion, just facts. We give context and clarity to the breaking stories of the day. Remember, we don't cut things down or make them shorter. If something live is happening, we bring it to you in its entirety. If something else is happening at the same time, we'll play it out for you mere moments after the fact because we can't get to it when it's happening. And remember, if you want to follow us on Twitter, go to @NewsNowFox. We would love a follow there on Twitter. If you want to follow me on Twitter, I'm Andrew Kraft. That's @AndrewKraft. And if you want to tell your friends and family about where they can watch us, you can go to NewsNowFox.com, and that's lists all of the platform partners that we have and where you can find us to tell your friends about us. We would love for more people to experience NewsNOW from Fox, especially going into this last month of 2020. We appreciate everyone for watching December 1st today. Hope everyone had a great Thanksgiving holiday and Thanksgiving weekend. We're going to take a quick commercial break. This will be 2 minutes long, and some of you will see this, but some of you will not. But stick right here with us on NewsNOW from Fox. And like I said before, I'm Andrew Kraft. We do want to take it back out to that Mayo Clinic update on the coronavirus pandemic. So let's hear from a little more on that, and then we'll have a few more live reports going in to the night hours here. Remember, we have extended coverage during the weekdays. We go to 1 a.m. Eastern now, and on the the weekends, we have live coverage as well, because the news never stops, and breaking news can happen on the weekends or on a holiday. So we are 7 a.m. to 7 p.m. Eastern on Saturday and Sunday. But back to that Mayo Clinic update on the coronavirus pandemic.
I think that hasn't changed with the pandemic, but to me what has changed is a great gratitude that I get to be here for people in their what might be one of the worst times of their lives. During a pandemic like this, I think what's changed about how I feel about my work is not just that we are here for you, but we're here for each other as healthcare workers as well. We've had a strong unity between everyone here.
Wait, you went on mute there, Andrew, somehow.
Sorry about that.
Back up with that last sentence again.
I was just saying that I think that what's most changed is just I'm just very grateful to be a part of a team that gets to be here for everyone during this pandemic and being a part of a greater whole, really.
I also agree with Andrew. I'm thankful. I'm proud of the work that I do. I work in a department of over 200 respiratory therapists, and we care for all patients, from the premature babies all the way up into the elderly population before this pandemic. And I think one thing is our work has now been brought to light with this pandemic, and I'm thankful, because I often say when I'm feeling extra sassy and people ask what I do, I say, you know, all those big machines on TV or the ones you hear about in the newspaper, most time in pictures, they're strategically sandwiched between a doctor and a nurse. Those are my machines. We are the ones running those machines and maintaining those machines to help people breathe.
I'm also very proud of the work that I do, and it's mainly because this has brought to light the team of infectious disease doctors from Mayo Clinic, and it's really been important. They are working so hard through the entire enterprise, and with their research and with all of their care, with the vaccines, with the medications, with everything that they've all been doing, working hard with patient care, to what can we use to clean, to everything, the vaccine coming now. Every one of them has been putting in endless hours and just being fantastic. And that's really made me super proud of our team, and their dedication to their patients and to each other has really been great and makes me want to work harder. So, and they just condemn that, you know, they just honor the staff so much every day, say something about it. So it's nice.
That's great. Amy, do you have anything you want to add there?
I could definitely jump on the bandwagon of how proud we all are of the work that we're doing. And nothing has changed in my thoughts of being a nurse and a caregiver. If anything, it's gotten stronger, because we give these patients absolutely everything that we can, because we know that we're there for them and that it's a pandemic. This is unforeseen territory that no one has been in before. And we are very proud of the work that we're doing, being there every single day and being there for the patients. So it's a good opportunity, a great opportunity for us to continue to strive to be better. And the things that we do and the changes that we're going through, we just take them and move on. So it's been an interesting couple months.
More than a couple. Time has passed more than. All right.
Almost
thank
a year.
you. All right. This question comes from the Associated Press from Amy for Liddy. Are you dealing with staff shortages in your units? And if so, what sorts of things are being done to ease that? Are you working lots of overtime, using different scheduling models, hiring traveling or temporary nurses? Amy, do you want to tackle that one first?
Yeah, definitely have been short with this increase in patients coming in. Mayo has reached out, and they've hired some fantastic travel nurses who have become a part of our team. I think we've had them probably since August, and they've fit right in. They also have a great model to have an on-call option. So on your days off, we have the option to be on call, and if the hospital needs you, they will just call you in. So it's a great way to get some extra people in, a great way to come in and help your coworkers on your days off. Yeah.
Are you getting days off?
Yeah, we are. So we typically work the 3 12-hour shifts, and then it's your option to pick up extra time. So definitely need those days off to recuperate and revive yourself and just kind of forget about everything that happened that week and know that the next week is a new week and to continue on. So.
All right, thank you.
And I think also it's a time to recognize, the strength within your department. I know for us, there's, people coming in early and staying late. Our management has stepped up and also picked up shifts and are there to lend a helping hand. And I think that it truly is, I mean, we are short and we need caring people to continue to do the good work that we're doing. And I think everybody's stepping up in any way they know how to help out.
Great, thank you. All right, this comes from Matt. Do you understand, though, the vast difference between your experience and those of ordinary people? You have seen things that others haven't. Doesn't that create a great divide in terms of understanding the virus? You've experienced it, others haven't. What would you say to that, Tracy? Let's have Tracy answer that one.
Yeah, I do. And that's the part of being a nurse that is a blessing and a curse, that you do get to see things that other people don't. And so I do understand the division that has put, but the other thing is it is important that people realize we see the things we see because of what can be happening in the community. And so their actions determine what we see. Meaning if more people are wearing their masks and doing the things that public health recommendations are, it can ease our burden. Just like if, more people are getting the flu shot every year, we see the flu rates drop. I've had the blessing of being able to give the first monoclonal antibodies here in La Crosse, and still got to see how a patient can react to that and not have to be in the hospital setting, away from their family and away, they get to go home after they get their treatment. And it's really just great. And the fact that they're not away from their family and in the hospital, cooped up and, just surrounded by strangers, basically, and they get the same type of treatment, and they get to go home and be in their own bed and heal in their own space, is just amazing. And, the community doesn't get to see that either, the good work, the hard work that's being done in that area. So that's important stuff too.
That's great. Thank you, Tracy. Amy, what about you? Do you find yourself sort of thinking like, if you could see what I see, you would feel different? Do you find yourself thinking that?
Absolutely, I do. It's hard not to feel that way, that if you, sir or ma'am, who aren't wearing a mask out on the street, if you could see the things that I see, if I've thought it many times, if I could just wear, a camera on my head and they could see just the chaos that is a part of the unit right now, that you would think you would think twice about not wearing a mask or going and celebrating Thanksgiving with your family, or doing anything with a group of people. It's hard when they don't get to see that, but I understand that also that, it's not made for everyone to see either. I chose this profession to take care of people and to help them ease their pain, and not everyone chose that. So I know that I still have to bear that, but I would sometimes like for them to see exactly what we see.
I bet. All right, this question comes from Maureen Perry. Do you think there's an opportunity now for a broader health message about improving your baseline health to mitigate underlying conditions and comorbidities? Do you see that being emphasized within Mayo? Who do we want to ask that question to? How about back to Tracy?
I do. I think this is a good time for everybody to step back and take a look at their overall health. As we're seeing, comorbidities are taking effect with the pandemic, and overall COVID in general, how it affects you. And I think people are aware of that. And I've had people say to me, you know, I think if I wasn't obese, this wouldn't be such a big deal. Or, you know, if I didn't have the COPD, it would be better, right? You know, things like that I've had patients say. Or they've even said to me, I probably should have quit smoking a few years ago. And, well, you know, we don't know that, but, you know, as we're going, we don't know the long-term effects of COVID. They're doing a lot of research on that. They're really looking into it. So all we can do is take care of what we have right now. And that's kind of what I tell patients is moving forward, we do the best we can. And so they really do hear that. And so I think moving forward, we're going to do as a community a better job, and hopefully as a nation a better job taking care of ourselves. And so yes, I think Mayo is definitely looking at that. Mm-hmm.
So when you spoke earlier, Tracy, about some of the anxiety that you see in the testing tent, does that sort of correspond with the people who have underlying conditions?
Yeah, it does. They know that if they have COPD or breathing issue, they're obese, because they've had a little sedentary life, they're smokers, different things like that. They have a heart condition. There are a lot more angst there about getting tested. What if I have this? What if, you know, what if? But the other thing is just the general anxiety being the testing site is really, you know, also they've seen and heard about being tested overall is the general anxiety of getting a nasal swab. So that can be hard for them too. So, it's really important that you just do it and take care of whatever questions they have and be honest with them is the most important thing.
That's great. Thank you. So Jennifer from CARE, your question on the number of ICU beds available. We do have Dr. Amy Williams, who's the Executive Dean of Mayo Clinic Practice. She's doing a briefing today at 2:30, and she is going to speak overall to our testing, our hospital capacity, our staffing. She's going to give updates on all of that. So if you need an invitation to that, just let me know and I can get that to you. You can email me. I'll put my email in the chat there. I'll make sure you get that. So we are at about 12:45, so we have about 15 minutes left. One of the things that I wanted to talk about a little bit, and I want to ask this of Amy and Desiree. So I've heard a lot about just the loneliness, the isolation of those patients in the ICU, the ones who are really, you know, facing mortality, and they can't see their families. Can you speak a little bit about that, Amy or Desiree, you know, from your experience? What are the patients saying and how are you helping them through that?
Yeah, as bedside nurses, we do try to do Zoom calls every day, at least once a day with their family members, so then they can at least see each other and spend some time talking to each other. If the patient is intubated, we still do that with the family. We make sure that the family can still see their family member, the patient who is critically ill, and making sure that they know that there's someone in the room with them at all times. It's very hard for the patients, and especially during the holidays, but we try to do everything that we can on the unit, such as we've got cards coming into the ICU right now to help with the spirits of not only the patients, but also us as nurses and respiratory therapists, the doctors, the PCAs, everyone. We're trying to just lift the spirits of everyone during this very dark time. We just do absolutely, like I said, everything we can. We celebrate their birthdays with them. I worked Thanksgiving, and we tried to celebrate Thanksgiving with everybody that could celebrate. We just try to lift their spirits with any way that we can.
I think Amy's being a bit humble there too. She's the one that put that together with the cards and the well wishes for both the staff and the patients. The bedside nurses do an amazing job in treating the patients like they would treat their own family. And we as respiratory therapists try to do our best also. Thank you, Amy, also for getting all those cards and including all those people in the well wishes, because I know that that is sure to brighten people's days and to make maybe this stay in the ICU a little bit easier.
All right, thank you. So what are some, I mean, without sharing specific patient information, just, can you share any anecdotal stories about, some of those conversations you're having with patients, some of the things that really just, that get to you, that, where they're facing their mortality? What are they saying? How does that feel for them?
Yeah. One story that I have is one of my very good friends and coworkers. He's a nurse. He spent 8 hours on a Zoom call with a family while they were saying goodbye to their family member. The patient had, or the family and the patient had decided to go comfort care. And he sat in the room with that patient in all PPE for 8 hours, holding an iPad for the family members so they could be there with their loved one. We've got stories like this that are abundant. We have stories where, like I said, sometimes we feel that we're going to be the last people that they talk to. We had a gentleman last weekend who told the nurse that he hopes that he gets through this so someday he can repay the kindness that he's been given. We had last week a gentleman who he was needing an emergent intubation, and we were frantically trying to get the family on a Zoom call so he would be able to talk to them, hopefully not for the last time, but possibly for the last time. That we just do our best.
So we've been listening to this Mayo Clinic update on the experiences of frontline workers there. The Mayo Clinic is based in Rochester, Minnesota, so a lot of nurses and frontline workers were kind of giving their experience on, what people say to them, what their experience has been like dealing with this pandemic for almost a year now. We're just on the horizon of vaccines. Vaccines are coming this month. The CDC announced today that after a panel ruling among their experts there at the Centers for Disease Control and Prevention that we now know who will get the vaccine first. Remember, there are a number of vaccines that are coming by Moderna, by Pfizer, and so now we know that frontline workers and those in long-term care facilities will be first in line to get that vaccine. So we'll bring more information on the vaccine front into the night here. It's it's almost 8:30 here in Phoenix, Arizona, almost 10:30 there on the East Coast. We have a great report coming up at 9 p.m. here Mountain Time from one of our reporters who follows the Biden-Harris transition. So we're going to get an update from her. In the meantime, we want to play out for you, in case you missed it from earlier, President-elect Joe Biden announced his economic team. This is his team of economic advisors, cabinet posts, special advisors who'll be consulting with him on how to get the economy roaring back to pre-pandemic levels. Remember, the economy was booming back then, now not so much. So we want to play that out for you. It's about 40 minutes, and then we're going to take that live hit and get a little more insight into what's going on in the Biden-Harris transition. Before we do that, though, let's take a quick commercial break. This will be 2 minutes long. We'll see you right back here. And like I said, let's go back out now to Joe Biden, the president-elect, announcing his economic team from Wilmington, Delaware.
Thanksgiving, even if it was far from the traditional large gathering of family and friends, apart from many we loved, but I hope you had a good Thanksgiving. And I know times are tough, but I want you to know that help is on the way. Last week, I announced the nominations and staff for critical foreign policy and national security positions, a first-rate team that's going to keep us safe and secure. And today, I have the pleasure of announcing key nominations and appointments for the critical economic positions in the administration. a first-rate team that's going to get us through this ongoing economic crisis and help us build the economy back, not just build it back, but build it back better than it was before. A team that's tested and experienced. It includes groundbreaking Americans who come from different backgrounds, but who share my core vision for economic relief here in the United States of America. And given a fair shot and an equal chance, there's nothing, we all believe there's nothing beyond the capacity of the American people. Let's not forget who built this country. Working class and middle class people built this country, and unions built the middle class. And from the most unequal economic and job crisis in modern history, we can build a new American economy that works for all Americans, not just some, all. We need to act now, though, and we need to work together. You know, in the weeks since winning the election, Vice President Harris and I have covered meetings with a number of people. We convened meetings with labor leaders and CEOs at the same time, mayors and governors of both political parties. There's a consensus out there that as we battle the COVID-19 disease, we have to make sure that business and workers have the tools, resources, and guidance, and the health and safety standards to be able to operate safely. The goal is simple: to keep businesses and schools open safely. And for millions of Americans who have lost their jobs or hours and have had to claim unemployment, we have to deliver them immediate relief. That includes affordable health care for millions of people who have lost it and are in danger of losing it. Child care, sick leave, family leave, so workers don't have to choose between work and family. Relief from rent and student loans. We need to support small businesses and entrepreneurs who form the backbone of the communities that we live in, that are teetering on the edge. You know, there's an urgent need to fund state and cities so the frontline workers on those jobs can stay in the jobs. You know, the founders are pretty smart. I could have gotten this lesson from the future Secretary of the Treasury. You know, there's a reason why all the states and localities have to have a balanced budget, but we're allowed federally to run a deficit in order to deal with crises and emergencies that we have in the past. And we have to keep vital public services running. We have to give aid to local and state governments to make sure they can have law enforcement officers, firefighters, educators, as we did in the Recovery Act of 2009. And right now, the full Congress should come together and pass a robust package for relief to address these urgent needs. But any package passed in a lame duck session is likely to be, at best, just a start. My transition team is already working on what I'll put forward in the next Congress to address the multiple crises we're facing, especially our economic and COVID crises. And the team I'm announcing today will play a critical role in shaping our plan for action starting on day one and move fast to revive this economy. They're going to help me help the country lay out my Build Back Better plan, a plan that an independent analysis from Moody's, a well-respected Wall Street firm, projected would create 18.6 million jobs. It's based on a simple proposition: reward hard work in America, not wealth. It's time to invest in infrastructure, clean energy, climate change, manufacturing, and so much more that will create millions of good-paying jobs. And it's time we address the structural inequities in our economy that this pandemic has laid bare. Economists call this current economy in recovery K-shaped. Well, like the two lines coming off of a K. Some people are seeing their prospects soar upward, while others are watching their economic prospects drop sharply. For those at the top, jobs have come back and their wealth is rising. For example, luxury home sales are up over 40% compared to last year. But for those in the middle and the bottom, it's a downward slide. They're left figuring out how to pay the bills and put food on the table. Almost 1 in every 6 renters was behind in rent payments as of October. Let me be clear. With this team and others, we'll add in the weeks ahead that we're going to create a recovery for everybody, for all. We're going to get this economy moving again. We're going to create jobs, raise incomes, reduce drug prices, advance racial equity across the economy, and restore the backbone of this country, the middle class. Our message to everybody struggling right now is this: help is on the way. My dad, you've heard me say this before, when he lost his job in Scranton when I was a kid, and we eventually moved the family not far from here, Claymont, Delaware, just in the outskirts of Wilmington, he used to say, Joey, a job is about a lot more than a paycheck. It's about your dignity. It's about respect, your place in the community. It's about being able to look your kid in the eye and say, honey, it's going to be okay, and mean it. He also used to say, Joey, I don't expect the government to solve my problems, but I do expect them to understand my problems. This team understands. For Secretary of Treasury, I am really pleased to be able to nominate Janet Yellen. No one is better prepared to deal with these crises. I wish it weren't as much of a crisis, future Secretary. But she'll be the first Treasury Secretary who is also Chair of the Federal Reserve, Vice Chair of the Federal Reserve, and Chair of the President's Council of Economic Advisors. Janet is one of the most important economic thinkers of our time. She has spent her career focused on employment and the dignity of work, which is really important to me and to all of us. She understands what it means to people and their communities when they have good, decent jobs. Respect across, being looked at by their neighbors and being respected, it matters a lot to them. And respected across party lines and around the world by Main Street and Wall Street. An educator, a mentor, above all, the daughter of a working class from a working class Brooklyn neighborhood who never forgot where she came from. Her husband, George, is pretty good too. He's won a Nobel Prize, but he's the one that married up. Janet will be the first woman to hold this office. We might have to ask Lin-Manuel Miranda, who wrote the musical about the first Secretary of Treasury, Hamilton, to write another musical about the first woman Secretary of the Treasury, Yellen. So that's what I'm working on right now, Janet. For Director of Office of Managing the Budget, I nominate Neera Tanden. You know, I've known Neera a long time, a brilliant policy mind with critical practical experience across government. She was raised by a single mom on food stamps, an immigrant from India who struggled, worked hard, and did everything she could for her daughter to live out the American dream. And Neera did just that. She understands the struggles that millions of Americans are facing, and she'll be the first woman of color from South Asia, and I think that to lead OMB. We also have another one of those women as Vice President of the United States of America. And so look, all being very serious, she'll be in charge of laying out the budget that will help us control the virus and deal with the economic crisis and build back better. But above all, she believes what I believe. A budget should reflect our values. Again, quoting my dad, for real, my dad's people would say, Joe, let me tell you what I value. And he'd look at them, he's a high school educated guy, very well read. And he'd look at me and say, don't tell me what you value, show me your budget, I'll tell you what you value. That's what you're going to do for us. As Deputy Secretary of Treasury, I nominate Wally Adierno. Wally is, you know, Wally, I don't know. I tell you what, Senator Warren really likes you. She highly recommended you, but I wasn't sure she worried I stole you as well. But thank you for being willing to do this, Wally. A skilled leader and thinker on issues ranging from macroeconomics to consumer protection and from national security to international affairs. I've worked with Wally during the Great Recession. That was my excuse to the senators, saying that's why I wanted to steal you. And I saw him tackle one big job after another. Deputy National Security Advisor to President Obama, Deputy Director for the National Economic Council, former Chief of Staff to Elizabeth Warren, where he helped create the Consumer Protection Bureau and Financial Bureau, which has done so much good. It's designed to protect consumers and working people from unfair, deceptive, and abusive financial practices. And now Wally will be the first African-American ever to hold this post and the highest-ranking African-American in the Treasury Department's history. An immigrant from Nigeria, the son of a nurse and an elementary school principal, Wally understands everything we do is basically for the people, for families, hard-working people, to understand their struggles and most of all their dreams, and he understands both. And I want to thank you, Wally, for being willing to do this. For chairperson of the Council of Economic Advisors, I nominate, notwithstanding she was a very distinguished professor at Princeton. I joke, my children who went to Penn used to always kid about, but Cecilia C.C. Rouse, one of the most distinguished economists in the country, an expert on labor economics and race, poverty, and education, dean of the Princeton School of Public and International Affairs, a member of the Council of Economic Advisors to President Obama, an advisor to President Clinton at the National Economic Council. More than that, she's a proud daughter whose mom, a school psychologist, encouraged her to pursue economics. And her dad, one of the country's first African-American astrophysicists who dared her to dream. She's done both. If confirmed, Cece will be the fourth woman to lead the Council of National Economic Advisors and the first African-American ever to hold that post. And as CEA chair, she'll serve as a member of my cabinet as well. As a member of the Council of Economic Advisors, we also appoint Jared Bernstein, an old friend who's been with me a long time, a brilliant thinker, a quick wit, with a heart as big as his head, and a heart he got from his mom, an educator who raised him correctly. A social worker turned economist, Jared is one of my closest economic advisors and friend. He served as my chief economist during the vice presidency. He was there in that foxhole during the Great Recession, with the economy on the brink and our country on our back. I couldn't think of anyone else who I'd want to be at my side to face the challenges ahead. Jared will be one of the leading voices of my administration on economic policy. I can always count on him to deliver straight from the shoulder, as his hero FDR used to say, straight from the shoulder. The one thing I can assure you is working people will always have a voice with Jared in this council. As a member of the Council of Economic Advisors, I appoint Heather Bousset. Heather, thank you for all the help you had in the transition team and getting me here. She's one of the foremost economists working to make sure we build an economy that works for all Americans. The daughter of a union family, it's no wonder she believes so deeply in the idea that leave no one out, leave no one behind in this economy. During the campaign, I relied on our counsel on addressing structural inequities within the economy. And I'll do so again as president because that's one of the central issues of our time. To this team, thank you for accepting the call to serve again. To your families and to your, thank them for their sacrifices because it's real sacrifice. We could not do this without you. And to the American people, this team will always be there for you and your families. This is family-oriented team. We got to make sure ordinary people get a chance to do well because they've never, when given a chance, they've never, ever, ever, ever let the country down. 11 years ago, President Obama and I entered office during the Great Recession and implemented the Recovery Act that saved us from a Great Depression. I didn't see the map of America at the time, nor did he, in terms of blue states and red states. We only saw the United States of America. We worked with everyone, for everyone, and we recovered and rebuilt together as one nation. Vice President Harris and I will do that all over again with an outstanding team. They're ready on day one. And to the United States Senate, I hope these outstanding nominees will receive a prompt hearing and that we will be able to work across the aisle in good faith and move forward as one country. So let's begin the work to heal, to unite, to rebuild an economy for all Americans. They deserve and expect nothing less. Thank you, may God bless you, and may God protect our troops. I now turn this over to the new team starting with our next Secretary of Treasury, Janet Yellen. Again, Janet, thanks for accepting. Appreciate it. I think they're going to clean this off for us here. No, I put it in my book.
Thank you, Mr. President-elect and Madam Vice President-elect. It's my great honor to have this opportunity to serve you and the American people, and to join this incredible economic team at this moment of great challenge for our country. Mr. President-elect, when you reflect on what your father taught you about how a job is much more than a paycheck, I hear my own father, who raised our family in working-class Brooklyn. When he graduated from medical school during the Great Depression, he looked for a home and a place to hang his shingle near the Brooklyn docks. Back then, Bush Terminal on the upper New York Bay was a thriving hub for manufacturing and transportation, and for the union workers whose livelihoods depended on them. Knowing they didn't have cars, my father found a home near a bus line. He started his family practice in the basement while we lived on the floors above. At the end of the day, he would talk to me, my brother, and my mom about what work meant to his patients, our friends and neighbors, especially if they lost a job, the financial problems, the family problems, the health problems, the loss of dignity and self-worth. The value of work always stuck with me, so much so that I became an economist because I was concerned about the toll of unemployment on people, families, and communities. And I've spent my career trying to make sure people can work and achieve the dignity and self-worth that comes with it. Mr. President-elect, I know you've done the same. I saw that understanding during the last Great Recession and the Recovery Act that followed. And now we're facing historic crises again. The pandemic and economic fallout that together have caused so much damage for so many and have had a disproportionate impact on the most vulnerable among us. Lost lives, lost jobs, small businesses struggling to stay alive or closed for good. So many people struggling to put food on the table and pay bills and rent. It's an American tragedy, and it's essential that we move with urgency. Inaction will produce a self-reinforcing downturn, causing yet more devastation. And we risk missing the obligation to address deeper structural problems, inequality, stagnant wages, especially for workers who lack a college education, communities that have seen industry disappear with no good jobs replacing lost ones, racial disparities in pay, job opportunities, housing, food security, and small business lending that deny wealth building to communities of color, gender disparities that keep women out of the workforce and keep our economy from running at full force. It's a convergence of tragedies that is not only economically unsustainable, but one that betrays our commitment to giving every American an equal chance to get ahead. But I know this team will never give up that commitment. As you've said before, Mr. President-elect, out of our collective pain as a nation, we will find collective purpose to control the pandemic and build our economy back better than before, to rebuild our infrastructure and create better jobs, to invest in our workforce, to advance racial equity and make sure the economic recovery includes everyone, to address the climate crisis with American ingenuity and American jobs, working together with the outstanding national security and foreign policy team you announced last week to help restore America's global leadership. And above all, we share your belief in the American dream of a society where each person with effort can rise to their potential and dream even bigger for their children. I pledge as Treasury Secretary to work every day towards rebuilding that dream for all Americans. And to the great public servants of the Treasury Department, I look forward to working with you and Wally to rebuild the public trust. To the American people, we will be an institution that wakes up every morning thinking about you, your jobs, your paychecks, your struggles, your hopes, your dignity, and your limitless potential. Thank you.
Mr. President-elect, Madam Vice President-elect, I'm humbled and honored by the trust you've placed in me to work with this talented team on behalf of the American people. I'm especially proud to work alongside leaders who understand that budgets are not abstractions. They are a reflection of our values. They touch our lives in profound ways, and sometimes they make all the difference. Like the Vice President-elect's mother, Shyamala, my mother, Maya, was born in India. Like so many millions across every generation, she came to America to pursue a better life. I was raised in a suburb of Boston, a middle-class kid. But when I was 5, my parents got divorced, and my mom was left on her own with 2 young children and without a job. She faced a choice: return to India, where at a time divorce was stigmatized and the opportunities for her and her children would be limited, or keep fighting for her American dream. She stayed, and America came through for her when times were tough. We relied on food stamps to eat. We relied on Section 8 housing vouchers to pay the rent. We relied on the social safety net to get back on our feet. This country gave her a fair shot to reach the middle class, and she made it work. She got a job as a travel agent, and before long, she was able to buy us our own home in Bedford, Massachusetts, and eventually see her children off to college and beyond. I'm here today thanks to my mother's grit, but also thanks to a country that had faith in us, that invested in her humanity and in our dreams. I'm here today because of social programs, because of budgetary choices, because of a government that saw my mother's dignity and gave her a chance. Now it is my profound honor to help shape those budgets and programs to keep lifting Americans up, to pull families back from the brink, to give everybody the fair chance my mom got, and that every single person deserves. That's the America Maya and Shyamala were drawn to. The America the President-elect and Vice President-elect are ready to grow. I believe so strongly that our government is meant to serve all the American people, Republicans, Democrats, and independents alike, all of whom deserve to know their government has their back. I look forward to working together alongside the dedicated career professionals of the OMB to expand possibilities for every American family. And I want to thank my own wonderful family, my husband, Ben, without whose love and support I would simply not be here, and our children, Alina and Jaden. Thank you all for this profound opportunity to serve.
Mr. President-elect, Madam Vice President-elect, thank you for this profound opportunity to return to the Treasury Department and serve the American people. I know firsthand the President-elect's capacity to lift our country out of hard times because I had the privilege of working with him to help Americans recover from the Great Recession. In California's Inland Empire, where I'd grown up in a working-class neighborhood, the Great Recession hit us hard. We were one of the foreclosure capitals in the United States. The pain of this was real for me. It wasn't just numbers in a report or stories on the nightly news, but neighbors and friends who lost everything. I was proud of the work I got to do at the Consumer Financial Protection Bureau, protecting American consumers, and at the Treasury Department, helping to grow the U.S. economy. I was proud also of getting a chance to serve with leaders like the President-elect, who oversaw the Recovery Act's implementation, investing in American workers, betting on their resilience and drive, and giving families a chance to get up off the mat. I believe that's what public service is all about at its best. Giving people a fair shot when they need it most, offering hope through the dark times, and making sure that our economy works not just for the wealthy, but for the hardworking people who make it run. Those are the lessons I learned from my parents, an elementary school principal and a nurse who came to America to build a better life for me and my siblings. They taught us that we have a responsibility to serve our community and the country that gave us so many opportunities. But I also learned early on how much more needs to be done to ensure that everyone has a fair chance they deserve. I look forward to working with Janet Yellen to reduce inequality in this country and expand the middle class and make sure that we build an economy that works for everyone. And as we build back better, we must also remain laser focused on the Treasury Department's critical role protecting our national security. This includes using our sanctions regime to hold bad actors accountable, dismantling the financial networks of terrorist organizations and others who seek to do us harm, and ensuring our foreign investment policy protects America's national security interest. The challenges before us today are unlike anything we have ever faced. But I know that what the President-elect so often reminds us of is true. The American people can do anything when given a chance. And I'm honored to be a part of this talented team and to work with them and all the American people to build an economy that gives everyone that chance and turns our nation once again from crisis to hope. Thank you.
Good afternoon, Mr. President-elect, Madam Vice President-elect. Thank you for this extraordinary opportunity to join this team. I'm humbled and honored and ready to get to work for the American people. To be perfectly honest, until recently, I did not anticipate I would return to public service. As every academic knows, when you've laid down roots at a school you love, with incredible students and colleagues you've grown with, it isn't easy to take a leave. It requires a rare combination of urgency and opportunity to pull you away. But that rare combination is precisely what our nation is facing right now. My path as an economist began in my first year of college. My mother, the school psychologist, encouraged me to take a course in economics. And it happened to coincide with what at the time was one of the worst spikes in unemployment since the Great Depression. It was impossible for me to separate what we were learning in the classroom from what I know was going on in towns across the country. And so I found myself drawn to the study of the labor market in all of its dimensions. The reasons that jobs disappear, the impact of education on people's job prospects, and the ways we can tear down barriers to job growth and make it easier for people to find long-lasting economic security. Today, nearly 40 years later, we are once again living through one of the worst job crises since the Great Depression. Millions of families have had their lives turned upside down. The safety net has frayed, leaving vulnerable Americans to slip through into hardship and hopelessness. And importantly, structural inequities that have always existed in our economy are being exacerbated like never before. This is a moment of urgency and opportunity, unlike any we've faced in modern times. The urgency of ending a devastating crisis and the opportunity to build a better economy in its wake. An economy that works for everyone, brings fulfilling job opportunities, and leaves no one to fall through the cracks. I look forward to working with the President-elect and Vice President-elect and this amazing entire economic team to address that urgency and seize that opportunity and make our economic system work better for every American. Thank you.
So we wanted to just show you here on News Now from Fox this event from earlier from the Biden transition where he was announcing his economic team, and it just so happens we have a live report from Wilmington, Delaware, from Fox's own Madeline Rivera, who's been following the transition ever since Fox declared Joe Biden the president-elect. Maddie, what can you tell us about this team that Biden announced today? Who's on it, and what are their roles, essentially?
Well, a lot of people might recognize some of their names, most notably Janet Yellen, former Federal Reserve Chair, and she is nominated to be the Treasury Secretary in Biden's administration. And if she's confirmed, a lot of firsts here. She would be the first woman to serve as a Treasury Secretary if she's confirmed. And then the other recognizable name that people might know is Neera Tanden. She's gotten a lot of criticism from Republicans and Democrats, a lot more that we can talk about in detail shortly, Andrew, but those are some two names that might stand out to people. But Biden talked a lot about the economic crisis and COVID-19, talking about how the two are interconnected. You know, some of the things that he talked about tonight were things that he mentioned throughout the campaign trail, talking about the need to build back better. And he talked about the need, called for the need for Congress to pass another COVID-19 relief package. And he said that even if Congress does pass a bill in this lame duck session, he says that likely won't be enough, saying that his transition team is already looking ahead, working on another plan to provide more economic relief to Americans. So those were some of the points that he touched on in his speech earlier today, Andrew.
And Madeline, also, I was kind of wondering as well, you know, congressional lawmakers introduced that bipartisan round of COVID relief today. And I was talking to our colleague Ali Rafa earlier this afternoon. Still no interaction between Mitch McConnell and Joe Biden. Is that right?
Not yet. You know, it's been a few weeks and a lot of reporters have been asking him whether or not he's spoken to the Senate Majority Leader. And Biden has said he has not yet spoken to Mitch McConnell. We don't know when he will start speaking with the Senate Majority Leader, but we all assume that he might at some point. You know, they have to work together in order to get things done, especially if Republicans maintain their majority in the Senate. They have to cooperate on certain things and maybe find some compromise. So you can imagine that they're going to eventually talk and have this conversation. But as of now, no conversation has been firmed up. Andrew.
Also, Maddie, I wanted to ask as well, just kind of about, you know, Biden and Harris both received their presidential daily briefs today. Was there a readout about that? Can you kind of give us any more inside detail on, you know, how that came about or what transpired this morning? Was it the first day or was it the second day today?
Well, today was the second day that they received the presidential daily briefing. They received the first one yesterday, and that was obviously monumental considering that Biden hasn't been getting those presidential daily briefings because of the holdup with the General Services Administration. And no, we don't have any information about that briefing. There is no readout, but one can imagine why there might not be a readout. It's classified information, so there might be some private information there that could threaten national security and such, something that the public should not be privy to. So it's not surprising that they're not sending out a readout of that meeting, but we expect that he's going to continue getting these briefings, obviously now that the formal transition process has been recognized. So we imagine he'll get another one tomorrow and obviously for the rest of the week, Andrew.
And, Madeline, we've been hearing from a lot of kind of disaffected Republicans who are speaking out about the Trump campaign's legal team and these allegations going forward with these lawsuits. Is the Biden team, is it your sense that they're going to issue some kind of statement? Why have they been kind of reluctant to do that? Are they kind of just letting the Trump campaign legal strategy run its course up until Inauguration Day? Do you think we'll hear anything about that from the transition team itself?
Well, they have been responding to it. Over the last couple of weeks, they've had these, news conferences with people talking about Trump's legal lawsuits in several battleground states. And the message that they have is always pretty much the same. They talk about how Trump's lawsuits don't hold any water and how they won't go anywhere, that regardless of how many lawsuits he'll file, the results will not change, that Biden will be the next president of the United States. And so they're always throwing cold water in some of the allegations and the doubts that the Trump campaign and the president himself might stir about this election, saying it's not true. And, no matter which way you spin it, one way or the other, the numbers are still there. Biden will be the next 46th president of the United States, Andrew.
And Madeline, I was just kind of curious as far as picking those top posts in his incoming administration. Do you have any insight into who's next, who still needs to be vetted, who still needs to be picked? There's still a lot of cabinet positions up in the air, aren't there?
Oh, gosh, I'd love to know, Andrew, but no, I don't have any other insider information on that. And, sometimes some information can leak, but nothing that we've heard of so far about any future positions that he might pick, Andrew. But I'm sure if we hear any more, we'll definitely relay that information to you as soon as possible.
And I know it's cold in Wilmington there, but just lastly, how long is Biden going to be in this boot when he hurt his foot? Do we have any idea on that?
Well, likely for the next few weeks. His doctor hasn't really specified a timeline, but he will be wearing a walking boot, obviously, as his foot heals from his fracture over the weekend. But hopefully he won't have it for Inauguration Day, but I don't know for certain how long he'll have to wear that boot, Andrew.
All right, Fox's Madeline Rivera there, breaking everything down, Biden and Harris for us in Wilmington, Delaware. Maddie, we appreciate you so much.
Thanks, Andrew.
And we're going to go back to the event from earlier today with Joe Biden announcing his economic advisors. We didn't get all the way through that, so in case you missed it, we want to play that out in its entirety for you. There's just a little bit left on that, and then we're going to have some great content going into about the last 2 hours here for our Tuesday night coverage on NewsNOW from Fox. I'm Andrew Kraft. I want to thank everyone for watching here on NewsNOW from Fox, where everything is live, raw, and unfiltered. We're speaking to reporters all over the country about the top stories of the day. If you want to follow that, you can go to our Twitter account at NewsNOW where we clip the biggest headlines and the biggest moments from the day's news. If you want to tell some of your friends and family on where they can watch us at NewsNOW from Fox, go to newsnowfox.com, where it lists all our platform partners and where you can find us. But first, before we do that, we're going to take a quick commercial break. So we'll see you back here in 2 minutes. Some of you will see this, some of you will not.
Good afternoon. I'm hard-pressed to find the words to express my gratitude to the President-elect and Vice President-elect for the chance to be here today. In thinking about the path that brought me here, a good place to start is 12 years ago, almost to the day, when I met with then Vice President-elect Biden at his home not far from here. It was supposed to be a job interview to be his chief economist, but it quickly turned into a conversation about economic justice and fairness, which, as many here know, is a common destination in conversations with the president-elect. Over the years, we've continued that discussion. Often it takes the form of some policy minutiae. Sometimes it's me hitting him with far more graphics than are necessary, or him telling me to stop speaking economese and start speaking English. Guilty as charged, Mr. President-elect. I suspect the reason we had such a meeting of the minds back then dates back to a common saying in my household when I was growing up. If you're not part of the solution, you're part of the problem. I grew up with a single mother, a lifelong educator. There was a picture of FDR on the wall. Her proudest moment wasn't when I got a PhD, it was when I got a union card. Local 802, the New York City's Musicians Union, but that's a whole other story. Of course, if you intend to be part of the solution, you need to accurately diagnose the problem. In that regard, I think the President and Vice President-elect's agenda is timely, resonant, and visionary. Yes, they've stressed the urgent need to control the virus and provide the relief needed to help families and businesses get to the other side of this crisis. But they've been just as adamant that simply getting back to where we were sets the bar too low. We must build back an economy that's far more resilient, far more fair, and far more inclusive. It is precisely the vision this nation needs, and I suspect I'm not the only person on this stage chomping at the bit to get to work on making their vision a reality. Thank you. Oh, yeah.
Mr. President-elect and Madam Vice President-elect, I am honored and very grateful for the chance to be a part of this absolutely exceptional team and excited to get to work helping build an economy rooted in the values that we share: equality, opportunity, and the dignity of work. It's no accident that I've focused my career on instilling those values in our economy, developing policies that help our nation grow stronger by growing more equitably. Like the President-elect and the Vice President-elect, those values were instilled in me at a young age. In the late 1970s, my dad got a job at Boeing. And if you grew up in Seattle like I did, you know what that means. A lot more than a paycheck, as Janet referenced, and as the President so often reminds us. And for our family, my dad's job at Boeing meant security. It meant union benefits, a place in the neighborhood, a place in the middle class. But when the recession hit in the early 1980s, one by one, the pink slips arrived for every family in our cul-de-sac. Every kid at my bus stop had a parent who was laid off. Our entire community saw its future dimmed, and one by one, it was my turn. So the first time I truly experienced this thing called the economy, it was my parents sitting down and explaining that things were going to be tougher for a while because my dad was on layoff. Too many kids in America experience the economy through those kinds of difficult conversations, or far worse. I was struck by the profound power this mysterious force held over my life, my friends, and my community. And I wondered if that power couldn't also be wielded to create happier conversations and fuller lives. I've dedicated my career to figuring out how we can grow and sustain the middle class and uproot the gender barriers and racial barriers that leave too many Americans outside the dream looking in. Through the organization I co-founded, I pursued solutions to reverse the dangerous march of inequality and bring us back to the core value of broadly shared success. That's the same value I see at the heart of the Build Back Better plan, and why I'm so excited and honored to help this team bring not just good jobs, but the good lives and peace of mind that comes with them to every American community. Thank you.
Mr. President-elect, congratulations on choosing this outstanding team of brilliant minds, this economic team. This is the right team for this moment. And to our nominees and appointees, thank you for your continued service to our nation. This is the team we need to deliver immediate economic relief to the American people, to get our economy back on track, and to make sure it works for working people. And as President-elect Biden noted earlier, completing that task could not be more urgent. Cases of COVID-19 are spiking, and beyond the tragic loss of life, the toll of this recession continues to mount. Across America, 1 in 6 adults with children say their families are hungry. Janet Yellen talked about food insecurity. This is real. We are looking at a hunger crisis in America right now. 1 in 3 adults are having trouble paying their bills, essential bills, the bills that need to be paid at the end of every month to get to the next month. And the number of open small businesses has fallen by nearly 30% due to this pandemic, while many others are hoping they can stay afloat until a vaccine is available. These are the struggles, the worries that keep people up in the middle of the night, that have them sitting at their kitchen table past midnight, trying to figure out how they're going to make it work. But Americans are not united by their worries alone. They are also united by their aspirations, the aspirations they have for themselves, for their children, for their families, and for their community. Because no matter where you live or what language your grandmother speaks, everyone wants to be able to get a job and keep a job. No matter what your gender or who you love, everyone wants to be able to buy a home and keep a home. And no matter how you worship or who you voted for in this election, everyone wants to be able to give their children a decent education and allow those children to pursue their dreams, even during a pandemic. And Joe and I understand that. We were raised to respect the dignity of work. We were raised by hardworking parents who always understood the dignity of work and the potential not only for their children, but of our country. And that's why I've always fought for working people, standing up for middle-class families who lost their homes in the Great Recession. Wally, you talked about that. Families in California were devastated, but they were able to rely on their government and the leaders, as Joe always talks about, who needed to see their condition and speak to that condition. And that's the work that needs to happen now. And I look forward to collaborating with this extraordinary team to put working people front and center in our administration. These public servants are some of America's most brilliant minds. They are proven leaders whose talents, achievements, and life stories, their life stories reflect the stories of the American people, and their stories reflect the very best of our country. And they not only have the experience, the expertise, and what is necessary to help end this economic crisis, but also what is necessary to put people back to work. And they also share in our commitment to building an economy, an America, where everyone has access to a higher minimum wage and affordable health care, paid family leave and paid sick leave, home ownership, and capital to start a small business. An America where opportunity is within reach for everyone, for all the people. So we've got a lot of work to do to build that America, and as Joe always says, to build back better. And President-elect Biden and I, together with this economic team, will be ready to hit the ground running on day one, because that is what this crisis demands, and that is what the American people deserve. Thank you.
So we're glad we could bring you that. That was from the transition team of Biden and Harris today from Wilmington, Delaware, announcing their economic team. Like our reporter in the field there, Madeline Rivera said, still remains to be seen who Biden plans to pick for other top posts, including Defense Secretary, Labor Secretary, Transportation Secretary, Commerce Secretary. So a lot of cabinet posts still need to be chosen. And remember, these cabinet confirmations can begin once the new Congress is sworn in, and that could happen before Inauguration Day. So we'll be on the lookout for that here on News Now from Fox. I'm Andrew Kraft. We want to thank everyone for watching. It is 20 minutes after 9 o'clock here in Phoenix, Arizona, a little after 11 o'clock on the East Coast. And we have something that we want to bring to you, and this was coming from the Fox News channel from today. Fox News anchor Martha McCallum interviewed former Trump campaign manager Brad Parscale. And so we're going to air that for you here. This is part one of part two. The second part will air tomorrow night in prime time on Martha McCallum's program, The Story, which airs at 7 p.m. Eastern. So we're going to give you what aired today. And this is Martha McCallum interviewing former Trump campaign manager of Trump 2020, Brad Parscale.
I've always had a lot of confidence in our plan. And I think the president and Jared had a lot of confidence in the plan. And it was unfortunate that we diverged from the plan right as we came down the stretch. But I think I think the president's still clearly in a position that he might be able to pull this off. And I'm not ready to call it off yet. Because I think it's weird. I just think it's still weird that, things like in Pennsylvania, the votes keep coming in day after day after day after day. Arizona, every 2 hours, the votes kept coming in. But states like where they had it really organized, Florida and Ohio, easily pulled away. And so I still think there's something to look at there. I'm not satisfied that this was a fair election.
You said we had a plan, me, the president, Jared, and it was diverged from at the end. Obviously, you left finally first in the summer, and then finally
I was removed.
In September.
I was removed.
How'd you feel about that?
I was hurt. That's an obvious sign now that I was hurt. I didn't get a warning sign, really, that no one asked me to change my plan. No one asked me to do anything different. I don't know exactly why I was removed and why all of a sudden we had to challenge the plan. I have a lot of thoughts of why I think that is. But, they paused the plan. Eventually went back to it, but we had a plan. I had a lot of time to plan. And in 2016, people don't like to admit it, but, I was a semi-quasi campaign manager. Never got to say that publicly before because I couldn't. Jared was the real campaign manager. I was the one doing the day-to-day, and we won. And it really didn't make sense to me why in 20 they had to change away from it.
2016?
2016. I'm saying I never really got to say what I really did. I never really got to say I was the semi-quasi campaign manager. Everyone got to say, oh, Brad didn't have the experience, but I had already won an election.
Kellyanne was the campaign manager, no?
Yeah, I think that was her title. But I think the people running the day-to-day operation were Jared and I. And I think that it didn't make sense why you would pull that team away if you're getting close in 2020.
So you say we had a plan. What was the plan? Articulate it.
Well, that's going to take a book to articulate the whole plan. It's a big campaign. It's $1 billion operation. But we understood where the weaknesses were. We need to pick up the votes. We understood what election day operations need to look like because of the legal fight. We planned that fight out 2 years in advance. I understood that this was going to happen. My team understood it was going to happen. We had a plan to increase the Latino and Black vote, which we did. We had a plan to try to keep the suburban housewives. We had a lot of plans, and we knew exactly what the path was to victory. COVID threw a wrench in it, but we still had a plan even through that.
Biden bested Hillary in 373 suburban counties in Pennsylvania, Michigan, Wisconsin, Georgia, and Arizona. So apparently they had a plan too, and it involved very little campaigning and very little door knocking. So a lot of folks look at the 80 million votes that Joe Biden got, and they say, how did he do that?
Yeah, well, we'll see exactly how that vote count goes out. But I knew, and my plan tried to make this a choice election, not a referendum. And I think that was one of the biggest disputes within the campaign. I knew that if it was a choice over the president with COVID and the economy, the president with his policies versus Biden, I tested 140 plus policies against Joe Biden versus Donald Trump. Trump bested him in 139 of them with American people. They knew the president's policies are what they wanted. The issue was how to keep this as a choice election. Joe Biden's America and going back, that he somehow could do this better, which I don't think he can, or Donald Trump who had made America better and his policies and make sure it didn't end up a referendum on him.
What was wrong with the plan from the point when you left and Stepien took over? What changed? What was wrong?
I'm not going to put the blame on any one person. These were the people I hired. Everybody that ended up running the campaign were my deputies. But I think what occurred, and I don't know exactly why, and this is why I started to really have a hard time, is because I tried to stay on to make sure the plan kept going. Like, I'll take a lesser position because I love Donald Trump. I mean, he's like family to me. That whole family is my family. And I want nothing more than him to win. I want nothing more than this country to progress the way it was. But they paused. They didn't know my plan. They didn't know to execute it or not. And they started to diverge away from it. And they started to test it. Should we use data like this? Should we buy TV like this? Should we run this? Should we do this? Should we even work with the RNC? Which I think were crucial mistakes. And I could name crucial mistakes. And I don't understand why. Because the president should have won by a lot more. He shouldn't be fighting. And I still think he might pull this off. Which will be, I give it 100% credit to him if he pulls it off.
When you were sitting at home in Florida during the last few months of the campaign,
yes.
What's going through your mind? You're watching the rallies all across the country during the middle of
watching
COVID.
us off TV.
You're watching the fact that they are pulling ads from swing states. You're hearing complaints that the campaign has run out of money, and in fact, those complaints are leveled at you for front-loading the spending too much, $10 million on a Super Bowl ad, all of that.
Yep.
So defend that and tell me what they did wrong.
First of all, let's defend the budget stuff. It was only $5 million on a Super Bowl ad. We ended up only going with a 30-second ad. And it was a great ad.
But you didn't need an ad at that point. He didn't have a candidate.
Well, let's put it this way.
Opposite him at that point.
In February of 2020, before COVID, the president and all of our polling was winning by 400 some electoral votes. The Super Bowl ad in itself paid for itself 2 times over, meaning his fan base, his voting base was so excited that he went up on the Super Bowl, the game they watch. They donated tens of millions of dollars to it. So you got to understand, not every dollar I spent was all done just as electioneering. It's also, how do we raise more money? How do we keep our fan base going even stronger? How does the voter get even more excited? How do we keep them fundraising the biggest campaign in history and what we were going to do? At that point, he was killing Joe Biden, 400 electoral votes. It was going to be the biggest landslide in American history since Nixon at that point. And we knew we wanted to win the black vote. Jared and I and the president sat down and said, what is the best thing we can do with the Super Bowl vote? And we chose to put the Alex Johnson up to show the truth between Donald Trump, who actually did prison reform, and Joe Biden, who put black people in prison.
It was a strong ad, I think, by most accounts, just an unbiased political look at campaign advertising.
Made money, helped with the black vote. I think those are 2 goals as me as a campaign man. Jared and I never got sideways on a concept. It's why we were such a strong team for all that time. And I think the worst thing they ever did was to break us 2 up. I think that was a decision that will go down if the president loses, being down the worst decision.
So Jared was also sidelined when you were sidelined?
This is my opinion. I feel like he was slightly sidelined. Not as much as me, but I think he said a little hands off and said, okay. And I think, since November of 2015, Jared and I talked every single day, and it was in our plan. Every day. How to use Facebook, what to do. And I think our relationship will go down as one that's pretty amazing in politics. But they got sidelined this summer, and I don't know why. I have no idea. I have a clue. I do.
And it is?
I think it's all the D-level people, all talking heads that are around the president that never done anything in their life, never created a business, never built anything successful, but talked themselves into something. And I think when the polling numbers were going down, they were in his ear, and I was out working.
There's a story that you have already responded to about him shouting into the phone at you when you presented some pretty unappealing poll numbers back in April.
Yeah.
You want to tell me about that?
I didn't like lying to him. I like telling him the truth. You know, sometimes that comes with a lot of, you know, painful days after knowing that I might have let him down or made him upset. But a lot of the D-level people that hung around him, they just told him what he wanted to hear. They were yes men. And I wasn't going to be a yes man. I was going to be a get it done man. And I did it for him. I did it for the family. I did it for this country because I felt like somebody needed to be the one telling the truth. And I think Jared did too. I think we both paid the price for that sometimes.
When you say the campaign didn't run out of money, I've heard from several sources in the campaign that they were running low on money and that they had to make tough choices. How do you back up the assertion that that's false?
Well, I think you look at the FEC reports. The FEC reports clearly show that there has been so many made-up stories. My life the last 5 years has been made-up story after made-up story after made-up story after crap. And the truth is, the campaign in 2016, the entire campaign had about $300 million. We had that in the bank with 3 months ago. We're still going to raise another $600 million. They didn't have a money problem. They had a strategy problem. They didn't know what to say. The easiest one to say is I don't have the money. And I think they got caught, you know, kind of in a catch-22 there because the FEC reports didn't say that. And I think the final FEC reports, when it's all said and done and history writes in the books, it'll show they didn't have a money problem.
Do you believe that if you and Jared had remained in charge, the president would have won, right, outright?
I don't know if he still not. I'm not saying that he can still win this. I think he wins easy. I think he wins by more. I think our plan was just right, and we knew what we were doing. And I think we were fighting a million pressures that are hard to explain. We had a plan.
So you saw that interview Brad Parscale did with the Fox News channel's Martha McCallum tonight in prime time. We wanted to play that out for you here on News Now from Fox. Parscale getting emotional, his voice breaking there when he was talking about how much he is devoted to the Trump family, still, even after his firing from the campaign, saying he feels like the Trump family is his family, and he was very hurt by his firing. Remember, it came as quite a shock to him. Those were his words, and saying that he thinks the president still has some type of path to victory. We'll just point out that the Fox News Decision Desk has called the election for President-elect Joe Biden. So there was an interesting conversation there. We're glad we could show that to you. We'll bring part 2 tomorrow night after it airs in prime time, 7 p.m. Eastern, on The Story with Martha McCallum. So in the meantime, we're going to take a quick commercial break. This will be 2 minutes long, and we'll see you back in just a matter of minutes. And once again, I'm Andrew Kraft, and remember, everything is live, raw, and unfiltered here on News Now from Fox. No opinion or bias, just facts, and we offer context and clarity to the day's breaking stories, the major stories of the day. Remember, we have extended live coverage now on the weekdays and weeknights going to 1 a.m. Eastern, picking back up at 6 a.m. Eastern the next morning. We have weekend live coverage now as well, 7 a.m. Eastern to 7 p.m. Eastern on Saturday and Sunday, because remember, the news never stops, not even on the weekends and not even on the holidays. You can go to News Now Fox, our Twitter account, if you want to give us a follow as well. There we clip all the moments, the highlights from the day. And you can go to newsnowfox.com as well, and that's where you can tell your family and your friends on where they can watch us, and it lists all of our streaming partners and our platforms. So, once again, I'm Andrew Kraft. Speaking of highlights from the day, in case you missed it, we're going to show you this about 12-minute clip from earlier today out of the state of Georgia, where the top elections officials there, including Gabriel Sterling, issued a really impassioned plea for the rhetoric to calm down, especially coming from the president, coming from those Republican senators in the state of Georgia, about all these baseless allegations of voter fraud there coming from the highest echelons of the Republican Party. And remember, the Secretary of State there and the other top election official, they're elected Republicans themselves. So here you're going to see Gabriel Sterling. He's mad, and you'll see that here on full display on News Now from Fox. This is from earlier in Atlanta.
I'm going to do my best to keep it together, because it has all gone too far. All of it. Joe DeGenova today asked for Chris Krebs, a patriot who ran CISA, to be shot. A 20-something tech in Gwinnett County today has death threats and a noose put out saying he should be hung for treason because he was transferring a report on batches from an EMS to a county computer so he could read it. It has to stop. Mr. President, you have not condemned these actions or this language. Senators, you have not condemned this language or these actions. This has to stop. We need you to step up, and if you're going to take a position of leadership, show some. My boss, Secretary Raffensperger, his address is out there. They have people doing caravans around their house. They've had people come onto their property. Tricia, his wife of 40 years, is getting sexualized threats through her cell phone. It has to stop. This is elections. This is the backbone of democracy, and all of you who have not said a damn word are complicit in this. It's too much. Yes, fight for every legal vote. Go through your due process. We encourage you, use your First Amendment, that's fine. Death threats, physical threats, intimidation. It's too much. It's not right. They've lost the moral high ground to claim that it is. I don't have all the best words to do this because I'm angry. And the straw that broke the camel's back today is, again, this 20-year-old contractor for a voting system company just trying to do his job. Just there. In fact, I talked to Dominion today and said he's one of the better ones they got. His family's getting harassed now. There's a noose out there with his name on it. It's not right. I've got police protection outside my house. Fine. You know, I took a higher profile job. I get it. Secretary ran for office, his wife knew that too. This kid took a job. He just took a job. And it's just wrong. I can't begin to explain the level of anger I have right now over this. And every American, every Georgian, Republican and Democrat alike should have that same level of anger. Mr. President, it looks like you likely lost the state of Georgia. We're investigating. There's always a possibility. I get it. You have the rights to go through the courts. What you don't have the ability to do, and you need to step up and say this, is stop inspiring people to commit potential acts of violence. Someone's going to get hurt. Someone's going to get shot. Someone's going to get killed. And it's not right. It's not right. And y'all, I don't have anything scripted. This is, like I said, I'm going to do my best to keep it together. All of this is wrong. DeGenova, who said for Chris Krebs to get shot, is a former U.S. attorney. He knows better. The people around the president know better. Mr. President, as the secretary said yesterday, people aren't giving you the best advice on what's actually going on the ground. It's time to look forward. If you want to run for re-election in 4 years, fine, do it. But everything we're seeing right now, there's not a path. Be the bigger man here and step in. Tell your supporters, don't be violent. Don't intimidate. All that's wrong. It's un-American. I don't know what else to say on that front. I mean, these are elections. One of our goals was to make elections boring again. Well, guess what? That didn't happen. This is all wrong. It's all too much. And I'll leave that for there. Okay, now, as I said, this will be a bifurcated press conference. Here's the stuff that we want to talk about. It's kind of hard to come back out of that. I apologize. There are 91 counties that have finished. This is going to seem really bipolar at this point, I guess, but 91 counties have finished their recount so far, and so far we see no real anomalies. Everything's going along the lines we would have expected. So I'm going to read off the list now. Appling, Atkinson, Bacon, Baldwin, Banks, Barrow, Ben Hill, Berrien, Bibb, Bleckley, Brooks, Bryant, Bullock, Burke, Butts, Calhoun, Carroll, Charlton, Chattooga, Clark, Clay, Crisp, Dade, Dodge, Eccles, Effingham, Emanuel, Gordon, Green, Habersham, Hancock, Harrelson, Hart, Hurd, Irwin, Jackson, Jasper, Jeff Davis, Jefferson, Jenkins, Johnson, Lamar, Lanier, Lee, Long, Lumpkin, Macon, Madison, Marion, McDuffie, McIntosh, Merriweather, Miller, Mitchell, Monroe, Murray, Newton, Oconee, Oglethorpe, Pierce, Pike, Polk, Pulaski, Putnam, Quitman, Randolph, Schley, I'm 99% sure it's pronounced Schley, Screven, Seminole, Stewart, Tatnall, Taylor, Telfair, Terrell, Thomas, Tift, Toombs, Troutland, Troop, Turner, Twiggs, Union, Walker, Ware, Warren, Wayne, Wheeler, White, Wilkes, Wilkinson, and Worth. So those counties, and it's 91 of them, have everything ready for their upload. The upload for the December 1st election today, those ENR sites will go live at 4 o'clock. The big counties. I understand Rob Pitts had a press conference trying to refute what I said earlier. I didn't watch it. I don't know what he said, and we know what happened, so we'll just go with that. They have 315,000 advance in person that they have to do, and they're taking the absentee by mail ones that have to be adjudicated to the English Street Warehouse away from the World Congress Center today. Gwinnett is still going apace and still scanning and adjudicating. Cobb, which we have been told had been done, they were only done with the election day votes yesterday. They're scanning absentee by mail now, and the early vote will be done by 7 p.m. tomorrow is their plan. DeKalb has under 1,000 ballots left to adjudicate, and they have already scanned everything. Chatham is going well. We see no anomalies there. And then for the specific absentee ballot numbers that were requested this morning, accepted absentees so far is 7,017, and we have 924,891 requests in, and another 52,602 that are on the absentee ballot portal dashboard for the counties to accept. That's a total of 977,493 ballots, so we're approaching 1 million. We expect to be there by the end of the week, obviously. And we'll begin to see more of these get accepted because, as I told you all yesterday, all of the all of the rollover voting ballots were mailed as of yesterday. So with that, I'll take any questions. About the threat. Young man, contractor, basically somebody took a video of him manipulating election data off of the recount. It was wrong, and then people started accusing him of treason. They started hanging things like a noose up, saying, you know, this is treason. You're going to pay for this. He's just a contractor, and now he's got a name. I'm not going to say it to spread the name more. But it's a unique name, so apparently they've tracked down family members and harassing them as well. I do know that Gwinnett PD has been contacted, I believe the Sheriff's Office as well. I don't know if we talked to the GBI yet, but I'm sure at some point in the near future they already have been, or they will be soon informed about the details of this. Justin. Well, this goes back to a couple of things that we've talked about as part of our elections package, that if the Secretary's office is going to be continually blamed for counties making mistakes and failing their voters, at some level we need to have the power to fire people who are in the way of this, similar to what they have in other states. And this is one of those where they've continually failed their voters. We saw the issues in Spalding County on Election Day. They didn't follow procedures properly. They didn't do it earlier. They basically Then they made false claims that they got a phone call of people saying that the stuff had been uploaded, that they later recanted. I mean, the trust in that particular office has been undermined. I believe all the local elected officials and local state officials agree that this person needs to move on to find a different kind of career. But this goes back to the fact that this office needs to have the power to deal with these things instead of having to call for other people to do it just to be able to do the jobs ourselves. Yes, sir. I'm talking about Senator David Perdue and Senator Kelly Loeffler, two people whom I still support in the election booth, but they need to step up on this particular thing. And that's me speaking as a Republican, not in this office, because I probably stepped out of line, but I'm kind of pissed. But yes, ma'am. We have said it repeatedly. I mean, it's been pretty clear. They called for us to resign, and frankly, when they called for us to resign, and the president called the Brad Raffensperger, who was a fine, upstanding, lifelong Republican, an enemy of the people, that helped open the floodgates to this kind of crap. It takes people who are already spun up, and you know, there are people who can have some righteous indignation to be angry, but there's also people out there at this point in the social media world. We see what happens. There are some nutballs out there who are going to take this and say, the president told me to do this. Essentially, you have to be responsible. You have to be responsible in your rhetoric. You have to be responsible in your statements. You have to be responsible in your deeds. That shouldn't be too much to ask for people who ask for us to give them responsibility. What else? All right, sorry. It's going to look like a regular ENR. You know, we have a banner on the Secretary of State site. It'll say recount results in the top banner, and then you'll click on that, and it'll look like a regular election night reporting. We probably aren't going to do that until tomorrow, probably around lunchtime, I think, because we want to get some separation because we have two ENRs going up tonight because the Congressional District 5 is a separate election project from the other state elections. So there'll be two different ones going up. We figured a third one might be confusing. They'll be posted. Counties will upload full results more than likely because what they're doing is everything's coming off a single ICC, and they'll probably put them all up at one time. They could put them up in parts, but I don't think so. All right, thank y'all.
So as you can see, the Georgia election official there, Gabriel Sterling, was quite fired up and was, visibly shaking with anger. And what he says is just really, really terrible things being directed toward himself, toward the Secretary of State, Brad Raffensperger, and his wife. Death threats, a lot of just vindictive, hateful messages. And he says it needs to stop. He said that multiple times, imploring the president and the Republican senators from Georgia to kind of put an end to this type of language that is, baselessly alleging massive voter fraud in the state of Georgia. So we're glad we could bring that to you there in case you missed that from earlier this morning in Atlanta. I'm Andrew Kraft. We have about an hour and 15 minutes left of live coverage here tonight on News Now from Fox. Remember, where everything is live, raw, and unfiltered, and we don't cut everything down or make it shorter. We bring it to you in their entirety. And if multiple live events are happening at once, which is always a good thing in the news, you want a lot of things happening, and especially on our News Now stream where we can bring them nonstop to you. Sometimes we can't get to them, all of them at once while they're live, so we'll bring it back and show it moments after the fact. If you want to follow us on Twitter, go to @NewsNowFox. If you want to follow me on Twitter, go to @Andrew Kraft. And we're going to take a quick commercial break before we show you some great content from our sister stations around the country, our Fox affiliates. They put together great stories for us each and every day that we love to show around this hour, having to do with the coronavirus, the coming vaccine, celebrity interviews, and many, many, many more topics. So we'll get to that in just a minute after this break. Stick with us here on News Now from Fox. And we're going to start with a story out of Fox 11 in Los Angeles, and we hope you enjoyed that. And we're going to just roll through these as the night goes on and probably come back on camera a little bit, but this is some great content, and we hope you enjoy it.
Adriano Ortiz goes by the name Nana. born with a rare disease that essentially attacks his bone marrow. The good news is, as we showed you on Friday, he just completed his last round of treatment.
This is our second family, right? Yeah. You love everybody here, right? Mm-hmm. Say thank you, everybody. Thank you, everybody.
That little sweetness of light, Nano, all outfitted in his beautiful mariachi outfit, ringing the bell. You know that bell was felt and heard for miles. We wanted to check in with him now that he is home. Nano and his beautiful mama, Eliana, join me now. Good morning, Eliana. Good morning, Nano.
Good morning, Kayla.
How's everybody feeling? Eliana, tell us how it feels to have Nano home with you.
It feels really good, actually, because I get to be home not only with him, but with everybody together as a family. And it feels good. It feels, we're happy, right?
Mm-hmm. We're happy. He's a man of very few words, but I'll get him talking in a second. Eliana, you talk about that. I mean, it's been a long haul for you. That you've been away because you've been at the hospital with him. Those are long, sleepless nights. Talk to me about that.
It was really tough because when I went into the hospital with him, I was actually pregnant. So it was really hard being pregnant, being away from my kids, and seeing my son go through what he went through was really tough. It was stressful, and it was hard, but we got through it, you know.
How'd you get through it? What do you think it was?
It was the whole family standing strong. You know, my mom, my husband, the support. My mom always told me that, don't worry, Mija, he's gonna get through it. You know what I went through. My mom had breast cancer, so it's not the same thing, but it's something similar. Sure. She's like, I got through this, and he's gonna get through this too.
He's quite a little fighter, Nano. He is a strong man. He's like Iron Man, right, Nano?
Yeah. Who are you?
Iron Boy. You're Iron Boy. Yes, you are. And I know music means so much to you. What's your favorite song, Nano?
What's your favorite song? Cantas no llores. What's the name of the song? Cielito lindo. Yeah.
And he used to do little performances. Talk about the music therapy program there at Children's Hospital. I think that this is something worth shining a light on. I don't think people realize it isn't just them coming in to cheer up the kids. It's really working with them to allow the music to soothe them during these tough days.
Correct. Yes, music therapy gave him the strength while he was at the hospital. And there was days where he was so sick. And, you know, I would think that he would tell her, you know, go away, I don't want you here. But no, he wanted her to stand, play music next to him, you know, to soothe him. And it really helped him get through his whole transplant when he was having them tough moments. Ha, mijo. He loves Hana. Music is just him, and, you know, it helped him a lot.
Yeah, music, you know, it's interesting. We saw Hannah sit in some of the video sitting in with him, and he really comes alive when music plays. I understand, Nano, you would give concerts in the hospital. Is that true? You give little mariachi concerts, singing and playing your maracas?
Yeah. With the microphone, right?
Wow, he became awfully popular.
He would want me to put on his outfit within 5 minutes, and he's like, let's get ready, Mom, I'm gonna do a performance. And I would put it on quickly, and he would run out the door, and he's like, I'm ready, and start singing.
And not just the little bit of light and the smile that it gave everybody on that floor in the ward, but it made you realize that the spirit of this little kid was strong in your son.
Yes. Since he was born, there was something about this little boy that always, something inside of him that always, you know, caught a lot of people's attention. And he has good spirits. And, you know, he brings joy and laughter to a lot of people. And, you know, I love him so much.
Yes. Well, I mean, look at that little face. He's got just the most gorgeous smile. And he's also a big brother, right? You had your baby. How old is the baby now?
He's one now, so he's a BMT baby. That's what we call him. He's a BMT mascot because he was raised there. So I was pregnant when I went in and I had him, and he was just raised on the BMT unit. So,
You're a bone marrow transplant kiddo too. Yes, you sure are, Nano. You sure are. So what do days look like right now? What do days look like right now, Eliana? He's doing well. He's doing well. Does he have to go back for follow-ups?
He goes twice a week. We're still going twice a week, which is better than being in the hospital.
Sure is.
So, yes, he still has to go for checkups twice a week to make sure everything is okay. Sometimes he goes in with low sodium, high potassium, but it gets fixed right there and then. So, yeah. We're still going to the hospital twice a week.
But you're home, and that's the key. I love meeting you, Eliana. So proud of you as a mama. Nano, you just brought joy to so many of us. And my love, I send you a big kiss. Besito. Mwah. Can you catch that? Mwah. Back at you, honey.
Thank you.
Oh, you take care of yourselves and have a safe and happy holiday season. You guys stay safe, okay?
Thank you.
Many blessings to you all. Oh my goodness, what a beautiful family.
All right, 9:33 is the time right now. In today's parents panel, we're talking about the holiday season being in full swing. Due to the pandemic, it won't look like years past, and some parents having to get creative with traditions and gift giving. So, here to weigh in this morning, our owner and founder of DC Area Mom Collective, Courtney Whittington. Courtney, good morning. Wave your hand so the people out there in TV world can see you.
Thank you for having me.
All right, a DC Area Mom Collective contributor, Tatiana Laborde. I hope I got that right. Wave your hand. There you go. All right. And the owner of PJ Watch and Jewelry Repair, Danny Mago. Did I get all those right?